bring it out in the open and ask for help, and how help needs to be there for everyone with no stigma, no barriers. In this pandemic, she's taking that same impulse, those same lessons, and working to make sure we reach more and more New Yorkers who are going through so much. I want to thank her for that, and particularly for the work she is doing to bring these extraordinary military professionals in to help us further. So now I'll turn to our First Lady, Chirlane McCray.
Thank you, Bill, for your leadership and especially for your compassion. For weeks now, all our frontline healthcare workers, who I think of as our soldiers of grace and mercy, have been pushed to the limit. Inside our hospitals, we've had battlefield conditions with triage and fear in the hallways. But when the emergency field hospitals and morgues close, after the TV crews leave and the clapping stops, our soldiers, our healers, go home. And we have to wonder, how do these healers manage their stress after seeing so much death and suffering? Their emotional state is a crisis within a crisis, and an urgent mental health emergency. And that's why we are working with the Department of Defense, which has brought together a joint force from the Navy, the Air Force, and the Army. They are experts in dealing with combat stress and have a unique insight into how to help those who provide care in this kind of setting. The Department of Defense will train 1,000 behavioral health staff in helping healers heal, champions as trainers who will further train H&H, Greater New York Hospital Association, FDNY, and EMS staff. The Department of Defense will also conduct assessments, sharing advanced decompression and wellness strategies for combat stress management. This work with the Department of Defense is a critical new piece of what we are doing for all of our essential frontline workers in New York City. So how will we provide more support for our healthcare workers? Well, these DoD trauma specialists will look at individual hospitals and also the entire system. You know, every hospital is different. They'll want to talk to frontline leadership to get a picture of the most pressing mental and emotional needs. And they'll add to the programs, training our team on combat stress. At first, they'll do small groups from FDNY, health in hospitals, and private hospitals will also be trained. And next, we'll train more than 1,000 health and hospitals personnel and other staff. The Department of Defense will provide a whole new higher level of trauma care for those on the front line. Our heroes will have the opportunity to receive an individual assessment. And all of this work is already underway. We're ramping up to be fully operational in May, with the program fully in place by June. This is not the time, nor is it appropriate for us to hide the level of stress that is experienced by our nurses and doctors and medical technicians. We have to face this head on. This is not something that we should be secretive about. And I have to say that once again, New York City is a leader in this effort. No other city has a comprehensive mental health program for healthcare workers at this scale. And it will not be a one-off. This program, with the trainers and other resources, will be incorporated into our healthcare facilities so that even long after this pandemic is over, our healthcare workers will have these services. I want to thank the U.S. military, H&H, Office of Emergency Management, and the New York Fire Department. The service of our frontline healthcare workers is beyond what anyone could have rightfully asked. They have inspired a city and a nation, but it comes at a steep price. In recent days, we've lost John Mondello, an EMT working in the Bronx, and Dr. Lorna M. Breen, an ER medical director at Presbyterian. Please join me for a moment of silence in their memories. We owe these workers the world that we will enjoy after this virus is defeated. And we will not forget them. We will not forget this debt. When people ask our hospital workers, what did you do during the great pandemic of 2020? We want them to say, with pride, I showed up. I did my best. I saved lives because my community supported me. I was able to take care of myself while taking care of others. And I stayed healthy in mind, body, and spirit.
Thank you, Shalay. That's a beautiful sentiment, and it's exactly the spirit we have to bring to everything we do to support our heroes, and this incredible initiative with the U.S. military is going to help us do it. And remember, every single one of you, every time you say thank you to a healthcare worker or a first responder, every time you applaud them, every time you ask them if they're doing okay, if there's anything they need, that helps so much. But what our military is going to do is going to be outstanding, because we've seen they bring a special ability, and their presence, as I said, in our hospitals, not only their skills, but that extraordinary confidence it gives everyone to see them present has been really, really crucial to getting through this crisis. So thankful to everyone who's brought together this new initiative to address the combat stress that's the reality for so many here. Now, there's another important new approach we're going to take to protect our heroes, and it is to give them more information about what they've experienced during this pandemic. I want to talk to you about testing. And what we've talked about before is the coronavirus test. It's called the PCR test. And that is the test that answers the most immediate question at this exact moment. Are you infected with the coronavirus? That's the test that is crucial to so much of what we're going to do going forward. That's the test I wish we had had a lot more of when we needed it earlier on. But there's another test that really will provide a lot of help and support as well, and that's the antibody testing. And I'm going to talk to you about a new initiative that will reach so many of our healthcare workers and first responders. And I'm going to tell you why this is so important and the sweep of what we're going to do here. I'm also going to give a few qualifications, because it's important to recognize what we know and what we don't know when it comes to antibody testing. But here is what we do understand, that particularly good antibody tests, there's many different kinds, but the ones that are most accurate and effective give you a clear indication of whether you have been infected by the coronavirus previously. And they give you some real confidence, because here's what we can say. Anyone who has been infected and came through obviously had the ability to beat this disease. And knowing if you've been exposed to it is powerful information. Our healthcare workers and our first responders who are dealing with folks who might be infected, it is going to give them additional confidence to know if they've been previously exposed. Think about what it takes every day to get up and say, I'm going to go where the COVID-19 is, where I know it is. The folks who go into the hospitals, the emergency rooms, the ICUs, the paramedics, the EMTs, all the folks who know they're going to where the danger is. They're, of course, thinking of their families, their own families too. So having a sense of whether you've been exposed previously is very important. And giving the best answer we can brings a lot of value. On top of that, we are seeing really impressive results with treatments based on plasma that needs to come from those who have already been exposed. So there's a growing hope that when you identify people who have been exposed, you're identifying folks who can then give blood that then allows for the treatment of more people who are sick and help save lives. And we know one thing about our healthcare workers and our first responders: they are doing this work because they care so much about saving lives and helping other people. So knowing that they could be amongst those who give blood that saves other lives is entirely consistent with everything they've devoted their lives to. And then there's the fact that we're going to get information that can help us fight this disease. We all understand, the entire global medical community is still trying to understand the coronavirus, figure out the best ways to fight back. One day there will be a vaccine, one day there will be a cure. But the more information we gather, the more likelihood we get to that day sooner. So antibody testing brings a lot to the table. And our goal is to reach a lot of people who would like to take advantage of it on a voluntary basis, of course. But I'm talking about our healthcare workers, I'm talking about our police officers, our firefighters, EMTs, paramedics, correction officers, so many who would like to have this opportunity, and now it will be provided for all who want it. So, thinking about our healthcare workers, thinking about our first responders, we are initiating a plan to reach 150,000 of our heroes and give them this antibody testing, to give them that knowledge and that peace of mind, and to ensure that they are also helping us take the next step in fighting this disease. We have agreed to a partnership with the federal government, with the Department of Health and Human Services and the Centers for Disease Control. And more details will be announced in the next few days. But the plan is to begin as early as next week to offer the tests in hospitals, at firehouses, at police precincts, at correction facilities, wherever our healthcare workers and our first responders are, to make the tests readily available. Again, this will be provided for free. The federal government is covering the cost, and it will be provided to all who want to take advantage of this test. Now, I mentioned that I'm going to say the antibody test, no one is claiming it is perfect. It does not tell you, the best of I understand from all of our healthcare leadership and from listening to Dr. Fauci and others, it does not tell you if you're entirely immune in the sense we all think of that word. When we hear the word immune, we think you just can't possibly get something again. There is not yet confidence that having been exposed to the coronavirus once means you can never get it again. Now, common sense tells us if you're exposed once and you made it through, you're in very good stead. You're in a very good situation to make it through again if you ever were exposed again. But we don't know for sure if anyone can contract this disease a second time. The good news is, honestly, there's not a lot of evidence that people have, but we don't know for sure. So that's a limitation that we have to be clear about. And it's also important that even folks who get a positive result do not think that means that they can let down their guard. I'm not saying people would think they're invincible, but they have to be really clear that there still are dangers because we're dealing with an unknown disease. We're dealing with so many questions. So for healthcare workers and first responders, they would still continue in their work to wear the PPEs just as they were previously. And we still need to practice the same concepts, the social distancing, and we still have to be watchful for symptoms even if someone has tested positive. But again, it's not a perfect test, but it does give real information. It is helpful. It tells you something very important, and it's part of solving this bigger puzzle of the coronavirus and fighting it back. So this, again, more details to be announced, but a wonderful step forward and a huge initiative. The goal is to reach 150,000 of our heroes. Now, let me talk about another effort to protect people. And this is now about how we protect some of the very most vulnerable in New York City, homeless New Yorkers. Again, the compassion I talked about earlier, New Yorkers feel tremendous compassion for folks whose lives in some way came unraveled and they ended up on the street or they ended up in shelter. So a few weeks ago I told you we had a goal of having 6,000 homeless in hotels rather than congregate shelters to make sure that people were safe. And that goal has been reached. And now we are going to go farther. This week we will move an additional 1,000 homeless individuals from congregate shelters to hotel facilities. The priority will be on folks in those larger congregate shelters that are having more trouble with this social distancing. And there's going to be a constant effort to evaluate all shelters, and wherever there are social distancing problems, continue to take people out of the shelters into hotels. 1,000 this week. We are prepared to do 1,000 more each week going forward as the need indicates, because we want to make sure people are safe. Now again, there are real reasons for people to be in shelters who need the services in shelters. So for some people, it actually can be much, much better to stay in the shelter setting. But we've got to make sure there's enough space. We've got to make sure that we strike that balance. We're also going to provide additional medical oversight. Our Health and Hospitals team is going to work with the Department of Homeless Services to bring additional medical oversight to all homeless services sites. The goal is to constantly be vigilant for anything that might pose a danger to homeless New Yorkers. And starting this week, we will begin a program of testing homeless individuals at homeless services sites. Of course, anyone who tests positive will be isolated. This initiative will begin this week and expand over the next couple of weeks. The goal is to reach across the entire shelter system by the middle of May. All right, a few more things before we turn to our colleagues in the media. And we've talked about some serious and somber topics, but now let's turn to something I think people are going to be happy to hear about. And you know, look, when our lives changed so profoundly over the last weeks, it's almost been impossible to take stock of all the things that are different and the things we miss and the things we need that we can't have right now. And some of those things are going to take a while longer, but there are other things that we can start to bring back, if only online for now, later in person. But there's some things that we need to make available to people online that could really change their lives for the better. And we know there were a lot of folks in the weeks leading up to this crisis who were planning on doing something absolutely beautiful. They were planning on getting married. And Shirley and I are coming up on our anniversary on May 14th, 26 years. And we know what a beautiful reality marriage is, what it means to people, how it frames their whole lives, and yet folks haven't been able to get married in these last weeks. So the good news is we're going to have a very, very good new visitor in our city. Cupid is coming to New York City. Project Cupid will allow couples to get married online. And this will start later on next week, and it'll be available in 11 different languages. And this is a great team effort. And we want to thank Speaker Johnson of the City Council. We want to thank the City Clerk's Office and our colleagues at Do It, our Information Technology Department, who all put their minds together in a spirit of love and said, how do we figure this out? How do we get back in the marriage business and help people who are ready to tie the knot do so online? So again, not this week, but late next week, this will start up, and information will be available at nyc.gov/Cupid. And I want you to know, this is such a great example of New Yorkers saying, you know what, even in the face of a pandemic, we're not going to let it change us, and we're not going to let a pandemic stand in the way of love. We're going to let people get married and go forward with their lives and look to the better days ahead. Okay. Let's now talk about what we talk about every single day, which is the daily indicators. So as I go into them, I can say we've had a good day, not a perfect day, but a good day. And we got to keep pushing and we got to keep doing better. So the first indicator, unfortunately, is up. The daily number of people admitted to hospitals for suspected COVID-19 went up from 112 to 136. But the other indicator is going in the right direction. Daily number of people in ICUs and our public hospitals for suspected COVID-19 down from 745 to 734. Percentage of people testing positive for COVID-19 citywide down from 27% to 23%. Public health lab tests down from 56% to 29%. That's great. So progress, like most days we've seen, progress, but not what we still need fully to get everything going down in the same direction. Now, we're going to talk, I am certain, about the challenges of maintaining social distance. And I can tell you, we have to stick to it. And yes, we're about to have warmer weather. And yes, everyone's going a little stir crazy, but we have to stick to it, because every time you see these indicators go in the right direction, that's because of the work you've been doing. But if we loosen up, these indicators will start to go in the wrong direction. Now, unless there's someone out there that wants to delay the restart, and wants to see this horrible crisis continue, I think we can all agree we got to buckle down and beat this disease. And every time you socially distance, every time you stay home, you're helping to fight back the disease and save lives. We got to stick with it. I'll just close before saying a few words in Spanish, and then we'll open to our colleagues in the media that, we're going to be spending a long time trying to figure out everything that happened here in terms of the human impact over these last months, and certainly the months ahead. And the mental health piece of this is in some ways probably going to be the hardest to make sense of. As we always say, it's different than the physical reality or the physical scars. The mental scars take longer to uncover and process and make sense of. But so many people are dealing with these challenges in one way or another. The bottom line, as you heard from the announcement today, whether you're one of our heroes, whether you're an everyday New Yorker practicing social distancing, whether you're a parent trying to support your kids, whoever you are, you're not alone. And we're going to be there for you. And 24 hours a day, 7 days a week, multiple languages, and for free, anyone who needs help can call 888-NYC-WELL. And get a trained counselor and get that support. Lots of people are doing that, and it's helping them through. I want to invite anyone who needs that help to take advantage of it. A few words in Spanish. Esta pandemia ha resultado en una crisis dentro de una crisis, ya que afecta a la salud mental de tantos neoyorquinos, a nuestros trabajadores de salud y de emergencia les afecta mucho. Y necesitamos ayudar a todos los héroes que nos ayudan. A nuestros héroes les vamos a dar el apoyo que necesitan para llevar este cargo, para que vuelvan más fuertes que nunca. With that, we will turn to our colleagues in the media. And again, always remember to give me the name and the outlet of each journalist.
Hi, all. Just a reminder that we have First Lady McCray and Police Commissioner Shea here in person. And on the phone, we have Fire Commissioner Nigro, Health Commissioner Barbeau, Social Services Commissioner Banks, and Vice President and Chief Quality Officer for NYC Health and Hospitals, Dr. Way. With that, I will start with Ashley from the New York Times.
Good morning, Mr. Mayor and everyone on the phone. I wanted to ask a two-part question. One, there was some suggestion by the shul that the funeral in Brooklyn that was broken up last night had been coordinated with the police somehow. I'm wondering, Mr. Mayor, if you could tell us if you were aware of those plans. And then for Commissioner Shea, can you tell us in detail about any contact or plans that the NYPD may have made with pertaining to this individual's funeral? And also answer, are there others planned, and how do you plan to deal with this in the future if there are other deaths in the Orthodox community?
Ashley, I'll start and I'll turn to the commissioner. I heard about this situation. I believe it was somewhere around the 6:30 to 7 o'clock. I was very concerned when I heard there might be a large gathering. The commissioner will talk about how the NYPD approached it. But I have to say, again, I understand that when people are going through mourning, they're in real pain. But we have to understand what it means to hold a large gathering in New York City today. It means, unfortunately, that people who go to that gathering, some will be sick with this disease. It's just a fact. We know this. Some will spread the disease to others. People, as a result, will die. So I have a long, deep relationship with the Orthodox Jewish community. A lot of personal relationships, a lot of people I know and respect. I have a lot of love for the community. The notion that people would gather in large numbers, and even if they didn't mean to, would spread a disease that will kill other members of the community is just unacceptable to me. So we have to do something different. And we have to break out of whatever we thought was normal in the past, because these are not normal times. So we're not going to be allowing these kind of gatherings in any community. This was by far the largest gathering in any community of New York City of any kind that I had heard of or seen directly or on video since the beginning of this crisis, and it's just not allowable. So we have to change this reality. We will work closely with the community to do it, but we have to change this reality. Commissioner?
Yeah, Mr. Mayor, I think you hit the nail on the head. Before we get into the specifics of yesterday's incident, what troubles me most is, as a department, as a city, we've been through a lot already. And members that have gotten sick, members that have given their life, whether it's in the health field, certainly in the police department. Make no mistake, this large gathering such as this is putting members of my department at risk. And it cannot happen, and it will not happen. And it's going to be met with very stern, as it was last night, immediately being broken up and stern consequences. What we know about yesterday's incident was at approximately 3:30 in the afternoon, we learned of the passing, unfortunately, of a prominent rabbi from the Williamsburg section of Brooklyn. Immediately, within minutes, members of the local precinct were in contact with clergy liaisons and members of the Jewish community in terms of what to expect at that location. Plans were put in place, a detail was put in place. Unfortunately, when you look back at some of the past incidents, there's been a lot of work done throughout New York City with every faith. And people, again, have been overwhelmingly compliant. But there has been a couple incidents that were not so. So contingency plans were put into place. A number of officers were detailed in the unlikely event that large numbers came, and we thought that was a possibility. But absolutely, I think we've been pretty consistent, Mr. Mayor, for what seems like a longer time, but probably months now, that there are to be no gatherings in New York City, such as what we saw last night. So within, as the time unfolded last night, there was probably several thousand people that came in and around that location on Bedford Avenue. Additional officers, I was in conversations with members of the upper echelon of the NYPD. Additional officers were called in, and in pretty short time, that crowd was dispersed. And a number, I think the final tally I saw was 12 summonses were issued for a variety of offenses, certainly social distancing, and then including some for a refusal to disperse. But I want to end where I started with this. What happened last night simply cannot happen. And we need all New Yorkers have come together during this crisis, but they need to do it more than ever. And we need community leaders to stand beside us. We cannot have people unnecessarily being exposed to a disease that is having catastrophic effects on our membership and really New Yorkers as a whole.
Next, we have Henry from Bloomberg.
Mr. Mayor, good morning. My question has to do with how you are going to assess the different levels of risk involved in human activity. For example, why can't people play tennis? Why can't you regulate the amount of people who will be visiting or who could visit city pools when it's 98 degrees in the summer, or regulate the traffic going into city beaches and give people maybe a ticket or a rain check for another date if they can't go to the pool that day, and regulate the time period and the amount of use at that pool? Because we're facing what happened last night is almost like a release of a valve. There's going to be a level of frustration in this city that will be very difficult, I think. Maybe I'm wrong, but it'll be very difficult to manage the expectations and the needs of this population. I mean, am I wrong? What is your response to my question?
Well, Henry, I think you said a couple of different things. I think the issues you raised obviously are being felt all over New York City. But again, I want to say a large gathering, this is a different issue. When you talk about pools or beaches or tennis, you're talking about what individuals do. What we saw last night was absolutely unacceptable. It would be unacceptable in any and all communities. It was a large gathering, again, tragically, thousands of people. The amount of danger created by that kind of gathering is inestimable. The fact that people will die because of it, which goes against everyone's values. I want to separate that kind of thing from the question you're asking, which I think is a fair and important question about what can we do for everyday people, individual people from all parts of our community as we try to, over time, work our way back to normal. So I'd say is the first rule is there will be no large gatherings of any kind anywhere. And anyone who equates a small number of people around, a blanket in a park with what we saw last night is entirely missing the point. We are talking about thousands of people in close proximity in one site. We will never, ever allow something like that to go unchecked anywhere. Now, if you say, okay, people are understandably yearning to get outside and the weather's going to get warm, we're working on this all the time, and we're going to have announcements on this soon, how we're going to address the warm weather. We've worked with the City Council on one piece of it, which is to try and open up more space in certain key areas with enforcement. But when you talk about pools, beaches, tennis courts, each thing's going to be looked at individually. There's the whole different piece of the equation, which we've talked about, which is what can we afford to open, and that's going to be all about what happens with the stimulus in Washington, whether we even have money to open some of these things, and that's a big question mark right now. But then beyond is the question of what will keep people safe, the most important question. What will protect people's health and safety? And places where a lot of people might congregate create a real danger. We have to know we can manage them properly, and there can be proper enforcement, and that the time is right. So the indicators will tell us when we can start opening up, and we're going to do it very carefully, methodically. And each thing you mentioned will be looked at in turn when the time is right, but only when the time is right.
Next, we have Marcia from CBS.
Good morning, Mr. Mayor. How are you doing today?
Good morning, Marcia. How are you?
I need to ask you about what happened in Williamsburg, because a number of leaders in the Jewish community are quite upset that the members of that community were singled out when there's been violations of social distancing in many places. Number one, they're asking for an apology, and number two, they're inferring that the fact that you're singling out a Jewish community could add to the number of anti-Semitic incidents that happen in the city. So I'm wondering if you will apologize if you feel bad about singling them out. Also related to social distancing, wondering if the NYPD will repurpose some staff like crossing guards who are not being used to help with social distancing. And on an unrelated topic about medical examiners, are you thinking about the possibility of directing the medical examiners to extend the hours on weekdays, maybe to midnight, and possibly staying open on weekends?
Okay. Marcia, respect all those questions. Our team will follow up with you on the medical examiner because, again, I'm asking everyone, in the interest of fairness, all your colleagues have been doing 2 questions up front, 1 or 2, and we're going to stick to that rule. So I will speak to your question, and the commissioner can speak to the crossing guard question. I spoke last night out of passion. I could not believe my eyes, Marcia. It was deeply, deeply distressing. Again, this is a community I love. This is a community I have spent a lot of time working with closely. And if you saw anger and frustration, you're right. I spoke out of real distress that people's lives were in danger before my eyes, and I was not going to tolerate it. So I regret if the way I said it in any way gave people a feeling of being treated the wrong way. That was not my intention. It was said with love, but it was tough love. It was anger and frustration. At what I saw, no, Marcia, it's not happened other places. Let's be honest. This kind of gathering has happened in only a few places, and it cannot continue. It's endangering the lives of people in the community. So to all those, and I understand politicians, everyone has said, oh, look, you know, this is like people gathering in the park. No, it's not like people gathering in the park. It was thousands of people. Can we just have an honest conversation here? It was not acceptable. We will not tolerate it. I also will not tolerate any anti-Semitism, ever. And for decades, I've made it my business to stand up for the Jewish community, and people know that. Won't tolerate anti-Semitism, won't allow it to grow in the city. We've fought it back many times. My message was to all communities, and that was written in black and white. But it was also to be clear that what I saw, I had not seen anywhere else. And I was trying to be honest about the fact that there's a problem that people have to come to grips with and deal with, or else people in the community will die. And that's not something to get somehow shunted aside. I understand the power of words, obviously, but I'm not going to let that power, that concern about words overcome the value of human life. We're here to protect human beings, and people were put in danger last night. Members of the Jewish community were putting each other in danger. They were putting our police officers in danger. Now, if I see it in any other community, I'll call that out equally. So again, if in my passion and in my emotion I said something that in any way was hurtful, I'm sorry about that. That was not my intention. But I also want to be clear, I have no regrets about calling out this danger and saying we're going to deal with it very, very aggressively. Commissioner, do you want to speak to the crossing guard issue?
Sure, and if I may, I mean, just to echo the mayor's comments on last night, there were thousands of people crammed onto one block. And when you look at everything that we are going through as a city, we live in an imperfect world. And we, you know, my department, certainly, I have seen instances of not social distancing. But I could tell you, Marcia, that you, as you know, there was 2 funerals last weekend for members of the NYPD. We would normally have probably tens of thousands of people at that funeral. We had a handful. People have to be accountable for their own actions, regardless of what neighborhood, ethnicity, where they come from. We cannot have what we had last night. We will not tolerate it. We are going to break it up immediately. And really, you cannot even go to that event. That's what it comes down to. Regarding the crossing guards, you know, we've been hit hard throughout the department. We have really positive news. We still are praying for a number of members that are in the hospitals, but we're on the road back, thank God, in terms of our sick rates. One of the things that we are still watching closely is who is at work, who is essential, across many titles. And when we look at crossing guards, I think it's well known. You tend to have people that are a little bit older. So we are very cautious of how we use those crossing guards, in what capacity, and people in terms of their age, prior medical conditions, and the situations we put them in. Of course, we're looking at any and all employees of the NYPD, how to get the most out of what we use. We've worked with other city agencies in terms of lending some of our expertise to other city agencies, and we would not be against continuing to do that. But we're also going to do it in a smart manner that really watches out for everyone's safety.
Next, we have Katie from the Wall Street Journal.
Hey, good morning, everyone. I wanted to follow up with the questions of many of my colleagues. The one thing that I can get some clarity from the commissioner on is, the NYPD's involvement with the organization of last night's funeral. So former city councilman David Greenfield said, I guess, that this was allowed. He tweeted, I guess, some information that, this was organized with the NYPD's approval. I don't know if they knew that, if your department knew there would be so many people who showed up, but questions on that and more details on that. When these summonses were issued, was it after the mayor came and asked for it to be broken up, or did it happen before? And just for the mayor, there have been multiple reports. The governor has cited these reports of funerals, and I even drove by a large funeral once on the BQE a few weeks ago. So why were you so shocked that this was the case? Because it seems to have been a consistent problem.
No, Katie, I'll start and pass to the commissioner. Again, respectfully, I'm not, you're saying I was shocked this was the case. That's not what I'm saying. I've been talking about this issue previously, that we won't tolerate. I even said we wouldn't tolerate. Again, I really want you guys to take the fact that we constantly are briefing you and respect that we're trying to give you a lot of information, and you're all intelligent people. You've heard in great detail telling people they cannot gather from all religious communities in their houses of worship. That's been going on for weeks. Telling people they can't even do services in a living room because that's going to endanger lives. We've been talking about all of these dangers and the fact that we're not going to tolerate them, and we are going to enforce. And we've talked about funerals before as well. That's why I'm so angry that we have given plenty of warnings, worked with community leaders to ensure they gave the warnings, and they have, by the way, overwhelmingly. Let me make sure this is crystal clear. I've said it many times, but I know there are many in this town who love to create confusion and division, so let me try one more time. I want to thank the Jewish community leadership. I want to thank the rabbinical leadership, who have consistently said people should not gather for religious services or anything else because it will endanger their own community. I have seen total unity, and I appreciate that unity. And so it's up to everyone in every community to respect these voices of their city government, of the leaders of their communities. There have been clarity across the board. What is so frustrating to me is after all those messages were so clear that so many people would still choose to gather. I understand that they lost someone very dear and important to them, but this is still a pandemic. People's lives are put in danger when people gather. So what's shocking to me is that after all the warnings, something of this size would happen. And that's where I'm making very clear, unapologetically, that the next gathering will be met by summonses and arrests, period. No more warnings. And that's true in every community. Equal opportunity in New York City. If you gather, I'm not talking again about a few friends hang out in the corner. I'm saying if you have a large gathering, hundreds of people, thousands of people, they're not even going to have a discussion. It's just we're going immediately to summons, and if we have to use arrest, we'll use arrest. Go ahead, Commissioner.
Yeah, Katie, and I think I touched on it before. We've been in constant contact with leaders of different communities throughout New York City, of different faiths. Just last week, I could tell you, members of the Muslim community, members of the Jewish community. I spoke to the Cardinal just this week. This is what we do. And in terms of social distancing, probably not a day goes by that myself and the mayor don't talk about whether it's social distancing in parks, whether it's the sick rate of our employees, whether it's testing that came up earlier today, mental health yesterday, and certainly funerals and religious events comes up. I don't know of anyone in New York City that doesn't know what's going on 2 months into this. I think from the mayor's executive orders, from the governor's executive orders, from watching the news every night, everyone knows what is acceptable and what is not. And conversations between members of the NYPD and leaders who, by the way, members of the Jewish community, extremely helpful in navigating circumstances with this over the last 2 months, because there have been a couple incidents. But planning for what shouldn't happen is in no way having a conversation regarding, you should not equate that with having a conversation regarding condoning a particular event. That event last night never should have happened. It better not happen again. It can't. It is, again, we can talk about this till the cows come home. It doesn't get any crystal clearer than this for me. You are putting my cops' lives at risk, and it's unacceptable.
Next, we have Julia from the Post.
Hi, good morning to everyone. I have two questions, one for you, Mr. Mayor, and one for Ms. McCray. For you, you addressed the homeless and the shelters, but I'm wondering if you could talk a little bit more about your plan for the homeless in the subways. I see that the MTA worked with the NYPD last night to get some people off the trains, but it seems unsustainable to do that night after night. So what's the long-term plan? And then for Ms. McCray, I'm wondering if she can just list her specific credentials for co-chairing the Racial Inequity Task Force and the Mental Health Program for Frontline Workers, given that critics, including Councilman Reynoso, has called the first appointment cronyism and nepotism.
Well, let me speak to the homeless issue, and then I'd like to preface on the question of the commission, since I'm the person who decided how to approach that internal task force, I should say. And I'll certainly turn to Shirlane then. On the homeless, I had a conversation yesterday with Sarah Feinberg of the MTA to emphasize that we are ready immediately to implement a plan in those 10 terminus stations that I talked to you about in detail yesterday. And this is something Commissioner Shea and Commissioner Banks and others, we all gathered together to discuss and have real faith this would be a game changer. But to be a game changer, we have to disrupt business as usual, which means we have to close those stations in the late night hours, 12 midnight to 5 a.m., replace the service with a shuttle bus for anyone who needs to get on that line outbound, and they'll still be able to use it just like you use a shuttle bus when there's maintenance or anything else. So it won't disrupt service for people who need service, but it'll allow for deep cleaning of the stations, and will allow for the NYPD and our outreach workers to engage people in a much more effective manner. And it will change the pattern that, Julia, has existed for decades in this city, where a homeless individual could ride a subway line back and forth and back and forth. And that's something that's just not right. We need to address that. What we are seeing here is a real problem, but it's not because something fundamentally changed compared to all the previous decades. It's that there are very few people riding the subways. There's much less service. And so the homeless individuals who have been there all along are obviously standing out more, but it's also a clarion call to help them, to do more to get them out of the subways, off the streets, into long-term shelter, into affordable housing. And I feel for all the riders who are distressed. It's painful to watch, it's unpleasant to watch, it's unsettling to watch. We don't want anyone to go through it. But this city's been dealing with this issue for decades. We've got to do things differently. That's why we came up with the Journey Home approach. That's why we came up with Homestat, and these things are working. But this is a new approach, NYPD feels strongly this is the X factor to end that habit of an individual just being able to stay on that train, or maybe only get off briefly and get right back on and go the whole other way on the line. We're kidding ourselves if we think we can get a different result by doing the same thing over and over again for years and years and years. So I talked to Sarah Feinberg. I said, we're ready to do this. We're ready to cover the cost. All we need is the NPA's support. We had a good conversation. We're waiting for an answer, and we could get going immediately. And in terms of sustainability, this is a sustainable plan for sure. The Homestead Initiative has brought thousands of homeless folks off the street permanently. The Journey Home Initiative will transform the reality of homelessness on the streets of the city. I don't have a doubt in my mind. And if we can get the support of the MTA, we'll put in all the people power. We'll pay the cost to get homeless folks out of the subway in a whole new way. It won't be perfect, but it will be a game changer. It's absolutely sustainable, but we need the MTA to say yes. So please ask the MTA today if they will support this plan, allow us to pay for it and get going with it so we can really change the reality for not only the homeless, but for all the strap hangers who suffer with this problem. To the question of the internal task force on equity and inclusion. We have a disparity crisis in the city. We had it before. It's been made sharper and in some ways even worse by this disease. My goal with the internal task force, which came out of a variety of conversations among members of this administration, was to ensure that all city agencies maximally address disparity. There's been great work over the last 6 years. There's more that can and should be done. To ensure that happens, it was crucial to make sure that the leaders of this task force would be the people who had the strongest understanding of the issue, the greatest vision about how to address the problem, and carried the weight to ensure that all city agencies would follow through on the work of the task force. Your idea, with all due respect, Julia, of what is a qualification, well, you have the right to your opinion. I'll tell you what a qualification is. A qualification, in my view, is who has the weight and the gravitas, who has the intellect, who has the vision, who has the standing in this administration, because this is an internal task force. Well, this whole administration was created, and we talked about it long before you happened to be a reporter here, the way we did our transition, the way we chose our team, the way we've continued to build our team. The person who's been the architect with me has been our First Lady. And I've said many times she's my closest advisor and my partner in everything I do. So who better to co-chair an internal task force to make sure that the government is addressing these issues than her? Deputy Mayor Thompson has devoted his entire life to issues of inclusion and equity. And I also am announcing that we're adding a third co-chair, Deputy Mayor Raul Perea Hense, who brings a wealth of experience and obviously has expertise in some of the issues and agencies reporting to him in some of the areas where there's been greatest concern about disparity. But I'll turn to Shirlane and forgive my long intro by saying I know who will get the job done, and she will get the job done. Shirlane.
Julia, I would remind you that the primary task of this body is to listen, to gather information, and to make recommendations. It is not a decision-making body. It is a position that requires the ability to listen well, to convene, and be able to gather information. I'm a volunteer. I'm certainly well placed within this administration to take on this work. And I have a very committed approach to this work. I've been a mental health champion from the beginning of this administration, and I have been praised by leaders of national organizations around the country. I think that if you want to know more about my qualifications, that you should talk to my team, and we will let you know all of the things that I have done that would merit such a position and more. Thank you.
Thank you.
Next, we have Anna from the Daily News.
Hi, Mr. Mayor. Two questions. One, given the budgetary issues that the city is facing, are you guys going to move forward with the BQX project? And also, I'm just curious if the First Lady is going to have to give you a haircut at some point. You're looking a little, your hair's looking a little long these days. So I'm just curious if that's in your future.
I want to give Anna credit. We knew this day would come where a journalist would ask the question. Yes, this has been a topic at home, and Shirlane is a long, Anna, you may have seen some of my pictures from my younger years when I first met Shirlane, and my hair was at least as long as this, and so she's a fan of the longer hair, but yes, it's getting a little much. So we're going to have to figure out a new approach to hair management. The longer hairs day, I think, is coming to an end. But on the question, very good and important question about the budget, something like the BQX, which had just begun a whole phase of environmental impact review, it's going to be looked at now with all the other major capital initiatives. We talked yesterday about some things that have been absolutely essential, like the affordable housing program, which is being, some pieces of it are being delayed because of the reality of this crisis and our budget reality. So we're certainly going to look at the BQX and make decisions thinking about those same realities. I don't want to give you a firm answer today. It will be discussed in the budget process and be part of what we say around the budget in June. But it's a very good example of the kind of thing that now has to be thought of very differently, simply for the budget ramifications alone. Now, that was going to be obviously an initiative that could only work with a very substantial federal funding. But to the extent there was any city exposure, it has to be considered now as part of our budget process.
Next, we have Steve from Westwood One News.
Yeah. Hi, Mr. Mayor. Thanks again for taking our questions every day and giving us ample opportunity to get responses from you. We really appreciate this. Quick question about a major recreation space in southern Brooklyn. The Gateway National Recreation Area has been a really important release valve for people in Brooklyn and Queens who want to get outside, who want to be out there recreating with their families while maintaining significant social distancing and not having to worry about being close to others. But the MTA has decided to park idle buses because they're using fewer buses at the Floyd Bennett Field facility. And as a result, the entire facility, which had been used for weeks now for safe recreation, is now closed to the public. It's also cut off 400 people from their community gardens at a time when many New Yorkers are having trouble putting food on their tables, and those 400 people rely on the food that they're growing in those community gardens to feed themselves. I'm just wondering, it seems like the MTA and the Parks Department reached this agreement without knowledge of City Hall. I'm wondering if that's the case, and if there's anything being done to try to find an alternative, such as the Reese Beach parking lot, which is completely unused right now, or any other facilities to park these buses. And then one other question about the beaches, considering that we have people social distancing in.
Steve, you there? Steve? Well, we got part one, I guess. If we can get him back, we can do the second part. I'll start answering, and you'll let me know if you bring him back. Steve, thank you for your comment in the beginning. I want to say, I think for everyone, is Steve back or not? I'm hearing some feedback there. You good? Steve?
Yeah.
Okay, there you go. We heard you start to talk about beaches and then lost you. I think we're
as a second question. The beach issue was just, it seems like social distancing as it's maintained in Central Park and Prospect Park could also be maintained on many of our 14 miles of city beaches over the summer. Some of them may perhaps not. I'm wondering if that's being considered for approved recreation over the summer.
Yeah. Okay. So, Steve, thank you for the questions. And I want to say thank you for your kind comment about what I've tried to do, my team's tried to do here, which is to constantly make information available and take questions from all of you that would help the people in New York City get a better sense of what's going on, and obviously, answer important and tough questions that the public deserves answers to. So thank you. I want to thank everyone in the media, because this has been, an extraordinary situation where we're doing this so often. And I think the people of the city have appreciated that this dialogue happens so regularly. So thank you to all. To your two questions. So I'm not happy with what I'm hearing about Floyd Bennett Field. It doesn't make sense to me. Steve, what I don't understand is exactly who all the parties to this were. Obviously, the MTA. My understanding is that situation is controlled, that space is controlled by the United States Park Service. I don't know enough about what city agencies' involvement was or wasn't. I'll get down to the bottom of that today, and we can give you more of an answer later. But I can tell you I don't like what I'm seeing for the very reasons you outlined, that we want people to have access to recreation for just the amount of time they need each day, and obviously with social distancing, but people do need access to that recreation. People do need access to community gardens, again, following those rules. And I don't understand. It's not anything negative to the MTA. I just don't understand why, with so much less service going on, it would be necessary to knock out, those opportunities for everyday people. And, I have to believe there are other alternatives. So we're happy to work with the MTA on other alternatives, but we'll come back to you today on that. On the beaches, I think we're starting with the notion that, first of all, we don't know what the next few months bring. The normal time we would have opened the beaches would have been a matter of weeks from now on Memorial Day. That was inconceivable from everything that we have been experiencing, because remember, how do most people get to the beaches? They get on the subways, they get in buses, they drive their cars, and then a bunch of people congregate. That was not something we could possibly imagine for the near term. We are still fighting day to day to beat back this disease. You've been watching the indicators, Steve. We're making progress, but we're still not to the kind of progress we need. So that's where we knew we could not start the beach season anywhere near like normal. As I've said, we're open to later on in the summer, we may get an opportunity. And I think your point is well taken. If we get to something, we get to a point where we could start to open up, how would we do it and how would we do it smartly? I think it's fair to say I could see a scenario where we would do social distancing and limits on the number of people. But I also want to urge people to recognize that won't be easy. That's a lot to enforce. Comes with real problems and potential dangers. So that one would be a high bar from my point of view. We'd have to be really certain we were turning a corner on disease, really certain we could do it the right way, and that we could enforce it properly. But it's a perfectly fair idea and something we're going to look at as one of the options. But that's not happening overnight. That's something that would be down the road when we've had a lot more progress beating back this disease.
Next, we have Christina from Chalkbeat.
Hi, Mayor. Thanks for taking my question. There's obviously and rightfully a lot of focus on mental health right now. I'm just wondering if we can expect a specific plan for teachers and students who are also dealing with a lot right now with the shift to remote learning.
Yeah, Christina, absolutely yes. The chancellor mentioned this originally a couple weeks ago. And I tried to amplify yesterday how much we're focused and concerned about the mental health needs of our kids. I've spoken with the First Lady about it. The First Lady and the Chancellor are working together to take a lot of the initiatives that have been created through Thrive and apply them in the coming months with our kids remotely, but also to start the planning for September. And we understand that September there's going to be a challenge in terms of mental health for our kids that's absolutely unprecedented. And we're going to have to do a lot in every school to support kids who have honestly been traumatized. So you're going to, in the not too distant future, hear the specific plans to address mental health needs of kids over the next few months. And then as we get closer to the opening of school, definitely a plan is going to be put out on mental health services in all schools for September, and the First Lady and the Chancellor will be working on that together, and the First Lady is going to add.
Yes. You should know that the mental health services that are provided to our young people are continuing, that teachers are being trained in social emotional learning, which of course deals with the children's emotional needs, so that they are able to continue working with children online to a certain extent. In the fall, we hope to have a more expanded program because we know that so many of our young people are going to come back in distress. But we haven't stopped doing anything that we're already doing. We're doing what we can virtually, training the teachers, bringing them up to speed so that they will be ready in September.
All right, thank you.
Next, we have Melissa from News 4.
Melissa? I don't know if we have Melissa. Are you there, Melissa?
Hi, Mr. Mayor. How you doing?
How you doing?
Sorry, I was checking on my daughter in school.
That's important. You had your priorities right.
Walked away at the wrong moment. So, thank you. We've been reporting that a few children hospitalized here in the city appear to be experiencing some of the same inflammatory symptoms that British officials warned about over last weekend. Some of the children have tested positive for COVID-19 while others have tested negative. But we're wondering what you're seeing big picture. Your health department says since the inflammatory symptoms are not required to be reported to city health officials, they can't say exactly how many children are experiencing these serious side effects right now. Is this something you want your health department to be tracking? And what else do you know about this, if anything?
Thank you for the question. Look, I'm concerned because, you know, Melissa, we've talked about from the beginning, we're dealing with the great unknown here, and I think we have to be vigilant all the time to any new development that might give us a warning of something bigger, because obviously the entire mission here is to save lives, and particularly precious is saving the lives of our kids. So I'm concerned about it. I don't pretend to have expertise on the exact reality, but I'm very concerned, and I think we've got to figure out how to understand it better and if it is something to be tracked. Let me turn to Dr. Barbeau, and I know we have Dr. Eric Way, who's the Vice President of Health and Hospitals. I want to see if either of them would like to speak to this issue.
So, Mr. Mayor, I will say that I'll start with what we've been saying for a while. Every day we learn more and more about how this virus behaves, both from a public health point of view as well as from a clinical point of view. And, you know, recently we have been talking about the way in which coronavirus can affect the heart and the cardiovascular system. To date, we have not heard of ways in which the coronavirus has been affecting children's cardiovascular system. We do have regular ongoing calls with infectious disease specialists throughout the city. We have webinars with them. Additionally, we meet on a regular basis through webinar with doctors, leaders in the intensive care units of all of the hospitals, and we have not seen this to date. I've also been in communication with our medical examiner. She has not noticed this in cases that she has seen, but we are in contact with our academic partners to ensure that if this is a trend that's being seen through our clinical partners, that we work collaboratively to understand it better. We are always paying attention to what seems to be emerging, not only from the worldwide literature, but also what we're experiencing here in New York City.
Dr. Way, anything you'd like to add?
Thank you, Mr. Mayor. So similar to Dr. Barbeau, I am not aware of this being a trend in New York City health and hospitals. I think that was one of the things that we were most kind of, I guess, appreciative of, and being a father of two toddlers, 3 and 5, and a baby who's 7 months old. You know, being scared for our children. This virus seems to not affect our young patients nearly as much as the older and those with comorbidities. But as Dr. Barbeau mentioned, we are paying attention through our pediatrics council, our critical care councils, our emergency department councils, and we are not seeing a lot of children testing positive for COVID or getting very ill, ending up in our pediatric ICUs from COVID. But we are aware of the news and the literature that's ever changing out there about inflammatory changes, Kawasaki disease, and we're paying very close attention to that, and also listening to our science and our experts.
Last two for today. Next is Matt Chase from Newsday.
Hey, thanks for taking my question. I appreciate it. For the police commissioner, regarding gatherings, what exactly will you be doing differently going forward from what you did last night? How will your summons and arrest policy be different from what you did last night? And to what extent is the procedure changed for handling arrestees and folks getting summonses physically since the coronavirus? And for Dr. Barbeau, can you explain in epidemiology the difference between absence of evidence and evidence of absence?
Okay. Dr. Barbeau, why don't you take that first, since that sounds like a question I would certainly not have the answer to. So why don't you take that one, and then we'll turn to the commissioner.
That's a really good question. And when we say that there is absence of evidence, it means that there are not a good amount of studies that have documented evidence one way or another, what the particular finding in question or the particular question in question may be. So that's an absence of findings. And then the other part of your question, if you could restate it.
We have Matt still there?
Sure. Can you hear me okay?
Yeah.
Yeah, I was wondering if you can explain evidence of absence.
Evidence of absence meaning that scientific studies were done, clinical studies were done, observations, et cetera, and confirmed that there is no current association with the particular question in mind. Now, that's not to say that future studies may not find a finding, but that's what that means.
Okay, Commissioner Shea.
So what I'll say about the gatherings, we're 2 months into this pandemic at this point. And when you look at how we as a police department have policed, I am biased, but I think we've done a good job of balancing and using discretion and working with New Yorkers from one end of the city to another, in terms of whether it's in parks, whether it's at religious gatherings, whether it's outside housing developments, or whether it's on the street, lining up to buy groceries. I think we've gone into it with an appreciation of this is tough for everyone, and we got to get through this together. And we've empowered our officers for years now to use discretion. And I think that has come through in this. By and large, you've seen New Yorkers cooperate. You've seen incidents pop up. Certainly, we've had an increase in 311 calls. I view that as a good thing, that people are letting us know what's going on and taking interest in their city, and it is their city. Overall, we've seen really few, when you think of the tens and hundreds of thousands at this point, interactions across this city in a variety of circumstances. Arrests are the far extreme. There have been some summonses, really not a lot, and usually it's been a mutual cooperation. But here's the only thing that's changed. We are beyond, at this point, asking people to comply. We cannot have, for the third time, what we had last night. And that is irrespective of any religion, any race, any part of this city. It is simply putting you at risk. It is putting your families at risk. It is putting the critical workers at risk that are already risking their lives, saying goodbye to their children, and going into the unknown in emergency rooms across this city every day. And it certainly, for the last time, is putting my cops at risk. And what you should take away from that is how really unnecessary it is. We grieved this weekend for 2 fallen detectives, but we did not come out. We did it from our home, by and large. And there is no reason that anyone in this city cannot do the same in this unprecedented time.
Last question for today, Deborah Lee from Manhattan Times and Bronx Free Press.
Hey, good morning, everyone.
Good morning.
I wanted to follow up on the conversation that's being had around testing and how the capacity for it continues to ramp up, both on the city and the state level, to the extent that we're talking about expanding testing at NYCHA sites, at independent pharmacies, and the like. In doing so, can you speak to whether, in fact, the guidance on residents seeking out testing has changed? Has more testing, in fact, then led to a conversation about inviting residents in the effort to both test and trace and identify the illness, and that as it continues to progress? In fact, are we saying to residents, are we changing the guidance and saying if you're asymptomatic, potentially you should still seek out testing to be certain? And then in light of that, are we looking at a prelude, essentially, to what's already happened in Chile? And we've heard Dr. Fauci discuss, which are, essentially coronavirus certification or some kind of identification that speaks to whether you've tested positive and what that will mean. And then finally, when we talk about this testing and tracing policy, what concerns does the city have about how this will affect undocumented immigrants who are already concerned about, the big brother quality of some of these programs and, in fact, the disincentives to come out and get tested because there is this follow-through in a way that potentially might be invasive and they would worry might well lead to dire consequences?
Yeah, so Deborah Lee, appreciate it. Let me work through these questions quickly, and our medical colleagues might want to jump in as well, but let me take the first stab. For the undocumented folks, look, this is a city that has gone out of its way to show absolute and total respect for all human beings who live here, regardless of documentation status. I think that's something that's deeply understood in immigrant communities, that we do not ask documentation status when we provide services, especially things like health care. NYPD does not ask documentation status. We go out of our way to make sure that records are not kept that would be problematic. People have been told who are undocumented in this crisis, we want to make sure you get food and you get medical care just like everybody else. So, and obviously the initiative that we created with the Open Society Foundations to provide direct support to undocumented folks who don't have a livelihood is exceptional and says the level of commitment the city has to all human beings. So my hope is, when it comes to something as important as knowing if you have a disease that obviously can be life-threatening to you and your family, that is more important than anything else. Folks who have come here overwhelmingly to try and better the lives of their families, often from very, very difficult and even tragic situations where they came from. So I would like to believe that, notwithstanding the fears, there would be, the first impulse is if someone needed testing, they would get testing and know that it would be kept confidential by the city of New York, because we keep everything confidential. In terms of your larger questions, has the guidance changed? In a sense, yes, but in another way, I wouldn't say all the way. It's changed in the sense that we once had almost no testing in the city. And then we had to try to use the little bit we had to focus on the sickest patients and the healthcare personnel and the first responders, and now we're able, only in the last few weeks, to open it up to broader communities. So that's definitely a change. Our message to people is that getting tested is important, particularly if you are most vulnerable, older, and or have pre-existing conditions. So that's been consistent. But what will change for sure, much more deeply in the next few weeks, is when we go to a huge test and trace approach. Then we're saying to tens of thousands, ultimately hundreds of thousands of New Yorkers, we want to maximize testing. And then we want to test anyone that, if you test positive, we want to test the people that you had close contact with. So the guidance is changing, but it's going to change a lot more. I think on the question of certificates, That's something we have to think about for the future. It has been used as a tool in one way or another. A certificate or something that's an online registry has been used in different places. I think it's certainly a commendable idea, but we have not made any conclusions on that. Would have to be done in a smart way. There's a lot of things we'd have to think about legally, privacy, other issues. But it's certainly on the table as something we're looking at, how you support a really broad gauge testing system and how you get us back to normal with the information that testing system provides. So those are some answers. Doctors, anything you want to add?
Yes, Mr. Mayor. I will add that it's important to tease apart the two tests that we're talking about, because I think all too often antibody tests get lumped in with testing for the actual infection. And so it's important for us, A, to tease that apart. With regards to testing for infection, the guidance remain in terms of wanting to make sure that individuals who have chronic underlying illnesses that put them at greater risk for bad outcomes are prioritized for testing. But then as the availability for testing increases, we want to then test more individuals. In addition to that, we are doing everything we can to maximize the number of ways in which we increase access to testing. And so recently we announced that we are moving forward, H&H, and then we, through the Public Health Lab, will also do nasal swabs instead of nasopharyngeal swabs, putting less of a strain on PPE. So that's how that testing arm has evolved. When we talk about testing for antibodies, we have to be very clear that there is no science that tells us that there is durable protection or immunity if someone tests positive for those antibodies. And so we want to be very careful not to give false hope for people, because there's no correlation with immunity. And in fact, there have been some preliminary studies that indicate that people can be potentially reinfected with COVID-19 in the same season. And so we're waiting for more studies to be done to tell us whether those findings are corroborated or not. I think where antibodies may be helpful for us in the future is to give us a better understanding in the next season. If people who have antibodies for this season get reinfected next season, then we'll have a better understanding of what those antibodies really mean and whether or not they are protective. And if they are protective, how long they last.
Dr. Way, anything you'd like to add?
Thanks, Mr. Mayor. Yeah, and I would just reinforce what Dr. Barbeau said. The antibody tests, I think there's benefits even to our healthcare workers in terms of the psychological safety of knowing that I've been exposed and I wasn't one of the ones who ended up on a ventilator in the ICU. But we don't know how much immunity, and so we don't want people to relax their social distancing or their PPE usage. And then on the undocumented immigrants comment, I mean, that really resonates with health and hospitals, with the mayor's administration. It is part of our ethos. It is in our mission statement. The two most important words are without exception. We want to help New Yorkers live their healthiest lives without exception. We don't ask. I, as a doctor, don't care about your immigration status. I care about your health. And if that health is at risk because of COVID-19, I want you to get a test, and I want to provide you the appropriate treatments and results. And so I don't want anyone to think that at health and hospitals we will be asking immigration status, because we don't. We care about your health.
Nicely said, Doctor. Thank you. And let me conclude by us going back to where we started, the extraordinary work, the heroic work so many healthcare workers have done, so many first responders have done over these weeks. Unprecedented, unimaginable what so many have gone through, and that no one could have foreseen, and yet the heroism has been so clear and so sharp. I want to thank the First Lady. I want to thank our police commissioner. The idea that we will all support our healthcare workers and our first responders in every way is absolutely crucial. So it's, of course, everything that's been done up to now to give them protection, to get those PPEs, the personal protective equipment, and that effort is going to be ongoing, and we're going to deepen that effort. All we have done to try to support them and thank them, but now going deeper with testing, going deeper with mental health support. We need to be there for them through this whole crisis and then beyond. And this is a good example when they say that phrase, we'll leave no stone unturned. That's what we're talking about when it comes to supporting the heroes of this fight. There's a lot they need. There's a lot we have to give to them to support them. And everyone recognize every time you say thank you to one of these heroes, every time you offer to help them in ways big and small, all those wonderful people have come out to applaud at 7 o'clock at night, all the people who have brought food and support to hospitals and to our EMTs and paramedics and all of our first responders. Every bit of it helps. And we're going to be there for them because they have certainly been there for all of us. Thank you, everybody.
And that was the New York City Mayor, Bill de Blasio, wrapping up his news conference update. And just a reminder, everybody, that we're about 30 minutes away from President Trump Oval Office news conference. That is expected in the next 30 minutes. We'll have it for you right here on News Now. Of course, coronavirusnow.com as well. You are taking a look at a red hot market. I should say a green hot market, right? Up 532 points in the green. Yeah, we'll take it. Definitely another good day for those 401ks there, no doubt. Let's continue the coverage here while we do wait for the president. Take you out to our sister station, Fox 2 in Oakland, for some coverage there.
I'm Claudine Wong, joining you from the San Francisco Bay Area, and I'm joined by Michael Jensen, who is the founder and the CEO of Labster, which is a virtual reality, very cool system that is set up for scientists, for future scientists, and is maybe now more relevant than ever. How are you? You're coming to us from Switzerland. How have things been going?
Doing great, actually. We've been working harder than ever, as you can probably imagine, here over the last couple of weeks, really helping so many teachers and students around the world getting access to the high quality learning that we provide. So exciting times, challenging times for sure, but we're at least happy and proud that we can help so many teachers and students at these times here.
So let's talk about this, because when you try to explain Labster to someone and say, you know, I have this, and let me just say, I mean, we are understanding virtual learning and online learning in a whole new way. Anyone who was reluctant to do it before has no choice to do it now. But Labster, I heard you describe it as, you know, a flight simulator for pilots, like equating that for students, which I thought was really interesting because that's a great way for someone to visualize what exactly it can do for students. Tell me about Labster. This has been a project long in the making before we ever heard of COVID-19.
Yeah, no, and I think it's definitely the simplest way I can explain it. It's literally like a flight simulator for training pilots, only we're training the next generation of scientists and really not just training them, but also inspiring them and engaging them in the world of science. And I think what's really exciting about this virtual way of learning is that it brings up also new opportunities for the students to engage in science, such as traveling to other planets like Mars to learn about gravity in a completely new way, or new types of chemistry and chemical formulas and so forth. So we really work hard with top professors across the US to understand what are the topics that we want to teach the students, and then design learning experiences and gamified learning journeys where the students not just learn the concepts in science that they need to understand, but also why they're learning them and how they can apply that to solving real-world challenges and problems, such as curing, for instance, coronavirus is literally some of the topics that we teach the students around antibodies or other types of methods for curing diseases. So that's
awesome,
what we
yeah.
do, and yeah.
Let's because we want to talk about this partnership you have with the California community colleges, but before we do that, people are sitting there going, okay, I can't see it, which we can show them because they should be able to see it to really get the full
Very visual experience.
expanse. So this is what a student would see when they would go, you know, you put VR goggles on, or
So it works on a laptop, so even a low-end laptop, and most students just play it on their laptop, and they go in this virtual gamified world, similar to as they're playing games. And you know, we gotta get to the students at the level of engagement and excitement that they're used to today. And that's where we provide, for instance, in this case, also opportunities for the students to experiment in typically learning, for instance, through failure, which is a very important thing in science. And typically you cannot let students fail in a physical laboratory, but in these virtual worlds, we can really give the students unlimited access to all the equipment, $1 million equipment, so that they can learn science in a whole new way. And there you saw they were actually traveling to another planet to learn about ecology as well. And continually, we also see the benefits of virtual training, where the students can repeat experiments over and over until they really master the concepts. So we've done a number of research studies showing that the learning outcomes more than double when you use these online tools effectively, combined with follow-up teacher lectures. And we also see that students that typically would struggle in a normal traditional learning environment can actually follow up and catch up with the rest of the classroom better, typically because they can go at their own pace. We continuously quiz the students, make sure they understand the concepts before we kind of let them move on. So this more mastery-based learning approach. So
and they can
while
walk
it's
into any lab with any kind of problem-solving thing that you know, their teachers want them to address, or their professors, and so you have different types of labs for them to go into.
I mean, it's a very interesting, with virtual, there's literally only your imagination sort of sets the limit. And we look especially at areas where it's either very expensive or very time consuming, or either dangerous to normally teach in physical laboratories. So that's actually been a driver for us for many years now, more than 10 years. And we have 110 people continuously working on designing these learning experiences around the topics where we can provide the biggest impact.
Yeah, I was watching a TED Talk that you did 4 years ago. So, you know,
yeah, it's
way
been a
back
long
kind of
journey.
in the middle of your journey. And I actually took note of this graph that you put up, and this is what you were talking about with the learning impact, which I thought was so interesting. And it's one of those things that, I mean, you're talking to someone who was a liberal arts student, so science and math, you know, in terms of engaging and having this passion for it. And you talk about people who were you know, maybe struggling through it and or just didn't have the understanding. It seems to me too that Labster comes to them kind of at the where they are in terms of the types of learning that they're comfortable with. I mean, if you take a look at video games, because I know that you said you integrated video game design into this type of thing. You know, that's what the kids do, right? In Minecraft, or, you know, in some of these other, they build these worlds, and they are used to going into these spaces and creating. They're probably more comfortable in it than people in older generations, right?
Yeah, no, typically we see that. And we work very closely both with game designers and pedagogical experts, and of course scientists who are the experts on the topic. And we see it now as we launch this incredible partnership now with the California community colleges, which we're incredibly proud of, by the way, where we get to reach out to now more than 2 million students across California, as well as several local colleges now in Oakland. And we believe that this is an opportunity for teachers and college institutions also to advance their learning. While it's definitely very challenging times for them right now, moving everything online, it also provides opportunities. And we see that now as I speak with teachers every day, and we hear the feedback from the students where they see the excitement and engagement that the students have for their learning. That all really helps contribute to the learning outcomes that you saw in that study. And we've now we have 16 different peer-reviewed published studies documenting all these benefits of this virtual learning environment. So I'm proud of the work we've done. I'm incredibly proud of the partnership we have with the California community colleges. And I'm confident that we'll see a huge boost in the interest and the opportunity in using these virtual learning environments in combination with physical as well.
Give me
so,
more
yeah,
details about how this partnership came into being, and specifically with California, you know, in terms of their need, how you guys connected, you know, and why that system really, in this timing, it seems like great
Yeah.
timing.
I think we had early already partnership with several of the colleges and working really closely with several professors and teachers in the region. So we already had that interest. And when we started working closely with the system, we saw an incredible opportunity to collaborate together on serving the needs, because right now is an incredibly challenging time for teachers and students who are at home having exams, and they need the tools that so that they can continue their learning in these challenging times. And it was an obvious fit. It actually went incredibly fast. Within just a matter of weeks, we were able to roll out to more than 100 different colleges across California, train the teachers, which is also an important part of what we do. We really coach and support the teachers through the journey, and we have live support as well for the students. So really incredible partnership. It's really a win-win-win all around for everyone involved here, as I see it, and as we hear from the teachers and students as well. So yeah, incredible. And this, by the way, as you see here, is one of the examples of the teacher dashboards where the teachers, we like to say that we give the teachers a little bit of a superpower as well, where they get now insights into how every student is performing in these virtual learning environments. And they can really see in their classroom where are the students struggling the most, so that when the professors have the follow-up lectures, they can really focus down on the areas that benefit their classroom the most. So there's so many great benefits for online learning. And we see now how teachers really are, of course, obviously forced to explore this more, but also then experiencing and seeing those benefits in using these tools.
I mean, I know when you first started talking about virtual labs too, one of the things that you talked about was someone could do it virtually because it was safer, and then go into an actual lab and do it for real and see it in a real space. For these students, a couple of things occur to me. That one, these labs that they are going into virtually are probably much nicer than any lab they've actually seen in person for the general cost of it. But virtually and the actual, real lab life, how different are they? Or are these just supposed to give you this, kind of scorecard to kind of get people to the concepts and get people to, what we know to be true? Or these are just actual experiments where we know the end game, and so we know we can really break down how they would change if someone did something in a different way?
I think so. So there's so much, in the virtual world, again, we can provide unlimited access. And I think that's really the key message here, that every student everywhere should have $1 million laboratories. If it's already there, we have it, it's available. And it's more about really working with the individual systems and colleges and professors to show them and train them in using these tools. And as we saw there earlier, we can do that incredibly fast, roll it out quickly, give the students this training opportunity. And then once we go back to the physical laboratories again in the future, the students are prepared. Just like a flight simulator, you want to have the pilots do most of their training first in the safe virtual environments. And then once you have all the practical skills, the concepts mastered, then you're ready to go into the physical environment. And I believe we'll see a lot more of that going forward. There's so many benefits, and cost is also another important factor in all of this. A lot of colleges and students across the country are very challenged also from a cost perspective now. And this is an opportunity where you can actually virtualize learning and not compromise the learning quality, and still give them the students the opportunity to maybe at the end of their training do the physical hands-on training.
So how expensive is it in this partnership for these colleges to tackle this and to take this on and to offer this for their students?
Yeah, so it can be as little as a few dollars, where we also offer to provide the training for the teachers, and so a fraction at the cost of what a physical laboratory costs. And as a response to this COVID-19, we really realized that we as a company needed to step up and provide this access to as many teachers and students around the world. So we really provide this as heavy discounts, even below our own cost here at Labster. But we believe it's the right thing to do. This is about helping the students and the teachers at a time where they need it the most. And again, we're super proud about what we've been able to achieve, especially in this partnership with the California Community College System.
Where does it go from here in terms of, the learning, the sharing, the technology, and how we really kind of reimagine education in general? I mean, I think we've had to do that just out of necessity. You know, and obviously you've been reimagining how we could do it for a decade, and I'm sure you're like, keep up, everyone. I've been here for a while. But do you think it's going to change really, you know, higher learning? You know, colleges in general right now, if we go into that college space, aren't sure that they can put a bunch of people in a classroom anyway, you know? And so, you know, as we look at how it's going to change, where do you see this going?
It will definitely change. Yeah, and we already see it. We obviously speak with a lot of chancellors and professors and institutional leaders, and it is already kind of in motion. Every of the partners we work with are already planning for longer term shifts. And it's interesting also in the education space, it's actually one of the industries that are the least digitized in terms of digital versus non-digital content spend. And we are already seeing an acceleration of this. So we believe there will be a huge boost and trend towards more online learning. It will never replace the physical fully, but we see a great opportunity for working with more of these technology providers and the collaboration between colleges, high schools, districts, working together to provide the best combination of digital and physical on-campus training is where I think we'll see, or we already see that big shift. So,
have you always loved science?
I do, yes. And honestly, I'm so, you know, our mission again is to empower the next generation of scientists to change the world. And we started this company to inspire students to go out and solve challenging problems, such as curing corona, COVID-19, or diseases like this. I think this is such a critical time for us as a nation, as a world, to inspire more students, give them the tools, the training they need to go out and help us solve all these challenging
do you think that was a challenge? I mean, the term science is cool was created to try to tell children specifically that science is cool, that you should like this, that you should want to be a part of it, and maybe there was a disconnect.
All right, folks, we are going to another live event here while we are waiting for the President of the United States at the White House doing a news conference. We're going back out to New York. This time it is the governor of New York.
We don't have a conceptual plan. We don't have an abstract plan because there is no conceptual plan. There is no abstract plan. You have to have a plan that is based on facts, based on specifics. This is not about politics. This is not about spin. This is not about emotion. There are no conspiracy theories at work here. We outlined a 12-step plan that is factual, that is based on numbers, based on data, and then it has a numerical circuit breaker that is not subject to personal emotion or desire, but just checks and monitors that infection rate that we just saw in Germany and is watching for those increases. And if there's an increase, circuit breaker stops the reopening at that point. Some of the specifics we're looking at: you must have 30% of your hospital beds available. We can't go back to where we were, where we overwhelmed the hospital system. We have to have a 30% buffer. We have to have 30% of ICU beds. We have to have that buffer before we start bumping up against total capacity. And we have to watch the hospitalization rate and the diagnostic testing rate, how many are positive, how many are negative, which we'll take on a continuous basis. You see that number start going up, worry. But it's all based on the data and the numbers. I'm sorry. And the rate of transmission, RT, rate of transmission, not road and track, rate of transmission has to be 1.1 or less. We just said Germany is at 0.1. Because to 1.1, that is textbook outbreak. So watch the numbers and watch the transmission rate. And how do you do that? You do that with testing, right? And that's why everybody's talking about testing. The testing allows you to continually test, sample, how many people are positive, how many people are negative. You see the positives start to increase through your day-to-day testing. That is a pause sign. We were doing about 20,000 tests. We said we wanted to double that. We're now on average about 30,000 tests per day. which is a dramatic increase, not where we need to be, but a dramatic increase. Where we are now, you should know, is New York State is doing more than most countries are doing. So we have been very aggressive in testing, and we have made great progress, and New Yorkers should feel good about that, but we have more to do. On elective surgeries, we had canceled all elective surgeries so we could have increased capacity in the hospitals. When you cancel elective surgeries, hospitals feel a financial pinch because that's where they make their money, is on elective surgeries. So for areas that don't have a fear of a COVID surge, we're going to allow elective surgeries to begin. That's primarily in counties upstate. Again, counties where we're still worried about a surge in the COVID beds, we're not going to open it up to elective surgery until we know we're out of the woods on the COVID virus. And this is a list of counties that are eligible now for elective surgeries. I'll do an executive order on that today. We've been worried about frontline workers because they are the heroes who are out there every day so everybody else can stay home. Somebody asked me yesterday on a radio interview, well, you know, you're out there every day. Are you taking care of yourself? I'm out there every day. Forget me. I'll tell you who's out there every day. The nurses who are in the emergency room, the doctors who are in the emergency room, the police officer who is going into homes and apartments because there's a domestic disturbance. The EMTs, the fire department, the delivery worker who goes to 50 doors a day and gets paid. Those people are out there every day. So they're the ones who are really doing the work. Compared to them, what I do is de minimis. And they're doing it not because they get paid a lot of money, not because people say thank you, God bless you. They're doing it because it's their value and their honor and their pride and their dignity. And they show up. Even when it's hard, they show up. My hat is off to them. But I want to make sure that we do what we need to do to protect them, that they have the equipment, they have the PPE, they have our respect, they have our gratitude. And I also want to make sure we're testing so we get them the results of tests so they can be taking care of themselves. I also want to see if we have a significant problem in any of those frontline workforces. So we're doing testing. We started with the New York City Fire Department and New York City Police Department. What we found so far, Fire Department, which also has the EMTs, tested 17% positive, NYPD 10% positive, number much higher in the FDNY EMTs. We believe that's because the EMT number is driving it up, but we have to do more numbers and more research to determine that. Remember, the EMTs, they are the front line. They're the ones who are there assisting the person in the closest contact in many ways. FDNY also. But we want to find out exactly what's going on. They compare to a downstate average of the general population of about 18%. And again, we'll do further research, further surveys to look at it by race and gender also. We're also going to do the same thing with the transit workers, the people who drive the buses, the subways, who clean the buses and the subways. Without those buses and subways, the essential workers couldn't get to work. Why didn't we just close down subways and buses? Because you close down the subways and the buses in New York City. Don't expect the nurses and the doctors to be able to get to the hospital. Don't expect a delivery worker to be able to deliver food when you ring on your telephone. So we need that public transportation to transport the essential workers. But those frontline workers are at risk. So we're going to do additional testing for the transport workers. I also commented yesterday, the Daily News had pictures of things that are going on in the New York City subway system, where the cars were filthy, they were disgusting, homeless people were there with all their belongings, and it was not just the Daily News picture. It reflected what has been in the press and what people have been saying, which is the deterioration of the conditions in the subways. Some crimes are up in the subways, even though ridership is down 90%. I don't even know how mathematically that is possible. The trains are filled with homeless people, and you're not doing the homeless any favor. I've worked with the homeless all my life. To let homeless people stay on the trains in the middle of a global health pandemic with no masks, no protective equipment, you're not helping the homeless. Letting them endanger their own life and endanger the lives of others is not helping anyone. So I told the MTA yesterday, in 2 days, which means tomorrow, I want a full plan. How do we disinfect every train every night? Period. Any essential worker who shows up and gets on a train should know that that train was disinfected the night before. We want them to show up. We don't want them to stay home. We owe it to them to be able to say, the train you ride, the bus you ride, has been disinfected and is clean. Also, state and local funding from Washington is essential. This is now turning into a political brawl on state and local funding. More and more, some of the elected officials in Washington are saying they're against it. They're led by Senator Mitch McConnell, who leads the Senate, who makes it blatantly political. No blue state bailout. No blue state bailout. What is he trying to say? The states that have coronavirus are Democratic states. And he's a Republican, so he doesn't want to help the Democratic states. He went so far as to say, well, he'd be in favor of the states going bankrupt. First, states have never gone bankrupt. States can't go bankrupt. There are serious constitutional questions about whether or not a state can go bankrupt, declare bankruptcy. And you need a federal law that would allow the states to declare bankruptcy, even if you got around the constitutional question on bankruptcy. So if he believed that, if it wasn't just political rhetoric and personal vitriol, then pass a law that allows states to declare bankruptcy. He would have to do that. And I dare him to do that and get that bill signed by the president. So, but to make it partisan is what is most disturbing. And you can see they're now rallying the partisan troops. Senator Scott from Florida says we're supposed to bail them out. We versus them. We're supposed to bail them out. It's we and it's them. That's not right. Who is we and who is them? Who is we and who is them? Them, the people who had coronavirus. They are the ones who had the coronavirus. We, without the virus, are supposed to bail out those people who have the virus. What an ugly sentiment. First of all, on the facts, it's not even close to right. And why they would even want to go down this road when the facts damn everything they're saying. And there are still facts. I know it's hard to communicate facts in this environment. I know a lot of the filters don't communicate facts. They all communicate spin now. Everybody has their own spin. But there are still facts that are not political theater, right? New York State bails them out every year. They're not bailing us out. We bail them out every year. New York State pays $29 billion into that federal pot, $29 billion more every year. that we never get back. Our state contribution into the federal pot, the United States of America pot, every year we put in $29 billion more than we take out. On the other hand, they take out every year $37 billion more than they pay to the federal government. Senator Mitch McConnell, you are bailing out New York when every year you take out more from the kitty, the federal pot, $37 billion more than you put in? Who is bailing out whom? Senator Scott, Florida? You're going to bail us out? You take out $30 billion more every year than you pay in. How dare they? How dare they when those are the facts? How long are you going to play the American people and assume they're stupid? They are not. And they can add. And they know facts. And I don't care what the news media tries to do to distort these facts. They are numbers. And they are facts. And they can't be distorted. And this is every year. And look, what this is really about, it's the Washington doublespeak. You look at the bills that they want to pass and who they want to help. They want to fund the hotels, the restaurants, the airlines, the big corporations. That's who they want to fund. Well, who do state and local governments fund? State and local governments fund police, firefighters, nurses, school teachers, food banks. That's who I want to fund. And that's what it means to fund a state and local government. And that's the choice that they're making. Everybody applauds the healthcare workers. Jets fly over in tribute to the healthcare workers. That's all nice. Saying thank you is nice. How about actually rewarding them and making their life easier? How about giving them hazard pay? How about helping with their child care? How about helping families who can't feed their kids right now? How about helping the police and helping the firefighters and all the people who are out there right now killing themselves to make life easier for us? That's what this is really about. They want to fund corporate America. That's who puts money in their pockets. And I say, let's fund working Americans. That's the choice. Bail out, us, them. No, it's just theater. It's just smoke and mirrors to avoid the American people seeing the reality, which is whose pocket they want to put money in versus whose pocket state and local governments want to fund. The reason it is so disturbing to me, I'm not surprised by anything in politics. I've seen the good, the bad, and the ugly for many, many years. I was in Washington for 8 years. I know what it's like. But if there was ever a time that one could reasonably believe you could put aside partisan politics, if there was ever going to be a moment where we could say, you know what, let's stop, just for one moment, the partisanship, the ugliness, the anger, the deception. Let's just stop for one moment. If there was going to be a one moment to hit the pause button, the moment would be now. You have human suffering. You have people dying. You can't stop the politics, even in this moment? Even in this moment, when people are dying all across the country, you still want to play your politics? That's what this is about. And that's why it is so disturbing on a fundamental level. Politics, I'm getting up and I'm reading that death toll number. I'm speaking to the widows and the brothers and the sisters and the children of people who died. And then we're going to play politics with funding that's necessary to save people's lives? I mean, when does it stop? And the disconnect is between the political leadership and the people. Because the American people, it's not them. They are principled, they are kind, they are better than what they are getting. The American instinct is to help each other in crisis. The American instinct is to be good neighbors. The American instinct was the farmer who sent me the one mask to help a New Yorker when he only had 5 masks and a wife with 1 lung and underlying illness. And he sends 1 of his 5 masks to New York. Think about that generosity, that charity, that spirit. That's America. Why? Because we're good neighbors, because we care about one another. America was when I said we need help in our emergency rooms and hospitals, and 95,000 nurses and doctors from across the nation said, we will come to New York to help. We'll come into the emergency room. We'll come into the hospital. I understand it's COVID. I'll leave my family and I'll come to help yours. That's America. That's who we are. And that's who we have shown ourselves to be in the middle of this crisis. The crisis brings out the best and the worst. Yes. And the best of America is beautiful. And that's what we've seen. Because yes, we are tough. Yes, we are smart. Yes, we're disciplined. Yes, we're united. Yes, we're loving. Because we are Americans. And that's who we are and how we are as Americans. And I just hope the political leadership of this nation understands how good we are as a people. And the textbook says politicians lead, elected officials lead. No, sometimes the people lead, and the politicians follow. And that's where we are today. Follow the American people. Look at what they're doing. Look at how they're reacting. And politicians, try to be half as good as the American people. I want to show you a self-portrait that was done by American people. This is a self-portrait of America. Okay? That's a self-portrait of America. And you know what it spells? It spells love. That's what it spells. You have to look carefully, but that's what the American people are saying. We received thousands of masks from all across America. Unsolicited, in the mail, homemade, creative, personal, with beautiful notes from all across the country, literally. Just saying, thinking about you, we care, we love you, we want to help. And this is just people's way of saying we care and we want to help. This is what this country is about. And this is what Americans are about. A little bit more of this and a little bit less of the partisanship and the ugliness, and this country would be a better place. Thank you. Thank you, guys. Questions, Bernadette?
Regarding the MTA and the cleaning, you want it done on a 24-hour basis. How will this be done?
I didn't say on a 24-hour basis, Bernadette. I said when people get into the train in the morning, they had to know that that train was disinfected the night before.
So what time will this happen and will it impact service?
I don't know. I told the MTA, give me a plan whereby you will clean and disinfect every train every night so that I can say to the essential workers who are killing themselves for our state, we are keeping the subways open for you, and when you get on the subway in the morning or in the afternoon, know that that car was disinfected the night before.
How realistic is this, and is there money for that?
It's realistic. It's an essential. How realistic is it? What is the alternative? Essential workers go to work. By the way, you may get infected with the coronavirus on the train on the way to work. That's not realistic. I'm not going to do that.
How come this hasn't been done prior? I mean,
We have been starting. It is a tremendous undertaking that has never been done before. And you're going to have to get homeless people into shelters where they can get housing and the services they need. So that's a second operation. And the MTA has been going back and forth with the NYPD about this for weeks and weeks and weeks. The MTA hired private security guards to help. But all a private security guard can do is call 311, which is the city hotline, which then has them call the NYPD, who are there in the first place. So the MTA's story is they're at their wits' end. But what I said is, look, I don't care. I don't care who's to blame. I don't want to point fingers. I don't care. I'm at a place where I'm dealing with people losing their lives every day, okay? I just want to get it done, and I will get it done. Just tell me what I need to do to get it done. Let's start telling the truth. Let's stop with this filters and everyone covering their own rear end and people skewing facts to cover their own rear end. And let's start telling the truth, the blunt truth. And if it makes some people unhappy, that's the way it's going to be. But it has to stop. The trains have to be clean. The homeless need the services that they need. And we have to be able to do it as a society. We have to. Tell me what it takes to clean the trains and disinfect the trains so I know that I can say to the essential workers, it's safe to go on those trains.
You don't think it should be on a 24-hour basis? Because right now they do a 72-hour cleaning and then other high-touch areas.
I'm not going to do a cleaning schedule. I don't do that. I told them, give me a plan as to how to make sure every train is cleaned so that when the train comes in the morning, it is cleaned. It's their job to figure out the schedule and how they do it. But however it has to be done, I will do whatever I have to do to make that happen. You can't be in a position where you say, we're going to send a plain tribute to the nurses and we're going to applaud the nurses at Elmhurst Hospital. And yesterday I got out of my car and I applauded the nurses in Syracuse and the doctors in Syracuse. And I said, on behalf of every New Yorker, I thank you from the bottom of my heart for what you did. On behalf of every New Yorker. I believe that. But then at the same time, if that's what you believe, well then help them. And you know that they're getting on the subways to go to work, make sure the subways are clean.
Can you tell homeless people, what should be done with homeless people?
Homeless people should be in shelter. Look, I've been working on the homeless issue. Bernadette, I've been working on the homeless issue since I was 20-something years old. I did the first plan for Mayor David Dinkins on how to help the homeless in New York City. Mayor Dinkins accepted it. Next mayor was Rudy Giuliani. He came in, he accepted it. We made tremendous progress on the homeless. I then went to Washington. I did a homeless plan for Bill Clinton, for the nation on how to help the homeless. He accepted it. We implemented it. It made tremendous progress. It was called the continuum of care. This federal government still is operating the program. We have done this before. This is a false choice. Well, the homeless are on the trains. They have a right to be on the train. No one wants to live their lives on a subway train. And we have a higher obligation as a society than to say, okay, you can sleep in a subway car. No, you deserve a shelter that is safe and services if you need them to help you improve your life. That's what we should offer, and that's what we will. Jimmy?
We've got more problems with nursing homes, more infections, more deaths. Is the state at any point going to take action to set up maybe some kind of overflow facility for nursing home patients, as we've seen in other states? And
what facility, I'm sorry?
One major source of controversy has been your policy that nursing homes have to accept COVID patients subject to all the restrictions. But it seems in many ways that's setting up an impossible standard. So is New York going to set up some kind of overflow facility? There have been calls to use these federal facilities.
All right, let's do the facts again, okay? We've done that. Just let me give you the fact, okay? Because facts. We're talking about facts. You can have an opinion, but you can't have your own facts, right? Senator Daniel Patrick Moynihan. A nursing home takes a COVID person if, capital I, capital F, if they can adequately care for that person. If they cannot adequately care for that person, they say, I can't adequately care for a COVID person. Fine. Either they transfer that person to a different facility, or they call the Department of Health and say, we have to transfer that person. We have other facilities. We have COVID-only overflow facilities, just what you're talking about. We have it. We've discussed this. So we can do that. But it starts with their determination. They have to say, I can't provide for this person. As long as they say, I can't provide for this person, and by the way, nobody even asks why. It's just, I can't provide for this person. Okay, we'll take the person. And we have overflow facilities. Nick?
Governor, and maybe this is a question for the Commissioner Zucker. There's a Department of Health guidance that essentially allows asymptomatic nursing home staffers to work with COVID-positive patients. Some local officials are raising some concerns with this because it means people are still going to work while they're asymptomatic and are COVID positive. Is there any concern that you have with nursing home staffers still going to work even though they've tested positive for coronavirus?
Yeah.
Sure. So the patients who are, your question about being asymptomatic, we make sure that they have the necessary precautions that they need if they're going in there to care for other individuals there, and that includes all of the PPE, and we monitor them, and we're working on a way to test, and we are testing individuals who are in the nursing homes, both the workers as well as the patients.
Is there any indication of how many nursing home staffers are COVID positive, asymptomatic, and are still going to work every day?
We are looking at those numbers.
Governor, do you agree with that policy of allowing 6 staffers to continue?
Governor, hashtag extend the lockdown is trending on Twitter today. Yesterday you said one of your fears early on was that essential workers would not go to work out of fear of coronavirus. As you get ready to open businesses in the state, are you worried that the next round of workers will not want to go back to work, will be fearful of going back to work?
Just let me understand the question. Extend the lockdown is trending, meaning people want to extend the lockdown and not open up?
Yes.
Okay. Last week, your question was, we had the protest outside. People wanted to go to work and I was oppressing people by keeping them in lockdown. So today, may artificially open the lockdown.
The people outside said that they wanted to go back to work.
And these
Now,
people are saying they don't want to go back to work.
Because they're still fearful of the coronavirus.
So we have people last week protesting because they want to go back to work. This week we have people protesting because they don't want to go back to work. Yeah. Welcome to America. That's right. You have some people who say they want to go back to work, liberate democracy. You have other people who say, I don't want to go back to work, I want to live. Yes. What I'm saying is, I hear both voices. I hear the politics. I feel the tension. I get the tension. Let's decide on the facts, because this is emotion on both sides, right? And I get the emotion because this is an emotional time. Everybody's under stress. Everybody's anxious. Mental health issues are way up. Domestic violence is way up. Alcoholism is way up. Substance abuse is way up. People are anxious. These decisions we have to make without emotion, and we have to make them on the facts. And I'm not going to be swayed this week by this one, and now the next week by the other one. Make the decisions on the facts. Make the decisions on the numbers. I laid out yesterday 12 steps. First plan that we've ever seen on the numbers. You can reopen if you don't increase hospitalizations and you don't increase the infection rate, because you can't overwhelm the hospital. What does that mean? Here are the numbers. Here are the numbers. And we'll make the decision on the numbers. We've said from day one, follow the data. Follow the numbers.
Legitimate concern, though, from some small business owners is that their employees went on unemployment, and now they may not be able to get those employees back. So is there a way to deal with that if a business tries to reopen and then they can't get their workers back to function?
Forced labor, not in this country.
Governor Bill de Blasio.
Maria.
Governor, who are the 900 to 1,000 New Yorkers who are still coming into hospitals every day for COVID? Are they family members? I think you might have mentioned that yesterday, or frontline workers. Do we know who these people are?
Marina, I don't know that we have a statistical breakdown. The 1,000 people are troubling to me for all the progress we made. I mean, just put it in perspective. If I came in here one day and said we have 1,000 people who tested positive for the COVID virus, you'd say, wow. In one day? Yeah. So it is startling news. The only thing that makes it less startling is that relative to everything we've gone through, it's relatively positive news. I don't know that we have any data, though. They're predominantly downstate New York, right? They track the statewide numbers, predominantly downstate, Western New York, upstate. But I don't know if we have any breakdown of who they are, where they're coming from.
It's by region, so we know which hospitals they're going into, but not necessarily people's occupations. The governor announced a couple of weeks ago a study with the University of Albany, the Department of Health, on diagnostic testing to collect a lot more demographic data. So we know who's getting tested, who's positive. That doesn't necessarily result in hospitalization rates, but it will give us a better sense of who's testing positive in the state. That's not ready yet. They've just begun that study.
Why did you stress that New York was the quickest to shut down after the first known state, when many other states since then have responded swifter? Like, what's one thing you would change about New York's initial response going forward, just based on what we know now as a lesson learned?
Yeah, I said at the time, New York was the fastest state to shut down. We went from our first case to total shutdown in 19 days. That at the time was the fastest shutdown. Since then, other states that came later that saw what was going on moved faster.
Governor, if I read your charts correctly, it appears that Saratoga Hospital can resume elective procedures, but Glens Falls Hospital cannot. Why is that? And as long as we're talking about Saratoga, How do you feel about the racetrack opening up this summer if they can guarantee that their employees and their staff are safe?
Yeah. The Saratoga Glens Falls, do you know that?
So some individual hospitals, if they have to meet the governor's criteria, the criteria that established by the Department of Health, which is 30% bed capacity overall, 30% ICU bed capacity, and then not an uptick in a number of COVID patients per day. So some of the individual hospitals don't meet one of those tests, and some of the counties haven't met that test. So that's why you see some of the differences in the regions, just based on the hospitalizations of those specific regions.
So the Saratoga and Glens Falls hospitals are not too terribly far apart. Many people consider them to be in the same region.
Right. The issue is, though, they have the bed capacity they have. If there are emerging issues where they think they do have the capacity, the Department of Health has established an exemption policy, but they want to review that to make sure that there is actual capacity at those hospitals, because you don't want to be overwhelmed. So what they're seeing in that data are increases in hospitalizations potentially, so we want to make sure that those beds are available as potential infections increase.
Yeah. This runs into our new concept of attractive nuisance, although the lawyers would say this is an improper use of the term, which it is, but we'll just bother the lawyers a little bit. You can't open an attraction that could bring people from across the state to that attraction and overwhelm a region. State Fair in Syracuse, Saratoga Racetrack. I don't think we have time, first of all. But today, I don't think you can open those unless we do it statewide, because there is such a pent-up demand to get out of the house and do something. You open the Saratoga Racetrack, I guarantee you have the highest attendance in the history of the Saratoga Racetrack. You will have people from the entire Northeast region driving to the Saratoga Racetrack just because they want to get out of the house and they want to get. Now, you could say, well, that's great for the Saratoga Racetrack, but density is not our friend, right? Even when you talk about opening a venue, you look at some of the pictures of some of the states that are opening venues, 2 seats apart, 6 feet apart. You know, how do you do 6 feet apart at the racetrack? How do you do 6 feet apart at the state fair? How do you do 6 feet apart at the racetrack or the state fair when you have double the attendance you've ever had and people are all crammed in there, you know? So I think it would have to be a statewide opening, coordinate with Connecticut, coordinate with Jersey. Otherwise, you will have a much, much more dense situation if you wind up being the only attraction in town, and town is a tri-state region. Let me just make sure I put an exclamation point in a point that I was trying to make earlier. This political patina, this politicalization of what we're going through in this country is extraordinarily dangerous. We are dealing with probably the most dramatic situation we've dealt with in modern political history. We're dealing with a situation that we don't really understand and we don't know how to deal with. This is all uncharted water. I've talked to every expert on the globe. Nobody has been here before. It's going to take us at our best to navigate this to save lives. At our best. At our best, we have to be working together. We have to be logical. We have to be cooperative. We have to be sane. We have to work with people who sometimes we don't like. We have to work across the aisle. We have to be at our best. When you start to politicize this situation and you start to say red and blue and this team and that team, you may as well take a wedge and hammer it right into the middle of this country. And if you do that during this time, and this becomes a political football, or closing and opening becomes a political football, or funding becomes a political football, or this becomes a finger-pointing blame game, and you divide this country, the worst could lie ahead. We think we're coming out of it, but that's only if we do what we have to do. And what you hear coming out of Washington, and I was there for 8 years, I've heard this music before. This is the music of a campaign season. This is a music of a rally and balloons, and it's us versus them, and we're good and they're bad, and that is poison right now as to where we are. Thank you, guys.
All right, folks, that is the governor there of New York, Andrew Cuomo, and we are still waiting for that President Trump meeting. It is happening right now at the White House, but what has to happen is they do the meeting, the cameras are rolling, and then we wait until they play it out for us. So that meeting has now been going on for 35 minutes. We'll have it for you in full as soon as we get the playback from the White House. We thank the more than 13,000 of you watching on YouTube alone and thousands more on coronavirusnow.com. We're going to keep an eye out on the White House here. As soon as we get some tape playback, we're bringing it out to you right here in full. We do it in full, too. We don't show you 20 seconds, 30 seconds, even 90-second bits. It's the whole thing.
This is Good Day New York.
And experts say that Connecticut isn't going to hit a peak of the pandemic until sometime this week, as the National Guard now begins inspecting and reviewing nursing home facilities in the state due to a spike in deaths in nursing homes. Joining us now with an update, Connecticut Governor Ned Lamont. Good morning, Governor. Thanks for being with us.
Good morning, Lori.
I know your state has some 215 nursing homes, and now with the National Guard.
Residents who are dying at home, and some of those numbers aren't being counted. To the city's credit, they are starting to have a different number called those are likely passed away. So the numbers you gave would actually change. In the city, we're over 17,000 people who have lost their lives. In the city, over 22,000. That makes the city and the state among the worst response to corona in the entire world, on the planet. And I just need to say that's not entirely Donald Trump. That is the governor of the state, and to some extent the mayor, who failed to respond properly, took too long to respond, and never adapted the measures. And it's just agitating to watch it every single day. So I'm glad that the NYCHA is finally responding. We still know that some people are going and making repairs without PPEs. This is a problem. We still know access to healthcare is still a problem. We are glad that the mayor took our advice and a suggestion, I should say, and created a task force to address this. But there's still a lot of questions that need to be
Let's talk about the task force, because while you commend the mayor for establishing it, you also wrote a statement basically that laying out the caveat that you didn't want to see it waste time doing various studies, that you wanted to get right down to the nitty-gritty because time is really not on our side.
It is not. And again, I have to say, and I want to make sure the accountability here, I applaud the mayor and the governor for pushing the president to get resources. But where those resources went, the amount of time we took to address the concerns belongs squarely to the mayor, and to even more extent, the governor, who asked for and received more power than he's ever had. Those decisions were done locally. This task force, we need to know who's going to be on it. What's the timeline of the task force? And is it going to affect this budget that's coming in June, where the mayor is trying to cut every single youth job that exists after the governor cut Medicaid to these same communities that are going to need assistance, while the governor is asking for another 10 billion cuts without ever acknowledging the need to raise revenue from people who make $5, $10, $15, $100 million a year.
So do you not have confidence in the task force? I know that the mayor has established several task force that he wants to implement right now and have them run, some that will be run by the First Lady. Do you have confidence that it'll be run the right way?
Well, I'm looking forward to working with Deputy Mayor Thompson, who is, I guess, the co-chair of the task force that's going to focus on why there was disparity, more importantly, what we need to do to address that disparity. It's hard to talk about confidence when I don't know who's on the task force, when I don't know what the timeline is, when I don't know if it's going to affect the budget that is about to pass in June. And so those are questions that we still are asking, and we don't have the luxury of time. And my hope is that we move expeditiously. I do credit the mayor at least for acknowledging this problem. The governor still really hasn't. And when you look at their press conferences, what frustrates me again is on the city, state, and federal level, the executives don't look like the communities who are most affected. And the people around them, and you look at those press conferences, aren't that much more diverse either.
I know that, that the governor did establish a partnership with ready responders who can test on site at some of public housing, but I would imagine you feel that's not enough, but at least it's a beginning.
It's April 28th. Some of those testing started a week ago. Maybe 2 or 3 weeks ago, we started translating services into other languages than English. There was a lot of missed opportunities here, and there has to be accountability for that so that we don't make the same mistakes going forward. And we all should be concerned the very people who made us the worst city and state in the planet for responding to Corona are the only ones that might be responsible for the response and the recovery. And so we want to make sure there is a pathway for people from these communities to be at the table really directing the decision-making and what's going to happen. And so I want to work with the mayor, I want to work with the governor to make sure that these communities are not left behind. 2/3 of the testing in the top 30 zip codes went to wealthier, whiter communities. So maybe we shouldn't have had the Jacob Javits and the Central Park open. Maybe we should have had Prospect Park open. Maybe Baisley Park in Queens.
All right.
And I want to know what data they were using in the first place for these bad policies to be made.
All right. New York City Public Advocate Jumaane Williams, thank you for being with us this morning.
Thank you.
Stay on top of it.
We can't get together. If we do come together as one New York, we will get through it. And I want to say thank you to essential workers and frontline workers.
All right. I'm sure that's echoed all over the city. And in response to the COVID-19 crisis, Congress passed the CARES Act, aid to those unemployed, loans for shut down businesses, and most recently, additional funding for small businesses, COVID testing, and hospitals. But to the frustration of Governors Cuomo and Murphy, along with Mayor de Blasio, Congress has been unable to agree on aid for states hardest hit by the coronavirus pandemic. Senate Majority Leader Mitch McConnell has gone so far as to tell New York and New Jersey to declare bankruptcy. Join us this morning, New York Senator Kirsten Gillibrand. Senator, thanks for being with us this morning.
My pleasure. Thank you for having me.
When you have the majority leader say something like that, when you have the president also floating the idea and expressing skepticism as to whether or not blue states should be allowed more funding, how do you counter that?
Well, I think it was unfortunate rhetoric. I don't think either of them fully believe that it makes sense for states to go bankrupt. President Trump is determined to be reelected, and he believes the economy is going to determine whether he will be elected. So he will invest in states. So will Senator McConnell. Senator McConnell came out today or yesterday saying that, in fact, he would consider investing in states and cities. Our state needs billions of dollars. We have to close the budget shortfall. Without it, then governors and mayors across our state will have to fire police officers and firefighters. We will have to lay off lots of public servants, as well as cut budgets to things like education, and nobody wants that to happen. So I believe that we will, in this next package, be able to do a significant investment in cities and states, and I'm optimistic that we will find the bipartisan support to get that done.
So what would be different in the next round? What was not addressed in these various packages that needs to be?
So far we've passed 4 bills, and all of them, in my opinion, were triage bills, meaning greatest need as quickly as possible just to stem the flow of pain and suffering in cities, states, and localities. What we did was put money into the hospitals immediately because they would have to shut their doors if they didn't get revenue, and they were only treating COVID patients and emergency patients, no paying patients. And so they had no revenue streams. We immediately got money to people who are unemployed. 26 million people filed for unemployment in the last few weeks. That is an outstanding number. That is frightening. And all those families needed money just to literally put food on the table and to pay whatever bills they can. We also sent money to small businesses. We just did a plus up of that small business account and made provisions that the second tranche of money would go to more minority-owned, women-owned small businesses who didn't have relationships with the big banks that already had SBA loans. We needed to get money into places that used credit unions or community banks who didn't have those relationships. And so this next bunch of money for small businesses should go to different places around New York that didn't get it the first time. And we also put money in for testing. We put $25 billion in to start testing, because if you do want to reopen any city or state in America, you really can't do it responsibly if you don't have testing and contact tracing, so that you don't have another resurgence as soon as everything opens up.
You know, the other thing I know you're very passionate about are postal workers. I have to tell you, I still write all my checks. I love my postal office I'm at, you know, once a week at least. I know all of them very well. I know you want some legislation that addresses the needs of our postal workers out here, who are definitely on the front line, and we need to thank them every single day.
So post offices are essential to our communities. A lot of small businesses rely on post offices to send the things they sell. A lot of people rely on post offices to send letters and send checks and send things that are important to families and friends and customers all across the country. So we need our post offices. And because of COVID-19 and other reasons, it's about to collapse. It will collapse by the end of the summer. So there's 3 ways to save our post offices, 2 of which are specific to right now. First of all, we need post offices to be able to do mail ballots. We need to make sure this next election is secure. So we want to know that in every 50 states, we can have absentee ballots. So if we're still with COVID in November, which is likely, we can mail in our votes. It's important that everyone has that right to vote and that it is secure. Second, post offices used to be used for banking, for basic banking for lots of families since the early 1900s. It was really important during the Great Depression for families to be able to have savings accounts, checking accounts, small loans. If you could get a $500 loan from your post office, that might be enough to pay a heating bill. It might be enough to pay part of a rent check or a medical bill. And so small loans, mortgages, anything that is so small that the big banks just don't cover it. They don't offer checking accounts to low-income workers. So there are 30,000 post offices around the country, and every single branch could be used as a bank. We could have postal banking. That would raise for the post office $9 billion a year, which would stabilize them immediately. And then last, to save our post offices, they have this ridiculous provision that says they have to pay their retirement accounts out for 75 years. Nobody has to do pensions. Yeah, their pension and retirements have to be paid for 75 years in advance. That's absurd. No business, no entity in America has to do that except for the post office. It was a stupid law passed in the early 2000s that should never have been there.
Unbelievable.
So we need to take that provision away and allow our post offices to thrive. And so those are 3 good ideas about how to do it that solve other problems along the way.
As we wrap up the interview, Senator, the last time you were on, we talked about reopening the state. You said it couldn't even happen without first addressing the school system and opening it. The governor did float the idea about summer school. What are your thoughts of that?
Again, I think summer school, if it's done remotely, is smart and appropriate, given that for a lot of kids, distance learning is really hard, and many kids didn't even have computers or tablets in the first few weeks of distance learning. So if we want to continue distance learning through the summer, I think that is wise and appropriate and smart. If you're talking about opening schools as early as May or June, I don't know how we open schools before we have universal testing. So I've introduced legislation for a health force, 1 million people to be trained in the next 2 months to do contact tracing, testing, and eventually vaccinations all across America. It's like the AmeriCorps. It's like what we did during the Great Depression when we had the Works program, where everyone was trained to do work that was needed in infrastructure and rebuilt the country. People would be trained to do this medical work, and it would be a pipeline for medical professionals long term. But it's a great way to get people who are now unemployed employed into something we desperately need to reopen. So if we can pass this bill in the next COVID-4 package that we're working on, then we could get this training up and running in 2 months. And then maybe you could open schools by September, because you'd have enough testing and contact tracing to be able to test every kid before they go back, and every kid that gets a fever, test it again. It's how you stop COVID from having a resurgence this fall.
All right, fingers crossed. That would certainly be nice. As the weeks go on, it is getting harder to stay at home, but it's important to know that doing so still is saving lives. Here to tell us why now is more critical than ever during this crisis is Dr. Arabia Mollett. She is an emergency room doctor at Brookdale University Hospital Medical Center. We're going to have her join us in one moment to talk about what's going on in hospitals. It's interesting. She wrote an op-ed piece that was in the Daily News some time ago, and it was basically saying to New Yorkers, listen up. Here is the hard truth about what we're going through. She said, even though we're practicing social distancing and isolation, that in itself does not get rid of COVID. It will still exist when we get out. But what we have to do, again, of course, is try to flatten the curve. She's also been talking about the need for when you drop your loved one off of the hospital, make sure that you have information. We do have Dr. Arabia Mollett on the phone now or with us. Dr. Mollett, thank you for being with us.
Hi.
Glad we worked all that technical stuff out. We're ready to roll now. I got to tell you, I looked at the op-ed that you wrote, addressing it to New Yorkers, that here is the hard truth that we need to learn and deal with involving coronavirus. You said that you're not seeing that slowdown in your ER room, are you?
So as of recently, yes, we're seeing the slowdown of the volume in our emergency room, and but we're still at the peak, and the curve is not necessarily flattened completely, but this has definitely have been a slowdown. But we're still in the midst of this pandemic, and we're still preparing and still taking care of those that are arriving at our emergency department.
Now, you talked about how there are moments you're so busy sometimes that you can't keep the count of the patients that you're seeing, that whenever you do have a break, it's a moment where you're either letting tears flow or just trying to deal with the gravity of it all. And I would imagine that is mirrored with all healthcare workers right now of the challenge of what you have to do, but still keep it together.
Yes, I mean, and the thing is that we are trying to do, or we're doing our best, is to check on each other. We're not okay, and in itself, it is okay. But it's important that we continue to check on each other and have that space to express to one another what we are going through. As we all know, recently, one of the top emergency physicians in New York City recently passed away and due to suicide. And that was a severe blow to all of us in emergency medicine. And my sincere condolences to her family and her friends. I didn't know her personally, but we did share mutual friends. And for what I was told, she was a beautiful spirit. She was kind. She advocated for her patients and went above and beyond for many. And this is something that we need to talk about, is mental health care reform.
You're, of course, talking about 49-year-old Lorna Breen, who was the medical director of New York Presbyterian Allen Hospital, and her father was so eloquent in talking to the New York Times, talking about his daughter with such great love. And she had COVID, mild symptoms, but had gone back to work. So what do you look at as this? You've said this is not going away. So how do you deal with the mental part of it for healthcare workers? You've talked about seeing people die before they can get out of the ambulance, let alone in the hospital.
My honest opinion is that we need some or extra mental health or post-traumatic stress disorder benefits for those who are on the front line during this pandemic, especially for physicians and especially in this case, for physicians who need a break after this without worrying about losing their jobs. And I think that's the biggest problem is that if I take a break from this, am I going to lose my job? And no one should have to worry about that. There was a recent study in China that examined mental health.
All right, folks, as expected here is the tape playback of President Trump.
Okay, so a trial that the National Institute of Allergy and Infectious Diseases, which is the institute I direct, sponsored, called the Adaptive Co-Virus Disease Treatment Trial, or ACCT-1, was started in February 21st of this year, and it was a randomized placebo-controlled trial comparing the Gilead drug remdesivir with a placebo. It was highly powered with about 1,090 plus individuals, so it is the first truly high-powered randomized placebo-controlled trial. It was an international trial involving multiple sites, not only in the United States, but in various countries throughout the world, including Germany, Denmark, Spain, Greece, the UK, etc. The primary endpoint was the time to recovery, namely the ability to be discharged. When you have a study like this, we have a Data and Safety Monitoring Board which looks at the data. And they are independent, so there's no prejudice on the part of the investigators because they're doing the trial or the drug is from a certain company. The Data and Safety Monitoring Board on Monday afternoon contacted me on April 27th, first on Friday, the week before, and then again on April 27th, and notified the study team, namely the multiple investigators who are doing the study throughout the world, that the data shows that remdesivir has a clear-cut, significant positive effect in diminishing the time to recovery. This is really quite important for a number of reasons, and I'll give you the data. It's highly significant. If you look at the time to recovery being shorter in the remdesivir arm, it was 11 days compared to 15 days. And that's a p-value for the scientists who are listening of 0.001. So that's something that, although a 31% improvement doesn't seem like a knockout 100%, it is a very important proof of concept, because what it is proven is that a drug can block this virus. And I'll give you an example in a moment of why we think, looking forward, this is very optimistic. The mortality rate trended towards being better in the sense of less deaths in the remdesivir group, 8% versus 11% in the placebo group. It has not yet reached statistical significance, but the data needs to be further analyzed. The reason why we're making the announcement now is something that I believe people don't fully appreciate. Whenever you have clear-cut evidence that a drug works, you have an ethical obligation to immediately let the people who are in the placebo group know so that they could have access. And all of the other trials that are taking place now have a new standard of care. So we would have normally waited several days until the data gets further, dot the I and cross the T. But the data are not going to change. Some of the numbers may change a little, but the conclusion will not change. So when I was looking at this data with our team the other night, it was reminiscent of 34 years ago in 1986 when we were struggling for drugs for HIV. And we had nothing. And there was a lot of anecdotal reports about things that maybe did work, maybe not. People were taking different kinds of drugs. And we did the first randomized placebo-controlled trial with AZT, which turned out to give an effect that was modest. But that was not the end game, because building on that every year after, we did better and better. We had better drugs of the same type, and we had drugs against different targets. This drug happens to be blocking an enzyme that the virus uses, and that's an RNA polymerase. But there are a lot of other enzymes that the virus uses that are now going to be targets for this. This will be the standard of care. And in fact, when we look at the other trials we're doing, we were going to do a trial with another antiviral. Actually, it isn't an antiviral, it's an anti-inflammatory, a monoclonal antibody. We're going to now compare the combination of remdesivir with this. So as drugs come in, we're going to see if we could add on that. So bottom line, you're going to be hearing more details about this. This will be submitted to a peer-reviewed journal and will be peer-reviewed appropriately. But we think it's really opening the door to the fact that we now have the capability of treating. And I can guarantee you, as more people, more companies, more investigators get involved, it's going to get better and better. So I'll stop there, but I'd be happy to answer any questions.
Dr. Fauci, does any of this data Does that make you more comfortable?
Why don't you go first and then you go?
Does any of this data change the timeline and the development of a vaccination?
No, this has nothing to do with vaccines. This is treatment for people who are already infected. Vaccines is to prevent infection in those who are at risk.
Do you have new data on vaccines?
No, nothing more than that. What I continue at the press conferences that we have regularly, keep you up to date, that everything is on track with the phase 1 study. We're in the third part of it. We're going to go into phase 2 in the summer, but nothing has changed that anything I've said when we had press conferences.
Tony, they're writing a lot about Oxford. We know Johnson & Johnson is well
There's
advanced.
another candidate, another one of several candidates that are moving along, because we're going to have a lot of shots on goal when it comes to vaccines.
That's good. That's great. Yeah, please, go ahead.
How does this news influence your thought process on states reopening their governments? Do you think people should be more comfortable knowing that there is a drug that is proven effective?
Well, I think it's a beginning. I thought Tony explained it really well. It's a beginning. It means you build on it. I love that as a building block. You know, just as a building block, I love that. But certainly it's a positive. It's a very positive event from that standpoint. And we're going to be very careful as we open. A lot of people, a lot of governors are opening. I know you're very advanced. You're going to be very advanced in getting it going. But we're doing it very carefully. We've learned a lot over the last couple of months. And if there's a fire, we're going to put it out. If there's a little ember burning, we're going to put it out. We're going to put it out very quickly. And I think we've learned how to do that. There have been some areas that have really started up, and we put it out very quickly. So we've learned a lot. Yeah, please.
Mr. President, the self-spread guidelines expire tomorrow. Do you intend to extend those?
Well, I'll let Mike. Do you want to explain what we're doing on that?
I think, Mr. President, we've issued the guidelines. Now it was actually 45 days ago. First 15 and then 30 days to slow the spread. And frankly, every state in America has embraced those guidelines at a minimum or even done more. And now our focus is working with states as governors like Governor John Bell Edwards unveil plans to open up their states again. And the new guidance that we've issued is guidance for how they can do that safely and responsibly. And so not only the gating criteria for when we believe it's appropriate for states to enter phase 1 are included, but also the very specific guidelines for when states open and how they can open in, as the President said, in a safe and responsible way are included in the President's guidelines for Open Up America again.
So the current guidelines then will not be extended?
The current guidelines, I think you can say, are very much incorporated in the guidance that we're giving states to open up America again, but maybe, Mr. President,
And I think a way of saying it, they'll be fading out because now the governors are doing it. I've had many calls from governors, Governor of Texas, Greg Abbott, and many governors, Tennessee, Arkansas. We're speaking to a lot of different people, and they're explaining what they're doing, and I am very much in favor of what they're doing. They're getting it going, and we're opening our country again. Do you want to explain that, please?
Yeah, I think you could see from California, they made slow the spread the phase 1 of their 4 phases. So every governor is adapting both currently where we are and moving forward of how to move through phase 1, phase 2, phase 3. So if a governor feels like they haven't met the gating criteria, some of them have made that their own first phase 1 and some of them made it phase 0. So we've been very encouraged to see how the federal guidelines have helped informed, or at least provide a framework for governors in moving forward all the way through from what they now call either phase 0 all the way through phase 3.
And Ron DeSantis, as you know, Governor of Florida, was here yesterday, and he gave, I thought, a really good presentation of how he's doing it, what he's doing, how he's opening. You might have seen it.
I did.
And he did a very good job. I thought, really a very good job.
Mr. President, I would say that if you look at the plan that you had put out for 30 days to stop the spread, the mitigation measures that you promoted in that plan are carried forward in the guidelines for reopening. And so it's sort of a seamless way to do it by keeping those mitigation measures in place that you need to as you reopen, especially for the vulnerable population. So it's really, I would agree with the Vice President that it is carried forward, not just theoretically, but expressly in the document that you gave us. And
thank you for mentioning the vulnerable people, because we've made it clear from over the last 8 weeks that there was certain risk groups that were particularly vulnerable to serious disease. That has held up. We see in most of reports about 95 to 96% of the individuals with serious disease and hospitalizations are still in those groups. I think in a way that's reassuring, but it also should be a message to all of our vulnerable populations, as we have said for the last 8 weeks in phase 1 and in phase 2, as well as in slow the spread. We've been very clear about them continuing to shelter and those families protecting them from becoming infected.
Mr. President, what are you hoping to learn about China and the World Health Organization with this investigation you commissioned with the intelligence agency?
Right, it's coming in, and I'm getting pieces already, and we're not happy about it, and we are by far the largest contributor to WHO, World Health, and they misled us. I don't know, they must have known more than they knew, because they came after what other people knew that weren't even involved. We knew things that they didn't know, and either they didn't know or they didn't tell us, or, you know, right now they're literally a pipe organ for China. That's the way I view it. So we're seeing and we're looking and we're watching, and again, we give $500 million. We have over the years from 400 to 500 for a long time, for many years, and China is giving $38 million, and yet they seem to work for China. And they should have been in there early. They should have known what was going on, and they should have been able to stop it when you talk about stopping the spread or stopping the embers. That could have been stopped there. And then why did China allow planes to fly out, but not into China, but they allow planes to come out? And planes are coming out of Wuhan, and they're coming out, they're going all over the world. They're going to Italy, very, very big time to Italy, but they're going all over the world, but they're not going into China. What was that all about? So we had you'll hear, we're coming up with a very distinct recommendation, but we're not happy with it. We're not happy with it. Even today, I've heard some statements that are very positive. There's nothing positive about what happened in China having to do with this subject, nothing positive at all. And I finished a number of months ago with a trade deal, and you would have thought it would have been like somebody would have said, hey, they could have stopped that at the source. They didn't have to let airplanes fly out and loads of people come out. And we're lucky, as Tony said, we're lucky that we stopped it in January, flowing into our country from China, outside of our citizens. You know, people now say, oh, well, you shouldn't have let our citizens back in. Let's forget about that one. We're lucky we stopped in January. A lot of people, long after that date, as you know, thought that the measure that I took was much too strong. John Bell, we're lucky we stopped it then. You know, we put a border, we put a ban on people coming in from China. So we'll have a recommendation pretty soon, but we are not happy with the World Health Organization. That I can say.
Mr. President. On the World Health Organization or a recommendation on China?
On World Health, with China to follow.
Mr. President, can I ask a question of Dr. Fauci? There was also a study out of China of remdesivir that came out today that didn't find a significant statistical significance with the treatment. I'm wondering if you saw that. It was a Lancet study, and why that.
Yeah, it's an underpowered study, and it's not the kind of study where, that's the reason why I was very explicit in saying this is a randomized controlled, placebo-controlled trial that's powered to the tune of over 1,000 in hospitalized patients. And the endpoint was a clear endpoint, the time that you essentially are discharged, and the secondary endpoint of death. So even though, I mean, I don't like to poo-poo other studies, but that's not an adequate study, and everybody in the field feels that.
Mr. President, what can you do to help businesses with liability issues as workers come back in states that have opened up?
Well, as you know, we just worked with the meat processors, and if you think about it, a form of delivery, we have tremendous product, we have ample supply, but there was a bottleneck caused by this whole pandemic, and it was potentially pretty serious. And I just got off the phone with the biggest in the world. I mean, the biggest distributors there are, and the big companies that you've been reading about. They are so thrilled, they're so happy, they're all gung-ho, and we solved their problems. We unblocked some of the bottlenecks, and I'm sure you've seen it, I'm sure you've heard. I spoke to him about 2 hours ago, signed something very important last night in terms of Defense Production Act. And it was very important. They were so happy. They're like, it's like a new business for them. They were being very unfairly treated, very unfairly treated. So the farmers are very happy, and the ranchers, and the companies that we're talking about. You know the ones I'm talking about, because they've all become very well known. They were well known anyway. They're big companies, but they're now being treated fairly. They're thrilled, and that whole bottleneck is broken up.
So the Defense Production Act protects them from
Well, we
liability?
use it. No, that's what we did. We used it, and it helps them greatly to do what they have to do, because they're ready to do it, but they needed some help.
How do you protect the workers, though, in those plants? What are you doing?
Well, we're doing that. We're going to have a report on that probably this afternoon. We're going to have a good form of protection, and through quarantine, when we find somebody that's not, they're going to be very careful. They are, as to who's going into the plant, and the quarantine is going to be very strong. And we're going to make people better when they have a problem. We're going to get them better. Hopefully, they're going to get better. You know, we have a very good record of having people getting better. A lot of people don't talk about that, John Bell, where people go in statistically, but you don't read about the tremendous success we've had. We're just about #1 in the world in terms of success. Germany's doing well. We're doing well. A couple of countries are doing okay, but we're doing very well. So the statistics are very good on that. So we're gonna get them better. Yes, Steve?
Just a quick follow-up to Dr. Fauci. When might we see remdesivir on the market? How soon might we see that?
Well, right now it's happening that the FDA, literally as we speak, is working with Gilead to figure out mechanisms to make this easily available to those who need it. With regard to getting to the market, will obviously have to be approved by the FDA for licensure, and the FDA is very well aware that this is something that is very important, so I'm sure they're going to be moving very expeditiously. But I can't give you a date.
Right. Tony, would this be used in the earlier phases or in the late phases?
Again, thank you for that question, because there are a lot of different permutations. This is in hospitalized patients, and the end point was the time to discharge. So it's unclear yet right now from this study whether or not it would be better for early. We don't know. It could be. But we only make statements about what we've proven. And the only thing that's been proven now is in hospitalized patients. So good question, but we don't have the answer. Thank you.
Mr. President, fiscally speaking, GDP shrinks 4.8%. Curious your reaction on that, and what, if anything, you want to see out of another possible stimulus package?
So if you look at what's going on in the market, where the market's at 24,000, and this came from us blind. We never knew. We had the greatest economy ever in the world, in the history of the world. We had the best economy. I say it openly. Nobody even challenges it. And they would if they thought I was wrong. We had the best economy ever, and we're going to have it again. What happened is, look at the market today, 24,000, above 24,000, I think, Kevin. In fact, I'll ask you to say a couple of things about that. But if you would have said that we would have had the worst pandemic since 1917, over 100 years ago, with the disturbance to 184 countries at least, because that was as of last week, and that we were at 9,000, and now we're going to be at 24,000, and we were at a low. I think we're having one of the best weeks.
And welcome everyone here to News and Now. Well, we used to have to wait a little bit later in the day for a White House coronavirus task force briefing. Well, we're getting one right now inside of the Oval Office. Hi, everyone. Mike Peschier, welcome to News Now. There is big news at the top of this meeting. So what we're going to do for you is play it in its entirety for you on Fox 10 Extra, so you won't miss a thing about this. Dr. Fauci just saying that there is a new COVID-19 drug out there that they are testing that would hopefully really limit the problems that this virus is having for our country. And he says the early results are amazing. So let's get right to it right here on News Now. For everyone on coronavirusnow.com, you get to see this, and we will show it to you in its entirety right here on News Now, everyone.
Institute of Allergy and Infectious Diseases, which is the institute I direct, sponsored, called the Adaptive Covirus Disease Treatment Trial, or ACCT-1, was started in February 21st of this year, and it was a randomized placebo-controlled trial comparing the Gilead drug remdesivir with a placebo. It was highly powered with about 1,090 plus individuals. So it is the first truly high-powered randomized placebo-controlled trial. It was an international trial involving multiple sites, not only in the United States, but in various countries throughout the world, including Germany, Denmark, Spain, Greece, the UK, etc. The primary endpoint was the time to recovery, namely the ability to be discharged. When you have a study like this, we have a data and safety monitoring board which looks at the data. And they are independent, so there's no prejudice on the part of the investigators because they're doing the trial or the drug is from a certain company. The Data and Safety Monitoring Board on Monday afternoon contacted me on April 27th, first on Friday, the week before, and then again on April 27th, and notified the study team, namely the multiple investigators who are doing the study throughout the world, that the data shows that remdesivir has a clear-cut, significant, positive effect in diminishing the time to recovery. This is really quite important for a number of reasons, and I'll give you the data. It's highly significant. If you look at the time to recovery being shorter in the remdesivir arm, it was 11 days compared to 15 days. And that's a p-value for the scientists who are listening of 0.001. So that's something that, although a 31% improvement doesn't seem like a knockout 100%, it is a very important proof of concept, because what it is proven is that a drug can block this virus. And I'll give you an example in a moment of why we think, looking forward, this is very optimistic. The mortality rate trended towards being better in the sense of less deaths in the remdesivir group. 8% versus 11% in the placebo group. It has not yet reached statistical significance, but the data needs to be further analyzed. The reason why we're making the announcement now is something that I believe people don't fully appreciate. Whenever you have clear-cut evidence that a drug works, you have an ethical obligation to immediately let the people who are in the placebo group know so that they could have access. And all of the other trials that are taking place now have a new standard of care. So we would have normally waited several days until the data gets further, dot the I and cross the T. But the data are not going to change. Some of the numbers may change a little, but the conclusion will not change. So when I was looking at this data with our team the other night, it was reminiscent of 34 years ago in 1986 when we were struggling for drugs for HIV. And we had nothing. And there was a lot of anecdotal reports about things that maybe did work, maybe not. People were taking different kinds of drugs. And we did the first randomized placebo-controlled trial with AZT, which turned out to give an effect that was modest. But that was not the end game, because building on that every year after, we did better and better. We had better drugs of the same type, and we had drugs against different targets. This drug happens to be blocking an enzyme that the virus uses, and that's an RNA polymerase. But there are a lot of other enzymes that the virus uses that are now going to be targets for this. This will be the standard of care. And in fact, when we look at the other trials we're doing, we were going to do a trial with another antiviral. Actually, it isn't an antiviral, it's an anti-inflammatory, a monoclonal antibody. We're going to now compare the combination of remdesivir with this. So as drugs come in, we're going to see if we could add on that. So bottom line, you're going to be hearing more details about this. This will be submitted to a peer-reviewed journal and will be peer-reviewed appropriately. But we think it's really opening the door to the fact that we now have the capability of treating, and I can guarantee you, as more people, more companies, more investigators get involved, it's going to get better and better. So I'll stop there, but I'd be happy to answer any questions.
Dr. Fauci, does any of this data, does that make you more comfortable?
Why don't you go first and then you go?
Does any of this data change the timeline and the development of a vaccination?
No, this has nothing to do with vaccines. This is treatment for people who are already infected. Vaccines is to prevent infection in those who are at risk.
Do you have new data on vaccines?
No, nothing more than that. What I continue at the press conferences that we have regularly, keep you up to date, that everything is on track. with the phase 1 study. We're in the third part of it. We're going to go into phase 2 in the summer, but nothing has changed that anything I've said when we had press conferences.
Tony, they're writing a lot about Oxford. We know Johnson & Johnson is well
There's
advanced.
another candidate, another one of several candidates that are moving along, because we're going to have a lot of shots on goal when it comes to vaccines.
That's good. That's great. Yeah, please, go ahead.
How does this news influence your thought process on states reopening their governments? Do you think people should be more comfortable knowing that there is a drug that is proven effective?
Well, I think it's a beginning. I thought Tony explained it really well. It's a beginning. It means you build on it. I love that as a building block. You know, just as a building block, I love that. But certainly it's a positive. It's a very positive event from that standpoint. And we're going to be very careful as we open. A lot of people, a lot of governors are opening. I know you're very advanced. You're going to be very advanced in getting it going. But we're doing it very carefully. We've learned a lot over the last couple of months. And if there's a fire, we're going to put it out. If there's a little ember burning, we're going to put it out. We're going to put it out very quickly. And I think we've learned how to do that. There have been some areas that have really started up, and we put it out very quickly. So we've learned a lot. Yeah, please.
Mr. President, the Stop the Spread guidelines expire tomorrow. Do you intend to extend those?
Well, I'll let Mike. Do you want to explain what we're doing on that?
I think, Mr. President, we've issued the guidelines. Now it was actually 45 days ago. First 15 and then 30 days to slow the spread. And frankly, every state in America has embraced those guidelines at a minimum or even done more. And now our focus is working with states as governors like Governor John Bell Edwards unveil plans to open up their states again. And the new guidance that we've issued is guidance for how they can do that safely and responsibly. And so not only the gating criteria for when we believe it's appropriate for states to enter phase 1 are included, but also the very specific guidelines for when states open and how they can open as the President said, in a safe and responsible way are included in the President's guidelines for Open Up America again.
So the current guidelines then will not be extended after tomorrow?
The current guidelines, I think you can say, are very much incorporated in the guidance that we're giving states to open up America again, but maybe, Mr. President,
and I think a way of saying it, they'll be fading out because now the governors are doing it. I've had many calls from governors, Governor of Texas, Greg Abbott, and many governors, Tennessee, Arkansas. We're speaking to a lot of different people, and they're explaining what they're doing, and I am very much in favor of what they're doing. They're getting it going, and we're opening our country again. Do you want to explain that, please?
Yeah, I think you could see from California, they made slow the spread the phase 1 of their 4 phases. So every governor is adapting both currently where we are and moving forward of how to move through phase 1, phase 2, phase 3. So if a governor feels like they haven't met the gating criteria, some of them have made that their own first phase 1 and some of them have made it phase 0. So we've been very encouraged to see how the federal guidelines have helped informed, or at least provide a framework for governors in moving forward all the way through from what they now call either phase 0 all the way through phase 3.
And Ron DeSantis, as you know, Governor of Florida, was here yesterday, and he gave, I thought, a really good presentation of how he's doing it, what he's doing, how he's opening. You might have seen it.
I did.
And he did a very good job. I thought, really
you know,
a very
Mr.
good
President, I would say that if you look at the plan that UIL had put out for 30 days to stop the spread, the mitigation measures that you promoted in that plan are carried forward in the guidelines for reopening. And so it's sort of a seamless way to do it by keeping those mitigation measures in place that you need to as you reopen, especially for the vulnerable population. So it's really, I would agree with the Vice President that it is carried forward, not just theoretically, but expressly in the document that you gave us. And I
Thank you for mentioning the vulnerable people, because we've made it clear from over the last 8 weeks that there was certain risk groups that were particularly vulnerable to serious disease. That has held up. We see in most of reports about 95 to 96% of the individuals with serious disease and hospitalizations are still in those groups. I think in a way that's reassuring, but it also should be a message to all of our vulnerable populations, as we have said for the last 8 weeks in phase 1 and in phase 2, as well as in slow the spread. we've been very clear about them continuing to shelter and those families protecting them from becoming infected.
Mr. President, what are you hoping to learn about China and the World Health Organization with this investigation you've commissioned with the intelligence agencies?
Right, it's coming in, and I'm getting pieces already, and we're not happy about it. And we are by far the largest contributor to WHO, World Health, and they misled us. I don't know. They must have known more than they knew, because they came after what other people knew that weren't even involved. We knew things that they didn't know, and either they didn't know or they didn't tell us, or, you know, right now they're literally a pipe organ for China. That's the way I view it. So we're seeing, and we're looking, and we're watching. And again, we give $500 million. We have over the years from 400 to 500 for a long time, for many years. And China is giving $38 million. And yet they seem to work for China. And they should have been in there early. They should have known what was going on. And they should have been able to stop it at you talk about stopping the spread or stopping the embers, that could have been stopped there. And then why did China allow planes to fly out, but not into China, but they allow planes to come out? And planes are coming out of Wuhan, and they're coming out, they're going all over the world. They're going to Italy, very, very big time to Italy. But they're going all over the world, but they're not going into China. What was that all about? So we had you'll hear. We're coming up with a very distinct recommendation, but we're not happy with it. We're not happy with it. Even today, I've heard some statements that are very positive. There's nothing positive about what happened in China having to do with this subject. Nothing positive at all. And I finished a number of months ago with a trade deal, and you would have thought it would have been like somebody would have said, hey, they could have stopped that at the source. They didn't have to let airplanes fly out and loads of people come out. And we're lucky, as Tony said, we're lucky that we stopped it in January, flowing into our country from China, outside of our citizens. You know, people now say, oh, well, you shouldn't have let our citizens back in. Let's forget about that one. We're lucky we stopped in January. A lot of people, long after that date, as you know, thought that the measure that I took was much too strong. John Bell, we're lucky we stopped it then. You know, we put a border, we put a ban on people coming in from China. So we'll have a recommendation pretty soon, but we are not happy with the World Health Organization.
But just to clarify, a recommendation on what? On the World Health Organization, or a recommendation on China? What do you mean?
On World Health with China to follow.
Mr. President, can I ask a question of Dr. Fauci? There was also a study out of China of remdesivir that came out today that didn't find a significant statistical significance with treatment. I'm wondering if you saw that. It was a Lancet study, and why that.
Yeah, it's an underpowered study, and it's not the kind of study that's the reason why I was very explicit in saying this is a randomized controlled, placebo-controlled trial that's powered to the tune of over 1,000 in hospitalized patients. And the endpoint was a clear endpoint, the time that you essentially are discharged, and the secondary endpoint to death. So even though, I mean, I don't like to poo-poo other studies, but that's not an adequate study, and everybody in the field feels that.
Mr. President, what can you do to help businesses with liability issues as workers come back in states that have opened up?
Well, as you know, we just worked with the meat processors, and if you think about it, a form of delivery, we have tremendous product, we have ample supply, but there was a bottleneck caused by this whole pandemic, and it was potentially pretty serious. And I just got off the phone with the biggest in the world. I mean, the biggest distributors there are, and the big companies that you've been reading about. They are so thrilled, they're so happy, they're all gung-ho, and we solved their problems. We unblocked some of the bottlenecks, and I'm sure you've seen it, I'm sure you've heard. I spoke to him about 2 hours ago, signed something very important last night in terms of Defense Production Act. And it was very important. They were so happy. They're like, it's like a new business for them. They were being very unfairly treated, very unfairly treated. So the farmers are very happy, and the ranchers, and the companies that we're talking about. You know the ones I'm talking about, because they're all they've all become very well known. They were well known anyway. They're big companies, but they're now being treated fairly. They're thrilled, and that whole bottleneck is broken up.
So the Defense Production Act protects them from
Well, we
liability?
use it. That's what we did. We used it, and it helps them greatly to do what they have to do, because they're ready to do it, but they needed some help.
How do you protect the workers, though, in those plants? What are you doing to protect
Well, we're
them?
doing that. We're going to have a report on that probably this afternoon. We're going to have good form of protection, and through quarantine, when we find somebody that's not, they're going to be very careful. They are, as to who's going into the plant, and the quarantine is going to be very strong. And we're going to make people better when they have a problem. We're going to get them better. Hopefully, they're going to get better. You know, we have a very good record of having people getting better. A lot of people don't talk about that, John Bell, where people go in statistically, but you don't read about the tremendous success we've had. We're just about #1 in the world in terms of success. Germany's doing well, we're doing well. A couple of countries are doing okay, but we're doing very well. So the statistics are very good on that. So we're gonna get them better. Yes, Steve?
Just a quick follow-up to Dr. Fauci. When might we see remdesivir on the market? How soon might we see that?
Well, right now it's happening that the FDA, literally as we speak, is working with Gilead to figure out mechanisms to make this easily available to those who need it. With regard to getting to the market, will obviously have to be approved by the FDA for licensure, and the FDA is very well aware that this is something that is very important, so I'm sure they're going to be moving very expeditiously. But I can't give you a date.
Tony, would this be used in the earlier phases or in the late phases?
Again, thank you for that question, because there are a lot of different permutations. This is in hospitalized patients, and the endpoint was the time to discharge. So it's unclear yet right now from this study whether or not it would be better for early. We don't know. It could be. But we only make statements about what we've proven. And the only thing that's been proven now is in hospitalized patients. So good question, but we don't have the answer.
Thank you.
Mr. President, for fiscally speaking, GDP shrinks 4.8%. Curious your reaction on that, and what, if anything, you want to see out of another possible stimulus package?
So if you look at what's going on in the market, where the market's at 24,000, and this came from us blind. We never knew. We had the greatest economy ever in the world, in the history of the world. We had the best economy. I say it openly. Nobody even challenges it. And they would if they thought I was wrong. We had the best economy ever, and we're going to have it again. What happened is, look at the market today, 24,000, above 24,000, I think, Kevin. In fact, I'll ask you to say a couple of things about that. But if you would have said that we would have had the worst pandemic since 1917, over 100 years ago, with the disturbance to 184 countries at least, because that was as of last week, and that a market would be, we're at 29,000 and now we're going to be at 24,000, and we were at a low. I think we're having one of the best weeks. We're having one of the best periods in terms of stock market, which to me is jobs and future. I don't view it as a stock, I view it as jobs and future. If you would have said to me that we'd be at 24,000, and we started off at, when I was elected, the number was much lower, much lower, as you know. It's called in the teens. But if you would have said we would have been at 24,000 with what we've gone through as a country, John Bell, it's pretty amazing. And I think I read where this is one of the best weeks in the stock market, this last short period of time, that we've had since the 1950s or 1940s. So I think there's a tremendous feeling of optimism in this country. I can only say that there's going to be a tremendous feeling of optimism. I think the third quarter is transitional. We're transiting into, but it's a very transitional period. I think it's going to do good, but I think the fourth quarter is going to be fantastic. I think next year, all of the fruits of what we've all done together, between the doctors and the business people and yourself, thank you very much, of course you're a doctor, but all of the work from the task force, all of the people that have worked so hard, we're going to have a tremendous year next year. And you're going to start to see that, I think, in the fourth quarter, maybe even in pieces of the third quarter. But that's, again, very transitional.
Mr. President, spending, though, is there a day of reckoning coming with over $2 trillion spending?
No, it's about growth. It's about growth. We're going to be in great shape because we're growing. And we could have done it the other way. You don't spend anything and you're flat for years. You know, There are ways of looking at it. You have to throw money at it, but we're throwing money at the people that lost their job unfairly. You saw some of the people yesterday in the White House where they were down and out, and we came along and helped them. So we could have been flat for a long time as a country, or we could grow. I think you're going to see tremendous growth. It's a stimulus, and it's a great stimulus. Now they want more stimulus, and they're pushing for things, though, but I don't know that we should be working with states that have been suffering through bad leadership or bad management for 25 years, and we're supposed to fix that. So we're going to have to talk about that.
Mr. President,
maybe they should have brought that up sooner.
Captain Crozier, would you like to see him returned as?
I think he's I don't know him. I've never spoken to him. I think he's a very, very good man who had a very bad day. And then he wanted to be Ernest Hemingway. You know, he starts writing long memos. You can't do that when you're a captain of a ship, especially that ship. That's the ultimate nuclear aircraft carrier, the best in the world, 5,000 crew members, and he decides to become Ernest Hemingway. You can't do that. You can't do that. With that being said, I said he had a bad day. We all have bad days.
Has Secretary Esper asked for your advice on how to proceed?
Well, I don't want to comment, but I have my feelings on it. And I just think he's a very good man who had a bad, and I think the acting secretary is a very good man also. And he had a bad day. They both had bad days. You want to know the truth? They both had bad days. And that can happen. They were under a lot of pressure because it went very public. And so they'll be seeing me at a certain point. But I think he's a very good man. I think they're both very good men. But you know, when you talk about spreading, so it started with 2 people, then it went to 12 people, then it went to, I got a report yesterday, it was 851 people. Now they have 5,000 people. So it starts with a little group, and then a few weeks later, how long is that? 4 weeks. 800 and some odd people. And they're sailors, they're young. There is one death, as you know. There's one death. There's about 10 people in the hospital right now, but we expect all to get better. But there is one death out of it, but that spread like wildfire, right? Think of that. You know, it was 2 and 12, and then we thought it ended at 41. You didn't think so. I don't think you thought so, right?
Just the right environment for spread like that.
It was a tough environment.
Mr. President, on testing, yesterday you said that we will very soon be testing 5 million people.
Well, I don't know where it came up.
Yeah. You said that.
I'd like to refer to these 2 people because I don't know where it came up. Everyone kept saying, you said there'd be 5. That was a study that came out. Somebody came out with a study of 5 million people. Do I think we will? I think we will, but I never said it. We're testing millions of people. We're testing more people than any country in the world by far, by double, by much more than double, more than everybody else combined we're testing. But somebody started throwing around 5 million. I didn't say 5 million. Somebody said 5 million. I think it might have been the Harvard report. There was a report from Harvard, and they said 5 million. Well, we will be there, but I didn't say it. I mean, I didn't say it, but somebody came out with a report saying 5 million. It sounds like a lot. Yesterday, I looked at Deborah. I said, what's with the 5 million? I think that was from the Harvard report. But we are going to be there at a certain point. We'll be there, but we're more advanced than any country in the world on testing. And not only that, the testing is the best test, not only the most. We've not only done the most, even when you look at so many people, they love the Abbott Laboratories test. You might have had it. Did you have it today?
Yes, sir,
Good.
I did.
He's
Thank
okay. You got a test out of this deal.
I did.
But everybody comes in, they give them the test. In 5 minutes, they know they're okay or they're not okay. So far, we haven't found anyone not okay. But it's a great test. But that was not even, nobody even thought of that 2 months ago or 3 months ago. You know, that was developed over a very short period of time, brilliantly developed by Abbott. So, no, we'll be at whatever number it is, but we're so far advanced over any, and you know, it'd be really good if the press would give credit for it to the people that have done such a good job, because they're always saying, well, you know, you're doing millions, but what about 5 million? I'm saying, where did that number, I keep asking, where does it come from? I really learned this morning, I think it was probably the Harvard said that'd be nice, and sure it would be nice, and we'll be there, but But again, we didn't say it. Who said it is a report. We have other reports talking about a much lower number. But we're doing better than anybody in the world by far. The people that have worked on it have been incredible. And, you know, John Bell is testament to it. Testing is one of the great reasons that you've been successful in Louisiana.
Yes, sir, with a lot of help from our federal partners. And the best news that we got as a state, quite frankly, and all states got it, was on Monday when Admiral Giroir said that our plans had all been received last Wednesday, and they were going to be able to resource the testing kits. Yeah. So I don't know about $5 million for the country, but Louisiana is going to do our part with $200,000 per month. And I think if you extrapolate that out, that comes close to $5 million. I don't
Pretty
know,
much,
but
yeah.
I don't know what time period you're talking about.
Dr. Burks, Admiral Giroir said to Time Magazine that 5 million tests per day is simply not possible. Do you agree with that?
So what we have talked about and what was in the blueprint and talking with states, and you can see, I mean, this is Louisiana's curve. They got to this curve of mitigation and containment across the state with about 26,000 tests per million, or about 26,000 tests per million. So million of their population. So these tests, and I've been very clear about it, these are RNA tests, which means you take the virus out of your nose, you've got to crack the virus open, extract out the RNA, amplify the RNA, and then get an answer. And you can see that's happening inside of machines. Sometimes lab directors and lab technicians have to physically mix all of those reagents. That's when you hear about extraction reagents and why they're needed. And so what we had in the blueprint is really a call to action to really work on developing antigen tests like we use for flu. Because when you're using an antigen test in a doctor's office, then you can get to potentially that number. I'm not sure we need that number. I don't want to validate that number, but I'm saying is with this current test and the complication of how it has to be run, that's not physically possible. And I think that's what Admiral Giroir was speaking to. But as we talked about ID Now, we continue to develop more testing and different platforms. But I think we do need that kind of new breakthrough to a new technique, a new measurement, to get to the kind of numbers that Harvard's talking about. But I think we've made it clear all along that states have controlled and mitigated with the current number. And as you heard from the governor, he didn't shut everything down. There was still, he has a curve like this with still a significant number of Louisianans working. So I think what every governor is working on is how do I get the most people I can back to work and still maintain high level of safety. And I think what's the roadmap and the criteria and the testing come together to create that. This will not be a testing alone piece. And as you just heard about the Roosevelt, and I bring this up every time, this asymptomatic spread will be important. And we just heard about 800 cases, 10 or less than 10 in the hospital, or 10 to 15 in the hospital. 800, 10 or 15 in the hospital. If you're only diagnosing symptomatic cases, you may be missing a large part of the spread. And I think that's why strategically using testing in a new way, a monitoring way to proactively find asymptomatic individuals, particularly when they surround our most vulnerable groups, whether it's Native Americans or long-term care facilities. We want governors to simultaneously work on finding the cases, as they did so superbly, and then work on a proactive measurement to find the asymptomatic cases. And I think those two pieces have to come together. And I think that's what's in the blueprint. That's what we're having the calls with the states with, and really see how do we effectively use our current testing capacity to ensure we're both monitoring and diagnosing.
And you know what's interesting about that number is that I remember when we did 1 million, we said, we just did 1 million. And the media said, oh, when are you going to do 2 million? I said, soon, pretty soon. Then we do 2 million. And then they said, when are you going to do 5 million? In other words, it's sort of a setup, because no matter what, and by the way, when we hit 5 million, when are we going to hit 10 million? It's a little bit of a trap. You know, it's called the media trap. It pertains to me, it doesn't pertain to other people, but it's what I've had to experience for 5 years.
Mr. President, a number that indicates to you that it is safe.
Well, I don't know. I heard the 5 million is totally unnecessary. Now, that doesn't mean we're not going to hit it pretty easily, but again, I think it's a media trap. I think the number, you know, I've just, all I know is this. President Moon of South Korea, because we've heard a lot of good things about South Korea, have good relationship. He called me to congratulate me on the testing. He said, your testing is the greatest in the world. How did this happen? I kept hearing about South Korea, South Korea. And he said, I want to just tell you that what you've done with testing is incredible. Okay? So our people should be congratulated. And what they'll do is, no matter what, if we test, as they say, 325 million people, they're going to say, when are you going to test them twice? Okay? So, you know, it's a trap. It's really a media trap, but that's okay. Look, we are better than anybody in the world on testing. We have tested more than anybody in the world, and we have the best tests in the world. And that's been all developed over the last couple of months because we started off with nothing. We had nothing. We had absolutely nothing. And that included ventilators, and that included, I always say the cupboards were bare. They were bare in the military, and they were bare medically in terms of pandemics or epidemics or whatever you want to call it. So our people have done an incredible job. Yeah.
Mr. President, concerning WHO, do you think that China is playing a better game in terms of soft power?
Say it again.
Do you think that China is playing a better game in terms of influence, soft power in the WHO?
Well, they've been doing it for years, and they play the game, and I guess we've had people over the years that never really focused on that game. You know, who would think you'd have to play the game? And it's, to a large extent, public relations, you know, public relations or whatever. But China's not to be congratulated for what happened, just so you understand it. They're not to be congratulated for what took place. And WHO is essentially congratulating them. And when they start doing that, we've got problems. And again, the United States pays almost 500 million, and they pay 38 million a year. 500 million versus 38 million a year. So there are lots of different people that we can give this to. You know, we can give this money to lots of different incredible groups. There are a lot of groups out there. Doesn't have to go to the WHO. We can give it to groups that are very worthy and get much more bang for your buck. But we're going to make a decision in the not too distant future. If I could, I'd just like to have John Bell finish up by talking about the great success in Louisiana. And you worked with our two great senators, and they were
Absolutely.
really, John and Bill, and they were really calling me a lot and saying, we got to take care of Louisiana. So you had a great relationship with them.
We do. I know Senator Kennedy worked on the ventilator issue, and Senator Cassidy and I last night were talking about testing and what we can do going forward with the blueprint, because he and Dr. Redfield had discussed that. But we've obviously turned the corner in Louisiana. We're in a much, much better place than we thought was even possible 5 or 6 weeks ago, I will tell you. And that's because of our local partners and our federal partners and hard work. We've had a lot of lessons to learn because there's no blueprint for this. There's a blueprint for testing now, but there's no blueprint for a governor. How do you respond to a pandemic? So we've had a steep learning curve, but I will tell you we're in a much better place. The field medical stations that you provided, the Navy medical personnel that you sent to Louisiana, the testing that we had early was the key, and that has informed our testing strategy going forward, and we're excited about the opportunity to have the test kits that we need allocated starting in the month of May to get to the 200,000. We'll do 43 persons per 1,000. That's what we're going to get to in Louisiana, and we're going to be in much better shape after that, Mr. President. We look forward to getting past this, returning to a newer sense of normalcy, which I don't think will come officially and fully until we get the vaccine. But we're looking forward to moving. We're looking forward to moving ahead, and just appreciate your work and your contributions to our efforts. It's been very helpful.
Well, it's an honor working with you. Thank you, the people of Louisiana. Great people. They've really gone through a lot.
Well, I'll just say they're the best.
I'll tell you what, they're right there. I agree. They're great people.
Do you feel like you have enough test kits and supplies to run as many tests as you think you need?
Well, what I believe is that with the commitments that were made this past Monday by Admiral Giroir, that having looked at all 50 state plans for testing going forward, that they've committed to resourcing Louisiana's request for 200,000 test kits per month. That gets us to 43 out of every 1,000 tested every month. We believe that that's sufficient for us to move forward as we are able to start reopening the economy. We know the lab capacity is there. We have Dr. BU here with me. He's done a phenomenal job. He's responsible in large measure for that curve coming down. And so we feel pretty good at that level. And that's one of the reasons I wanted to be able to come up here today at the President's invitation to thank him for that commitment. Because this, I'm only speaking for myself, but having been part of all the calls with the governors, this is the big piece that we've been looking for. And with that commitment, we really feel much better about going forward.
That's great. Great job. Would you like to say something, Doctor?
We know the importance of testing. We can't treat what we don't find. And early on, we knew that we had a problem, and we knew that we needed to surge our testing. And so we were grateful to have that support, especially in the epicenter in New Orleans, in the parishes right around there, so that we could get a sense of what's going on with COVID. And then we've continued that pattern through the rest of the state.
Well, it's been great, and all of that is coming. Everything went, and now it's coming, and you'll be in a position. I think you said 43. That's a big number. That's a great number. If you could do that, that'd be a fantastic number. One thing I think I'd like to just finish by saying, so we reached 1 million cases, and that's a tremendous amount. And the reason is because of testing, because other countries don't test. So if you don't test, you're not going to find cases. The reason we have 1 million, take a look at number 2. Number 2 is a fraction of that, because they don't test. They don't have the ability to do what we're doing. So it's a number that in one way sounds bad, but in another way is really actually an indication that our testing is so superior. I mean, to think that we have more cases than China. Does anybody really believe that? But the testing is different. And I think also the transparency is much different. Transparency is like from day and night. We are totally transparent, whatever it is, it is. But because of our great testing and because of what we've done and the amount we've done, we are able to point out far more cases than anybody else has. If other countries did the kind of testing that we had, now we're a much bigger country than most also in terms of people, but if other countries did this kind of testing, you'd see numbers that would be much different. Okay? Thank you all very much. Thank you.
Mr. President, how essential is it to you that these states wait 14 days?
Come on, guys.
Thanks, guys.
Thank you.
Come on, guys. Thank you.
Live look right now at the Dow here, up 563 points there in the green. We continue to bring you the very latest right here on coronavirusnow.com and worldwide, of course, for you. Stay right here with us. More coverage coming up next. In the meantime, let's go to New Jersey right now. Governor speaking there.
Any income is a big deal for many people. And President Trump said yesterday he would support state and local aid if, quote, we'd want certain things also, including sanctuary city adjustments. And to quote, I'm curious what your reaction is to those comments and if you think it's a fair trade-off.
Yeah, I think these are all going to be me, Matt Plack, and Matt, I introduced you in absentia. You're now with us. We'll see how it goes in terms of whether opening parks, if folks do what we're asking them to do, that will have a huge impact on our ability to take other, what I call baby steps. And I'm not implying opening parks as a baby step, but it will. The hip bone is connected to the thigh bone here. Let's see how the parks go, but no decisions yet or imminently on beaches, et cetera. And as Matt reminds me, there's only technically one beach that we control, which is Island Beach State Park. The other beaches these are going to be guidance that we offer to municipalities. I know that the Department of Labor has chopped through an enormous amount of the backlog, and I have enormous sympathy for the folks who are out there who still haven't gotten theirs, and they're frustrated and their accounts are dwindling. I think what I'm going to suggest is, Dan, to ask you to get Rob Angelo to go directly to Matt and give him.
All right, listening here just a little bit to the governor of New Jersey. We got so many events and content to bring to you, and we're going to try to get in everything that we possibly can right here on Fox 10 Extra. Of course, we have more time online at coronavirusnow.com, but I just want to keep shifting things around because the content is big and it is here today. I'm your host, Mike Pace. Thank you so much for joining us. I'm trying my best to bring you everything that is happening in the world of this COVID-19 pandemic. But right now we're going to go to our very own Fox 10's Renee Nelson. You know her from AZAM. She did a great interview with this best-selling New York Times author, Dr. Wallace Nichols, about the blue mind theory. His book, Blue Mind, really talks about finding comfort in the blue spaces, like water that is nearby, and just really getting lost in that. And that helps really ease tensions and anxiety and maybe a little bit of everything that is happening, really all of the above, what we've been seeing these last about 4 to 5 weeks already here. So let's bring that to you here. This is our very own Renee Nelson with the interview.
From Fox 10 Phoenix in Arizona, I'm Renee Nelson. The global pandemic forcing a shift in our daily routines and also leaving many of us without work and income. First responders are on the front lines of the fight and coping with the loss of life as we know it, leaving many of us grieving. And today we are talking to an expert about the top wellness trend of 2020, and he's sharing how to manage stress and anxiety and how water and achieving a blue mind state can help. So scientist and New York Times bestselling author, Dr. Wallace J. Nichols, joining us now. Good morning. Welcome, doctor.
Good morning. Good to see you.
Yeah, good to see you again. So this is an exceptionally difficult time in our history. And first, tell me, what is Blue Mind and why is it more important today than ever?
Well, Blue Mind simply describes that that feeling we get when we're near, in, on, or underwater. It's a more relaxed, calmer, more connected, more creative, even more collaborative state of mind that we get when sometimes if we're swimming, if we're in the bathtub or the shower. It's kind of a, maybe an obvious idea, but it's something that's should be part of our wellness toolkit, and it's often overlooked, especially when we're really stressed out. Everything goes out the window and we kind of forget our best ideas. So it's just a reminder that our water can help us be more centered and more calm.
And you break this down kind of into 3 parts. So blue mind being the good part, red mind being somewhat necessary, but gray mind definitely being an area you just don't want to go.
Right. So blue mind is best understood in contrast to what we call red mind, which is our kind of our new normal, where we're anxious about the future. There's uncertainty. We're overstimulated. There's a lot of technology, a lot of screens. We're behind. Maybe we're stressed economically. The news perhaps might be bugging us. And so that's our new normal, that red mind mode. And that mode is really actually pretty useful when it's harnessed, when it's used as a force for good. But for a lot of people, it kind of gets carried away. We just have too much anxiety, too much stress. And that can lead to the third mode, which we call gray mind. And gray mind is burnout, it's breakdown, it's kind of that disconnect, even a sense of mild depression. And so we want to avoid gray mind, and we want to move between red mind, which is our action mode, and blue mind, which is our calm and restorative mode, and not get pulled into that gray mind burnout, which really has no real purpose. It's not a very useful mode.
Well, and we've talked about a little bit, anxiety, stress, burnout, it's really not new. So this was kind of the way of life even before the pandemic. So we've needed better tools for a while.
That's right. The American Psychological Association puts out an annual report called Stress in America. And recently, just a couple of months ago, they said, over 40% of Americans are feeling sort of unmanageable levels of anxiety and stress in their lives. And that was pre-pandemic. So, we know we're carrying a lot of burden. We know that we can't carry it all ourselves, and we can't carry it forever. We need to have healthy outlets to reduce that anxiety and stress, for sure.
Well, talking about carrying that burden, let's talk about first responders. So what makes, just the concept of Blue Mind so important for healthcare workers right now?
So, the people in our society who respond first to an emergency, call them first responders. And they may be, firefighters, maybe police, they may be emergency medical personnel, maybe the people in our emergency rooms. They can even be journalists who respond first to breaking news. They represent us. They work for us. They fight for us. They run towards the danger on our behalf. And when they do that daily, day in and day out, week after week, month after month, it certainly takes its toll on them, even in the best of times. Especially now, what we're seeing is our first responders are carrying an extra heavy burden. And we really need to think of ways to help them to stay resilient, to hit their reset button, if not daily, certainly every week, so they can come back physically and emotionally stronger to do the jobs that are ahead of us. We're not anywhere near done with this particular crisis. So, we really want to take this Blue Mind message to our first responders, our health practitioners, and all the people who are considered essential workers who are out there, maybe carrying a little bit of an extra level of stress on our behalf.
What does that look like? I mean, what do people that are dealing with that kind of stress, what do you do to achieve that Blue Mind state?
So I think the first thing, and probably one of the important things, is to recognize blue mind, red mind, and gray mind, and to name it and to label it, and to not be afraid of talking about your emotional health. And that's often a big part of the problem, especially for people who serve others. They have a hard time saying, you know what, I'm really tired and I'm on the brink of burnout here. They have a hard time doing that, so they don't, and then they just double down. They reach for that coffee rather than some blue mind, and they work even harder, which creates even bigger problems. Or they make choices that create bigger problems. Maybe their mechanism for taking care of their anxiety makes matters worse. So first of all, you need to recognize that you've got too much red mind, you're moving into gray mode, and you need to get to blue mind. Next thing is to actually practice blue mind, to prioritize it in your life. We're all very busy, so that's hard to do, but carve out that 15 minutes, maybe an hour once a week, where you can really just disconnect from the voices, from the screens, from the chatter, from all the noise, all the responsibilities, and take that time to sit in your water, whatever water that may be. And it could be in your home, it could be virtual water, it could be your bathtub. You've got lots of options, even when we're practicing this stay-at-home mode. We have lots of options for getting our blue minds on.
Got it. And Blue Mind's not just an idea. There's science behind it. So talk to me about the science and what the research says.
Yeah, the past decade, we've seen just a true explosion of research that bolds and underlines this idea that water is good for our physical, our emotional, and even our social health. So what we see is that being near, in, on, or underwater reduces stress hormones like cortisol. It slows our breathing rate, slows our heart rate, moves us into that blue mind state, that more calm, more creative, and more connected state of mind. Neuroscientists and psychologists have been measuring the effects of water on our bodies and our minds, and finding it's really one of the best ways that we can take care of ourselves, is to exercise in the water, to sit calmly by the water, to take, when we get those chances to take those vacations, even if it's just for an afternoon, take a walk around a lake, take a walk by the river, sit by the pool, and let your mind really relax. And so the research is really clear. It's pretty exciting that we're moving into this new phase that I think Blue Mind will become common knowledge for kids and adults, and especially for first responders.
And we're talking about it a little bit, where you can go to, achieve your blue mind. A lot of people, they flock to the beaches, maybe to rivers and lakes, but there's other ways just within your home. Can you touch on that a little bit more?
Yeah, sure. There's, the one sphere for blue mind is the wild water. So that would be your lakes, your rivers, oceans and ponds, creeks, springs, hot springs, all those wild waters that we love to visit. But there are two other big categories that are important. One is the domesticated water. So it's the water in our homes. It's the swimming pool, the spa, the tub, the shower, even the sink, maybe a small fountain. People have fountains in their homes or in a courtyard. Urban fountains are domesticated waters. And really making use of all that domesticated water in our lives and enjoying it, prioritizing bath time. really enjoying the time you get in the shower. And then the third category is virtual water. And those are all the depictions of water where there in fact is no water present. So that would be photography, art, even music, or very popular recordings of the ocean, recordings of rain, recordings of rivers. All those are very, very popular tools for helping us calm. So maybe turn off the radio, turn off the TV, and go online and look up ocean sounds and just let that play for 15 minutes, or whale songs, or the sound of a river, or the sound of rain, and just let that wash over you while you just kind of calm down. It sounds overly simplistic, but if you just do it, you'll agree that it really helps a lot.
And I've read that you said that achieving Blue Mind is almost as much about what the exposure to water, being in water, takes away. Can you talk about that a little bit?
Sure. So the water brings all of this to us, the enjoyment and the feeling of buoyancy, but really it also precludes a whole bunch of activity. So you can't really bring your laptop into the bathtub. It's not very compatible. Most smartphones really don't want to be in the shower with you. And so as we practice Blue Mind, we're also leaving a lot of the sources of red mind behind. So the screens, other people, lots of voices, traffic, billboards, all the mental, visual, auditory stimulation that can make us distracted and stressed. The water kind of disallows it. So Blue Mind is as much about what it takes away from us as what it gives to us when we get in the water.
When should we be learning about or even teaching Blue Mind? Is there certain stages or ages, or is this applicable across the board?
If I had a magic wand and I guess a budget to back it up, I would make Blue Mind something that every child learns in school, from kindergarten all the way through 12th grade. I would make it something that every doctor, nurse, first responder, therapist learned in their training. I would make it something that all teachers understand and practice and teach, and certainly all parents. That's a tall order, but we can start with ourselves. We can start with our own families. We can start with our own children and our grandchildren and the schools that they attend. And really, for you to understand your own Blue Mind, it's a right and it's a privilege. It's a basic operating instructions for being a human being, to know that water, the single greatest feature of our little blue planet and our bodies, helps us with our emotional health as well as our physical and social health. And we should all know that. We should all have access to our Blue Mind, and we should all be able to practice Blue Mind throughout our lives. When we're kids, it's maybe more about play. As we get older, perhaps it's more about calming down after those stressful, responsible weeks and days. And then even as we get older in life, it becomes more therapeutic when gravity starts to maybe feel a little heavier on our bodies as we start to slow down. So I think Blue Mind should be part of the human toolkit and should be taught in school at all ages. And that would be, I guess, our vision for this work.
It's interesting, Doctor, because anytime that we've covered Blue Mind and maybe posted the video or a story or anything, there are a lot of comments from people that say, oh yeah, I feel great when I go to the beach, or I used to live at the beach or near a lake and I miss it. And they connect with that immediately. What do you hear from people that kind of connect and are changed by the whole Blue Mind practice?
I love talking to people about their Blue Mind and their water, because everybody has a story. And whether it's a swimming pool that they learned to swim in, or a creek, a lake, maybe a beach, an ocean that they fell in love with, that they spent important time at, everybody's got a story to share. And a lot of times people forget about that feeling. Maybe it harkens back to childhood. Maybe they were a little nostalgic about it. But I love talking to people about their water and hearing their water stories, their Blue Mind stories. It's really fun, and you can feel the light go on when people understand how powerful this idea is and how useful it is. And then the light goes on even brighter when they understand that there's some really cool neuroscience and psychology backing up the practice of Blue Mind. Clinical research is on our side. And so it's, I think it's a universally applicable idea. Anywhere you are in the world, you can practice Blue Mind, whether it's wild, domesticated, or virtual water. And it's extremely useful.
Well, it's interesting. You also said that, accessing water usually doesn't have a monetary element attached to it. So what's your goal with this message?
I think my goal is for Blue Mind to become a knowledge for everyone to understand their own Blue Mind, for everyone to have access to it, whatever that means wherever you are. So it means something different for me in California than it does for you in Arizona, to someone maybe in the middle of Australia, far from the coast. But wherever you are, understanding Blue Mind, having access to a source for it, and then practicing it, that's the key. Because we can have access, we can understand it, but if you don't do it, none of this conversation matters. So that's really the key piece, is the practice part, and building new habits in your life that involve healthy ways of reducing your stress and anxiety. I've spent a lot of time this past couple of months working with groups that serve veterans and first responders and health practitioners, groups that do things like surf therapy and dive therapy and float therapy for the people who need it most. And I can tell you that it's really a wonderful way for our first responders and our veterans and people carrying a lot of stress, post-traumatic stress, to help process that by getting in the water and really reconnecting with not only themselves, but the people they're in the water with and our planet. And so that's our goal, is to make this common knowledge, make it widely accessible, and help people practice it as much as possible.
Got it. Can we see a peek at the book? Do you have that accessible?
Oh yeah, sure do. Yeah,
okay.
Of course. There we go. That's
there
what the
it
book looks like. I just want to say, my dear friend Celine Cousteau, Jacques Cousteau's granddaughter, wrote the foreword. It's the best part of the book. She's a wonderful water advocate and part of a family of heroes of mine.
Sure.
And her grandfather was certainly an inspiration for many of us.
Yeah. Great. Well, it's good to take a look at the book. You also have a free online Blue Mind conversation that's coming up. How can people find out more about that?
So we do online Zoom conversations, and on a monthly basis. So if you go to my website, which is simply my name, wallacejnichols.org, you'll find the link to register. And we just spend time together talking about Blue Mind, helping people understand it and figure out how to access it and practice and answer questions, and just kind of keep the conversation going is the goal. And Zoom is all the rage these days, so we really love that platform.
Well, it is an important conversation to have right now, for sure. So the book is Blue Mind, the surprising science that shows how being near, in, on, or underwater can make you happier, healthier, better connected, and more connected and better at what you do, that is. It is a long subtitle, for sure, Doctor.
It may be the longest subtitle of any book, I'm told, but
It's still a good one. Well, Dr. Wallace J. Nichols, thank you so much for being here today.
All right, thank you very much for chatting.
Yeah, great to have you. For Fox News Now, I'm Renee Nelson.
All right, and our thanks there to Renee and Dr. Wallace Nichols for providing that content there for us. The author there of Blue Mind, and for more information you can go onto his website or his Facebook page, Wallace J. Nichols. He's doing that event tomorrow for first responders, so be sure to check that out and get more details from his website or his Facebook page. All right, everybody, on coronavirusnow.com, we are continuing our coverage here, providing you the very latest that's coming across the country. Let's listen to New Jersey a little bit more.
Working literally morning, noon, and night on testing of all shapes and sizes, including antibody. And we want to make sure that we spend our bullets appropriately. And Matt and I were discussing this earlier. There is this, and I think for folks out there who may not have a good sense of it in a non-medical sense, you've got sort of two options here: the snapshot of a moment in time versus the watching the movie and seeing your life play out, and that's sort of the difference of the regimes here. I suspect we're going to firmly come down, and we need both, and we need them for both for different reasons. But Christina will clean this up. Before again, the incomings, I don't even listen. I think if you don't have a thick skin, you're probably in the wrong seat, given the one that I'm in. But it literally is irrelevant to me. I do want folks to I want to remind folks rather that we overwhelmingly make decisions based on fact and science and data, period. And some of that is hard, fast numbers, the curves that we're watching. Again, notwithstanding what is a softer but very important argument that Judy has been making, other commissioners have been making, we all have, as it relates to mental health and the impact on that, which is harder to put on a curve, but we are incredibly and deeply sympathetic to that argument, more than anecdotally, but certainly anecdotally, but more than that. We're also looking at hard numbers, so notwithstanding the fact we may be sympathetic to the mental health challenges, whether they be all the things we've talked about.
All right, we will check in a little bit later there with the governor in New Jersey, but here's a live look at the COVID-19 map. Welcome back, everyone. Here to News Now on Fox 10 Extra and worldwide on coronavirusnow.com. We're taking a look here at the total number of cases around the world, and we're at 3.1 million cases in the U.S. Yesterday, we hit the 1 million mark, and now we have 1,027,000 cases in the U.S. Unfortunately, for the number of dead, we have just under 60,000. So we'll keep an eye on those numbers, of course, right here on the COVID-19 pandemic map. But we have one more hour for you right here on Fox 10 Extra. And of course, we go a little bit longer on coronavirusnow.com. I'm your host, Mike Page. Thank you so much for joining us here today, as we always try to bring you the top stories and news headlines from across the country regarding this COVID-19 pandemic. We're going to go out to our sister station, Fox 29 in Philadelphia. They got Dr. Mike on deck there. We try to get to him every day. We love those segments. He gives us great update of just what is happening in the fight of this pandemic and all the updates regarding this virus.
Dr. Mike Srigliano with Penn Medicine joining us from Philadelphia. It appears the race, Dr. Mike, for the vaccine is accelerating. Drug maker Pfizer announcing plans to start U.S. testing. I think it's going to happen next week. Could we see a vaccine ready for emergency use by the fall?
I don't know about the fall, Thomas. Remember, we have to have two things. It has to be safe and it has to be effective. And there's only so much you can rush a vaccine into production. I mean, it takes time to see if people develop immunity. You just can't rush certain things. And so I would love to see a vaccine available by September. I don't know. I'm thinking more realistically January, but that will be the final nail in the coffin of this nightmare. And if we can just get that vaccine going, we're going to be in a whole different, better place. But I really think it's going to take a little longer than the fall. Maybe I'm wrong.
So what exactly is Pfizer going to start doing next week?
Well, basically, what people do when they develop a vaccine is they get phase 1 trials and they get people started with the vaccination. And they look for side effects and they look for the development of antibody response. Remember, antibodies are the key to preventing illness, and that's why we vaccinate just about everyone that we can when it comes to other illnesses like flu and measles, mumps, rubella, all of those things.
I want to talk about this dire warning from Dr. Anthony Fauci, of course, the nation's leading epidemiologist. He said a second round of coronavirus is, quote, inevitable. Say that is the fact, Dr. Mike. What will determine how bad this round will be in the coming months?
Well, it depends, Thomas, How many people go down to Georgia and get their hair cut and get a tattoo? Or people in California going to the beach? Or people in Chicago going into a house party with 300 people there? If we don't treat this right, Thomas, we're going to be right back where we were 4 or 5 weeks ago, and I'll again be getting ready to be deployed with my bags packed to an ICU somewhere. So we have to be very judicious in our way of opening up the country. There's no getting around it. I want everyone to get back to work. I absolutely do, but you can't do it haphazardly or flip a switch and get the country back to work.
Looking closer. Yeah, looking closer at that timeline. I want to talk about man's best friend here, Dr. Mike. The first canine positive result has appeared. This coming out of North Carolina, a pug, and the CDC now offering new guidelines. What are they?
Well, basically, given the fact that we are now seeing coronavirus in dogs, cats, lions, and tigers, all kinds of animals, basically social distancing with your pets, especially if someone in your house is very sick or they have the virus, it's possible that that could be spread to one of your pets. Now, the thing that keeps me up at night is the fact that this virus originated in animals, in the animal population, and came to us. Now, we don't think that you can get this from your cat, but theoretically, in the way I'm thinking, if you're immunosuppressed, you have lupus, you're on medication, or you have psoriatic arthritis or something, and you have a cat or a dog now that has COVID-19 and they lick your face, how is it that that doesn't present a theoretical concern? It does to me. We have to watch and wait.
Yeah, I know it's difficult, but you may have to, kind of set yourself aside from your little furry friend here. Would the course of treatment be the same? I know so much is unknown about treatment for animals, but would you just have to let it run its course as well?
Well, Thomas, when I find a treatment for COVID-19 in us, I'll be happy to share it with dogs, cats, and lions and tigers. I just want something. We're still struggling. Are we going to give plasma therapy to a cat? Maybe, if the cat is on a ventilator. And look, I have patients and I have friends who their animals are everything to them. I could see that happening. If a cat develops, and luckily we haven't really seen severe cases, but treatments, sure. Yeah, bring it on.
So let's move back to the antibody test here, because we're hearing more and more every day about these tests, these antibody tests. Those who have recovered, those who have antibodies, there's a sense of feeling now that I'm clear, I'm protected here. But the truth is, we still don't know whether people are protected, right, from a second infection?
We don't know yet. Most diseases that are infecting, an infectious disease that causes a problem with one of us, the immune system develops antibodies. It has a response, an immune response, so that if it comes along again, we're able to fight it off. Now, these antibody tests, because this is a new virus, the novel coronavirus, we don't know. So if you get a test and it shows you have antibodies, my concern is, will they offer protection? Will you then decide you're free to roam the country? You then take your mask off, you go, forget social distancing, and start infecting other people. That's my concern. We need more time, we need more data, we need more study. I think that if you have the coronavirus, just like if you get a vaccine, it will stimulate your immune system and then you will be protected. Or if you get it again, it will be a more mild case. But right now, I wouldn't hang my hat on an antibody test.
What is this we're hearing about short-term, long-term antibodies?
Well, basically what we are looking at is different sorts of antibodies. There are IgM antibodies, which protect you earlier on after an infection, and then IgG antibodies, which protect you further out. And so the immune system works in a way that is protective of you. Now, this adds to the complication. Are these tests accurate that check for antibodies? What are they actually checking for? And when you do get an antibody test, is it accurate? Now, there are about 100 companies that are coming out with antibody tests, Thomas, and none of them have been reviewed by the FDA. They waived that. So we don't know whether the sensitivity or specificity is up to speed to say that, hey, you actually have it. Where there is a benefit to antibody testing is knowledge of how many people may have been exposed to this virus. That's important. And if you want to donate plasma. So if you have antibodies on one of these tests and you want to donate plasma, you'll then get a second test, make sure that you have proper amounts of antibodies, and then you can donate plasma. So
there are countless research being done, as you know, a number of studies. There's a small pilot study, and this is out of Emory University in Atlantic. It's exploring whether low-dose chest radiation therapy may actually improve lung function. What do we know about this low-level radiation?
What I love about medicine and what one of the things that is intriguing to me about this illness is that it's bringing back things from 100 years ago. So in 1918, we had the Spanish flu, and because I am in Philadelphia at the University of Pennsylvania, which was the first medical school in the country, we have all kinds of history. Well, back in the day, low-dose radiation was used for pneumonia. This was before antibiotics. And what that radiation does is it reduces inflammation. And remember, we've talked about this cytokine storm, this problem that your immune system just overwhelms your body, leading to lots of inflammatory changes. And so the thought is low-dose radiation may calm that inflammation down and may actually help with people that have severe pneumonia. Right now, we don't have a lot of options other than plasma therapy, people on ventilators. It needs to be studied.
Yeah, looking at all possibilities here. I want to get back to the discussion that we had regarding young children and the virus. This initially started with a report out of the UK regarding a rare condition called Kawasaki disease. Now, I know a US doctor saying that one of his patients may have a possible infection, a young child, 6 months old, of this rare inflammatory condition called Kawasaki. What more do we know? What are doctors dealing with?
Well, if you look at the history and how Kawasaki comes about, it is common in epidemics. And so what do we have right now? We have the big time epidemic of epidemics. And so it's not strikingly unusual to see things like this. Now, by the grace of God Almighty, kids have been, for the most part, spared a lot of the ravages of this virus. But it doesn't mean that they can't get it. And if they get it, it can actually lead to an inflammation of the blood vessels. Remember, we've talked about people getting strokes and having inflammation, even heart attacks. This virus damages the lining of vessels. And so it's not a real stretch to think that Kawasaki disease, which is due to an inflammation of blood vessels, could be caused by this. The good news is most of the time it is self-limited and there are some treatments available.
Yeah, it is important to point out young people, not children, but young people with coronavirus are having those blood clots leading to strokes and heart attacks. I want to get to a couple of online questions here. And the first one being, can coronavirus travel by wind? Is it safe to go for a walk or exercise outside if someone jogs or bikes past me?
So, Thomas, if you are in close quarters, for instance, the NBA has announced that they're going to open up their practice facilities a little bit. I love you, Thomas, but I'm not sure I'm going to want to play a sport with you like basketball if we're not wearing masks. Because if you have the virus and you're exhaling and breathing heavily like you do, then you can spread it. So if you're out jogging and you're with a bunch of people jogging, yes, it is possible. Now, say we tell everybody you have to wear a mask. Well, I really worry about people wearing masks, especially well-fitted masks like N95s that limit transfer of air, you could get into big trouble, especially if you have asthma or some other medical conditions, if you try to go jogging with a mask on. So we have to be very careful with that. I'm all about exercise. If you want to jog, stay away from everyone. You should be fine. Don't wear a mask, but don't get close.
But you're concerned it could restrict your airflow.
If you have asthma or you are going for a jog, I would not wear a mask. You need to socially distance yourself from everyone, and you should be okay. I'd rather see you do that.
Yeah, I want to keep that in mind. Another question, are some blood types able to fight this coronavirus better than other blood types?
Well, according to some limited data from China, if you have type A, blood type A, it may, and I put a big capital M there, may increase your risk of getting COVID-19 and having complications. But this is very limited data. I wouldn't worry about it. Some folks have found that type O blood reduces your risk. But if you have blood, I would worry about COVID-19. I don't care what type right now.
If I test positive, how soon can I start associating with my loved ones, Dr. Mike?
Well, you need to realize that for you to get symptoms, you can go anywhere from 4 days up to 14 days before you have symptoms. So then you get symptoms, say 14 days after you contracted the virus. Well, you come to Dr. Mike. I test you and you're positive. Well, your loved ones probably were with you for the prior 2 weeks, right? So what we need to assume is that if you were living with them, they probably were exposed. Now, if you were isolated and you were then found to have the virus, we tell people for the most part to self-quarantine for 14 days. And then, Thomas, if you have no symptoms, no cough, no fever, then after 3 to 7 days, I'll let you go back to where you need to be. But if you are immunocompromised, if you are a healthcare provider dealing with cancer patients that are immunosuppressed, that time may be longer, and we may want to test you to make sure that that is a negative test, a PCR test, a molecular test, and have no symptoms. So
I want to follow up on that real quick here, because if one person in the household tests positive and they show symptoms, we assume everyone around that person is asymptomatic. Would everyone eventually be tested for antibodies?
Well, antibody tests, maybe. And that would be a good thing to do down the road when we have accurate tests and we have enough of them. Again, for epidemiologic reasons, and if you wanted to donate plasma. Okay. But for the most part, we assume that if you're in a house with someone that has it, everyone has been exposed.
All right. Dr. Mike, our daily reminder to stay safe.
We're going to get through this, Thomas, and the light at the end of the tunnel, at least in my mind, gets a little brighter every day. I'm concerned about the lack of social distancing and letting our guard down in a second wave. But I think as each day passes, we're getting closer to an effective treatment and a vaccine that works. And then we will move on with our lives.
That we're waiting on. Dr. Mike Sirigliano with Penn Medicine helping us to navigate through all of this. Always good to see you, my friend. Stay well.
You as well, Thomas.
We continue to bring you the very latest right here on coronavirusnow.com. Thank you so much for joining us. We'll be right back with you in just a little bit. We always appreciate you joining us here with these updates that we can provide to you as they're happening. Welcome back, everyone, here to News Now. I'm your host, Mike Page, as we continue to navigate all of the content that we are getting provided from our sister stations across the country on this COVID-19 pandemic. Thank you so much for joining us here, as we always try to bring you the very latest as it's happening. Let's get you an update there from our Fox affiliate, Fox 32 in Chicago. And that'll help. If I can get this, let me see what the shot is. There it is.
Grim
Thank you.
milestone. The country now accounting for a third of COVID-19 cases worldwide as some states begin a slow return to normalcy this week. Good day, Chicago. It is Wednesday, April 29th. I'm Sylvia Perez, and welcome to our 9 o'clock hour. There have now been more than 1 million confirmed cases of coronavirus in the U.S. It is a troubling reminder of just how quickly this virus has spread, given the first known COVID-19 death in the U.S. was only 3 months ago. And here in Illinois, the state has hit a tragic landmark of its own.
I'm Michelle Fiore in downtown Chicago. Another 144 people dead from coronavirus in Illinois. Why health officials say you shouldn't let those numbers startle you. We'll explain next.
I'm Joni Lum. Some of your favorite restaurants might not be around after all this is over, but there is a big effort to save them. That's coming up.
I'm Terrence Lee at a local high school that is stepping up in a big way to help the community. We'll talk about some of the ways they are reaching out to those in need.
Plus, with the state just days away from its public face mask requirement, how do you make sure yours is effective? I'll be speaking with a scientist about the ins and outs of proper mask wearing and what to do with it once you get home. We're going to get to all of that for you throughout the hour, but first, let's get a check on today's headlines for you. Here's where we are this morning. The state of Illinois reporting more than 2,200 new cases of COVID-19, along with 144 new deaths. As a whole, the U.S. has now recorded more than 1 million cases since the start of this pandemic and more than 58,000 deaths. That is more than the number of U.S. troops killed during the Vietnam War. The president has used the Defense Production Act to keep meat processing plants open. Tyson, JBS, and Smithfield Foods had closed facilities due to outbreaks and warned of disruptions to the food supply chain. In the meantime, the country's biggest owner of malls will begin opening next month. Simon Properties will begin returning 49 malls to operation. That includes a large group of malls it owns in Indiana beginning on May 2nd. Well, that triple-digit death in Illinois marks a tragic record for our state. It is the highest number of single-day fatalities since this outbreak began. Michelle Fiore is live now with what officials are saying about this. Michelle?
Good morning, Sylvia. It may be difficult to do, but health officials say don't let that daily tally startle you. You have to look at the bigger picture, namely exactly how many tests have been given for that day and balance it with how many new cases are out there. Now, we did see 144 lives lost in Illinois between Monday and Tuesday. 72-year-old Verna Jackson and her son, 40-year-old Courtney Benton, are both coronavirus victims. The same family hit hard this month. The latest 24-hour report added 2,219 more confirmed cases. That brings the state's total to 48,102. Among the latest numbers, 80% of patients are from northern Illinois, 44% white, 28% black, 13% Hispanic, and 8% Asian. And while people are saying that they just don't know while people are saying that their mental health has been suffering from this, we do know that state health officials can offer support.
I know this virus is causing devastating economic consequences, just as it has caused tens of thousands to become ill and thousands to die. For 2 months, not a second has gone by where the economic impact on our working families and our small businesses hasn't been an important and paramount consideration of my decision-making.
Again, Illinois is testing about 10,000 people every day now. That number is expected to rise to 20,000 test kits a day next month. Reporting live downtown, I'm Michelle Fiore. Back to you, Sylvia.
Okay, thanks so much, Michelle. More than a dozen workers at a Tootsie Roll factory in Chicago have come down with coronavirus. The Southwest Side facility has confirmed 18 cases so far. Tootsie Roll says it is increasing social distancing and requiring anyone who came in contact with the infected employees to self-quarantine. Well, one of the hardest hit industries in the wake of this coronavirus pandemic has been restaurants. Here in Chicago, some of the most popular have had to temporarily close their doors or pivot their business models altogether. Joni is live now with more on these developments. Joni?
Good morning, Sylvia. It's a long time without any income, and as customers, Chicagoans have done their part in trying to help their favorite restaurants, but the pandemic has claimed some of them. Toast, after 24 years, the owner has decided to close for good, both locations, and she says it's like a death in the family. Restaurants are often family business, and that's why they're trying to find ways to keep it going and take care of their employees. Here in Bucktown, it is the scene for local eateries and bars, all dark now and through May. So some are providing takeout and delivery, but they just don't know how long they can sustain the business that way. Some of the industry giants, the Gibson's Group and 50/50, are conducting a webinar today to share strategy and survival skills.
And I hope that other restaurateurs that are, jumping in, or people in the hospitality industry that are jumping in, that are maybe much smaller businesses, people with 1 or 2 locations, will take some advice from these, from these guys who have been through a lot, and maybe learn a thing or two, or maybe be able to take some of these ideas and implement them in their business.
And the big ones have had to let go of employees. They say that is heartbreaking for them. The restaurant executives are going to be meeting today online. They've invited all sorts of restaurant people to join them, and they're going to make all this available for free for people in their industry. That's how they operate in the restaurant industry. And remember, there's like a second tier of businesses, of vendors and suppliers who are also impacted right now. In Bucktown, I'm Joni Lum. Back to you.
Okay, thank you, Joni. Well, we received the latest reading on the health of the economy just a short time ago, and we have learned that gross domestic product in the U.S. plunged 4.8% in the first quarter. Now, this is the first negative GDP report since the financial crisis and was dragged down because of weak consumer spending. Now, it's important to note here that the reading only takes into account a couple of weeks of most of the state's stay-at-home orders. The Commerce Department is expecting future readings, though, to be even worse. Vice President Mike Pence is facing some backlash for what he didn't do during a visit to the Mayo Clinic. Pence toured the clinic yesterday to thank healthcare workers, but never put on a face mask, even though everyone around him was wearing one, and even though it is hospital policy. The VP saying he didn't put one on because he is regularly tested for the virus. The governor of Florida will be announcing plans today to reopen his state. Governor Ron DeSantis met with President Trump at the White House yesterday. He says the reopening will be done in a, quote, thoughtful and measured way. The discussion came the same day that 83 more people died in Florida. That is the state's largest one-day death toll so far. In the meantime, California's governor says he wants children back in the classroom by July. Gavin Newsom says he's hoping to start the next school year early to make up for all the lost time due to coronavirus closures. He says opening in July would help close learning gaps and get parents back to work full-time. The city of Chicago has set up a new grant program to help micro business in low and moderate income neighborhoods. 1,000 businesses will get grants of $5,000. To qualify, businesses must have no more than 4 employees and revenue of less than $250,000 annually. The grant program is being funded with support from foundations and One Chicago Fund. Let's take a break now and get a look at our forecast. It is raining outside, and the question is, how long is this going to last, Caitlin?
Until Friday.
Karen
Aurora to DeKalb to Chicago. Now, with the heavy rain, we even had the heavy rain yesterday, we are watching a concerning area for flooding. That's going to be north of the city, where 1 to 2 inches has already fallen. Keep in mind, we could see an additional 1 to 2 inches of rain before dry skies return. So this flood watch is in effect until Thursday at midnight. So visibility, of course, is going to be limited too. We do have fog close to ground, and with that rain coming down, it's going to be hard to see in locations like Aurora, down to 2 miles, 2.5 there in Waukegan, 2 miles in Valparaiso. Once this rain moves out, we're going to have very strong gusty winds tomorrow, and then our concern is going to be shifting to lakeshore flood warnings, which I will show you in a few moments with our next
right to your doorstep.
I see how serious it is now. I definitely do.
Very serious. So you don't watch the news like most people, adults, right?
Most of us young people, we really don't watch the news, because it's a lot of killing, talking about, people of color, getting killed. That's basically every time you turn on TV.
If you knew that we should not have social gatherings anymore, would you have thrown a party?
I wouldn't have thrown it.
There it is, an apology from the guy who threw that big bash on Chicago's West Side over the weekend. It made headlines across the country and made some people here really angry, but he is now apologizing, as you see, and he promises to work with State Representative LaShawn Ford to get out the word to our young people.
Our farmers and small businesses. Many farms, farmers farm part-time. They have a small business on the side. Many rely on a second income. So one of their spouse may work somewhere. And as you can imagine, we've got some serious problems when no income is coming in. So pork plants are being shut down. So commodity prices are crashing. And we know we've witnessed what's happened to the oil prices. So yeah, there's a terrible problem.
The 109th District happens to have among the lowest hospital bed availability and ventilators in the state. The district is also home to the county experiencing Illinois' highest death rate per capita from COVID-19.
Governor Pritzker responding with frustration after downstate Representative Darren Bailey won temporary restraining orders that applies only to him against the governor's stay-at-home mandate. Another Illinois lawmaker has now joined in to challenge this order. Representative John Cabello, who represents the 68th District, has filed a lawsuit in Winnebago County. So what does this all mean for the state's stay-at-home mandate? Joining us via Skype is our legal analyst, Karen Conti. Karen, thanks for joining us this morning.
Good morning.
Okay, we're going to apologize first because there's going to be a long delay for some reason, but we're going to get Karen's answer. So Karen, let's break this down. In Representative Bailey's case, the judge ruled in his favor. Now, this only applies to him, as we all know, but here is his argument. He says that the governor's extensions of the stay-at-home order are illegal, overreaching, and he quotes the Illinois Emergency Management Act, saying the governor's powers are restricted to 30 days from the day he declared a disaster, which was March 9th, and today, here we are, April 29th. Does he have a legitimate argument here?
I don't think he does, and he's right in that there is a law in place about these types of things, but that law really deals with the issue of quarantine, and this is a different situation. This is a pandemic, and the governor certainly within his police power, which is granted by the Constitution, he has a right and a duty to protect the citizens of Illinois and can do so as he sees fit, as long as it's narrowly tailored not to harm the people and to inflict on their constitutional rights. And this idea that it just applies to him really doesn't go very far unless everyone starts filing lawsuits like this.
Okay.
And there's nothing to say that this has any precedential value either to other courts.
Okay, so here's some interesting background to note, I think. So Darren Bailey, that downstate rep, he comes from a small rural town of fewer than 400 people. In his county, for example, of 13,000 people, there are only 2 reported cases of COVID-19. So he says that's why counties and not the governor should have control. Now, even though the judge's decision was only applicable to him, what do you think this is going to mean for the rest of the state? Because I think he is riding this wave of this, what they're calling corona fatigue. What do you think the fallout's going to be?
I think the fallout is that we're going to have other lawsuits in other counties where people are going to try to get the judges on board with this particular ruling. This issue might end up in the Supreme Court of the Illinois Supreme Court, because if there's conflicting jurisdictions having different rules and different injunctions or denials of injunctions, there may be a higher court that has to decide this. And listen, there's no walls between counties, and nor are there walls between states. So, my belief is that the governor has really strong powers here to do what he believes is right, and that ultimately the courts are going to side with him.
Okay, let's talk about the governor's power, because the Illinois Attorney General is appealing this now. So what are the grounds he's appealing on, and how quickly do you think this will happen? Because supposedly our stay-at-home order is until the end of May.
Right. And this injunction is going to block that order on Friday. So I think the courts are going to move very quickly on this, probably in the next couple of days. And I think the state has huge power here. The police power means, a governor can say we need seatbelts. A legislature can say we need polio vaccines. These are things that are granted by the federal government to the states to keep the states safe. And yesterday, I think we had the peak of all reported illnesses in Illinois. So we're not done yet. We're not there yet. And I believe that the governor has power to do this, and that the courts are going to uphold him.
But what is the governor's power to keep people at home compared to, how does this collide with our own civil rights as individuals?
In the law, we always have these collisions of rights, right? We have the right of the people to go to work and to eat at restaurants and to go in parks. Yes, there's a constitutional right. But what trumps that right? Is it that people are going to die if you allow this to happen? So the police power, and where the civil rights, that line gets drawn, there is no bright line. There is no line where you can say this is right and this is wrong. It just has to be narrowly focused on doing what it needs to do to keep people safe. And that's about the best analysis I can give you.
Okay, well, one more question for you. So on Monday, William Barr issued a memo ordering all U.S. attorneys to be on the lookout for any state or local restrictions on civil liberties. We are at such an interesting stage of our lives right now when it comes to our basic rights. We are being recorded with our cell phones to watch our movement, to track this virus. The government's telling us when we can leave our homes and that we have to wear masks. Are we at a turning point where we're going to be beginning to see more government control under the parameters of public safety? And where is this going to lead?
I think that's a real legitimate concern, because the government is giving us money here. The government is handing things out and people are taking them. And at the same time, the government is telling us we can't exercise our civil rights. So this is a very dangerous time. And this is why our Constitution and why our courts are really important here, to uphold what only needs to be done to keep people safe, and nothing more and nothing less. And so again, it's hard to predict exactly where this is going to go. But my belief, having seen precedent in the past, is you have to keep people safe, and that you're going to have to give up a little bit of freedom to have safety.
Okay, Karen Conti, our legal analyst, thanks so much for breaking this down with us, and more lawsuits to come, I'm sure. So we'll be talking to you in the future. Thanks for joining us. Coming up, it is the local restaurant group working.
All right, folks, what we are going to do now is keep you in Chicago, but this is a live update from the mayor there, Lori Lightfoot.
Voices out there. But what this shows, as I said, is people who are part of this ecosystem recognizing the interconnectedness that they have with each other and stepping up in a very big way to say, we're all in. We're going to do what we can to support our customers, our borrowers, our renters, our mortgagees in a time of great need in our city. And I feel like this is something that is a very proud moment for us in the city.
On to other topics.
Sure.
Another lawsuit filed today against Governor Pritzker. This one is a class action saying that it's time to reopen Illinois. There will be a rally at the Thompson Center as well on Friday. What's your take on that?
Well, look, I'll say this. I don't think that these lawsuits will ultimately win the day. And this is clearly headed to the Illinois Supreme Court. I support and have supported all along the efforts that the governor has taken to make sure that residents all across the state are safe. And the notion that we are going to open up before the data and the science tell us that we're ready is really foolish, and we would be putting lives at risk to do so. I'm very mindful mindful of what's happening in other states that haven't taken the steps that we have taken here in Illinois. And what are we seeing? We're seeing a doubling of cases at an unbelievable rate, even 6 weeks in to this crisis. So I feel very comfortable about the steps that have been taken here. As far as Chicago, we are staying the course.
But Craig Dellamore raises the question, we've seen the in-house parties, the warmer weather, it's going to be a nice weekend. Could the sentiment really bloom because of that and people defiant against this order?
Well, I think that what these incidents, and I don't want to have public policy dictated by TMZ videos, right? What I know is
it's a real video.
It's a real video, but what I also know is that the vast majority of people in the city are doing what they need to do. They're staying at home and they're being compliant. Yes, have we seen some instances where that hasn't been so? And I will tell you, while these TMZ videos, and of course that's what TMZ does, it's a tabloid, they like to sensationalize things. There have been challenges in other parts of the city that haven't gotten the national or maybe international prominence that these videos have. But what it tells us is it gives us an opportunity to go deeper into certain sectors of the community, whether it's the millennial and the millennial African American community in particular, but there's also other communities where we got to keep doing the education, educating people into compliance, and if necessary, taking decisive action to set the clear tone that we have to comply. It's not a hope and a maybe, it's a have to, because we know that that is the only way that we're going to slow the spread, as we have, of this virus, but continue to get on the other side of it, and we're not there yet. If we just throw it all up for grabs, then God help us.
Tia Ewing from Fox TV is asking, what is the protocol for tracking down non-essential businesses? She found a nail salon operating in Logan Square. The customers weren't wearing any PPE, and with so many complaints coming in, how can these businesses be held accountable?
Well, number one, if you see that, call 311 and report it. Our Business Affairs and Consumer Protection Department is very diligent. We've been following up on all along on a number of complaints. We send people out there. If we verify the complaint, we give them a citation, and if necessary, we will shut them down.
Back to the party, it is quite a question. Another reporter is asking, Jennifer Struzik also from Fox, what about the wedding that took place on the street in front of a residence? Should large gatherings not be treated the same?
They should be treated exactly the same, and we are making sure that we identify who's responsible, and we will be taking the same kind of decisive action against that large wedding where the video shows people in cars, but people on the street, not social distancing, not wearing appropriate mask or garb. We can't tolerate it anywhere. It's not just the black millennials. It's a problem wherever it rears its head. We're going to move decisively to, again, help educate, but where necessary, take action to give citations to the people who are responsible.
Dana Kozlov from WBBM is asking, the Chicago Fire Department is going to start at shift change COVID testing at random firehouses. Should this have been done sooner, along with requiring firefighters to wear masks in rigs and at the firehouse?
All of that's been done and been in place for quite some time.
The testing at the firehouse, have they been testing?
I believe so. I'll double check that, but there's been testing of first responders from the very beginning of this, because we have been concerned, obviously, about the folks that are on the front lines and making sure that they're safe. Dr. Artie is standing up and saying, I want to answer that question, so come on up to the podium, Doctor.
She actually had asked if Dr. Arwady had not seen her here, so thank you. We always like to see you, Dr.
Just to clarify, so certainly first responders have been prioritized for testing, have been able to get testing, but yeah, well, that's what I was going to say. So we've now started to be able to really have some more specific testing and investigation in conjunction with the Chicago Fire Department to really make sure that we're bringing testing wherever it is needed. That is always our goal, and recognizing that firehouses themselves could be perceived perceived as congregate settings. If you recognize that there are people who are sleeping there, who are spending time there, and so we've been working closely with the Chicago Fire Department and are doing everything we can to make sure that we bring even better testing access to our first responders. They're high on our list as we're continuing to build access to testing across the city.
Do you see that envisioned at police stations as well then for those employees, or no?
So we're prioritizing always getting additional testing and really to our first responders. They've been high on our list. Obviously, lots of PPE distribution, lots of work really in partnership with those organizations, and particularly as more testing, rapid testing has started to become available, we're really working to prioritize and make sure that our first responders, just like our healthcare workers, are able to better access that.
Thank you. From Fran Spielman from the Chicago Sun-Times, Police Superintendent David Brown has apologized for failing to give aldermen advance warning that police officers in their districts would be temporarily moved to the south and west sides for a so-called surge strategy to tamp down crime. What lesson should he have learned from this experience? What should he do differently going forward? And why do we need a surge strategy that takes police officers from one neighborhood and moves them to another?
As always, Fran asked about 5 questions in one, but I'll try to tackle them as best I can. Well, first of all, look, the superintendent, in my conversations with him, both during the interview process and even before he was officially confirmed by the city council, understood the sense of urgency that we have. I've said this before. We are fighting not only the pandemic of COVID-19, but we're fighting the continuing epidemic of gun violence. We have no time to waste on either. So in working with his executive leadership team and recognizing that we are in an unusual time where while first responders are out there and they're on the front line, they're human. They're concerned about their own well-being, they're concerned about their safety, and they're concerned about what that means for their families. That's one of the reasons why early on in this process we stood up a hotel just for first responders, not those that were sick, but for those who were working those long shifts, wanted to have respite, but worrying about taking something back to their families. So in an effort to continue to move forward on public safety, recognizing the risk attendant to physical contact, officer to resident, the department has conceived the surge strategy, which really effectively is bringing in lots of marked cars into areas that are really suffering from gun violence, in conjunction with stakeholders in the community, and being present with lights, with sirens. And I'm going to knock on wood before I even say it, we're starting to see some promising results. Now, of course, this can't be a circumstance where we drain resources from those districts that have been under-resourced for way too long. And I think the superintendent now understands that. We've had very productive and candid conversations with the aldermen. This isn't a permanent taking of the resources from those departments, from those districts. It was spend a couple hours doing these fixed posts and boxes in these neighborhoods. That's what it's about. And we're moving around different days. We did some on the north side, we did some on the west side, doing some on the south side. But this strategy is a way to engage our law enforcement resources at a time when policing in the way that we traditionally do it is challenging because of the risk of COVID-19.
Fran also wants to know, her question, as a diehard Sox fan, she means you, of course.
Yes.
How do you feel about the latest MLB plan to start the season in June in empty home stadiums and have the Cubs and Sox in the same division to cut down on travel?
Well, look, I have been following closely the news coming, one, because I'm a ridiculous sports fan, but I've been following very closely the news that's been coming out of the various league offices, whether it's the NBA, MLB, NHL, and so forth. There is a desire to get the teams back on the field, but recognizing that doing it in the current environment that we're in carries risk. And so we'll be having and continue discussions with them about a way to do this safely, to minimize on travel. Look, there's a great reluctance to and get on a plane, and I understand that. Our airline industry has just been devastated as a result of people's concerns about travel, but also because of travel restrictions that have been put in place by cities and states and all across the country. So giving people an opportunity to see baseball in Chicago, I think is a good thing, but we got to do it in a way that is safe, not only for the fans, but think about all the employees that are going to be needed, even if we don't have vendors and concessions. There's still a lot of employees that are going to be there in the ballparks. And of course, if we do that, then you have to think about what's the ripple effect on the surrounding businesses that are, their livelihood is around these sports venues. So there's a lot of thinking that we have to do before we get to, you know, the first pitch that's going to come out. But I think we can do it in a way that is safe, but we've got to
collaborate. It doesn't sound 50-50 though to you. I mean to me right now from you for this summer.
I think it's going to be a challenge. I said this the other day. It's hard for me to conceive of a world now where we go back to full stadiums with fans.
But just even empty stadiums.
But empty is a possibility with public health guidance and precautions to keep people safe, including the players. You know, baseball's not a contact sport like football, but you know, you when you're running the bases and you're running hard, there's contact that's going to happen. And you sit in the dugouts, there's contact, and social distancing will be challenging. So we just got to be thoughtful about the way in which it's done, and it can't be done independently. It's got to be done in collaboration with the local jurisdictions to make sure that we're adhering to the data that is on the ground in localities. What we're experiencing in Chicago may be different in LA or Seattle or Baltimore or New York or Atlanta and some of the other venues across the country. So we just got to make sure that we're talking to each other.
Have you perhaps Dearborn, Clark Street, whatever it might be, with Lakeshore Drive closed, Michigan Avenue is certainly busy on nice days to have folks just be able to walk in the middle of the street or ride their bikes?
You know, that's something that's come up a number of times, and we are looking at what the actual experience is of other cities. So we haven't ruled it out, but we also haven't ruled it in. We just want to understand what the impacts are going to be on travel.
And the latest on Lollapalooza?
No update yet, but I expect that we'll have an update shortly.
And does that mean this week? Do you think we would hear? I would think folks would want it. It's getting pretty late.
Yeah, again, we're in conversation with the organizers of Lolla, and as soon as we arrive at a definitive decision, we'll certainly let people know.
Thank you, Mayor, very much. Appreciate it.
A couple of quick questions, Mayor, from Mitch Dudek at the Sun-Times. People who make their livelihoods by offering Lake Michigan charter boat rides are hurting and await the day they can reopen with social distancing guidelines in place. What guidance can you offer those folks and other boaters when Chicago's harbors will open? May? June?
Well, I don't want to speculate, but I've been very clear. For now, the status quo remains. We are working through some of the nuances that flow from some of the loosening of restrictions that the governor indicated will be in effect as of May 1, and we'll be putting those out publicly very, very soon. And I recognize I've heard from a number of boaters who are anxious about whether or not they should move their boats from Wisconsin and bring them down to Lake Michigan. But for now, we're going to maintain the status quo.
From Lisa Donovan at the Chicago Tribune. Mayor, yesterday President Trump suggested that if state governments want federal COVID-19 relief funding, that in his words, and I quote, "We'd want certain things in place, also including sanctuary city adjustments, because what's happening is people are being protected that shouldn't be protected, and a lot of bad things are happening with sanctuary cities," end quote. Considering Chicago's a sanctuary city, what kinds of concerns do you have about being used as a bargaining chip? Do you think it would affect how federal funding relief comes to the state and down to the city?
Well, we're a sanctuary city, and proudly so. And we're never going to retreat from our commitment to support the life and safety of immigrant and refugee communities here. You know, look, the president has said a lot of things over his 3 years. plus as the president. And unfortunately, many of the things he says are divisive in nature. And over the course of this pandemic, unfortunately, we've heard him really pander to his base. He's not stopped campaigning, and that's evident and on display every single day when he holds a briefing. So I'm not surprised that he would say that, but I have some confidence in Congress that they are not going to condition whether or not cities, localities receive assistance on the basis of whether or not we pledge allegiance to a racist and xenophobic ideology that the president articulates on a regular basis. We are not going to divide and conquer and barter with the livelihood and lives of our immigrant and refugee residents. They are precious to us. They are part of our
All right, for the better part of 20 minutes, we were listening to this update in Chicago. Let's keep our coverage going here on coronavirusnow.com and, of course, right here on Fox 10 Extra. For just a little bit, we will showcase the governor of Ohio speaking now.
As a retail business has to make sure its employees are safe and feel safe and they can recruit people to come in as the same way with customers. So they have an economic incentive, good business practice to do this, as well as the mandates that we have set down.
This is Jackie Borchert from the Cincinnati Enquirer. My question is for Dr. Acton. Dr. Acton, it's been a while since you talked about serological testing, and given that since then we've seen some studies out of New York and California, kind of trying to nail down the prevalence of the disease. I'm wondering how widespread is serological testing in Ohio today, and is the state collecting that data or conducting its own prevalence study?
Yes, thank you for asking. So again, the science of serologic testing is evolving, but I can tell you, I was on the phone call last night. We have our work group on testing overall that's led by past governors Taft and Celeste, and just some of the most, it was one of these conversations, I wish everyone could hear them because they were just so thoughtful. Some of the best researchers talking about this. We do have some innovative research going on right here in the state to get that good serologic testing, but it's still an evolving science. And I won't go into all the nuances. Someday I'll do a little 101 on serologic testing. But we're still trying to get, and the Lieutenant Governor has been fighting hard to get us those 1,000 tests from Celix. That will allow us to do that. But we're very much hoping, we've had the science, we have the study set, and we're hoping to begin our prevalence study this Monday. It'll be the first of many studies on prevalence here in Ohio, and we're very excited about that. You've maybe seen the results from some of the first studies done in New York City. Fascinating results, and we're going to do that very same work here in Ohio. And that will be ongoing. We'll do larger and larger sample sizes over time. But I feel very good about that. And once you start it, it takes about 2 to 3 weeks to do the study and get the results. We also have a very fascinating survey underway, piggybacking off of an already existing Medicaid survey that's out in the community, so we can learn more about people's symptoms and risk factors. So we're doing some innovative studies, the like of which we've never had the opportunity to do, in partnership with amazing universities here in Ohio, as well as Battelle. I do want to take one moment to just add to what the governor and lieutenant governor said. I have felt all along that, and I think we really have to avoid this going forward, that there are these sort of false narratives out there that pit things like business is doing well in the economy versus health. And, in a complex world, people are always saying what's bad about this time. I think one of the things that are going to be great about this time that we have learned, I hope as a lesson, is that the world can be very complex and nuanced, and that we shouldn't get caught in zero-sum games. We as a team are constantly fighting to find the win-win solutions. And I think we should really hold ourselves to that and aim higher. We've been aggressive on the way in. We're being aggressive going forward. We are not accepting that people have to die to have a good economy or this or that. We are really trying to maximize our well-being. And if you think about this, we, 11.7 million Ohioans, are the business owners, and we're the customers, and we're the workers, and we're the nursing home people. We're in the nursing home, and we're the workers there, and we're in the prison, and we're the workers there. We cannot accept leaving anyone behind. These are not, we don't have to have a zero-sum game. Let us innovate so we all win together. Thank you.
Good afternoon, Ben Schwartz with WCPO. Governor DeWine, we've been hearing from a lot of people who say that ever since word got out about things beginning to start to open back up, they've immediately started seeing people completely ignoring social distancing guidelines. I want to know if you have a recommendation for what Ohioans who are taking social distancing seriously, what they can do if they see something like that.
Well, Ben, that's a real good question, and I referenced that the other day when I looked at all the newspaper headlines around the state, and it was talking about opening up and announcements. And my concern was that people wouldn't read the fine print or wouldn't read the story, but would look at the headline and see things are opening up, and they are opening up. We're trying to get this economy moving forward, but at the same time, we have to be just exceedingly careful. The virus is still very much out there. It's not gone away. It's not going to go away for a while. We're going to do some very innovative things with testing and tracing to go after it and basically stop it from going from one person to the other. But the way it travels is still the same. It goes, when we have people grouping together, one can spread it to the other. And I guess the thing I would ask our fellow citizens to remember is, even if you're not sick, even if you don't feel bad, you could be carrying it. There's a lot about this virus we don't know, and we continue to learn. And as Dr. Acton tells me, certain things we don't know, but it would appear that you can have this, and that there are a significant number of people that could be having it, and they never know it. And so they go out and they intermix with a bunch of other people, and they could be spreading it to, a bunch of people. So we've got to have the discipline as we start back and get jobs opening up, which is what everybody wants. At the same time, we can't be foolish. At the same time, we can't lose our discipline about the social distancing, and we've got to be careful. There's a reason that we did not really change the stay-at-home order. There's a reason that we did not change the number of people that could gather together. It's 10 people. We kept those, and that was a signal, we hope, to people across the state of Ohio that they have to continue to be careful. Dr. Acton, anything on that?
No, I think a good way to think about this is an ever-expanding essentialness to our lives. Like, we are trying to expand out and regain the things that make our lives whole and increase our productivity and keep things maximally going. And so by going in this very measured way in partnership with all sectors, we're going to keep finding those sweet spots. And it is a sweet spot, I said, this razor's edge of maximizing all the things that we can do. And so I think for those of us, to keep living our lives in this healthier at home, that we still really want to decrease our spread and be conscious of the fact that we can't spread this with each other. It takes a person to spread it to another person. And we're going to try to do more and more things, but still honoring the fact that that is true. And it does take perseverance. It takes a certain amount of patience. But if we do it well, we'll get there faster and we'll do it better, and we'll save more people in the process. So I really think there is a sweet spot. Everyone in the world is trying to find it. I'm very amazed at what Ohio is doing. I think we could be leaders in finding it. So thank you.
I will add something to that because every day I get calls, when's this going to be over? And I keep reminding folks, it's going to be over when we defeat it, which means isolating it and not spreading it, because that's the only way you kill it. And the more we socially, the more we comply, the more we socially distance, the more we wear masks, the more we wash our hands, the more that we do this, the faster we get through it. And we get to move on to the next phases of recovery. And so I just ask, I come from a team sports background. It is a team game. It literally is. Everybody has to do their role for the team to win. And I think what win means is getting this behind us and moving on. And so the more we do this, the faster we get through it.
Marty Schladen, Ohio Capital Journal. Governor DeWine, I have a question for you. We're talking about reopening workplaces on a day when deaths are going up. And as you do so, have you given much thought to low-income workers, particularly service workers who might be elderly, might have compromised health, might have kids at home, who are faced with the choice between going back to work or staying home and losing their workman's compensation benefits? Is there any consideration to creating some way for people to get waivers?
Well, I've thought about them a lot. That is a great concern, that someone who is, because of their age, because of their health situation, is certainly very, very much at risk. I don't have a great solution. I do know I had a conversation with my friend John and my mutual friend Albert Ratner in Cleveland, and I also talked to others in Cleveland about this, and in other communities about foundations and others coming together to try to figure out the people who are most at risk, who have to work or feel they have to work, figuring out how we can help them. So I don't have the answer today, but it weighs very heavily on me, because there are people who should not be taking that risk, but they feel that they have to, and I fully understand that because of their economic situation, because they're the family who earns the money. They have to work to bring that in. So I don't have a good answer today, but it's certainly something that we think a lot about, and it concerns me a lot.
Hi, this is Danny Eldridge with Hannah News Service. My question is for the governor. Can you talk about what kind of liability businesses may have if they don't require customers to wear masks, and if their employees get sick?
I'm not going to play lawyer today, so I don't have a comment about that. That would be people should obviously talk to their own lawyer about that. This would be an area, I would suspect, an area of the law that is not really defined. And my guess is, I don't know this, but my guess is there aren't too many court cases directly on point about that. So again, under our order, any business has the right to require anybody walking in that store to have a facial covering. We just did not mandate that they had to do that, but they have the right to do that, and they can do that if they wish to do that.
Would you say it's good advice to mandate those if you want to avoid lawsuits?
Well, I don't know about the legal side of it. I would be talking about something that I've not studied or not looked up or not been advised about. We know from a health point of view that having people wear masks coming in, a facial covering is the best thing. Again, I'm the eternal optimist, as my wife will tell you, and I'm hoping that as we continue to move through this, that people will understand that it is, unless they have a physical reason for not wearing one, and some people do, but if they don't have a physical reason, that putting on a facial covering, something like this, it doesn't have to be as pretty as this, or my wife Fran made this, but just putting something so you're covering your mouth and your nose is a protection for everybody that you come in contact with. And I think we're on a journey through this. This is uncharted. None of us ever been here before. But I think as we go through it, and the evidence is clear that when you put this on, you're not so much protecting yourself as you're protecting others. And when everybody does it, you layer on, as Dr. Acton said, another layer of the Swiss cheese, and you cover some holes and you give more protection. So I'm hoping that more and more people will do this. I just came to the conclusion that mandating it in a retail setting was something that Ohioans just weren't ready for the government to tell them to do it. But what I hope is that their own sense of what they should do will tell them to do it. That's what I'm hoping.
Governor, if I could add a little bit to that, because the question is about masks, and understand that there are legal reasons that businesses can't require masks. There are literally in some food settings that having a cloth mask is not allowable. It's not an industry best practice. It's the individual employee has a health reason that they don't want to wear a mask or can't wear a mask, and you really can't ask them directly about that because because of health rules and privacy rules. So there are reasons, there are legal reasons that you can't require a mask, and that's why, as the governor's point, this is not tested. These are best practices. These are things that we're requiring because we know that they will help in the aggregate, but an individual setting is different from business to business.
Hi, Governor. Andy Chow with Ohio Public Radio and Television, State House News Bureau. I want to talk about face masks. You've mentioned that, on Monday after you announced the face mask mandate, that the reversal kind of came because of public input. But what about in the last 24 hours? Have you heard a backlash from people who were in favor of the mask mandate? What do you tell them? And does the input from the anti-mask mandate side weigh more than the people who were for a mask mandate?
You're right, Andy. I've heard from everybody, it seems like, about this. People feel very, very strongly about it, at least the ones I've heard from. This was not an easy decision. We want people to wear, that can, unless there's a reason they can't, we want them to wear the facial covering. And look, in making these decisions, we don't take a poll. We don't see how many people send an email to me. We don't see how many people call me. But, I've lived my whole life in Ohio. I'm in contact with average Ohioans every single day. Now, not in person, but in other ways today. And we have asked Ohioans to do a laundry list of things. And we mandate a bunch of things. And they've done them. By and large, they've done them. But when we got to the government telling an Ohioan, if you're going to walk into a retail establishment, we're going to compel you to put on a facial covering, it was clear to me, and should have been clear to me before I made the mandate, that was just too far, and that there's a significant number of Ohioans who were offended by it, thought this was government overreach. As we go through this, we've gotten this far. We've saved the lives we've saved, not because of what I have mandated or Dr. Acton has mandated, but because of what Ohioans have done. And if we lose that feeling that Ohioans and their willingness to do some tough things and to do some things that they've never done before, none of us have ever done before, if we lose that willingness, then it will be disaster. We will lose many, many more lives. Our business will not come back. So we can't lose that sense of here's what we're all in this together and here's what we've got to do. And so my decision was that was clearly too far. But again, I'm hoping, I'm the optimist, that Ohioans will study this, look at this, and say to themselves, I'm going to the store, I'm going to the grocery store, I'm going to the jewelry store, whatever. It is really not a great inconvenience when I get out of my car to put that facial covering on. And I'm convinced that as we move forward, more and more Ohioans will do that.
Hi, Governor. It's Andrew Welsh-Huggins with the Associated Press. I know we're supposed to hear from the DRC director at some point, and I recognize you talked about that huge shipment of PPE earlier today. But we are hearing a lot of concerns from corrections officers in the state prisons that they themselves don't have enough PPE still, and they're wearing the same mask over and over. What are your concerns about these state employees in this very dangerous congregate setting not having enough equipment themselves, and what do you think might be done about it?
This is difficult circumstances. It certainly is difficult circumstances for a state employee who is working in our prisons today. We're doing everything we can to get PPE into them. I've made it very clear to our team we need to go after the PPE, and that our prisons are a top priority. I've also made it clear to our team that testing is a top priority. The reason that you are seeing numbers out of our prisons that are much, much higher than other places is because we made a decision to go test everybody. And when we've got a hot spot, we move in and we've surged testing in. But the director will be here tomorrow, and I'm going to defer to the director who deals with this on a minute-by-minute basis, and she will be able to fully explain exactly what we're doing in regard to PPE, but not only PPE, all the other things that we're doing in regard to our prisons. So if I could beg off one more day, she's the expert. She'll be in here, and she'll talk about it. She'll be on Skype. She won't be in here, but she'll be on Skype tomorrow.
Thank you.
This is Laura Hancock from Cleveland.com. I have a question about cleaning for Dr. Acton. Lysol, disinfectant wipes, that kind of stuff, it's not really readily available. People have asked me about this. Will soap and water suffice, being that it doesn't kill off as effectively as like all that stuff that Dr. Weir was talking about last week? Surface killing stuff on surfaces. Can you talk a little bit about this, since we have a lack of a lot of these surface cleaning products?
Yes, so I want to advise folks to go to our website, coronavirus.ohio.gov, where we do have cleaning guidance. And there's some other sources that you can go in more detail, especially if you're in a sort of a business or hospital setting. There are different things. There are EPA, cleaning things. Once again, we have to use everything we have at our disposal and fight the war with the tools we have. Soap and water are still a very, very effective thing. Doing it more often. As Dr. Ware said, even when we clean something with one of those excellent cleaners, we're talking about microscopic things we cannot see with our eye. And when I wipe down something, I've probably killed maybe 99% of them, but a few are going to get away. They're going to start to multiply. So it's the frequency of cleaning, and it's the layering of all these things. So the more often I do it, that next swipe I get more of it, and the ones that were starting to multiply. And I'm saying this as a person who has not cleaned her house, being a little busy lately. So I'm just imagining myself at home trying to do this. But it is this like doing our very best with the tools we have as often as possible. And for very specific guidance, please go to coronavirus.ohio.gov. And yes, there are shortages of things everywhere. And that's why we have to keep fighting together.
Good afternoon, Governor. Randy Ludlow with the Columbus Dispatch. The state today raced right past 800 deaths, didn't even stop in the 800s, went over 900. Cases went up more than 500. Our numbers seem to be tracking the wrong way. Yet I hear from people who cannot find masks, who can't locate cleaning supplies, they don't have a sewing machine or aren't handy, can't make their own. I hear from dental hygienists who are terrified. They're going back to work Friday and they don't have the right PPE. What can be done to make PPE more available to the general public?
Well, Randy, anybody who works in a medical situations, for example, in a dentist's office, obviously needs to have the PPE. There are normal supply lines that hospitals, that doctors, that dentists have. Now, the problem has been that these normal supply lines during this pandemic are just all messed up. And we've seen, we've seen kind of the Wild West over in China when people are trying to buy stuff. And you've seen people who are brokers and middlemen who are taking it out and almost putting it up for auction. And I could tell you more horror stories. So it is a problem. We are trying to do absolutely everything that we can. And we announced earlier at this press conference the things that we are doing, and we're not bringing these in and holding on to them. We're holding on to some in case there's a surge somewhere, but we're getting these out just as fast as we can out into the communities. So it is a national problem. It is not unique to Ohio. We have put the best people we can. We are spending the money when we can locate this stuff. We are making some of it in the state of Ohio. So we are very aggressive about it, but you're right, it does, for some people, remain a problem. And it is of big concern to us, and it motivates my team every single day. Every day, when I start my day, I get a report on the status of the PPE and what we have been able to obtain. Now, again, there are other supply lines. Normally, the state is not out purchasing this and distributing it. Usually, whatever group that needs it is doing that themselves. But the supply lines are messed up, and we understand that. And so we're trying to do anything that we can to help. And we're going to continue to do it. It is a top priority.
Governor, can I add one point to that? Under the rules, if you cannot supply the safety equipment and comply with the standards, then you cannot open. So that's a really important part to remember about all of this.
Just add, I'm not the expert on this, Randy, but there's a lot of ways to make facial covering. And a facial covering is obviously not the N95 mask. It's not, it is facial covering is basically, as Dr. Acton has explained, to protect not me, but other people. But I've seen people take all kinds of different things and just literally put it around, and they're covering their nose, they're covering their face. So I know a lot of people are making them and coming up with some great designs, but it's also, I've seen some people do it in a very, very simple way.
Governor, this is Laura Bischoff, Dayton Daily News. I'm the last question. I wanted to ask you about colleges. Urbana University is closing. University of Dayton is furloughing 450 workers and laying off others. How do you expect Ohio colleges and universities are going to weather this pandemic, and what will they look like going forward?
Laura, I don't know. It is of great concern. I wear a tie of one of our great universities every day, or most every day. One of the great assets that we have in Ohio is our universities, our colleges, both private and public. It was already a different time, particularly for the smaller schools, as the demographics have not been in their favor. Going through this pandemic, it creates additional problems. So I'm fully aware of that. that don't have a great answer. But I know that, you know, this is a time when people need to rally around their alma mater, their college, and help them out, because it's a very difficult time. And continuing to speak about colleges, this year's graduation will be different. Tiffin University, as I said, is planning on celebrating with a virtual commencement ceremony online this Saturday, May 2 at 2 p.m. As part of the virtual ceremony, they will be featuring a virtual choir, a recording made by their students singing the song "World on Our Shoulders." The song features the lyric, "I'm here standing with you, here standing with me, standing with the world on our shoulders." The song has a great message, and it's an example of the creativity that can be part and is a part of the graduation ceremonies for the class of 2020. So let's take a listen as we close.
All right, everybody, good afternoon. It is 12:27 almost. We're 3 seconds away here in Phoenix, Arizona. This is how they wrap up their daily news conference in Ohio each and every day. I would like to start by saying hello. I've been here on the set with you for almost 30 minutes since the top of the hour. And I would like to say happy hump day, happy Wednesday. So again, hello. My name is Pilar Arias. Regardless of where you news nowers are across the globe, we are so grateful that you are here, whether you're watching on YouTube or on coronavirusnow.com. Of course, we've got coronavirus updates from across the country. We bring you all the press conferences, but also what we're doing lately is a new partnership with the Fox Multimedia Reporters, bringing you also coronavirus related content in what we call package form, which is stories. And we're also doing live hits with these reporters as well, who are across the country. So it's very exciting times here. We're getting more exposure. We're getting more people on the show. And it's just a joy to be doing this. Me, Mike, and Christy with you all day, 5 days a week. And then guess what? Even 24/7 on coronavirusnow.com. We have a stream with updates as well. But please, if you're watching on coronavirusnow.com, the one reason I would invite you to come on over and watch us on YouTube is the fact that we have a chat. So you can get to know other news nowers across the globe, find out where they're watching from, how they found out about us, what it is that they enjoy about our coverage, and just kind of make a network, a community, so to speak. You know what I'm saying? It's a really fun experience. And yes, us hosts do chat with you as well on YouTube. And we also invite you to join us on other social media platforms as well. So even when we're not streaming, we're not here on the set, because, you know, all three of us take turns, you can stay in touch. That is definitely what we would appreciate. I'm going to take you out to the state of Michigan now, because they have been going for just a little bit. So they might be wrapping up soon, but that's A-okay, because like I said, we've got plenty of updates from across the country. I just wanted to say hello. I hope you all are staying safe, staying healthy. And let me know in the YouTube chat if you live in a state that's already started easing some of these stay-at-home orders and restrictions.
Workers are protected when they do return to their workplaces. Until I started staying safe and staying home, working from my own home, I worked in an office building about 3 blocks from here. And someday I'd like to go back there when the time is right. It's hard getting stuff done at home, but I'm willing to do my part as well as everybody else. But my first office was on the shop floor, and I'll never never stop making sure that working folks have a voice. So I'll share with you some of the same things that I've shared with the governor and with the CEOs on the Michigan Economic Recovery Council. Michigan workers are tough, gritty people who appreciate the dignity that a job provides. They take great pride in producing high-quality products or providing services for the companies who employ them. And they love their companies. And every worker realizes that the hopes, dreams, and aspirations that they have for their families are directly tied to their job. Now, there's a lot of people out there itching to get back to work. But I can tell you this, there's also a lot of workers who are just plain scared. They've been staying home for weeks now to protect themselves and their families, and by now, most people probably know someone who has died from this awful virus. I know more than I care to know. It's many. And all of these workers that I have talked to all over Michigan have told me the same thing. More than being worried about themselves, They're worried that when they do go back to work, they could bring the virus back home to their families and infect them and make them sick. So going back to work isn't going to be like flipping on a light switch. Workers are going to be very apprehensive, and there's going to need to be a whole lot of patience shown on everyone's part as they get comfortable in these new work environments with new work rules and more safety gear to deal with. I think mostly workers just want to know that someone's looking out for them. If they're represented by a union, they trust that their union will do everything it can do to protect them. But the labor movement cares about all workers, and for those who aren't fortunate enough to have union representation yet, they're going to need to know someone has their back too. And fortunately, Michigan workers can feel confident that our governor and her team are making these return to work decisions using the absolute best information available. In a time when it seems clear that national direction and policy is lacking, we should all be grateful for the strong, decisive state leadership we have benefited from through this crisis. And because of that strong leadership and working through the coalition of healthcare and public health experts and labor and business leaders, the labor movement stands committed to working together with all parties to identify guidelines and best practices that put worker safety first, and at the appropriate time and in the safest manner possible, as dictated by science, data, and health experts, we'll get Michigan moving again. And I'd now like to turn it back over to our governor.
Thank you. So, with that, I'm happy to open it up for a few questions from the press.
Governor, earlier this afternoon, your office released communication between your office and the Senate Majority Leaders indicating that you did not agree with their offer of 2 one-week emergency extensions in exchange for the public promise to do the next stay-at-home order legislatively. Why is negotiating stay-at-home orders with the legislature off the table at this point, and where do negotiations stand? Is the state of emergency extension not coming at this point?
So, a couple of observations. First, the Republicans in the legislature want to negotiate opening up sectors of our economy. They're acting as though we are in the midst of a political problem. This is not a political problem that we have. This is a public health crisis. This is a global pandemic. We've already lost over 3,700 Michiganders, more than we lost in Vietnam. I am completely focused on saving lives. I'm not going to engage in political negotiations with anybody. We don't have time for politics and games when people's lives are on the line. I'm going to make decisions not based on negotiation, but based on facts and science and data and risk. That's what the Michigan Economic Recovery Council work is all about. That's what our re-engagement, turning the dial up and going forward with construction next week, and there may be other things to come and to be announced. But the fact of the matter is, we remain in a state of emergency. I don't know of any other legislature in the country that is just deciding to declare that the global pandemic that killed 103 Michiganders since yesterday is over. It is not over. We remain in a state of emergency until the order is rescinded, and I do not have any intention of rescinding that right now.
Governor, I guess with the construction going back into business, why May 7th? Why sign it Friday and then wait 7 days? It seems a bit arbitrary, especially being a Thursday.
It's not arbitrary at all. It's to make sure that the industry has notice so that they can start to get prepared for re-engagement on the 7th. It also gives us enough time between the first wave and when this begins to really make sure that we are watching where COVID-19 is present. We continue to up the number of tests that we are doing, the tracing that we are doing. We do have a few places in Michigan that we are keeping our eye on. On the west side of the state, we have seen numbers increase. We've seen that in a few of our rural counties as well. And so it is not arbitrary at all. It is defined by what we believe is the lowest risk and the right cadence to keep risk down.
Governor, can you hear me?
I can.
It's the mask. So we have CDC data that suggests that there is an increase in the number of deaths that are not or do not appear to be COVID related. Do we really know how many, and this may be for Dr. Khaldun, how many actual COVID related deaths we have compared to non-COVID related deaths, and how many of those why are we seeing an increase in non-COVID related deaths as well?
I'm going to hand that one over to the doctor. Thank you.
So that's a good question. We're actively looking at all of our deaths. We look at all of our death certificates in the department. We are currently looking at how many deaths we're seeing that are related to COVID-19 versus things like heart disease and strokes. And we're actually partnering with some academic folks as well to look at those more closely. But again, it's really too early to really know exactly retrospectively why we're seeing increasing in deaths that are not necessarily related to COVID-19. I'll also add that what we're seeing in hospitals is that even though someone may have COVID-19, they may be dying from a stroke or something else that may be related to it, so we'll have to flush all of that out in the data.
Governor, where are you at on lifting the ban on elective medical and dental procedures, and would you consider lifting it based on regions as outlined by the Economic Recovery Council?
So we've been having a lot of conversation around that. I think part of the importance here is to acknowledge that when people use the phrase elective procedures, it actually is considering a number of different types of procedures. Emergent procedures, time-sensitive and urgent procedures like oncology procedures, time-sensitive but non-urgent procedures like a hip replacement or a knee replacement, and then truly elective, which would be kind of in the cosmetic realm. I'm looking at Dr. Jonay to make sure that I get this right. So. As we are proceeding, we've been having intensive conversations with our public health experts as well as our leadership in our various hospital systems, and I do think that there is going to be something in the coming days on that front.
Now, right now, across the street, the House and Senate are meeting, potentially extending or denying the state of emergency. Will that play any role in rolling out this Safe Start plan? Is there any impact that could come either way with whether they extend it or not?
I don't think if whatever determination they make changes the cadence that we have to proceed with. You know, we are making decisions based on the best science and data, with the counsel of some of our great business leaders as well as our public health leaders as we score risk and plan for protocols to mitigate risk. I think you saw the reaction from a lot of different businesses in the construction industry about how pleased they are with this cadence. I think that people are going to be able to really see that each of these steps depends on the level of risk and the ability to develop protocols to mitigate that risk. We're going to keep moving forward, but we've got to keep measuring every step of the way and listen to scientists and get the facts and make sure that we keep people safe. We don't want a second spike. I know that we maybe don't all see eye to eye on everything here, but I would put a lot of money on the fact that we're probably unanimous and that no one wants to see a second spike where we have to come back and do a stay-home posture. I can tell you I don't want to see that, and I presume that that's the case for everyone.
This is regarding executive orders, that there's either some confusion or some conflict on your authority to issue them and how long they last. Why do you get to decide which statute you're going to follow when it comes to emergencies and executive orders?
It's not for me to decide which statute. I am citing all of the realms of authority that are vested in the executive branch, especially in a crisis. This is a crisis that we haven't seen in 100 years in this country. We've lost 103 more Michiganders since yesterday at this very time. Garland Gilchrist stood here on this stage last week and talked about the fact that he'd lost 15 people in his life. We are nowhere near out of the woods on this. We are flattening the curve. We do have reasons to feel like the work that we've done is paying off. As we re-engage, we have to do so slowly. This is not a political conversation. This is not a political negotiation. This is about the public health. That's precisely what these emergency powers are all about. And so as I use them, we cite all the sources of that power so that people understand this is the very kind of crisis that they are used in. I don't enjoy using all of these levers of this office, but I have to do this to save lives. And that is what centers every decision we've made. I know that it's hard. I know that people are stressed out, that people are feeling squirrely from being at home so much with their family. I know that people are worried about getting a job so that they can pay their bills, or whether or not their small business is going to make it. I have those same fears. And yet, I know we can't make decisions based on feeling and fear. We have to go with the facts and the science. Lives are depending on this. And ultimately, our economic health is depending on us getting this right. And that's why I stand here with experts, so that you know we are doing the hard work. The data is driving this, and our plans to reopen are thoughtful. They will keep workers safe. They will continue to put us in a position where we can keep engaging additional sectors of our economy, and we will get there. We are making progress, but we're not out of the woods yet.
So you've said that workers would not be punished for staying home if they don't feel safe when their job reopens, or businesses would be banned from forcing their workers to come in. So what's the administration's plan for making sure that's the case? Are there going to be any additional executive orders or any additional rules necessary to ensure businesses comply with this?
I know it's kind of natural to ask the punitive question, right? But I think what is really important about the work that we're doing with, that is happening in the MERC, that is happening in the executive office, as we're getting all of the data, we know that employers want to go back to work and stay at work, that they want their employees to be safe, that having confidence of their employees that it is a safe workplace, and of the public that they can go there and be safe as well. All of these inure to our mutual benefit, and that's why I think we've seen such great businesses step up and really inform the kind of protocols that they think are necessary to keep people safe. Whether it is an auto manufacturer who's built in plexiglass separations where we can't have the 6-foot distancing that we are all supposed to be observing, whether it is let's say a landscaping business that knows that where you share instruments, they've got to be sanitized between uses. Our businesses are interested in making this work and making this work so that we don't ever have to think about shutting down again. And that's why we've partnered with them and our labor leaders and our healthcare leaders to make sure that we get this right. It's in everyone's interest to avoid a second wave at all costs. And so if a worker tests positive for COVID-19, the workplace, the employer won't want them showing up, and we don't want them to feel economic pressure to not be honest about their health. And so it is in all of our interests to make sure that we get this right. And I know that our great employers across the state, small businesses and large businesses, are vested in this same outcome that we are.
Your Futures for Frontliners plan, where is this money going to be coming from? Is this part of the projected $1 to $3 billion shortfall that's projected, especially with the unofficial budget deadline looming in a couple months?
These are federal dollars, some of which is the biggest chunk of which is from the Federal CARES Act, and then in the Department of Labor and Economic Opportunity, there's another $30 million, which is geared toward. Wait, I'm conflating two things, aren't I, Jeff? in the Department of Education. We have dollars that are also federal, but that are dedicated toward upskilling. So that's the two sources, but they're federal dollars.
The TCF Field Hospital in Detroit, how long, you were talking about the trends, how long do you anticipate that that will have to remain open?
We're making some decisions right now. You know, the great victory here is that we were ramping up the building of off-site alternative care facilities because we saw the trajectory that Michigan was on. The people of Michigan have done the right thing. The stay home, stay safe order has helped to flatten this curve, but it's really, an order doesn't flatten the curve, it's the actions of the people. People of Michigan have done the right thing by staying home. We've seen this curve absolutely drop. And so these 1,000-bed alternate care sites are not necessary. They're not filled, thank God. They are functioning and they're attending to some patients, but they're nowhere near used as we were preparing for, and that's a good thing. So we're going to make some adjustments. We know that it's critical that we continue to be good stewards of the taxpayer dollar, that we are able to meet need if we do see a spike, and so all of these pressures are driving the conversation about what our next steps are with TCF. And you'll know something in the next few days. I think we're on that trajectory. Is that about right, Dr. J? Okay, good. All right, thanks everybody.
All right, everybody, Pilar Area is still here with you. We are going to be shifting gears from the state of Michigan to the state of Illinois, where Governor Pritzker is currently speaking live, and you're going to watch it right here on News Now and on coronavirusnow.com.
What they typically have chosen to do in these circumstances is to test people who've been exposed to any staff person that may test positive or any other person that may have tested positive. And so they'll test those who've been exposed, but they'll assume that everybody needs to be isolated. And I think I have all the details of that right. I want to make sure I'm looking at the doctor because, as you know, IDPH oversees this. But it is very important that we keep everybody safe in these facilities. And honestly, if you assume that they have COVID-19, you're going to give them the same care that you would for somebody who is COVID positive.
Sure. Okay. Lots of questions about the second lawsuit that's been filed, Representative Cabello, broader than the first, and kind of giving you an opportunity maybe to revise the extended stay-at-home order before a hearing on Monday. Your thoughts to that? Are you considering it? What do you think?
No, I think it's a similarly irresponsible lawsuit. We're in the business here of keeping people safe and healthy. That's what the stay-at-home order has been about. And I just think that lawsuit is just another attempt at grandstanding.
In the same vein, Eric Hong with ABC7 wants to know, does the litigation have a point? Argues that many mom and pop retailers should be allowed to open if big box stores are operating. Similar shops can observe similar social distancing protocols. Why not allow those small business owners to do more than just drive up and delivery?
Yeah, one of the challenges that's come up during this crisis has been that, again, the list of essential services and businesses that are open focuses in part on grocery stores. But as you know, many big box stores have a grocery store inside them, which allows them under this order to stay open. They also have other aisles and other products that they sell. So that's one of the unfortunate challenges of this. Small mom and pop, as Eric is calling them, stores, the small business people, what we've tried to do for them is pick up and delivery for any kind of retail establishment to give them an opportunity to reopen. I am most concerned about those small businesses. It's one of the reasons we created, even in addition to the PPP program at the federal level, which I don't think has been great for those small businesses, we created a grant program at the state level to just provide $25,000 grants to local small businesses. There is no doubt about it that the first thing that I want to be able to do across the state is to open up those smallest of businesses. Those folks have risked their lives, risked their livelihoods rather, all of their savings to open up a business, and along comes this terrible pandemic that no one expected. And it's devastating, specifically those small businesses. So we're working hard to figure out how to make that happen. And of course, we will, give some guidance and guidelines for stores about social distancing, how many people can be in a space, certain number of people per square feet, just like you hear from a fire marshal, for example. But it is a top concern of mine to open small businesses as soon as possible.
We have a very similar question coming in from Greg Bishop at the Center Square, also from Craig Wall, Channel 7, and my colleague Mike Flannery, Fox 32.
All with the same question?
Pretty much.
We're on the same conference call?
I'm trying to tie them up with a bow here today. So in regards to this second lawsuit, they're also hoping, the legislator can get back. They want to have a conversation about all this. Is that a possibility? Why not work with the entire legislature to pass a law clarifying such powers in order to be able to go back during a situation like a pandemic?
Understand completely, and just please, everybody should understand that under the executive order, the legislature has the ability to meet. There's nothing barring the legislature from meeting. Obviously, they have to follow social distancing guidelines and other things, but they are considered essential, as are governments around the state. And so that's something that'll get decided by the leaders and the members themselves about whether and how to meet. I have suggested to the legislature that if they want guidance, and I think they will want guidance, about how to do it safely, because that's the most important thing. We just don't want anybody getting sick. As to whether they meet today, a week from now, or a month from now, whenever that may be, we need to make sure that all the people who work in the Capitol for those legislators, as well as all the legislators, are safe. And so I have suggested to them they may want to get guidance from our IDPH or from epidemiologists, well-regarded epidemiologists in the state who would know how to design a plan for them to meet.
Has anyone asked for that guidance?
Yeah, the legislature, several of the leaders asked to know what would that look like, and so there was an outline provided to them of what it could look like. But not knowing the details of how the legislature wants to do this, it's hard for guidelines really to be written for what they want to do. For example, are they hoping to have committee meetings? If they are hoping to have committee meetings, how do people participate in that? How is there an audience in a small committee room when we can't have gatherings of 10 or more in a closed space? So those are complicated, and I just don't know what the legislature will want to do in that regard.
What about a virtual meeting? Is that
it's not allowed by law today, but absolutely they could. I know that the city council in Chicago has met by Zoom. I know that some of the aldermen don't feel like it's a very effective way to meet, but they are at least meeting. And so, that is something that the legislature could do, but in order to do that, they would need to meet in person and to pass a law to allow distance meetings.
So how would that happen? How do we get that ball rolling?
Yeah, I would say it's back to the legislators themselves. I mean, honestly, this is not it's not, forcing people somehow. I'm not going to go, push legislators. And they are, as many have pointed out, a co-equal branch. They do have the ability to make their own rules and make their own decisions. And that's something that's completely, on them. With any advice we'll be able to provide to them.
Kind of a more specific question from Craig Wall, Channel 7. Bill Brady suggesting today maybe wearing masks, putting up plastic shields, or maybe even meeting in a place like the United Center. Why, if the Department of Public Health can set regulations for how grocery stores can safely operate, can't the department set guidelines for how the legislator can convene to do its work?
Well, so we will and do, and it's kind of the same answer, and I don't know whether they would recommend wearing face shields or surgical masks or N95 masks. Again, I'm not an expert, and honestly, I think that if you think about it, there are 177 members of the General Assembly. And then when you add just even one staff member per legislator, you're at the 354 people. And then, of course, there are security people at the Capitol and others. So, when you add all that up, it's quite a lot of people. And in theory, you could meet anywhere, but of course, that too would be an expense that would have to be borne by the state, but it's doable.
And finally, in this category, David Gracing with the Better Government Association says if they can't meet, what damage is being done due to the legislature's inability to function during the COVID-19 pandemic?
Well, this COVID-19 has just been horrible. I mean, it's been the effect on people's lives, the effect on the state, the ability of the state to move forward. Think of all the things that we knew that we wanted to accomplish, and I've talked about accomplishing this year that I believe in, not to mention people who may disagree with me and the things they want to accomplish for the year. The idea that this session has been so delayed. Now remember, it is possible to meet at any time. It doesn't have to be today or next week or even next month. It really could be at any time. And again, that's up to the legislature. If I started dictating a date for them to meet, I'm sure that there would be blowback from legislators, and so I have left it to them to make decisions.
Okay. Now we have the miscellaneous categories. So Tony Arnold with WBEZ says, is there any legal advantage to bypassing the 5th State Appellate District and taking your appeal of Representative Bailey's court case directly to the state Supreme Court, considering that appears many more lawsuits are coming?
That has been done, that filing, or at least the filing with the 5th District. As I understand it, the Attorney General is filing an appeal with the 5th District and simultaneously or moments after filing for leave to take it to the Supreme Court.
Okay, here's a question from downstate Mark Maxwell of WCIA. He says he's getting this from several veterans. It's a Class 4 felony in Illinois to carry a concealed weapon while wearing a mask. Technically, prosecutors could charge a legal gun owner for obeying your executive order. The order doesn't take effect until Friday. Why not use your executive order to temporarily suspend that portion of the law?
So actually, we've allowed the state police to set some guidelines here, and it doesn't prohibit people from concealed carry. The rule that we put in place would not.
Sarah Schulte from ABC7. Some frontline healthcare workers are using shower caps and rain ponchos for PPE. Is that appropriate?
No, they should be provided PPE by their hospital, by their healthcare facility that they work for. We, as I have said, we have provided to every county health department and to hospitals and others across the state the PPE that they've asked for. Indeed, we are trying to keep some sense of the inventory that exists, and the inventories exist. So if there are healthcare workers that are not being given PPE, first they should tell their supervisor, knowing that there are stores of PPE at the facility. Second, if that is not effective, they should call their county public health department, who has received deliveries from our IEMA rather, of PPE. And we have PPE in this state. You know, we are constantly ordering more. We have, you know, as I mentioned, there's sort of a shortage of gowns, but as to all of the PPE, that should be available to those folks when they go to their healthcare facility.
What about those stories about those healthcare workers? They complain. Some of them say they're losing their jobs if they're complaining too much.
If they're complaining too much, that frankly, they should report that to the Department of Labor. Complaining, I mean, I'm not sure, you know, to what extent this is about complaining or if
about
it's
PPE.
Yeah, right. And so then I would say that is an inappropriate way to operate. If a facility is firing somebody for asking for PPE, especially given the moment that we're in, I mean, honestly, our Department of Labor, the Attorney General's office should hear from those workers, because those facilities are not operating within the parameters that we've asked them to.
Ben Bradley with WGN asking a question for Dr. Ezike. We're hearing from the families of medically fragile senior citizens who lived in nursing homes, were hospitalized with COVID-19, recovered, and are now concerned about returning those seniors to nursing homes where there's a current outbreak ongoing. What is the recommendation for these folks?
Yeah, so we know there's a concern for anyone going into any facility, because we know that essentially there's COVID-19 virus. The virus is everywhere, but specifically for people returning from hospitals, I have heard of issues of people not being able to return to their home. The nursing home is, in fact, their residence, and so there should be a process for everyone being able to get back home. For concerns regarding spread of the virus, again, all of the nursing homes, all the long-term care facilities, that's what we've been talking about every day, about how the appropriate infection control standards are supposed to be abided by and followed so that we can limit transmission of this virus even in the congregate care setting. So again, working with the staff, the medical team on hand, working with the county local health departments, working with IDPH, we are trying to make sure that everyone is apprised of all the infection infection control rules, that they're following them, that they know how to appropriately put on and take off the PPE. If there are issues in terms of getting the PPE, the governor has spoken over and over and eloquently about the process to be able to make sure that everyone has what they need. So all of those things being considered, people should be able to return to their place of residence, and they should feel that the staff in place is taking all precautions to prevent and limit spread.
Thank you, Doctor. Steve Bertrand with WGN Radio. Possibly another question for Dr. Ezike. Do you have data on what populations are making up the newly infected cases? We've been staying at home for several weeks, so are the new cases primarily essential workers, or are people who are staying at home still getting sick anyway?
Well, just to review how this virus is transmitted, if you have been home for, I don't know how many days now, if you have been home, the virus cannot come up de novo. Of course, we know that there are many people in our state that do have to leave the home, whether they're essential workers, and there are many, from the healthcare workers to the first responders to government officials to people working in the grocery stores, deliverers, people who are providing food. So there are many people that do go out. There are people who are under the stay-at-home but go, venture out. So there are still many opportunities for the virus to be transmitted. The good news is that we know, just even from the R0 value, from the doubling time, from the way that the number of cases and the number of fatalities have flattened, that we have curbed that number significantly. So I want to applaud the people of Illinois. They have done the right thing, and we have gotten the desired effect. Have we gotten to the point where there's no transmission of the virus? No. But we have done a fantastic job, and that's why we need to stay the course.
Thank you, Doctor. Lourdes Duarte with WGN asks, there are a handful of counties without a single confirmed case of COVID-19. I know my home county of Schuyler County only has one case. Any more thought to lifting or easing restrictions in those specific areas?
Actually, we did in many ways in this new stay-at-home order that begins May 1. That is to say, we identified state parks. Many of them are in those areas of the state, and we've opened those. We are opening those state parks, which had been closed in part to keep the residents or other visitors safe, but also to keep the state workers safe who have to congregate in small facilities there, or sometimes several of them in a truck all at once. So we wanted to keep them safe. So that's one way. There are other ways. For example, when we allowed elective surgeries, we made sure that the areas of the state that have the most availability of hospital beds and ICU beds had the most availability of elective surgeries. And so those are examples of the ways in which we've kind of, gradually allowed certain areas to do more than other areas. But I would also point out that, yes, it's true, there are 6 counties in the state that don't have any cases, several counties that have 1 case. But as you move up that list, and there are 102 counties, what you find, even in that bottom portion of fewer cases, is that by virtue of the population in the county, that actually their infection rate is higher than in Cook County or than in other areas that seem to have many more cases. But by population, you might have a hot spot in a small, less populated county. So we're keeping an eye on those areas, but I 100% agree with the idea that where it is safe and where there's more distance for people, and where we can open businesses that don't force people to congregate together in larger groups than 10 at a time and so on, then we want to do that.
I assume that's kind of part of the thinking of the phases that you've been talking about in the regions that's still on the table.
That's correct. The way we think about regions is really in healthcare zones. Where are the hospitals? How many beds are available at the hospitals that would serve a certain area of the state, rather than the way sometimes people talk about regions of the state as, well, I live in southern Illinois, or I live in Little Egypt, or whatever. These are all great ways to identify areas of the state, but the way we look at it is about health care and keeping people healthy. And so that's how, when you talk about regions, that's how we're thinking about it.
A couple questions from Marion Ahern, NBC5. Update on McCormick Place. What's the latest on what all the staffers are doing who were hired and now not needed?
Right, so the healthcare workers that are at McCormick Place that may not be needed are actually going to be used in other areas, for example, with nursing homes, other facilities. We still have, remember, staff people everywhere, healthcare workers everywhere are getting ill. They're putting themselves out there, risking themselves, and some of them are getting sick and need to be home isolated, or some of them even have ended up in the hospital, and of course some have died. And so we have a shortage of healthcare workers across the state. So those that aren't working at McCormick that we can redeploy, we are redeploying. As to the future of McCormick Place, we've talked a lot about standing down many of the beds that, for the time being, the facility is there to be used, but the idea of staffing all of the 3,000 beds that we were going to staff, because we didn't know how high the peak was going, frankly, we still don't really know, but we do see, like I've said, flattening. So we've stood down 1,000 of those beds, and it looks like we're going to have the ability to stand down much more of that facility. But again, I don't want to speak too soon, because all of these identified alternate care facilities need to be in a state of some kind of readiness in the event that there's a surge, either because we reopen and, God forbid, we reopen too fast, or because there's a surge that people expect in the fall.
Because there's a potential for that surge, do you continue to have McCormick Place up and running as an alternate care facility through the fall?
I can't project that far in advance, honestly. At the moment, again, everything that we prepared for what we thought would be a higher peak, and again, the reason we didn't hit a higher peak is because of all of you at home who are staying home and following the rules. But we need to be ready. We just don't know. And so I think we have to watch and see what the infection rates are, we've talked about the R0, how many people does a single infected person infect. So if it's 1 to 1, 1 to 3, and so on. And now we believe that infection rate, or the R0, as they say, the number of people get infected by one infected person, is less than 2, indeed less than 1.5 at this point. It had been up at 3.5. So all of those things factor into the way we think, and we try not to project too far in the future, because, gosh, at this point it would be hard for anybody who's not an epidemiologist to say, well, why would there be a surge in the fall? What does the fall have to do with anything? And yet, the experts say that is precisely the concern that we all ought to be focused on.
Do you have any idea?
Elizabeth, how many more do you have?
I have 5 or 6.
Okay.
I'll try to
Can we combine some of them?
I've tried. This is the miscellaneous
It's
category.
okay. I'll try to answer with shorter answers.
We'll move on. Michigan's, this is also from Marion Ahern. Michigan's offering a GI Bill for pandemic frontline workers, tuition-free path for college degree. Thoughts, something you would consider?
Absolutely. I think that the idea of providing what I'll describe as combat pay, for people who are on the front lines, that's something that we ought to be considering. As you know, we don't have any surpluses laying around in Illinois that would allow us to just pull that out of an old rainy day fund. There just isn't any in Illinois. There wasn't any when I showed up in office. So we are looking to the federal government to help us fund the loss of revenues in the state that's come from coronavirus. And I do believe that we should be looking at how to support the people who have been truly amazing. They're heroes to all of us, and I think they deserve to be recognized as such.
Greg Bishop from the Center Square, a standalone firearm range that doesn't have a retail component says they were told they can't operate under the order. If they aren't allowed to operate, they say they'll look into legal actions against the order. How do you plan to address non-retail firearm training and practice ranges?
It's not something I've honestly paid close attention to now. Now that you've raised it, I'll certainly look into it. But at the moment, remember, we're trying to focus on essential businesses, and we've tried to follow the guidelines of the federal Homeland Security list of essential businesses.
Okay. Mark Conkle with the Patch says, where's the First Lady? Is she accompanied by a state security detail? Has she engaged in non-essential travel? What is your response to people who say the stay-at-home order and non-essential travel bans aren't being abided by your family? I believe there's a report from Illinois Rising Action that says that she recently traveled to Florida.
Well, first of all, I want to say that in politics, it used to be that we kept our families out of it. My official duties have nothing to do with my family. So I'm just not going to answer that question. It's inappropriate, and I find it reprehensible, honestly, that reporter wrote a story about it.
Tu Ewing, my colleague, says Fox 32 uncovered a nail salon operating on the north side, ignoring your stay-at-home order. What can the state do to go after non-essential businesses? How many complaints has the state received for non-essential businesses operating during this temporary closure?
Well, again, we've asked people to follow the rules. We also, local law enforcement has the ability to go to engage with those business owners that are opening against the rule. We have enforcement mechanisms. Their permits can be taken away. The state can take action. Local governments can take action. So there are lots of ways in which those businesses can suffer some penalty as a result of not obeying these executive orders.
How does that feel when you see these businesses opened and not abiding, and parties and the stuff that we've seen?
Yeah, I think I want to talk about the businesses kind of separate from parties, because, look, I know that it's very, very difficult for these small businesses in this time, and so I know there is an urge to want to just open the doors because of the devastation that this coronavirus has caused. But we have to be responsible, because it's not just you, the business owner, that you're keeping safe by staying closed. You're also keeping the patrons safe by keeping closed. And so we just need a little while longer here while we move past this peak. If we can move, and I'm following, for those who think that the President of the United States is the person that they want to follow on this, all I can say is they put out a federal plan, some of which I think is right. And so, past peak, we want to make sure that we're moving down the other side of that peak, and then we can start to open things. As to people who are partying together, and I saw some comments by somebody who was at one of those parties, all I can say is that everybody at that party put themselves and everybody else there at risk, and they put their families at risk, their friends at risk, their communities at risk, because when they left there, remember, you can have COVID-19 and be asymptomatic, having no symptoms, right? So this woman who spoke about it said, well, I'm not feeling anything. It's been a day. I'm fine. Well, guess what? You can have it, and you may be asymptomatic, and you may be giving it to other people.
Amy Jacobson with WIND Radio has a question for the governor. Woodford County has a population of 38,000. 265 have been tested, 12 positive, 1 has died. Why do you think they should be treated just like Chicago? Density doesn't matter, data doesn't matter. Explain the science behind that position.
Well, like I said earlier, we, in fact, aren't treating every part of the state the same. And more importantly, as we began this, we didn't really know how this virus was spread. We didn't really know that there was even asymptomatic situations where someone could have coronavirus and not know. And so certainly we've learned a lot. All of us from the epidemiologists have learned a lot over the course of this, this novel coronavirus. And so we are, in fact, making changes, and you've seen some of those in the executive order that I put forward. More will come. But again, I would point everybody to the president said, indeed, I think Amy Jacobson mentioned the plan that the president put forward, and what it takes to get to what he calls phase 1 is indeed much of what we're following here.
Last question from Chris Hacker with Channel 2. New data from the CDC suggests there were an additional 700 deaths between March 8th and April 11th that were not directly attributed to COVID-19. Are you aware of the spike in deaths above the average for previous years? And if so, is it possible these could previously unidentified COVID-19 fatalities?
Yeah, it is. I mean, I think everybody's realizing, indeed, there's been a recent report out of California, I think, that shows that people had COVID-19 long before anybody thought here in the United States. And so it's probably true here in Illinois that people had coronavirus long before. And so some of the deaths that nobody was even talking about, they didn't have a name for this thing. People were dying, and they may have been put on their death certificate that they died of pneumonia. or some other respiratory illness. And so there's no doubt that we're going to need to go back through the records. That's going to probably happen in months hence because we have so much to do now to focus on keeping people safe and alive now. But we're probably going to have to go back and see, how many of these probably, based upon all the symptoms, were COVID-19.
John O'Connor at the AP, one feeling behind this week's lawsuits is you haven't listened to the needs of people downstate. Could you do better? Some examples of where you've done well downstate. Can you envision any scenario where you would negotiate with downstaters on less restrictive stay-at-home order in May?
Well, better than is being suggested by the question is that I've had many, many direct conversations with legislators, Democrats and Republicans downstate, and I've listened to them, and I think some of them would tell you that they were the ones who suggested some of the changes that we put into the May 1 executive order, and certainly the leaders of the Republican leaders of the House and Senate, also made suggestions that were incorporated into the stay-at-home order for May 1. So, is there more to do? Of course. It's hard to look back and say that I did everything exactly right, but I will say that I have listened, and I continue to listen to people on both sides of the aisle. I need best ideas. You heard me talk about Representative Mark Batnick at one point, who suggested that people in grocery stores and in essential businesses needed to wear face coverings. And he himself went out and promoted that in his district and has developed a terrific poster that I think should be more widely used and downloaded from his website about that. And I listened to him, and indeed, obviously a portion of what we put in place in order to lower the infection rates across the state was because of the suggestion of people in those essential businesses need to wear face coverings, and I thank the representative for raising that subject.
Tina at the Sun-Times, are there any plans to defer property taxes for small businesses? Some have reached out to say their bill is due in a few months and they won't be able to pay it since they have produced no income during the stay-at-home order.
Yeah. As you know, property taxes are managed by local governments, county governments, municipal governments, and I certainly encourage folks to think about what they can do to lower the or to extend the due dates or to change how it is they're charging people for their property taxes, but that is something that's being decided at the local level, and it's not a state issue.
Jerry Nowicki at Capital News, Illinois. ITPH data appears to show non-COVID patients in ICU beds spiked from 991 on April 23rd to 1265 the next day and 1448 on April 27th. Is there an explanation for a spike in non-COVID ICU patients in such a short amount of time?
I can only offer speculations as I don't have the diagnoses of all the people who are non-COVID. I know as I follow the literature, and actually from hearing anecdotal information, we are seeing people with acute heart attacks and strokes, and as I'm going through the literature, I'm seeing how this virus actually affects the blood vessels and how it's promoting clots. And so there may be additional heart attacks and strokes and other clotting events that may in fact be related to COVID. So again, without being able to study the medical records of each of those additional cases, we can speculate, but I think maybe the people in the hospitals could maybe round out the information and give us more granular details as we go forward.
Shia Politico, Governor, can you offer an update on the Midwest Coalition of States and whether anything has really happened with how you all are dealing with Missouri and Iowa or cross-border travel?
We are in consistent communication. I, in fact, was in contact.
All right, everybody, we're going to break into this to take you to the White House Live. We're talking about reopening America with President Donald Trump. Let's listen in. This is a roundtable.
Who have been truly great business leaders and are great business leaders, and you're opening up your company again too, if you think about it, right? You're sort of doing a reopening, but they're great companies and they'll do very well, hopefully better than ever before, and that's what we're seeing. We're seeing tremendous pent-up demand, and it's a beautiful thing to see. So it's wonderful to have America industry leaders, and that's what you are, true leaders, to the White House. You've been here before, all of you, and we've talked about it in different times. We built the greatest economy in the history of the world, and nobody even disputes that. And one day they walk in, they say, sir, we're going to have to close it up until we get rid of this hidden enemy, this terrible scourge. And that's what we did, and we did the right thing. We did an incredible job. We worked with the governments. We worked with states all over the country. We had no ventilators, or very few, from previous administrations, and we became the king of ventilators. We have thousands and thousands of ventilators. We're now helping other countries with ventilators. We had old-fashioned tests that didn't work. They were really obsolete. They didn't work. They were broken. And we end up, the testing has been incredible now, and to a level that nobody's seen. I got a call from President Moon of South Korea. He said, congratulations, your testing is just, nobody's ever seen anything like we're doing. We've tested more than all countries put together, and millions of tests, and the highest quality test. But it's great to be with you. We're joined by Matt Maddox of Wynn Resorts, Chris Reynolds of Toyota, Chris Nassetta of Hilton, Josh Bolton of the Business Roundtable, Walt Immer of Waffle House, and thanks to Vice President Mike Pence, Secretary Steve Mnuchin, and Secretary Eugene Scalia. That Scalia has very good genes. Where's Scalia? He has very good genes, that guy, I'll tell you. Scalia, he's got the Scalia genes, right? We all know what that means. We mourn, and I have to say this so strongly, we mourn every life tragically lost to the invisible enemy, and we're heartened that the worst of the pain and suffering is going to be behind us. We think we really have crossed a big boundary, and much better days are ahead. And I often say I see the light at the end of the tunnel very strongly. This demand is going to be incredible. I think next year is going to be an incredible year for our economy. I think the fourth quarter is going to be really, really good. Kevin, we were talking about that before. You maybe will say something. And we're going to be in a transition quarter next quarter, the third quarter. And I think we'll do very, very nicely there from an economic standpoint. But thanks to the devotion of the American people, the number of new cases continues to decline. The United States has now conducted nearly 6 million tests, far more than any other nation, as I said. So many tests, and so much has been learned about what we're fighting. And if it does rear up a little bit in the fall, or even a lot, we'll be able to put it out. We'll put out the embers, or we'll put out the flames. 2 weeks ago, we released guidelines to give states a real strong indication of what we want and how we want it done. We've really had a good relationship with the states. Mike Pence has worked very, very hard with the task force. He's headed the task force, so importantly, with a great group of people. And it's just been incredible what's taken place over a very short period of time, including the gowns and all of the surgical equipment and the safety equipment and masks. People don't talk about masks anymore. That's the other thing. They're not talking about masks. They were talking about where are the masks, because we had a cupboard that was bare. We didn't have a lot of equipment or medical supplies in the cupboard that we inherited. Now we're taking in millions and millions of masks. I'll give you a number that you won't even believe we have in order. 500 million masks coming in, and we've delivered millions and millions and tens of millions of masks all over. So you don't hear about that anymore either. You don't hear about ventilators, you don't hear about masks, and you shouldn't be hearing about testing, but that's the last thing they can complain about, I guess. You know, if we do 2 million tests, they said, how come you didn't do 3? Well, we do 3, and then they say, how come you didn't do 4? That's like a dream for the media. But we've done incredible with testing, and you'll see over the next coming weeks, Mike, you may want to speak about that a little bit, but over the next coming weeks, you'll see some astonishing numbers. I don't know that all of that's even necessary. You have some governors that love the tests. You have others that like doing it a different way, an old-fashioned way, with some testing, but we're going maximum testing. We've encouraged the more than 30 states that have taken steps to resume economic activity already. We've given them tremendous encouragement and support. We're backing them 100%. Many governors have called me, telling me their plans, laying them out. Governor of Texas, Oklahoma, governor of Arkansas, many governors. I spoke with Governor Cuomo. We had a great talk today on a different subject, but he wants to get open. Everybody wants to get open. They want to get open, and they want to get back to business. And their constituents, the citizens of this country, want to get back. And that's what's happening. So I just want to perhaps start off by introducing our vice president, and then we'll go around the table, and you'll introduce yourself and say a few words to the media. You're covered by very serious media out here. The audience can't see it, but these are the most wonderful human beings. Actually, this is a nice group. I can't imagine. We actually have a nice group of people. But Mike, if you could say a few words, please, that would be great, and then we'll go around the table. Thank you.
Thank you, Mr. President. I want to thank all the distinguished business leaders who are here and the literally millions of Americans that are employed at the businesses represented around this table. It's remarkable to think, Mr. President, that before the coronavirus epidemic came ashore, we had seen extraordinary growth in the American economy, not just the stock market setting records, millions of new jobs, more Americans working than ever before. But in January, when you stood up the White House Coronavirus Task Force, you said we had one mission, and that was to save lives and to make sure that that the healthcare providers in America would be able to render the level of care to any American struggling with the coronavirus that we would want our own family members to have. And thanks to your leadership, thanks to the partnership that we forged with states across the country, working with local health officials, Mr. President, as you said yesterday, we have light at the end of the tunnel. We really are encouraged by the progress in even the hot spots around the country. Cases are leveling off, and in some areas going down. Hospitalizations are declining, even in the greater New York City area. That's a testament to the American people, to the way the American people now nearly 45 days ago embraced the guidelines to slow the spread. And as we come to the end of this mitigation period, states across the country have all embraced those same mitigation and social distancing efforts. The American people have put them into practice. We've saved lives. We've protected the vulnerable. We've preserved our healthcare system, and we're well on our way to healing our land. As you mentioned, testing will be a part of how we move to the next stage. It was just on the 16th that you laid out a plan for opening up America again. And as we sit here today, I'm informed that 35 states have already released formal opening plans, many of which are consulting directly with our team here in the administration, and we're going to continue to work with all of them. Testing is a major part of it, and I can assure you, Mr. President, and the American people that we'll continue to scale testing across the country. We're doing more than 1 million tests a week now, 5.8 million tests total. We expect by next month very quickly to be at a capacity to do more than 2 million tests a week. We laid out our blueprint for testing, and as I heard again today on a conference call with America's governors in agricultural states, there's great enthusiasm for the blueprint for testing that you unveiled earlier this week, and we'll be surging supplies and resources and reagents into the states to support that increased testing. But we know that ultimately we've got to find a way to help America get back to work, and having the opportunity to hear from these business leaders about best practices that businesses are considering, whether they be restaurants like Waffle House or major corporations and hotels. We welcome that. We look forward to partnering with you, as the President said. America works when America is working, and we're absolutely committed, as soon as it is safe and responsible to do so, to partner with governors across the country, partner with businesses across the country, and open up America again. So thank you, Mr. President.
Thank you very much, Mike. And just before we go around, Puritan Medical Supplies, a wonderful company, will produce 40 million additional swabs per month starting in May. They've opened up a very big process, and that was funding authorized by the Defense Production Act. So that'll help the states. And again, we're there to help the states. A lot of states can buy their own swabs. It's not that big a deal, but we're here to help them. We want them to be successful. We had, as you know, the governor of Louisiana in today, and we told that story, which has been a really great story. And we had the governor of Florida in yesterday, and that was a great story. These were just incredible what's been happening. So maybe we'll start with my left. And Chris, you want to take it and tell them about you? I know a lot about your company, but maybe a lot of people don't. Tell them the story.
Indeed you do. Thank you, first of all, for inviting me back to the White House. I was thinking on the way down here today, I'm based in Washington, that I was here about 6 weeks ago. The world was a different place. We were not at the beginning, but we were in the thick of it fighting this war. And we've come a long way. We've made tremendous progress thanks to your leadership and the leadership of the administration that's represented around this table and otherwise. So thank you for that. We are very supportive as an industry and certainly as a company on reopening America. We think it's critical that that happen. The guidelines that you and the administration have outlined, we are incredibly supportive of opening in a safe and healthy way, which you and Vice President Pence just described. We have been trying at Hilton and as an industry to be part of the solution throughout. So in the middle of the crux of the crisis, when first responders were unable to get housing, even though our industry and our company has its share of problems, we provided with American Express 1 million rooms free of charge to first responders. Those rooms are still being provided to first responders as they fight the war. But now as we think about, and I spend my time predominantly on the reopening of our business, what we realize is that people do want to get out. They want safety. They want to be doing it in a way that is safe. They want to feel good about it, but they want to get out. They want to visit their family, their friends, their loved ones. They ultimately want to get around the country and do business again. And in order to do that, they want to feel safe. So all the work that you all are doing is obviously as an administration in the states is critical. What we're trying to do in our part is develop the best health and hygiene standards that exist. So when they stay in our hotels, they feel safe. So what we launched just this week was in a partnership with Lysol, one of the most respected brands with some of the best scientists on cleanliness and killing germs, and the Mayo Clinic, one of the most reputable health organizations in the world. We have developed and are working on the absolute best protocols so that when people come into our hotels, the rooms have been cleaned, they've been sealed, the public spaces have, and that they can feel safe and secure in that environment so they can get out and see the people they want to see and see this great country again like they used to. We've also been trying to work with the industry, and industry, to their credit, is trying to mobilize to create a consistent set of standards so that this isn't just Hilton. The whole industry, would have a set of health and hygiene standards that would make people comfortable. We will be sharing it with the administration, sharing it with governors already to try and create a standard. We stand ready as Hilton, and we stand ready as an industry to help get America open and moving again.
That's great. Thank you very much. Great company, and you'll have it up and running again very soon. I know you very well, and you're going to do a great job reopening. We're reopening Hilton, and we're reopening our nation. A lot of companies are very excited right now. Steve, do you want to say just a couple of words about where we are with the different things, please?
Well, I think, thank you, Mr. President, Mr. Vice President. It's great to see these companies here today. It's great to see the reopening. I think we're making an enormous amount of progress. Yesterday, we met with small businesses that we saw the benefit of the programs. Today, we're meeting with big businesses. I was particularly pleased to hear from Chris. He's been able to access the capital markets. Just the announcement of our facilities with the Federal Reserve created liquidity so that public companies could access the capital markets and not need to come to the governments for support. Thank you.
Thank you very much. Please, how you doing?
I'm doing great. Thank you, Mr. President. I'm Walt Amer with Waffle House in Atlanta, Georgia. It's an honor to be here today. Thank you for including me, probably a well-dressed cook and dishwasher. I don't know about big companies, but we're happy to be included. And thank you too, Mr. Vice President, for for all of your support. I am here representing our industry, I believe, and in large part the independent restaurant companies of America that are out here that have helped create the fabric of our country with the restaurants that they've put in our communities and the connections they have to the communities. And we, in a small way, feel like we are a part of that. We did have the opportunity this week in the state of Georgia and the state of Tennessee to open up some of our dining rooms to dine-in customers again. And it was very welcomed by our people. It was welcomed by our customers. Our customers are ready to see some sign of progress that we are beginning to move forward. We've done it in a safe way. We have followed all of the guidelines, your guidelines, the CDC guidelines, and how to make that happen. But what we believe when we started out on this journey, we said we really have several goals. And the first goal was we wanted it to be a safe environment for our customers and for our associates. And our second goal was to create financial safety for our workforce. And I wanted to thank you personally on behalf of our workforce, for all of the stimulus funds that have gone directly to the workforce of America. It is making a difference. It has made a difference. It is keeping the economic engine turning ever so slowly right now, but it is helping keep people put food on their table and a roof over their heads. So on behalf of our workforce, I thank you for that. As we got into this, we felt like we needed to make a lot of adjustments coming in. One of the great things about a restaurant and the entire restaurant community, the restaurants are the second largest private employer in the country. And there is 1 million restaurants out there, and probably no other industry has been hit as hard from a revenue standpoint or a layoff and furlough standpoint. But restaurants, if you think about it.
What's number one?
What's number one? Healthcare is my understanding.
Really? Good.
Yeah, private employers. I assume you guys are number one overall. But so, you know, restaurants have a unique opportunity to help lead us out of this. And the reason for that, in my opinion, is that we have been practicing safe food handling for years. The safety of our guests has always been paramount. So what we have done is we've taken a workforce that is trained to do that and added more sanitation practices to it, more touch points, more social distancing as you have prescribed and the CDC has prescribed. And we have basically turned our restaurants into the ability pretty much at half capacity to seat guests in our restaurant. And it's given us an opportunity to get the wheels of the economy, our engine turning a little bit, because the next thing we want to make sure is we protect the jobs for the people that work for us and the people in our industry. So we're very appreciative. I did want to say that ever since my daughter was young, she every time she saw the WH on the TV screen, she thought that stood for Waffle House. So I don't know if you have the trademark for the WH or we do, but we could probably work something out if I wore my WH tie for you today.
This one was here first. And
well, we might have to talk then. So, but thank you for including us, and on behalf of all the restaurant operators out there in the country, we appreciate this opportunity to begin the journey to move forward.
And thank you very much, Walt. We appreciate it. Chris Reynolds. Chris of Toyota.
Yes, Mr. President. Thank you first for inviting us. Thank you, Mr. Vice President, and giving us an opportunity to share how Toyota is working within the American automotive industry to return to work safely, to reopen America safely. We announced on March 18 that we were suspending production due to the awful scourge of the coronavirus. On March 19, we started to plan to reopen. We started right away. And just to give you some quick background on Toyota, we've been here in the U.S. for over 60 years, 1,500 dealers, 1.2 million units of cars and trucks manufactured last year, 475,000 people employed, including a great number in the state of Indiana, from where our Vice President is from. Going to the next slide, we, with that as background, really are trying to apply 3 fundamental principles to how we're going to return to work. Principle number 1 is we need to stay connected with our team members. So every week we conduct phone surveys with all 32,000 of our factory workers, asking them how are they feeling, what's their health, what's their family's well-being, what's their confidence level in returning to work. And we also preview with them all of the new safety protocols and processes that we're going to put in place. We share pictures of the reconfigured factory workplace so they can have confidence that we're doing everything possible, Mr. President, to keep them healthy, safe, and productive. The second principle that we follow is that we've prepared our plants and facilities for safe and healthy working. So, like many here, we're engaging in marked-off areas that require social distancing, the provision of masks and face shields where appropriate, daily temperature screening, as well as a daily app-based questionnaire that before you come into work asks you, how are you feeling today? Do you have any symptoms? So that we can try and manage and contain the virus. And we're using best practices not only from your own Center for Disease Control, Mr. President, but also from around the world to try and increase the safety and health of our team members as they produce. And then the third principle is we're not date-driven, we're data-driven. So our current plan is to open on May 11. It'll be a slow, gradual opening of our plants around the country, but we're flexible. Every plant will be different. We'll have staggered shifts. We'll do many other things to comply with the Centers for Disease Control guidelines, and our goal is to prioritize team member and health. Mr. President, one final point. We all know that our team members live in communities. It's not just the workforce that they're in communities. So what Toyota has done is it's tried to support the communities in which our team members live, including manufacturing 500,000 face shields just since the start of this crisis to distribute to healthcare centers, nursing homes, first responders around the country so that our team members can feel that we're also part of the community. And we've also put together, just released yesterday, a community service announcement aimed at those communities of color that have been particularly impacted by the lethal nature of this virus. This announcement includes celebrities encouraging everyone to engage in safe practices promoted by the Centers for Disease Control. So we think it's a holistic process. We think it's also a process that requires commitment, and thank you for the commitment that your administration has demonstrated. We're going to get through this as a family, Mr. President. Thank you.
So, Chris, what's Toyota doing in Japan? Are they open? Are they semi-open? What's happening in Japan?
Mr. President, in Japan, the situation varies prefecture by prefecture. It depends on the plant. Some facilities are operating, some are not, and that's really a function of both the situation on the ground in a given prefecture like our state, or it's a function of demand. So it varies, sir.
Well, great job. You're going to have a great Olympics next year, too, by the way.
Thank you, Mr. President.
Really great Olympics. Thank you very much. Matt Maddox, please. Wynn Resorts. Hi,
yes. Thank you, Mr. President. First, I'd like to echo what you're saying about testing and testing capacity. We have seen a real expansion in testing capacity in Las Vegas, so much so that our university hospital is going from a couple hundred tests a day to 10,000 tests a day. They don't have enough people to test. So I signed a deal with them to allow all Wynn employees to get tests anytime for free, and they're going to set up on-site testing. So that's moving forward. We also, during this time, decided to pay all 15,000 of our employees, from housekeepers to head of sales. Right. And we did that because I thought that could help accelerate the economy. So as an example, we took our call center, and we've had our call center team up with the health district to become contact tracers. We tripled the amount of contact tracing ability on us for our state to get that moving.
Great.
And we published a 23-page plan for the whole world to see 10 days ago that lays out exactly what we think a strip opening would look like. We have thermal cameras at our entrances. We have company-supplied PPE. We have just about every UV technology that you can think of for disinfectant. So we're ready, and I'm encouraging our state that we need to begin a phased approach and get back to business.
So, Matt, when do you think the Las Vegas Strip will be opening? Do you have any idea?
So the plan that I put forward to the state is this week, let's start phase one, golf course, tennis courts, small restaurants, small retails, nail salons, et cetera, with social distancing in place. Judge the benchmarks that we've prepared. We prepared 3 benchmarks based on disease growth, ICU capacity, and testing positivity rate. We're going to have them out there public every day. If we're inside those benchmarks in 3 weeks, then on Memorial Day, I would hope that we're open.
And you have a lot of excess testing capacity. That's great.
We do.
Others have said that, too.
We do.
Ron DeSantis said it yesterday.
So all 12,000 of our employees in Las Vegas can now go get a test.
That's fantastic. Thank you very much. Great job. Say hello to all of my friends.
I will. I will, of course.
Josh Bolton, please. Josh, Business Roundtable. and does a great job at the Business Roundtable. Thank you, Josh.
Thank you, Mr. President. Thanks for this opportunity. I'm Josh Bolton. I'm CEO of the Business Roundtable, an organization of nearly 200 of America's leading CEOs who collectively employ over 15 million people. Every sector of the economy is represented in our organization, so we have an opportunity to get a view of the big picture. And Mr. President, we don't need to tell you that right now the big picture is very challenging. We're facing the largest economic crisis certainly in our lifetimes, and all of our members are keenly aware of that. We think now is the moment that it's critical that the country start getting back to business as rapidly as possible, not just for the health of the economy, but for the health and well-being of all of our citizens in our country. Successful reopening will depend, as the other panelists have said, on a lot of different elements, and if I may, I'd like to highlight three. Top of the list is safety first. Business Roundtable companies are all uniformly committed, above all, to protecting the lives and the well-being of their employees and their customers. And that means following sound public health guidance like the guidance that has issued here from the very capable people on your team. At Business Roundtable, all of our members either already have in place or are formulating careful plans for responsibly transitioning back to work, like the plans we've heard about just now this afternoon. They're devising new measures around personal protective equipment, cleaning procedures, virus screening, ongoing social distancing in the workplace, all of the things that you know about, and they all seem to be excellent plans. Which takes me to my second point, which is consistent guidelines. No matter how good every company's transition plan is, and we've heard a lot of good ones here this afternoon, public confidence will be undermined and the speed of the reopening will be dramatically slowed if we're all doing different things. And that's why the Business Roundtable has called for clear, science-based guidance from the federal and state governments on appropriate safety measures in multiple workplace and commercial settings at different stages in the progression of the disease. The White House guidelines, Mr. President, that you highlighted in your first slide, the ones that came out 2 weeks ago, are an excellent start in identifying a common set of phases for dealing with reopening. And a number of states are off to a really good start in identifying recommended safety measures in each of various different settings. Now we think, since we are now on the cusp of many places being ready to reopen more fully, we think more specific guidance is needed. And so on Friday, we sent to the Vice President and to all the governors a set of recommendations on the kinds of consistent guidance our businesses feel is necessary for the safest and fastest reopening. And we're grateful for the chance to engage with the Vice President's team and all of your task force on those issues. And I should say, Mr. Vice President, that everybody in your administration, despite the heavy burdens on them, has been very receptive to taking advice from the business community, and we're very grateful for that. Final point, ample testing and monitoring. The only thing worse than an unnecessarily slow recovery is a reversed recovery. So to avoid serious setbacks, as our businesses reopen, we need to stay vigilant, identifying rapidly and isolating new COVID cases and carefully tracking the spread of the disease, as I know your team is working very hard on. The robust testing and other forms of monitoring are the keys to the vigilance, and they'll also teach us what's working and what's not working and allow us to make adjustments. It'll take a while for our economy to return to normal, but the traditional American virtues of vigilance, adaptation, and innovation, we are confident will see us through and get us to the other side of this crisis as safely and rapidly as possible. Thank you, Mr. President, for this opportunity.
Thank you very much, Josh. That was great. The numbers, when you look at the stock market today, the enthusiasm is great. It's up very substantially, as you know. And I think people are seeing a very big year coming up next year, and I think they're seeing a very big fourth quarter. Larry, would you like to say, Larry Kudlow, a few words, please?
Just a few words. Thanks to everybody, Mr. President, Mr. Vice President, and all the business folks, and my friend Steve Mnuchin. This is a tough one. I've been around a while. This is a tough one, and the contraction is going to go on for a bit. But I like what I hear around the table, and I agree with the President. We will see a growing, recovering economy by summertime and the back end of the year, and it's going to extend into 2021. That's what I think is going to happen, and I think the stock market is signaling some of that. I wanted to buck it over to my dear friend and colleague, Kevin Hassett. He gave it to me over in the Oval yesterday. I want to send it over to him today, but I appreciate it, Mr. President. Thank you, sir.
Thank you, Larry. And Mr. President, Mr. Vice President, I think when I first came back in early March, that it was clear that you had a first objective with respect to the economy of building a bridge to the next shore, the other shore, when we could restart the economy. And it was really massive fiscal action that made it so that a day like today could be possible, whereas you look around, there are all these businesses that have the wherewithal to start up, and it's because they've stayed connected to their employees. The checks that we've mailed to citizens means that there's going to be demand for their products. And so the big negative numbers that we're going to be seeing over the next few months don't necessarily mean what they would have meant absent all those policies. And so I think that we all have a great deal of optimism about how quickly the economy can come back, and it's precisely because of what we see in the room today, that people have come up with plans based on the guidance that your task force, Mr. Vice President, have given that make it so that they can operate safely, and they're gradually across the country opening up and getting back to work, and they're able to do so because of the lifeline that you, Mr. President, threw them with all of the first three phases of fiscal policy. Thank you.
And it's great to have you back, too. Very talented guy. At least you made a lot of good predictions, and your predictions all turned out. Between you and Larry, that's a tremendous team. Thank you both very much. Jean, Secretary of a very important thing called labor. What's more important than labor?
Well, it is so important. And, Mr. President, I was pleased to be able to tell you earlier today that as of yesterday, all 50 states and the District of Columbia are now offering the additional $600 in unemployment insurance that was part of the CARES Act that you signed last month. This was an additional benefit on top of what the states were already making available in unemployment, and one important part of your program to support workers during this difficult time. As you know, the states have had some challenges with their computer systems. We've been working with them. This is not declaring victory on all aspects of delivering those unemployment benefits, but it is a milestone I wanted to note. I have been very pleased to hear the discussion among this group about all the steps that companies are taking to keep their workers safe. I think we all appreciate that confidence on the part of workers that they will be safe in the workplace is going to be an important part of the reopening, as well as confidence on the part of business about what needs to be done, and that when those steps are taken, they will have satisfied their obligations. We at the Labor Department have been working carefully in conjunction with the CDC to provide guidance for a variety of different workplaces so that employers and companies know what needs to be done, and employees know as well. And we'll continue to do that. We're also receiving complaints from workers who worry about safe work conditions, or that they might have experienced some adverse action for raising safety concerns, and we'll look into those, and we have the tools that we need from an enforcement perspective if workers' rights aren't respected. But I'm so heartened to hear the steps that businesses want to take and are taking to support their workers. Just a last observation, Mr. President. As you and the Vice President said, just weeks ago, we were enjoying such an extraordinary economy, and there were reasons for that. There were policies that you'd put in place, lower taxes, deregulation, that were vital to what we enjoyed before. Right now, we're in a period of very important government intervention. We need that. But as we look forward to the department, I think it will be important to remember as well the limits of government, and that the single best thing for workers is a vibrant economy, And that often comes from allowing free markets and free people to go about their business. We'll keep that in mind, too. Thank you.
Okay. Any questions for our panelists, please? Yeah, please.
This could be a question for any of the business leaders, but there are polls that show that Americans say, the vast majority of Americans say that once they're allowed to go back to restaurants, hotels, places like that, that they won't because they don't feel safe. So are you worried that until there is a vaccine, people really won't come back to some of these businesses?
Of course, we worry about it, and we see some of the same polling, and we're talking to our customers by the tens of millions, hundreds of millions. Last year, we served 180 million people, so we have a pretty big and extensive customer base. What we're hearing from our customers is that they're desperate to get back out and move around and see their country again and see their friends again. They obviously want to do it in a safe and healthy way, and so I think they're looking. Our customers are saying they're looking for the government, both state and federal government, to focus on testing so that they understand, what real mortality rates are, as work has been done with the Stanford test and the data in Norway and other data points that are coming out as the administration and states do more and more testing. I think our customers, what I'm hearing from our customers, they're starting to understand, while every life is precious, that the reality of the ultimate mortality rates here is probably much, much lower than had been estimated. And if they are old and infirm, that they have great risk, and those people should be protected. But if they're not, they probably are at a very low risk. They're then looking for, which is why we launched this week, Clean Stay, and while we're working with our industry, they want to know that people are being responsible, right? They want to know that we are doing the testing, the social distancing, that we are using protocols and PPE in protecting our employees so that they can protect customers, that we're being very thoughtful and sensible that when they do come and stay with us or they enter into a restaurant, where we've always had good hygiene, as you heard earlier. We are, our people are trained to have good hygiene, but we up our game so that when they're with us, they feel safe. So I think it's a combination of those things that are happening, of broadly understanding the real risk that they have, and then mitigating that risk even further by the specific actions that we all take in our places of work with our team members and thus ultimately with our customers.
And I haven't seen that because I will tell you, to me, I think there's a tremendous pent-up demand for people. I see it in Texas where they have lines going into stores, and a couple of restaurants, I guess, opened, and they literally have long lines. I think there's a tremendous pent-up demand. I've been at the White House now for many months, and I'd like to get out. As much as I love this is the most beautiful house in the world, in my opinion. But I think there's just a great demand to get out and, get our country going again. And that includes going to restaurants and hotels. And I think you're going to find, Chris, that you're going to do a lot of business that you're not even thinking about. I'm seeing it. I feel it. And I've felt a lot of things over the years, including, I think I can win for president, And frankly, I really feel that next year is going to be a very good year economically. We're going to be back in business. So we'll have to see. I mean, only time will tell, but there's a lot of good feelings and a lot of good decisions have been made by a lot of very talented people. So I'm feeling very much that it's going to be very successful.
Question for you, Mr. President. Do you want the FDA to issue an emergency use authorization for remdesivir?
Well, it's a big thing, what happened just recently, where they came up with something that has a very substantial percentage. It's a building block. Tony said it today. I thought it was very well expressed. He said that's a building block. That means it's a very substantial chunk of a step. And that's a building block to the ultimate step. That's a big building block when you hear, I guess, 31%. So it was very good. Yeah, I want them to go as quickly as they can. Stephen Hahn, Dr. Hahn, has been incredible at the FDA. He's getting things done at record time. There's never been anything like it. And yeah, we want everything to be safe, but we would like to see very quick approvals, especially with things that work. Thank you.
Mr. President,
Mr. Bolton and others suggested that they'd like to see federal guidelines for some of these companies, explicit federal guidelines for some of these companies and factories opening back up. So far, you've given a lot of discretion to companies and states, but is that somewhere where you'd be willing to step in and do more?
Well, we will step in if we see something wrong. We have given discretion to the governors. I've become very well acquainted with the governors. You have some very talented governors, frankly, and probably some that are a little bit less talented. That's okay, but it's a very talented group of people. And they're working with us. We're helping them, whether it's ventilators or swabs that they can't get, we're there. And we've taken in billions and billions of dollars worth of equipment and distributed to the states. And, you know, you've heard the calls, and we have no problems. We're doing really well, and we're backing them up. But we want the governors to call those shots. If we see something that we don't like or that's bad or that's unsafe, we'll stop it immediately. Okay?
What might the new normal look like 2-3 years from now? Say restaurant workers, hotel workers, might they be required to wear masks, that sort of thing? What would the new normal look like?
No, I don't see that. I see the new normal being what it was 3 months ago. I think we want to go back to where it was. I mean, when I look at a baseball game, I want to see people right next to each other. I don't want to see 4 seats in between every person so that the stadium becomes 25% of its original size. No, I want to see the NFL with a packed house. I don't want to see NFL with 3 seats in between people. No, I want to go back to where it was. That's where we're going to be. Look, this thing will pass, and when it passes, that'll be a great achievement. And we've done a very good job. It's far too many people, needlessly, because it could have been stopped at the point of origin. And somehow we weren't helped by whether it's World Health Organization or China, whoever. We weren't, they didn't do what should have been done. It's very sad, actually, for the whole world. It's a very sad thing. It's a very, very sad event. It's a war against the invisible enemy, and we're now on the other side, and we're, I think what I want to see is I want to see where it was. And I think we have a chance to have an incredible year next year. Now, not if somebody's going to come in like our opponents and raise taxes all over the place. They want to raise taxes. That will kill something very fast. We have something that's very special. We built the greatest economy in the world, and I want to get that back as soon as possible. I think we can start getting it back very, very quickly. Look at the stock market today. When it has that kind of Kevin and Larry, when it has that kind of Josh, when it has that kind of a bounce today, as much as it went up, but I think it set some kind, almost a record over the last week, right? It's almost a record. And this is in the midst of something. Now, we're not in the midst. They feel we're at the other side of it, or you wouldn't be seeing numbers like this. But so we're at 24,000, maybe even a little above 24,000, and we were at 29,000. We never broke 30 on the Dow. So that's tremendous. But what it really does, you have a lot of very smart people. That means that they're looking to the future, number one. And I look at it as jobs. I also look at it as sort of guidance. It's a guidance in a sense. It's the stock market. Who would think you could have a stock market at 24,000 after we've gone through the worst pandemic since 1917? That's over 100 years. You know, it's the worst since 1917. So I think that's a great indicator. There are a lot of very smart people that understand that world very well, and they have a lot of confidence in it. And that's some of the companies that we hear, public companies, but it means jobs. It also means not only guidance, it means some people, and I know some great investors, people really have a lot of confidence in what's going forward. And that's what I see, and that's where I want it to be, okay?
Mr. President,
yes,
are you open to making a deal with the Postal Service that would allow it to borrow from Treasury without raising its shipping rates, its package rates?
Well, you have to raise the rates on packages because they're losing a fortune on packages. They're losing anywhere from $2 to $3 or $4 a package every time they deliver, so it's not fair. And it's not fair to the people that work at the Postal Service. You have some of these companies, the internet retail, you look at that, and they drop millions of packages on the post office. The post office delivers a package, and every time they deliver a package, they lose from $2 to $5 a package. And what kind of a business is that? And you could never replicate the post office. The post office is massive, but they've got places in little sections of our country that no company could ever go to, that took hundreds of years to build the post office. And when you look at the size of it and you compare it to companies, it's much bigger than companies. I mean, much, much bigger. There's no company that's the size of that. No, we want to stabilize the post office, and the way you do that is these companies are going to have to pay more, not the people. We're not looking for the people, but the companies are going to have to pay a percentage of that loss. You can't do that. The government shouldn't have to do it. I think the post office could, wouldn't it be great if it could, after so many decades, break even? But we're making a lot of people rich and a lot of companies rich by subsidizing these companies. On top of that, they don't pay the same taxes as a retail store. It's very unfair to the retailers. You look at these stores, the retail stores are being just clobbered, and there are so many disadvantages. But no, when we deliver a package at the post office, every package it delivers, they lose a lot of money. And that's not fair. Those companies should pay for it. Steve?
The President, over a year ago, asked us to chair a postal task force to look at restructuring. A year ago, we didn't have any Board of Governors. We now have a Board of Governors that's overseeing it. They're conducting a search. We look forward to hearing the results of the new postmaster, and we think this is a business, and the people at the post office will have a terrific opportunity.
And we're protecting our post office, by the way, and we always will. But we want our post office to be successful. We don't want it to be a laughing stock and a stupidly run organization the way it's been for so many decades now. It's ridiculous. And then we make other people rich. We make other people rich because we're willing to deliver packages at a fraction of the cost, so other people gain by it. And by the way, and you're hurting a lot of other people because you're hurting retailers. You look at stores where the stores they have to pay rent and taxes and all sorts of things that these companies don't have to pay. So it's not a fair situation. We want to take care of our taxpayers, and we want to take care of, very, very importantly, the people that work at the post office. Yes, please.
Mr. President, if there is another round of aid for the states and communities, are you going to try to restrict that aid from going to sanctuary cities and states?
I don't think you should have sanctuary cities if they get that kind of aid. You know, if you're going to get aid to the cities and states for the kind of numbers you're talking about, billions of dollars, I don't think you should have sanctuary cities. And by the way, the people that have sanctuary cities, they don't like it. I think politicians like it a lot more. I go to California, I go to lots of different places, and I have people with a very liberal bent saying they don't like sanctuary cities. They don't want criminals to be in sanctuary. They want security. They want safety, and you know they want borders too. They don't want people pouring across into our country. And you know, I was there a long time ago. The wall is up to 175 miles built now, and the numbers are incredibly good because all of that 175 miles, nobody comes through. Nobody even comes close to coming through, unless you have a climber of Mount Everest. But even they don't. It's not even easy for them, Josh. So it's been good. But very important for you. We want our farmers to be able to get the help, and we work it so it's actually easier for them to get in. You know, they've been taking some people that they've had for years and years that come with the crops and everything else, and that really have been great for the farmers. And we want that to continue and actually continue at an easier pace. We're working it so it comes in, so that kind of help can come in even easier, which I think you have to tell your people.
Could I just follow up and
Yes,
ask
please.
Explicitly, will you seek to prevent that next round of aid from going to sanctuary states and cities?
Well, number one, we shouldn't have to pay anything anyway, because all they do is make it very hard for law enforcement. So that's number one. But I think in the bigger picture, I don't see helping cities and states if they're going to be sanctuary, because all sanctuary means to me is it's protecting a lot of criminals and others, many people, but there are criminals. And, you know, you write about it all the time. I see stories every day where somebody's being totally protected. ICE can't get to them. Law enforcement can't get to them. You look at law enforcement hates sanctuary cities. We want a safe country. We don't want people that are criminals and criminals from other countries in many cases protected and can't get to them. And then we're supposed to make massive payments to those states to bail out what they've done wrong over a 25-year period. So we'll see. That'll be a subject that will be discussed, certainly, sanctuary cities. I think maybe it was brought up yesterday, and I made the statement, and people were surprised to hear it, but they shouldn't be surprised. Okay? Thank you.
Mr. President, when would you like the country to fully be reopened to the way it was before, as you mentioned?
Well, we talked about it, and very strongly Josh mentioned safety. Have to have safety. But at the same time, people want this country open. The people here want it open. And there is a danger to too much being confined to a house or an apartment or wherever you live. You can't, we got to start moving along. And with all of the testing we're doing, with all of the things we're doing, you can do this now. And governors are actually, a lot of pressure is being put on governors right now by the people in their states. They want to get it open, and that's what you want. That's what we all want. And with all of the procedures and safety, we've learned a lot about this hidden enemy. We've learned a lot. And there'll be pockets of fire, and we'll put them out. We'll put them out very, very quickly. But, you know, during this period of time, I think we've really learned a tremendous amount about how to handle it. Nothing easy, but we want safety. So we want safety, and we want economic, where people can go and make a great living and go back to living the way, I mean, you had people, we had wonderful people in yesterday where the business was going to be lost other than what we did, Steve, with the great programs that we set up. Their businesses were gone. One man, he was a chef with 5 children, and his mother lived with him and his wife, and he lost his job for the first time in his life. Some of you were there. And you had others that were equally so. It was pretty amazing. I thought it was a pretty amazing display of what we've done to help a lot of people. And you have millions of people like that, millions that have been helped where they wouldn't have a job right now, and where the small business would have closed. Now, these are big businesses, but the small businesses would have closed. And I think it's great when WIN, which is a terrific group of people, but when Matt says that, you know, we're supporting all of the people, I know what that is. That's a big, you practically a full staff and you have no income. That's a big thing. That's a great thing. I hope you're rewarded for that.
Thank you. Thank you very much.
No, it's a tremendous thing.
Target date?
Well, yeah, its target date is as soon as possible. Some states are already open. I mean, they're opening up rapidly. We have a number of them opening up on Monday. We have a number of them opening up sooner than that, as you know, or at least partially opening. Some of them even even with a very strong bent toward opening, they're opening up where they'll open a certain amount here, restaurants at 25%, then going to 50%, then ultimately we want to be back to where we're 100%. We don't want. I had one restaurant owner come up to me and said, "Sir, you know, I'm going to be opening up, but if I distance too much, I have 50% of the restaurant I had." I said, "And you'll also have a worse atmosphere." We want to be back where we can we want it to be the way it was, because the way it was is the right way. We can't have somebody with a half a restaurant. You understand? He had 175 seats, now he's got half. That's not going to pay the rent or whatever. Same thing with an owner. I was on the phone with the commissioners and some of the owners of sports, of big-time sports, and he was talking almost like he was going to have 2 or 3 seats in between everybody that was there. And I said, you know, you're not going to have to do that for that long. You know, you're going to be back. He said, really? Oh, really? He was like, I don't want people to get used to this, because this virus is going to be gone. And when it's gone, you want to get back to normal. You're not going to have a stadium that's 30% the size of what it was 3 months ago. If I watch Alabama play LSU, I don't want to see 20,000 people instead of 120,000 people. We want it to be the way it was. Now, we've got to wait till it's gone, and it will be gone, and we've done a lot to get rid of it. But we want to open our country. The people want this country open.
So this 100% scenario you're laying out, going back to the way it was, is that before the vaccine or after the vaccine?
So a lot of progress is being made on a vaccine, but you never know, right? You never know. With SARS, they didn't come up with a vaccine, and sometimes they don't, and sometimes they do. I will say this, I don't think there was the same effort, because a lot of people don't know what SARS is, and some people do. But they do come up with vaccines. I mean, you look at what's happened, as an example, with Ebola, with AIDS, with others that have been so incredibly successfully, if not eradicated, certainly it's been incredible what some, with what these people that I'm dealing with right now, like Gilead today, with, what they came up with as an example, that's far ahead of schedule. So we're looking for vaccines, we're looking for therapeutics also. I mean, I think therapeutics right now, I'd rather, if you gave me both, I'd rather have the therapy, because that, makes people better right now, whether it's helping them along or makes them better almost instantly. We have to see. But there's tremendous work on therapeutics going on, and I think we're having some good results. One of them was Gilead today.
100% the full restaurants, the stadiums, theoretically could come before the vaccine.
No, I'm not relying on that. I hope that's going to happen. Johnson & Johnson, Oxford, you hear a lot of very good stories. I'm hearing them really firsthand, good stories, very promising, but they have to test it. Maybe it's not safe. Maybe it eradicates it, but it's not safe. And, they have to do testing with vaccines, whereas the therapeutics, it goes a lot quicker in terms of the process. No, if you don't have a vaccine, if the virus is gone, we're like we were before. But having a vaccine would be a great thing. And I think we're going to get there in this case, just based on what I know, but we'll see what happens. Look, the Gilead research has been, that's gone so fast. That's gone at a level of speed that nobody's ever seen before. And that's a stepping stone. So I think they're doing very well. But no, I want to get back with or without, but I want, obviously we have to wait till it's gone. It will be gone. And we want to be back to where we were. Yes?
Without a vaccine, sir, why do you think the virus will just be gone?
It's going to go. It's going to leave. It's going to be gone. It's going to be eradicated. And it might take longer. It might be in smaller sections. It won't be what we had. And we also learned a lot. Again, if you have a flare-up in a certain area, if you have I call them burning embers, boom, we put it out. We know how to put it out now, but we put it out. And now we're equipped. Now we have more ventilators than anyone thought was possible. I mean, we're doing a tremendous service for the world right now. We're giving ventilators. We're making hundreds of thousands of ventilators in, I believe, 9 different plants that made other products, in some cases cars, in some places other things. These companies, General Motors and Ford in another way, and GE, so many companies, have Honeywell, they've stepped up. 3M has been terrific. They've stepped up like nobody's ever seen before. And the job they're doing is great. And I'll tell you, I think the job that they're doing on vaccines and on therapeutics has been great too. We'll see. We'll let you know about that in a little while. Please. Anybody else?
Yeah, Mr. President, oil's up today, partially on reports that the Treasury Secretary and others may have...
What is it up to?
Depends on which, but it's about $25. But on the suggestion that the Treasury Secretary and others may have presented you with a plan for government assistance to the oil companies.
Well, we're not going to let our oil companies go and get in trouble. It's not their fault that they got hit by 50% less volume in one day. One instant, all of a sudden, these very great companies are employing all these people. So I'm talking to Steve, and we just saved the airlines. The airlines were having the best year they've ever had. And then all of a sudden they're like out of business. We can't let that happen. So we saved the airlines. That's done. We're saving other companies and industries. And I would say, Steve, maybe you can talk to it, but I think the oil industry is one of the top on the list.
So we're looking at a lot of different strategies. We have a dedicated team combined of people at Treasury and people at the Department of Energy. As I've said before, this is not going to be a bailout of shareholders, but this is going to be supporting the national security issue. I would just comment the Secretary of Energy has done an extraordinary job of taking in oil in the strategic reserve in being paid for the storage capacity in oil. We're also exploring potentially having the ability to store another several 100 million barrels. So we're looking at lots of different options. We're in touch with lots of people around the world, and the President is determined that we protect the national security interest and the jobs.
Announcement this week about?
Well, we had a very interesting thing because we had a lot of capacity, meaning you can fill it up in the national strategic reserves, and, you know, it wasn't full. And we made a great deal. If you would have told us that we could have had that filled up, or it's on the way to being filled up at the kind of pricing that we're talking about, I would have said, you have to be kidding. We're talking about 19, I'm not sure Chris is going to be happy about this because it doesn't pertain to the hotel business, don't get scared, but, you know, we're talking about like 1952 pricing. It's unbelievable. It's prices that are so low. And in some cases, we're storing oil and getting paid for storage because we have a tremendous capacity for it. So what's happened with the strategic reserves is incredible.
And additional aid might be announced this week, or do you have a timeline for that?
Say it.
Additional aid might be announced this week, or do you have a timeline for it?
On that?
For oil companies.
Well, you mean a plan to help them out?
Yes.
I would say shortly. I mean, right now we're dealing with some of the big ones, but the big ones are very strong. They've been very strong over the years. I think that they're not going to have the problem. But we have a lot of great people and a lot of great jobs in Texas and Oklahoma and North Dakota and other states that are great. It's energy. It's not. I don't even call it oil. I call it energy. This is the backbone of the world, really. You know, you can talk all of the green. I'm all for green. But the green can't power these massive factories that are being built in this country. It just can't. The windmills aren't going to be able to do it, and solar's not going to be able to do it. I love solar, but it's not going to be able to do it. And, you know, we're getting it for the right price, but we're not going to let we're energy independent. We're not going to let our energy industry down. We're not going to let them, and it's not our fault. It's not their fault. But we're not going to let anything happen to them, so we're working on that very hard. I think protecting energy and energy independence, to me, that's a very big part of what happened. You know, energy has really helped me turn this country into the economic power that it's been, and we're not going to let that go. And sure, it's going to have a couple of bad years. We have a tremendous oversupply. The reason we have the oversupply, though, number one, it was a very efficient business. And but the reason we have it is because the demand got cut in half one day by this plague. One day, all of a sudden, take a look at the roads. It goes from packed highways, everybody traveling, going all over, to no cars on the road. I mean, that was 25, 30% right there. But then there's other things, factories that aren't working right now because of this. We did a great thing last night, using the powers that we have to make sure that the processors and all of the delivery of our food chain, that it was protected and safe. And those people, we were on the phone with all of them this morning, pretty much all of them, as you probably know. They were cheering, literally cheering over the phone. We did some good moves, not money moves so much as common sense moves, because they were being hurt by stupidity. And we have them really back online. So I think that we put out, that's called burning embers too. We put out a fire. So there'll be plenty of meat and pork and everything that you want, yeah.
And Mr. President, you said you were anxious to get out of the White House. Might we see some travel in the next week or so?
I think so. I think I'm going to Arizona next week, and we look forward to that. And I'm going to, I hope, Ohio very soon. And we're going to start to move around, and hopefully in the not too distant future, we'll have some massive rallies and people will be sitting next to each other. I can't imagine a rally where you have every fourth seat full, every 6 seats are empty for every one that you have full. That wouldn't look too good. No, I hope that we're going to be able to do some good old-fashioned 25,000 person rallies where everyone's going wild because they love our country. Okay?
Do you expect that to happen?
Well, I'm going to Arizona, and that's a little bit different. That's having to do with industry, because it's too soon for for the big everybody get together and stand next to each other crowds. But that'll be next week. I don't know. It'll depend. It also depends on states. You have different states. Some states are really in great shape now, and some states will be in great shape. But a lot of progress has been made. A lot of progress has been made. It's pretty incredible. Even if you look in New York, I spoke with Governor Cuomo at length today, and they're on that other side of the curve, a lot less. It's been hit very hard. It's New York, and you probably would expect that. But they're on the other side of that curve. The bed usage and the people coming to hospitals is way down, much lower than it was. So a lot of very positive signs are happening. Okay.
So, President, do you expect to be able to hold rallies before the election? Do you think
so. I hope so. Look, we have a tremendous pent-up demand. They love what we're doing. They don't want to have taxes raised. They don't want to have stupid things happening. They like the trade deals. We've made great trade deals. I mean, the greatest trade deals ever made in this country. And that's what they want. And we have a lot of them that were lined up and ready to be done. Right, Kevin? We have deals that were lined up with countries ready to be done that were so good for our country, so good for our workers. And then this scourge came along, and, that's the last thing people are thinking about right now. It's, we put them on hold for a little while. But no, I hope to see football games and baseball games and basketball. Now, for basketball, you're going to have a little bit of a time. I don't know what they're going to do. Maybe they'll be able to play sort of toward the finals or the playoffs or whatever they're doing. I saw baseball's doing something very unusual. I don't know if I agree with that. I'd like to see the Yankees play at Yankee Stadium. I see they have some ideas for baseball that are very different. I guess I'm a traditionalist, but I think they'd be able to play at Yankee Stadium with obviously smaller crowds, and then the crowds would start to build as things get to be a little bit better. But no, I think you're going to see some big things happening. And again, this is going away. This is going away. I think we're going to come up with vaccines and all, but this is going away. And when it's gone, we're going to be doing a lot of things. And again, you have to look other areas. There are areas, we all look at New York, and we see New York and New Jersey and some of these very high-density places where they're doing a very good job. It's just, it's not easy. But you have areas that are really at a very low point and really I always say heading south quickly, and that's what we want. So we'll see how it all works out. I think it's working very good. How about one more? Anybody else?
Just on that point of this going away, not to belabor the point, but isn't it going away because people are staying in their homes and people are not traveling, and once they come back out, there's no evidence that it would go away?
Maybe that's it. And I cannot tell you how dedicated the people of this country have been in terms of that. Yeah, one thing, if you stay in your home, you're not catching it. If you stay in your place and you don't go out, and which is what people were doing, but they want to go out now. They want to get back, and they want to do what they have to do. And some of the facts are coming out, and we did all the right moves. I tell you, we wouldn't do. We were talking to Mike before. If we didn't do what we did, you would have had 1 million people die, maybe more, maybe 2 million people die. And if you think that we'd be at 65 or 70 or 60 or whatever the final number would be, 1 is too many. I always say it, 1 is far too many. This should have never been allowed to happen. Should have been stopped a long time ago before it ever got here or to other countries. But if you really think about it, you could have had, I take a look at Elmhurst Hospital, or I take a look at some of these places that I know growing up in Queens, and I know Elmhurst Hospital, I know these places very well, like the back of my hand. And you'd see body bags lying all over the hallways and outside and going into refrigerated trucks. And multiply that number by 10 or 20. If we didn't do what we did, it wouldn't be acceptable. It wouldn't be sustainable. Nobody would have accepted that. It would have been a terrible thing. We've done it right. I can't believe how incredible the American people have been, because they went out and they really did this, Chris. When you think they went out and they did what they had to do. Every once in a while, a country like Sweden will be thrown out, or Brazil. Now, Brazil's having a hard time because they're having a hard time. But Sweden, the people in Sweden, they're not running around and shaking hands and hugging and kissing each other. You know, the bars are closed and the people are staying in the house. The prime minister doesn't have to say in Sweden, stay in your house. The people stay there automatically. And, you know, they're using that as an example. But they've been hit hard. They've been hit hard. But again, you call it automatic. I mean, it's automatic distancing, it's automatic protection. But places were closed, the bars were closed. You can't stand at the bars, you can't do certain things. You know, what we did is a great tribute to this country. But if we lose 65,000 people, it's so crazy to say it, it's just so horrible. But if we lose 65,000 people, and instead of that going the other route, we would have lost 1 million or 1.5 million or 2 million, it's possible. It's possible that you lost more. But could you imagine, look how horrible it is to lose 65 and then multiply that times many, many times. That would not be sustainable. So I think with all of that, I want to just thank everybody, and I want to thank these business folks are just tremendously talented people. People have no idea how talented they are, the job they do, and we're getting our way back, and we're getting our way back, I think, much faster than people think, and I think it's going to be a much more successful launch than anybody would have thought. I really think next year is going to be a tremendous year, and I think the fourth quarter is going to be, Larry, I think the fourth quarter is going to be fantastic. I can feel it.
I feel great. Thank you.
Yeah, I can feel the demand. It's going to be really fantastic. Thank you very much, everybody. Thank you.
Let's just get up. Let's go. Just want to say thanks for being here with us on News Now. As you can see, we do have a live look at that Johns Hopkins University map and where we are getting the latest numbers of COVID-19 here in the U.S. More than 1,034,000 cases have been confirmed. We do have an update coming from the state of Florida. They are entering phase 1 as far as reopening goes. Let's go jump into that live right here on News Now.
Into what we're going to do today. We're going to put that out publicly for you all sometime, I think today or tomorrow morning, and you'll be able to see that report. So this was something where we really wanted to get it right. I would have liked to have announced what we were doing 2 weeks ago if I could, but I wanted the data, I wanted the facts. I've been able to consult with some of the top physicians in the state of Florida. Some of these are in some of the best hospitals in the world about the outbreak, about where they see this going, and about the next steps that needed to be taken. And so that advice from physicians and the input was very, very important in what I decided to do. Okay, so here's phase 1. This really tracks what the president put out for phase 1. The schools, since they are in distance learning, are going to remain in distance learning. We are not, of course, going to allow visitors to these long-term care facilities. I am willing to reevaluate that if we have enough rapid tests where someone could come and test, and if they test negative and they want to go see one of their parents, then maybe you let them in. But it's going to require that capacity before we relax that. Maybe if somebody takes the antibodies test as well, then they would be able to go. Shutting down the visitation, we had to do it because we didn't want to have an outbreak, but it's tough. You have people there that don't have human contact with their family. And this has been going on now for almost 2 months. So if there's ways that we can do it safely, I would certainly revisit it. I think the main changes that you're going to see are the elective surgeries are able to resume, and that's going to take place statewide. People talk about elective surgeries as if it's something like cosmetic surgery or something that doesn't need to happen. Elective in most cases just means it's elective exactly when you schedule it, but it's usually something you need to get done. So I want that to be turned back on. The requirements of that is that the hospitals represent, they're going to continue to maintain a surge capacity if we see an uptick in COVID, that they have adequate PPE and aren't going to rely on the state for that, and that they're willing, able to proactively work with the long-term care facilities and nursing homes in their communities to be able to prevent outbreaks. And I think they're all going to be willing to do that. The president's guidelines talked about, quote, large venues, and they mentioned restaurants, movie theaters, and churches. Now, I never closed churches. We relied on voluntary social distancing. I've declined to go for movie theaters now. I just think it's practically difficult to do the social distancing. Indoor environments, I think, are more likely for transmission. So even though you could have done that in phase one, I think prudence dictates that we go a little slow on that. The restaurants, what we're going to do is allow outdoor seating with social distancing, so you need to have at least 6 feet apart from the tables. And then indoors, they can do 25% capacity with the CDC recommended spacing. I think that outdoor transmission, as far as we've seen, has been more difficult than the indoor climate-controlled transition. And so I think being outside, if you're 6 feet away, to me, that would not be any more risky than going to Costco or some of the things that Floridians have been doing throughout this whole time. So I think it's a way to give people, and maybe may even reduce density in some of these grocery stores. I mean, you have some of these things are really, really packed. So maybe it'll reduce some density there by giving people another option. And then obviously, we want these folks to be able to get back in business if they can do it safely. And I think I was convinced that this is safe. I had some medical folks recommend the outdoors to me, and they thought that made more sense. And so we're doing that. Some people, the task force recommended 50% capacity inside. I think we'll start with 25 with the outdoor and then see how it goes. Retail can go for indoor. Now, we have had a lot of retail open. I mean, Home Depot, all this. I was in Broward the other day. They're all lined up with their face masks 6 feet apart outside. Some people come out the store, the new people go in. So there's a lot of process being done already on that. The rest of the retail, other retail, was never closed down on any of the orders I did. People would do curbside delivery, they would do phone orders, but the essential activity was not considered going into a store and congregating for retail unless the retail was deemed essential business. We're now relaxing that. We're allowing the 25% indoor so they can continue doing the curbside, everything they've been doing, now have a 25% indoor, have to follow the CDC recommendations for social distancing. We're not going to change the bars, and that was recommended not to change the bars. They said you could do the gyms in phase one. I'm going to look to see what some other states, how they've done it, what the results are. I do want people to be able to get into gyms, and if I get some guidelines that make sense and I see other states have done it and it's been okay, then we'll obviously reevaluate that. And I would say the same with some of the personal services like the hairdressers. A lot of these folks are small business folks. They have been able to sell a lot of their products on curbside, but this was something that was not considered essential business or activity to have the face-to-face close contact. I think there may be ways, we've gotten ideas about how you can do it to make it low risk. I'm going to look to see what happens in other states, but for now, phase one is not going to include that. Phase one in terms of our vulnerable populations, and we've been messaging this really since early March. If you're 65 and up, if you have a significant underlying condition, you need to avoid crowds, avoid close contact with people outside your household, and stay home as much as you can. This is a disease. If you look at our fatality rates, we have at least 93% of the fatalities, I believe, are 55 and over, close to 85 or 65 and over. Between 80 and 85% of our fatalities in Florida are 65 and over. So the risk is greater in these groups, and we advise them to continue to urge caution in how they interact. There's a lot of social distancing that's going to be going on. Restaurant, retail store, obviously the essential businesses we've been having have been doing social distancing. I would tell people the most important social distance we can do is distancing the vulnerable population from those who are not. Because if you're not vulnerable, you may be a carrier of this and not have symptoms or not know it, and you have a risk to pass it along. So if we can do that, we're going to see a lot of progress be made as we go forward. We're going to continue with the CDC guidelines about physical distancing when in public, social groups at 10 or fewer. We're going to continue doing that. And we're recommending face masks if you're in face-to-face interactions with people, particularly in the workplace, and if you can't adequately social distance. So this is not, we're not going to fine people if they don't do it. And I think sometimes if you're going by yourself for a jog, you probably don't need the face mask. If you're in a face-to-face business, that to me has got to be a business practice. And then if you're in situations just in the public where you may not be able to keep that distance, then this is a good thing to be able to do. Florida's next steps. We are going to be data-driven. We're going to focus on the facts. The things that we're going to look at to go to phase 2 are going to be the things that brought us to do mitigation in the first place, primarily hospital capacity and hospital resources. If we start seeing cases where more and more people are going into the hospital and we think that it might be a surge that they can't handle, that is going to be something that we are going to look at, and that is going to be something that we're obviously going to have to take into account. As long as there's continued availability, as long as we're not seeing a flood of people into the hospital, that obviously is going to be good progress. We are also going to continue to look at the rate of positivity for our tests. What's going to happen is you saw all the expanded capacity that we're going to have. We think we'll be able to do 30 to 40,000 tests a day. I don't know if the demand's there for that, but we think we'll have the capacity to do that on day 1 when we get into next week. What'll happen if you do 40,000 tests, you probably are going to find people who are asymptomatic and who are positive, who aren't going to need to be hospitalized, certainly are not at risk for fatality, but you're going to find those folks. So you may see the total number of cases go up. You may see out of 40,000, you may see 2,000. We've never had 2,000 new Florida cases. You may see that. People will probably write that cases are, quote, spiking. That's not a good way to look at it. I mean, these are cases that are there. We're identifying it with aggressive testing. The rate would still be 5% if you were doing it, if you were looking at that. So we're looking at the positivity rate more so than just the raw number of cases, because the raw number of cases does have a relationship to how much you're testing. I mean, we had 530 new cases yesterday, but we only had 8,000 or 9,000 test results, whereas we've had other days where we had 800 new cases, but we had like 15,000 test results. And so looking at it that way is something that is going to be very, very important. And so those are going to be the type of metrics that we're looking at. We're also going to be looking at some of the syndromatic symptoms in terms of if you see certain things with hospitalizations, people going to the ER visit for things like cough or fever. That's something that we're going to be looking at for sure. So we're going to be safe, smart, and we're going to do this step by step. We are trying to build a foundation for the future of the state of Florida. We did not ask to be put into this situation. This was thrust upon us largely because of the malfeasance of the Chinese Communist Party. We are where we are, but I think that we can get through it. I think we can build a foundation. And I'm reminded of an old story, an anecdote from the Middle Ages where you had 3 stonemasons. They were working stone in Germany. They were just hard at work. You had an observer there that asked the first mason what he was doing. First mason said, "Sir, I am shaping stone." He then asked the same question to the second mason. The second mason said, "Sir, I'm making a wall." Well, he finally got around to asking the third mason, and the third mason was very excited and proud to proclaim, "I am creating a cathedral." The cathedral that we are building today is a state that is healthy, safe, prosperous, and free. We can do it. God bless you all. Thank you very much.
You listed a couple of benchmarks there, hospital admissions, test results. How long does the current trend need to stay in place without those things happening before you go to more restaurants, maybe bars, hairdressers? Even you look like you're needing a haircut.
Oh, I need it worse than anything. I haven't had a haircut since February. And so, it's really interesting how some of these talking heads on TV, it's particularly the ones that don't want anyone to go back to work, How come they always look so clean shaven? They always look so nice and kempt. How does that possibly happen if they're not allowed to get a haircut? Gee, I wonder what they're doing. So there's not going to be a firm time. I thought about doing it that way, but we look at the data on an hourly basis, on a daily basis. My hope would be each phase we're thinking about weeks. We're not thinking about months. If we're making progress, we need to continue to put people back to work in a safe, smart, and step-by-step way, but it's going to be data-driven. We also have, because we have 50 states, laboratories of democracy, we're going to be able to look to see, there's some states that have done it a little different than we have. There's some states, I think I deliberately erred on the side of taking measured steps, kind of even a baby step, to return to not normal where we were, but to start us on the road to a brighter day. And I think that that's the right approach. There's some other folks that were way more aggressive. There's some other states that probably aren't going to do anything for another 2 months. I'm not sure that that's going to work out well, but I think that's what they're going to do. So we're going to be doing it every day, every hour, watching this, talking with folks. I really like the trends, particularly outside of Southeast Florida. But if you look at Southeast Florida, you are seeing downward movement, and it's not going to probably happen as quickly for them as it did for Orange or Hillsborough or some of these others, but I do think it's going to happen. I think they've worked really hard. We've worked great together with them, and we're going to continue to do that.
Governor, correct me if I'm wrong, but it sounded almost like you were choking up a little bit when you talked about how Mamie hasn't been held by her grandparents. Have you had private moments through this where you have shed tears over what's gone on in our state, our country?
Brennan, it's been very difficult for a lot of people, including me. The stuff we look at who gets infected. That stinks to get infected with this thing. Now, most people, the vast majority have recovered, not even close, which is a good thing. Someone ends up in the hospital. That's not good. I know some people that had serious hospital stays, fortunately pulled through. And of course, we have people who don't make it, which is very, very sad. I think we were consumed with that for so much of this. But I think probably, since she was born and just in the last couple of weeks, it's occurred to me, none of my family has seen her. She's not been held by a single person in any of our families. My wife and kids, they have not left the house since February except to give birth. We've not just gone to a park as a family. We've not just gone and had lunch somewhere as a family. And so the little things that I think have changed has really had an impression on me. I think about kids not being able to compete in sports. I think about the things that families used to do and take for granted. Those are moments that you just can't get back. And that's one of the reasons why I'm convinced that we can take this step. We'll be smart, we'll be safe, we'll do it step by step. But we should have hope. We're very resourceful, we're very innovative. We can get this done. It's not going to happen overnight. If there was some magic thing I could flip the switch and say everything's fine, I would do it, trust me. It just doesn't work that way, but we need to get there. And I'd like to be able to get in a situation where her grandparents can come see her.
What does phase 2 look like, and how many phases are there?
So there are 3 phases according to the White House's guidance. I think we're gonna use that as our roadmap. Now, I departed from that on the movie theaters. We're not going to do movie theaters. They said you could do it. There are elective surgeries is a little more aggressive than what they had. They only wanted outpatient, but because we have so much hospital space, we believe that they can do inpatient and still accommodate any patients that would come in for COVID-19. So we'll do the same thing. I think, I'd have to look at it, but I think you would do more, maybe you do some limited seating in bars, but not have people kind of freelance together. You would do some social distancing in some of the larger venues. I would like to get to a point, I'm not saying we're going to get it in May. I've helped recruit, I wanted the wrestling to be filmed in Orlando. I'd like them to do WrestleMania. They were going to do WrestleMania in April. That was hundreds of millions of dollars. I want to keep that good relationship. I want them to invest in Florida. We got UFC to come to Jacksonville. Again, there's not going to be any fans, but I think those are going to be a good event for people. I work with Phil Mickelson on making sure they have what they need for that Tiger Woods match. So there's going to be a lot of good stuff going on, but I don't think we're probably ready to have fans. But I do think if the trends are good, I think as you get into June, July, I think there is a window to have some fans. You're not going to have everyone packed in, but man, in 90-degree weather in the state of Florida, if you're out there and someone's 10 feet away from you and you want to watch a ball game or something, you may be able to do that. So this is something that we're just going to have to do. We're going to be driven by the facts, driven by the data. But I think that Major League Baseball coming back, I'm hearing this, I think that that's going to be exciting for a lot of people. And I just think that there's going to be a lot of possibilities. So let's just be resourceful and creative. So we are accepting Dade, Broward, and Palm Beach, but that is not, we consulted with them on this. This is kind of the direction they want to go. They just did a big announcement. I think yesterday was the day where their parks and marinas and golf courses were open. They were the only ones that didn't have a lot of that open. We had a lot of people, I mean, they've had golf, they've been doing boating and stuff, and I'm not seeing any outbreaks tied to playing golf. I think it was the right decision to give people outlets and give them the ability to do some of those things. So we left them out. The rest applies statewide. Because of the numbers in all these other places, I'd find it hard that a local government could go against the advice of the best doctors in the state of Florida. When I'm sitting there at Cleveland Clinic, when I'm sitting there at Orlando Health, when I'm there at Tampa General, and all these renowned physicians are saying, we've passed the peak, we're ready for the next step. To have some local official do it, you're going against medical judgment, you're going against what would be good for the economy, you're going against freedom from your kids. So I don't think that's going to happen. So we just did it, and we'll see how it works, but I'm pretty confident that we'll be able to stick. Yes, sir.
If the positivity rate goes up in phase one, and
if the what goes up?
If the positivity rate goes up in phase one, if you have more cases, at what point do you begin to reassess the situation around the state? Do you say we're going to go back to a lockdown if the cases go up to maybe 15 or 20% again?
Well, look, so if they went up to 20%, that we've never had 20%, even when we were just testing in the hospitals. So you were at the beginning really only testing the people who were really sick and ended up in the hospital. We still didn't have that. So I don't think that that's likely. But for me to reevaluate any of these steps, I would have to be convinced that those steps are causing the change in positivity. And sometimes there's these connections that get thrown out. I mean, people were so upset, and they're not in Florida, but throughout, about Jacksonville mayor, who's doing a great job, allowing people to walk on the beach 2 weeks ago. Okay, they said this was going to bring the world down. Have you looked how many cases Duval County has had in the last few days? They got 1 million people in that county. I don't think they've had very many. I think it's been very, very low for a county that big. So people will say, oh, this, and there's no connection to it. And so I would look to see if there's something that's being done that is sparking some type of an outbreak, then of course you have to reevaluate it. But I wouldn't say, oh, well, we should just restrict X because Y happened if there was no connection between the two of those things. And so one of the things I think people, though, should know as we go forward, you study all these super spreading events that have really spread like wildfire, there are a lot of things in common for these things. There was the big funeral in Albany, Georgia. You had a super spreader, and a funeral is, you're going to be in close contact with people. You're going to be hugging, kissing. It's emotional. You're crying, all these different things, and there's a lot of very close contact. Well, this spread like wildfire throughout the funeral, infected a bunch of people, and you had a large number of fatalities just from that funeral in Albany, Georgia. You look at when the New Rochelle super spreader, he was somebody that was going to religious services, was very close. I think he went to like a business conference. He was doing a bunch of things that were really close contact with other folks. And so as we go forward, the choir in Washington State, you had a choir in Washington State, and they were just sitting there singing for an hour. But, you know, when you're doing that, and you don't have to sneeze or cough, you're putting out drop, and a bunch of them got infected. So those are the types of interactions that we really need to be concerned about. And so eventually we're going to do conventions and things again. How is that going to work? Because if you're in a business convention and you're around people and you're talking for hours and you're close, that definitely is higher risk. So you're going to have to think clearly about how you're doing this.
You put a couple bullet points on the screen of businesses that can be open, businesses that have to be closed. I imagine a lot of business owners are watching this right now saying, well, my business wasn't on that list. Am I supposed to be open or closed? There's a lot of gray area, and since you're not deferring...
No, there's no gray area. If you read, we're going to put the order out. So the order continues the essential business framework. So anyone who was under that framework is good to go. And then it allows responsible activity to include these new things like the retail, some of the other ones. So if you were good before, you're good there. Now, my original order did not actually close any businesses when we did that. What we did was we limited certain activities. So if you own a hair salon, I would not be able as a Floridian to go in and have close contact inside your salon, get the haircut, because we were trying to reduce those interactions. But you could sell all your product and have people do curbside, and a lot of people did that. And so that's kind of where we're at. So a lot of those businesses, retail, never actually had to close. They could do curbside. This then allows some foot traffic on a limited basis, which I think is a good thing. The personal services is something that we're looking at. I just want to make sure that we're doing it in a way that's safe.
Leeway do local governments have on restricting for their communities?
So what we did was we accepted Dade, Broward, and Palm Beach, and we're going to work constructively with them to get them where they need to go. And then we put, these are the state rules. We didn't specifically preempt local government, but like I told Troy, or actually, was it Troy? Who asked me that? You asked me that, yeah. I think it'd be really hard outside of Southeast Florida, and they're not included, but if they were, you may make an argument in some of these places. You go to some of these places that have such low rates where all these main physicians are saying we need to go to phase 1, to say that these modest steps are somehow not acceptable, that's going against medical judgment, and I don't think that they're going to want to do that. So I'm confident that this will be a good roadmap. I want to get Southeast Florida on the board, and I want to be able to get them in a situation. They're close. And I'll tell you, the leadership, they've done great leadership. The administrators in Broward, Palm Beach, the mayors, Mayor Jimenez, we work very closely together. He's had a lot on his plate. I mean, he's effectively like a governor in many ways because they got almost 3 million people there. That's bigger than a lot of states in the plains. And so we're doing that. I think we're going to be able to get them there relatively soon, but that's going to be a collaborative process. And I think we're better when we do bottom up, when we work together. I think that's probably the best way. But Dade, Broward, and Palm Beach are very important to Florida's future. They were all doing so well before this happened. You drive in Miami, you couldn't move 10 feet without seeing a crane somewhere. I mean, it was unbelievable. You look at all the business that was going into Broward. We had the Spirit Airlines, all these other great things. Of course, Palm Beach has a lot to offer as we're seeing huge amounts of wealth going down there. So we want to get them going. I think we have a good path to do it, but it's going to be on a little bit different timetable than the rest of the state. I'm going to go home and see my family, but God bless you guys. Thank you. Stay tuned.
Good afternoon, guys. Thanks so much for being here with us on News Now. We are taking a live look at those COVID-19 numbers here across our country. Of course, we were just listening in live to Governor DeSantis. He was talking about how Florida is going to be entering that phase 1, starting to slowly reopen, letting restaurants take about 25% of their customers. And so that's probably what a lot of states are going to be doing. We're actually waiting. Arizona right here is supposed to be getting an update from our own Governor Ducey at 3 p.m. But we are also going to be going live with a reporter here in just a few minutes. Just to go over some of those numbers here with you, we do have more than 60,000 deaths here in the United States, unfortunately, from coronavirus. But thankfully, we have had more than 120,000 people recovered from COVID-19. And our testing has continued to increase here across the U.S. More than 5.7 million people in the U.S. have been tested for coronavirus. And those who are still dealing with those COVID cases, we do have a number in the hospital right now. In New York alone, more than 65,000 people in the hospital. I'm just going to make sure that our reporter, her name is Hunter Davis, she's going to be joining us live here in just a moment. If you can hear me, just give me a quick little thumbs up. Well, coronavirus has certainly had an impact on many things here across our country. And recently, President Donald Trump signed an order to try to keep meat processing plants open, but the virus has been hitting some of the bigger plants pretty hard. And we do have Fox's Hunter Davis joining us live, and she's going to be talking about what could lead to those shortages and trouble for our nation's livestock and farmers. Hi, Hunter.
We are suffering right now, I can tell you, especially on the production side, but all through the industry. It is a very difficult time for all of us right now.
Cattle producers trying to get a grip of their new reality amid the COVID-19 pandemic.
My fear is what will the new normal be like moving forward? The economic losses, all of us in the supply chain are going to see losses across the way.
The National Cattlemen's Beef Association predicts the cattle industry will take a $13.6 billion loss. The Texas and Southwestern Cattle Raisers Association says plant closures are causing a bottleneck, leaving some ranchers no place to send livestock.
The economics of that bottleneck going into the processing facilities, and we just can't get enough product through the pipeline, so to speak.
But processing plants are working to ease the pain.
We've required face coverings and have performed deep cleaning at a number of our facilities.
Tyson Foods is one of several big processors working to find a new normal after being forced to close processing plants in Iowa and Indiana due to the virus.
It's throwing a whole new set of problems at us.
In the meantime, ranchers say they will bounce back, adding they always do.
Historically, cattle ranchers have been pretty resilient, but this is pushing all of us.
We're here that we're going to continue producing a safe and wholesome product. That's not going to stop. We are dedicated to making sure that there's food on the table.
Yeah, and one thing that I did want to ask you about, we talked about the larger plants. What about those smaller plants? How are they handling this COVID pandemic that we're going through? And of course, we'll be keeping an eye on that, keeping everyone updated. Thank you again, Hunter Davis, for joining us live. All right, guys, once again, that was Hunter Davis giving us a live update. And we do have a live update coming from Arizona as far as what's going to happen with our state reopening here shortly soon.
And I want to say that your actions are working. Everyone is doing their part. It's just not that I feel that or it's anecdotal. You see it. My job, part of the contract, is that I come in every day. There's no rush hour. The guys that drive don't speed, but they could, because there isn't much traffic. It's a 40% decrease in terms of what's happened year over year. And really, that's been part of the objective. A lot of these decisions were so that we could have the social distancing and the physical distancing, so people have been paying attention to what's been asked. And again, I want people to know how grateful I am. And we're seeing some evidence that it's working. I want to take you through this chart. The gold line is the COVID-like illness surveillance, and this is back from December 29th, and the blue line is the influenza or flu-like surveillance. These are tens of thousands of visits, both to emergency rooms and inpatient, month over month. The stay home, stay healthy, stay connected order was put into effect on the 31st of March, and you can see the trend downward, and this is where we want to see a downward trend over the last few weeks. So this is good news and a good direction, and it gives us the ability to hopefully see what's possible and what's next in our state. Even with that good trend, this isn't just about numbers or trends or pie charts. This is about the people of Arizona. And we have lost to date 304 lives in this state. So we have it on sound authority that will grieve with those that grieve and mourn with those that mourn. Everyone in our state has been indirectly affected by COVID-19. No one more directly than these 304 families. These 304 people, these souls that have been lost. And we want to make decisions so that we reduce this number to the best of our ability, eliminate unnecessary deaths that are happening in our state, and to slow this spread. So let me give you the latest. So these are the COVID-19 cases day by day. If you look at the far side of the chart, our first case came again on January 26th. It seems a lifetime ago. The next day, we set up the Emergency Operations Center, and you can see the decisions as they happened over the course of time. The public health emergency declared on March 11th, schools closed on the 15th, dine-in restaurants closed on the 19th, the stay home, stay healthy, stay connected order on the 31st, and you can see what's happened over the next 30 days. Now, if you're looking for a takeaway from this chart, again, there's a lot of information here. There is case-by-case daily information, but there is not a trend. And what I'm looking for, what Dr. Christ is looking for, are trends. Those last 4 or 5 days lag, and those will be filled in. We also track deaths by day. This is something we want to see reduced. Again, a lot of information here. With the last 4 or 5 days having yet to be filled in, you don't see a trend. But I want to share with you the tough information. Now, if you look at this on a composite basis, if you look at it by week, and you'll notice the most recent week, so that we could fill in the dates, is April 19th. So the question is, have we plateaued? Are we decreasing? And what will the information look like at close of week, April 26th? And again, that lags 1 week. We'll have that information on May 3rd. But the fact, of course, that you see this decrease in deaths by week is scenario, and that's what we've been focused on, and we haven't seen it yet, if indeed it is coming in Arizona. So let me give you a brisk update on where we are. If this were to come in fuller force than what we've seen, we need hospital beds for our people. The gray line, or the gray color, indicates inpatient beds that are available. The blue line indicates the beds that are in use. And the gold or orange, depending on how it shows on your screen, that shows the inpatient beds that are being used today for COVID-19 patients. You can see that is a small population of our hospital capacity today, and it has hovered somewhere between 7 and 10%, and it's been fairly consistent. If there's a takeaway from this slide, it's that we have capacity today in our hospital system if necessary. I also want you to know, I should have introduced them as we sat down. To my right is Dr. Kara Christ, who leads the Department of Health Services. To my left is Major General Mick McGuire, who's standing up our Department of Emergency Management and leads the National Guard. Together, they've added 1,560 beds in hospital capacity over the last 24 days. Intensive care unit hospital beds. That's if you get sick and you're very sick, you need an ICU bed. Same graphic scheme here. Gray is availability. Blue is beds in use, and the orange indicates COVID-19 patients. It's about 18 to 20% of available beds, and it's steady. It's a plateau, not really a trend, but you certainly do not see an increase, and this is data that we have in real time. On the ICU beds, Dr. Christ and General McGuire were able to add 1,928 beds over the last 24 days. And lastly, several weeks ago, the big discussion nationally was on ventilators. We went into acquisition and discovery mode. Where are our ventilators? How many do we have? We knew of 300 in the state of Arizona. Gray represents available ventilators today. Blue represents the ventilators that are in use. And the ventilators for COVID patients, you can see there at the bottom, kind of represents what you've seen before, a flat line. There's not a surge, but a takeaway is there are available beds, there are available ICU beds, there are available ventilators. Arizona has been preparing, and Arizona is prepared. We were also able to surge that number of ventilators from 300 to 1,718 available today. Now there's a lot of discussion around testing, and we've done nearly 70,000 tests to date in Arizona. I think it's 69,077 we reported today. We need more testing. We need diagnostic testing and antibody testing. We're going to have a blitz this weekend in partnership with our community labs to rapidly increase diagnostic testing available at drive-through sites. I want to thank the partners, Banner Health, Walgreens, and others that are stepping forward. What this test will tell you, and these tests have been prioritized to people that were symptomatic or sick, and of course our healthcare workers. It's now being expanded. Dr. Christ has issued a statewide standing order allowing anyone who thinks they are infected with COVID-19 or has been recently exposed to COVID-19, you can be tested. And we will have available tests, thousands and thousands of them this weekend. So if you're in this category, if you think you are infected, if you think you've been recently exposed to COVID-19, please go to azhealth.gov/testing-blitz and sign up to be tested this weekend. And what this diagnostic test tells you is if you are sick right now. It tells you if you have COVID-19. You could wait in line, get this test, leave your car, open up a door of a public building, and contract COVID-19. So it's not only about finding out if you're sick, we of course want to continue to prevent people from getting sick. But that's the testing blitz. We're also going to be ramping up antibody testing. What that tells you is if you've contracted COVID-19 in the past and have since recovered. Sonora Quest Laboratories have 1,000 to 3,000 tests per day, and growing from there. You're going to see more on that in early May, where you can find information. I had Dr. Bobby Robbins here about 10 days ago. The University of Arizona is funding 250,000 COVID-19 antibody tests for healthcare workers, first responders, and I saw Dr. Robbins on a national news show last night. He said he's going to be able to test all of the University of Arizona faculty and students. I'd love to see that extended to all of our college students throughout Arizona, and I'm thankful to Dr. Robbins for his leadership on antibody testing. So going forward, I just want you to know that we're going to continue to act with both our heads and our hearts on this. We're putting public safety and public health first. I'm following the guidance and the health guidance, and we realize that every decision that's been made affects the citizens of Arizona. And we want you to understand why we're making decisions and in what orders, because we know that we have asked a lot of the people of Arizona. So let's get to today's announcement. Our travel restrictions order will be extended through May 15th. This was to areas of the country that had travel advisories. Most recently and today, that is New York, New Jersey, and Connecticut, and that will continue through the 15th. In addition, our stay home, stay healthy, stay connected order is extended through May 15th with modifications so that we can return stronger, not only from a health perspective as a state, but economically. I think you can see with what we've been able to share so far, we have avoided what has happened in so many parts of our globe and our country. Our physical distancing is working. Your cooperation is working. I'm confident that we can say that we've seen the spread has been slowed, and these have been hard-fought gains. We've earned where we are today, and we are not going to undo this. The objective is that we do return stronger economically. We are going to focus on public health, and we have our arms around that at this time. So I want to discuss a little bit about what returning stronger will look like. I've talked about turning up the light in Arizona's economy. This pandemic has dimmed our economy as a result of the sacrifice that everyone in our state is making to slow the spread of this virus and of all that we didn't know 45 days ago. Now we know more, and the objective, while continuing to focus on protecting public health, is going to be to turn up the light in our economy. Heading into this pandemic, Arizona was the brightest light in the nation for economic growth, development, and momentum. And I'm confident that if we're responsible and thoughtful and methodical, we will be the brightest light economically going forward. So let's talk about how we're going to do this. We're going to return to physical health and economic health the Arizona way. So it will be gradual and phased in. You can think of that dial, if we make the right decisions at the right time, will be turned up at the appropriate times in the coming weeks and months. We're going to balance public health with the idea of returning stronger economically. We're going to increase testing to return in May while maintaining strong physical distancing, so that these habits that we've acquired over the last 45 days will not be with us forever, but they're going to be with us for the time being. And we're going to phase in return on the recommendation of the Centers for Disease Control and health experts through May and June. So before I talk about that, I want to say I've been listening. I've had a lot of phone calls, a lot of teleconferences. I've talked to a lot of business owners, and just about everybody knows my background was in the business world before I came and ran for public office. I'm aware of what other states are doing. But my focus the entire time has been on the state of Arizona. Our circumstances are different than any other state in the nation, and our decisions have been made to do what's the right thing for the state of Arizona. I was talking with a Fortune 100 CEO of a major big box retail chain. Everyone would recognize the brand. And he was sharing with me the numbers that they were seeing across the country and in Arizona. And he said to me earlier this week, he said, Governor, 30% of your citizens are ready to go out tonight to dinner. They are ready to go. They are over whatever fear was there, and now it's all frustration. He said there's another 30% of your citizens that don't want to leave the house until a vaccination is found. The fear remains very high. They are concerned, and they are very scared of contracting COVID. And he said, and then there's a group in the middle, 40%, who aren't sure, that don't know, that want to see evidence as to how they make decisions before they re-enter the economy. So I want you to know that my decisions are going to be made on what's best in Arizona, but what good is it to make a decision if you don't have the citizen and consumer confidence of the largest portion of your population. Because I not only want to reopen the economy, I intend to reopen the economy successfully in doing this. I intend to have our largest cities participating in it, our industries participating in those decisions. And I thought of this because I saw some decisions that were made elsewhere in a state with some similarities in terms of population to Arizona. And some of the leading folks in the restaurant industry said, we're not opening. We're not going to participate. Now, many of you were there when I kicked off my campaign for governor. I kicked it off at a Sam Fox restaurant. Now, Sam Fox isn't political. We're just friends because we were in the same business some time ago. So he let me come to that venue and make the announcement. What good would it be to reopen our restaurants if leaders like Sam Fox said, we're not going to participate? So we're going to make the decisions in a responsible way so we're not only successful in doing it, but we have safe participation. So I want to begin because I don't think that anybody ever believed that on May 1st we would have a return to normalcy in Arizona. What we want to do is eventually and gradually get there. So to review what's closed, the objective was that we didn't have large gatherings. That's how you had the rapid spread of COVID-19. That's what we had seen in New York State, in Mardi Gras, in New Orleans, and in some other large cities. So schools, universities, restaurants, down the line, disbursement of spring training, the fact that Major League Baseball never started up, the NBA never finished up, places like casinos. And I realize the sacrifice around weddings and outdoor events, most retail and daycare. But what's been closed has made the difference in terms of where we are right now in hospital capacity and the fact that we can make different decisions going forward. I hope it's not lost on anybody that we did do things differently in Arizona. We had a later timing and a lighter touch. 32 states issued a stay-at-home order before Arizona. They did it because their circumstances were different. We wanted to do ours in alignment with Centers for Disease Control and Public Health. And if you want to be judged in this position right now, I'd say the first thing you want to be judged on is how did you protect the citizens around public health? And I would say so far, so good, with more to follow. What's next is how will we be judged on our economic recovery and rebound in the state of Arizona. So in Arizona, we allowed a greater number of industries to stay operating. Just this week, I had a call from another friend in the restaurant industry who said, I realize we're not ready in the restaurant industry to reopen today, but you've got to get other stuff open. Just open it up. And I said, well, like what? What are you talking about that you'd like to see open? They said, let's build something. Let's reopen construction. Well, I want you to know, look at this list. Health and public health operations never shut down. Construction never shut down because you can physically distance on a construction site. Our manufacturers never shut down, and they were responsible in their practices in their manufacturing plants. And down the line, delivery and takeout, grocery stores, pharmacies, essential retail, gas stations, hardware stores, hotels and motels, car dealers, auto mechanics. I asked people to be healthy. They've been out in our state parks, hiking and running and walking. A lot of the folks in the media didn't like that golf courses remained open, but there's no place that's easier to physically distance than in a golf course. Our charitable organizations have remained operating and doing a great job. Goodwill, the media, of course, has remained open, along with banks, credit unions, critical trades, postal services, laundry services, and at our last meeting, elective surgeries were reopened. So I want you to know, as much as we need to turn the dial and brighten our economy has not been completely darkened. There has been some energy and revenue flowing through it. That's been part of the gradual, responsible, and balanced approach, and that's what we'll continue to do going forward, step by step. So the next step in terms of breathing life back into small businesses is we're going to bring back a small step in terms of a revival of the Main Street with a partial reopening to retail. You'll see this beginning on Monday, May 4th, and expanded on Friday, May 8th. It will be voluntary. We've learned a lot from our big box operators, our Costco's and our Targets, our grocery stores, our Fry's and Safeways, in terms of how to socially distance. We're concerned most, not only about our most vulnerable in public health, but our small and medium business owners. And this will be a way to allow them to participate in a safe and gradual way. There will be more details on our website and ArizonaConnected.org. I also want you to know that we have a goal. We're planning ahead in terms of what we want to do. Next week, you'll see a plan that's going to be released, informed and in cooperation with the restaurant industry. We're working with the Arizona Restaurant Association and Steve Chukri within CDC guidance so that we can begin to expand dine-in. Our goal is to do this sometime in May. We are aspirational at this time. The best case scenario, according to the industry, would be on May 12th. But it will have to be in coordination with the industry and public health. Our goal is to get this open in May. We're working with the leaders in the industry for best practices. A lot of people are talking about a new normal that's going to happen going forward. I'd like to think of it more as a temporary normal. And when you do walk in to one of those opened restaurants for dine-in, it will be a different experience. It'll be a temporary experience with food service workers and service workers wearing masks. Rather than coming to your table and asking you what you'd like to drink, they'll likely inform you that they've just washed their hands and ask how you would like your food delivered, et cetera, et cetera, et cetera. But a best case scenario on that is May 12th. We're going to work with the industry and we'll have best practices going forward. Elective surgeries were brought back last week. They'll begin on May 1st. They authorize hospitals and outpatient surgical centers to resume elective surgeries if they can demonstrate adequate capacity. Today, there's 1,090 of these establishments that are eligible to resume surgeries. So that includes hospitals, outpatient surgical centers, physicians, and dentists. So going forward, this won't change. The new habits we've acquired of washing your hands, avoid touching your face, covering your cough, this makes a difference. I think this is something that's just going to be good manners and good social etiquette going forward. So let's keep it up. And again, if you're sick, please stay home. Don't come to work as we see our economy begin to reopen. If you're teleworking today, continue to telework. We'll have more information on small and medium businesses in the coming weeks. What you can expect in May, and we'll visit as often as necessary, is we will continue in Arizona to put public health first. It'll be a step-by-step approach. We're going to have ongoing announcements as data informs our decisions. We'll give citizens and businesses the time to plan and adjust. The goal is that there will be no unpleasant surprises going forward. and we're going to follow the facts and CDC guidelines. So if you're looking for a headline among all this information and data, and I know that there is a lot here, I get to spend time with it every day. But if I wanted to summarize it, I would say that the stay-at-home order is in effect until May 15th, and Arizona's economy begins to gradually reopen. Dr. Christ?
Thank you. Do you mind going to the next slide for me? Thank you. So just to give a brief update on where we are, today we're at 7,202 cases. We've had over 68,000 tests performed in Arizona, and we're hoping that that will increase with this weekend's blitz. We do have cases in all 15 counties, and there have been 304 deaths of our Arizonans. So thank you.
Thank you, Dr. Christ. Now I'm going to turn it over to Major General Mick McGuire, who's going to give an update. If Arizona did have a hot spot, a thing that informed many of our decisions, it was on the Navajo Nation. It's something we've had a laser focus on protecting public health. I was able to address the community via their Facebook live meeting on Saturday night, and General McGuire, along with the National Guard, has surged emergency medical supplies and personnel to Navajo Nation. Will you give us an update, please, General?
Yes, sir, Governor. Thank you. As I mentioned last week, we did get a federal Type 1 incident management team up there led by Mr. Dave Samiago to join up with Brigadier General McDonald, working with President Nez and all of the leaders on the nation. In the last week, we've received 2 federal disaster medical assistance teams. I want to thank FEMA Region 9 for that. Those 2 teams are intended to man alternate care sites facilities in Chinle and Shiprock. The staffs arrived early, so we were able to get them integrated in Tuba City, Chinle, Fort Defiance, as well as Crown Point and Shiprock, to get them familiar with what's going on as we stand up. We're waiting final equipment for the 2 alternate care sites there, and we expect to open them this weekend. And then additionally, we continue to surge in task force logistics, meeting the food bank mission, and appreciate all the agricultural and food suppliers in the state stepping up and helping fill the requirement at the food banks. We've really increased that mission as we've pivoted away from the restocking mission and looking more at moving food to the food banks for our citizens.
Thanks very much, General. Thank you for the hard work of the brave women and men of the National Guard. Arizona and Navajo Nation is eternally grateful. We also, with Dr. Christ and General McGuire, we just got off a conference call with Secretary of Defense Mark Esper, who was specifically asking about Navajo Nation. I want to say President Trump, Vice President Pence, Dr. Anthony Fauci, Dr. Deborah Birx, Secretary Esper, Secretary Ross, who I'll be talking to later this evening, have given a real attention and focus on Arizona. We need that partnership and commitment, and we are grateful for it. And I'll close by just saying again to the people of Arizona, thank you. We are headed in the right direction. There is a real opportunity for May to be dramatically different than March or April. I'm cautiously optimistic, and we're going to make the right decisions with public health at the top of mind while gradually opening and increasing Arizona's economy. And with that, we'll take some questions.
Start on that side. We'll start with my heart. Governor, specifically, what would you need to see to open bars and restaurants? You mentioned today, I believe May 12th would be the best case scenario. Specifically, what would you need to see? And could you clarify what kinds of small businesses can begin to voluntarily open?
So good question. And the question was, what specifically would I need for bars and restaurants to open? So let me clarify that at this point in time, bars are not under consideration. Okay, it will be dine-in restaurants, And I realize that there are some bars or pubs where they serve hamburgers. Those types of settings will be different, and we'll work with the industry so that they have the guidance. But if you're thinking of a primarily that bar, that's later on in the White House and Centers for Disease Control guidance. And really, what we're measuring are the cases, the symptoms, and the hospital capacity, along with some data from testing. We do have some good trends. We just need some more data and information. I'm very hopeful. Like I said, I wouldn't have put out an aspirational date if I didn't think that it was achievable, or if that we could come within a week or two of it. If good news would accelerate, we could accelerate. I want you to know that we're working with the industry, and the industry has said to us the fastest we could open and have that temporary new normal inside our dine-in experience would be May 12th. Now, I've heard from a lot of business people who want to inform me on what other states are doing in other parts of the country that have other situations. I know there are states that have opened, I think this upcoming week, at 25% capacity. Well, anybody that's ever run a restaurant knows that 25% is the surest way to just continually lose a lot more money. Okay? We'll be able to open up within CDC guidelines, enforcing physical distancing, that it will allow restaurateurs to rehire and re-engage their employees and also have a pleasant consumer experience. So that's what you should expect first. Bars, larger areas like that don't have dine-in or sit-down will come later. And then the second part of your question?
Small businesses. You mentioned that some can open voluntarily. Can you clarify?
So it would be any small business that was out of that essential grocery category. Many of these closed voluntarily to begin with. I think it was Howie who asked last week, how is it fair that a Costco or a Target is open and some of these other small retailers are not? Well, again, people have stayed home. They haven't really been out shopping except for their essentials. These are basically pickup situations, and we've gotten much better at call-in, pickup, and delivery, with an expansion of that over time from May 4th to May 8th. It will be gradual, but it's really a catch-all category of small businesses.
Governor, we know you can't please everybody, but there are some businesses that have said they will reopen regardless of what your order is or your extension is today. What do you say to those businesses, those restaurants? And a follow-up question to that, what do you say to the small businesses that you're telling to stay closed for another 2 weeks if they can't hang on financially?
Well, the first thing I want to say is to every small business owner out there, to every medium-sized business owner, to every employee that is paid and lives week to week. That is the world that I came from. Those are the people that I have worked with my entire career. And I feel your frustration. And I have a sense of urgency to reopen. And I want to do that. I just want to do it at the right time, and I want it to be successful. It would be irresponsible for me to make decisions to reopen with the chance that I would have to come back because we didn't have the proper guidance or data and ask people to do this again. If we are able to do this and do this successfully, and what I've given is a line of sight till May 15th, I've actually said that the date on May 12th, and that's according to the industry. I would like to be there. It's aspirational, and it's possible. So I want to get there now. There's a raft of help that is coming from the state and from the federal government. We'll be talking more specifically about that for the employees. I don't want to see anyone get laid off, but if you are laid off, there's $840 a week in benefits from the state for 26 weeks with an extension of 13 weeks thereafter if it were to be necessary. And there's also the Paycheck Protection Program from Congress, and I understand the frustration that not everyone has been able to access this. I have relationships that have been able to access it, and I have relationships that have gotten stiffed on this. So I'm working with our congressional delegation, with our senators, so that we can make this right. And I'm asking people to hold on. We've worked with landlords and with banks so that no one is evicted, no one is locked out, no one loses their place of business. And once we can get reopened and we see that light at the end of the tunnel beginning to brighten, we're going to have options beyond that. Until that date, this order is in effect. And I'm asking everyone, as they have, this order's been in effect for 30 days. And I know it's been a long 30 days for all of us. Most of all, those that are the small business owners and the medium-sized business owners and their employees, people that have lost their jobs or had a reduction in pay. It's 15 more days. I'm asking for some patience.
Yeah, so Governor, I want to follow up to that question. There are many people, even in your own party, small business owners, who say they're going to reopen Friday morning. They've already put it on Facebook. They say there are no repercussions, so why not do it? How are you going to be enforcing this?
Well, so far, people have listened to the order, and I'm grateful that they've done that. Let me answer the question, please. I've got the question. To date, we've had where, of course, some phone calls have had to have been made or law enforcement has had to show up. But I would say, by and large, there's been, I don't know if I could say 100% cooperation, but pretty close to 100% cooperation. I'm asking for that going forward. If that's not there, this is an order that is enforceable by law. A violation is a $2,500 fine and up to 6 months in jail. And for those that own an establishment and are publicly going to flaunt the order, you are playing with your liquor license. Don't do that.
Governor, as you start to reopen segments of the economy, if there are employees who are right now they're getting unemployment because they're unemployed, and they're offered their job back, but they don't feel safe going to work. Maybe their immune system's compromised. Maybe their partner is a cancer patient. Are they still eligible for unemployment? What do you say to those people?
So, JJ, I'm going to restate your question because I don't know that everyone heard it. Before I do it, I just want to circle back and say I want everyone to remember, as a small business owner in the past, I don't take any joy at all in putting an order out there that's enforceable by law, that provides fines and et cetera. Let's remember why we're doing this, and it's to protect public health. It's because we have people that are dying that have contracted COVID-19. We've been able to reduce that number. We've been able to slow the spread. We're heading in the right direction. We want to continue heading in the right direction. And I want to be cautiously optimistic because I'd rather under promise and over deliver, but we're closer. So please stick with it. And the question beyond that was, as people are being rehired into the economy and they are on unemployment today, if their immune system is compromised, if they're affected by COVID-19, would they lose their benefits if they were not to take their job back? Is that fair, JJ? We're going to have flexibility. Okay, we're going to have flexibility around this. We want to see people that were employed reemployed. I'm thankful to the business owners that have been innovative and have provided telework, are allowing their employees to stay on. I know some business owners that have been able to access benefits, and they continue to pay their employees not only their salary and benefits to not work, but to hang on till they reopen. And the state benefits were there for just a downturn. We never imagined that it would be falling off a cliff like our economy did. But we realize that there's real fear and anxiety. There were many more unknowns going backwards. We're starting to fill in some of the blanks going forward. But the social safety net is not there to be punitive. It is there to keep people from falling through the cracks, and when it's properly administered, it should also serve as somewhat of a trampoline to appropriately return them to the workforce at the right time.
So does the existing legal structure around unemployment allow for it to not be punitive?
I'm going to be working with the legislative leadership, and I want to thank legislative leadership for being so helpful along the way to where we are to make sure we provide clarity.
Hi, Governor. Two questions. First one is strictly technical. I'm trying to think of restaurants. I know that your colleague, Mr. Abbott in Texas, had some very specific guidelines. I know why you don't want to do 25%, but he talked about things like non-reusable menus and one-use packets and things like that, and no salad bars. Can you give us some better idea of how this is going to work for restaurants? Because I think you've talked about it'll be a nice experience, but I'm not sure I understand how this is going to work.
Yeah, it's a good question, Howie. This idea of what will this temporary normal look like when you go out into a restaurant? Well, of course, I have a really talented team, but we also have some really talented restaurateurs here in Arizona. I think we've seen over the last 10 or 15 years, it's as good as anywhere in the country or the world. They are putting together some ideas around this because as much as they want to reopen at the earliest by May 12th, they want to reopen successfully. That 30% of the population that I talked about that's ready to go out to dinner tonight, that is not going to make for a successful restaurant industry. We want as many people as possible participating in the resurgence of our economy. So to do that, they're going to have to feel safe. And the 30% that I talked about that aren't going to, according to the large box retailer, their data, that aren't going to leave their home until there's a vaccine, well, it's possible that they're persuadable, that they'll be listening to that 40% in the middle who are saying when they went out that they could tell the restaurant was cleaner, that social distancing was enforced, that the server and the food people on the line not only had a mask on, but where appropriate they had gloves, that there was a reminder around hand washing and an increased sanitization. I'm certain that the restaurants will also have even better ideas. I know that there's concern around the menus and the spread of the virus on the menus. So we're going to work with them and have some time. So that's presented, and that's the standard of expectation and excellence that you would see. And then for us to be successful and for our restaurants to be successful, they're going to have people coming in, and I think people are going to have a healthy skepticism as to how things have changed and how can I feel comfortable that I'm not going to be exposed to this virus in your establishment.
Quick follow-up. You made a point of saying we're not like other states. We're not like Texas. We're not like New Mexico. We have 91 cities and 15 counties in this state. I've talked to mayors. I've talked to supervisors. And yet you want a one-size-fits-all for Arizona. I mean, Wilcox is different than Tucson. Flagstaff is different than Yuma. So are you going to leave an option in there for mayors looking at the facts on the ground to say, come May 15th, no, maybe we're not ready?
So let me clarify. Arizona is different than other states. We've taken a different approach. We'll continue to take a different approach. And your point is well taken. Different parts of the state are different. I realize that. That's one of the best things about running for this office is you get to all 15 counties and every part of our beautiful state. And your words, not mine, I do not want a one-size-fits-all. Of course, it would be more convenient for everyone if all guidance could be statewide. There would be less confusion. But if there were evidence that we could differentiate from that, we would, and it would be county by county. To date, none of the counties that we have, if you look at each section of the state, the northern part of the state, the central part of the state, or the southern part of the state, each of them have their own issues that wouldn't allow for that county-wide declaration. Now, I know nearly all of our mayors. We visit with them. We've certainly have gotten their input, and we're going to continue to listen. But we're going to make those decisions, whether it's continuing statewide or county by county. It would be whichever came first and was most responsible.
To make it clear, in the city of Tucson, if Mayor Romero says our restaurants are not ready to open up on May 15th, May 18th, whatever that is, she will not be free to decide that.
When I give guidance statewide, it is statewide and it is enforceable by law. It is the same when the governor gives guidance county by county. To date, our guidance has been statewide. Those are the options, and those are also the options and recommendations from the Centers for Disease Control and the White House.
Governor, thanks for taking a question. You said more's to come kind of on your roadmap with dine-in restaurants, et cetera. But why not release a phase-by-phase approach, the roadmap, so we can see what businesses are going to fall where so they have an idea? And how come you're the one deciding what business is more important than the other? So retail opening compared to a salon.
So I want to say that what Dr. Chris does is medical science. Okay, what we are doing in the reopening of the economy is with the guidance of medical science and protecting public health first, but the decisions are not. If you look at the decisions heading into the pandemic, it was to slow the spread, about shutting down the largest possible gathering points. If you look at what we've done in terms of the steps we've taken so far, it's been opening things in the most gradual of ways, and it will be ever increasing. Now, when you hear somebody say, play ball or batter up, or are you ready for some football when fans are allowed, these are the largest possible gatherings, and that will be an indication that we've come as close to a return to normality from where we are. But the decisions that I've been made have not been about which business is more important than another business. It's been around what public health is and where can we enforce social distancing. And you talked about a category that I have a lot of affection for the people that work in it, and that's our barber shops. I don't spend a lot of time in nail salons or hair salons, but they are in the same category. We are working with the industry on what best practices are around increased sanitization, business by appointment, social distancing inside the shop, facial coverings, both for employees and for customers in a voluntary capacity. There will be more to follow. And those are small footprints as well, Nicole. Those are smaller footprints. So those are things that we are aspirational to be talking about in May.
You're talking about large gatherings. We're just learning that the president is expected to come next week. He draws large crowds here. If people flock to where he is, what are you going to do with thousands and thousands of people, and should he be coming?
Well, first of all, I want to say the president's always welcome in Arizona. If we don't set the White House travel schedule from the governor's office. We've been talking, of course, I'm talking with the president and vice president every week. I think there's a specific reason that he wants to come to Arizona. I don't know that that's public, and it's not my role to disclose it.
Okay. And if large amounts of people show up, though, are you going to do anything for people?
I'm asking people to stay home, stay healthy, and stay connected.
So basically you're saying don't come to the president's rally?
I'm going to stand by the words that I've said, and Howie, that's not what's been announced.
We're going to go to Zoom next, so we're going to call on Leon Felipe Gonzalez from Univision. Leon, go ahead.
We've been
talking before about undocumented people and the importance of this community in our economy. They pay taxes, they are part of our economy, but they are not able to get unemployment benefits and also federal government help. What's your message for them in these difficult times in terms of their economy?
Thank you, Leon. And I do think, as thoughtful and hardworking as we have been, as Congress has tried to be, this is something that was not anticipated. I think people are making the best possible decisions that they can in this environment. The focus first and foremost has been around protecting public health and making sure that anyone that contracted COVID-19, that was in a situation where they needed assistance, a hospital bed, ICU, ventilator, that was available. We have that today. Now we're looking to navigate to the best of our ability to the other side of this pandemic, with still a lot of unknowns in front of us. But we're going to continue in that spirit.
We're going to do another one from Zoom. Lorraine Rivera from ADPM. Lorraine, go ahead.
Hi, Lorraine.
Lorraine, you're on. Can you hear us?
All right.
Go ahead.
Oh, can you hear me?
Yes, I can hear you, Lorraine. Go ahead.
All right. For some clarification, I noticed that you said that places like, it's not worth losing the liquor license. What about a hair salon that's selling product or the nail shop that's selling product? Are they able to reopen but not do things like nails and hair?
So I'd ask people, it's a good question. I think people can hear it because it was on the loudspeaker. Smaller retail that is selling product in a curbside delivery fashion and not in violation of any order that's out there or has not expired can go ahead and do that. The information will be at azhealth.gov or arizonatogether.org. And that would be to sell product. It would not be to conduct the additional services, but I am aspirational that we will get there. We're just not there yet.
Governor, follow-up question. There has been quite a bit of concern over liquor stores being allowed to remain open, but church services not. How have you made those decisions about which places can actually function?
Well, first I want to say we have not made decisions about what places can actually function. We have made decisions around what is the proper guidance to slow the spread of this disease, and it's been from the Centers for Disease Control that gatherings of fewer than 10 are what help spread the disease, and that's, as you look through the slides of the places that have been closed, the places that have been allowed to remain open, and the places that are reopening. It's still in that same spirit. There will be a point where we'll have gatherings of larger than 10. I want to say to the pastors, the priests, the rabbis, the faith-based leaders, they have been incredibly responsible through this. There's been guidance that's been given out from the Catholic Church, diocese by diocese, the LDS Church, and the evangelical community. And to date,
All right, everybody, it appears that we just lost Arizona Governor Doug Ducey's live picture there, but that is A-okay because I have somebody that I would like to introduce you to, and she's got a story that's coronavirus related. So this is Alina Shirazi. Alina, hi, thank you so much for joining us. How are you doing?
Hi there, how are you? Thanks for having me today.
Yeah, absolutely. So we've got a story from you that we are so excited to air. Members of One Generation say coronavirus is hurting them the most, especially when it comes to their finances. And you have that story of money and millennials. You're live in Virginia.
That's right. Student debt and empty retirement funds. Those are all some of the things that are hurting millennials right now during this pandemic.
Millennials really cannot catch a break.
Economists say the estimated 73 million millennials in the United States could feel the most financial pain from the coronavirus. 31-year-old Cassie Santorelli is part of that group. The health and beauty business owner in New York City says her company was finally taking off. Now she's barely making sales.
Now it's to the point where I live in this building and I can't afford my rent, and I've been set back so much.
Economist Gray Kimbrough says many millennials fought through one of the worst financial disasters in modern history in 2008. Now they're once again getting knocked off their feet.
The entire millennial generation is really in that sweet spot for you're still in your first decade or 15 years of your career, and you're trying to move up and to get better jobs and just have it all pulled out from underneath you.
Emily Smith is 27 and works in D.C. as a digital strategist. She says some of her friends are also in a tough spot.
I do have several friends who have lost their jobs as a direct result of the pandemic. Just personally speaking, it's also impacted my retirement savings.
An impact that will last for a long time.
I'm 31. It should be the time where I'm settling down and wanting kids and getting married, and I won't be able to do that because I'm just going to be so far set back.
Pilar, there is a silver lining for millennials right now. The White House is helping young adults pay off their student loans one at a time. Right now, they are freezing their monthly payments until at least the end of September. Pilar?
Alina, any other advice for millennials to get back on their feet during this time?
Right, economists tell me it's a great time to save right now. I mean, nobody's leaving their house, especially millennials who tend to spend a lot on the weekends. They go out to eat, they go to brunch, hang out with their friends and spend money that way. So right now is a great time to kind of take that money and put that in their savings so they'll at least have something to show for at the end of all this. A little bit could go a long way.
All right, Alina, thank you so much for that live report. Really appreciate it. Stay safe and healthy out there.
Thank you.
All right, everybody, I hope you all are enjoying these stories from our Fox multimedia reporters as much as we are here from the News Now set. This is a great partnership that we hope to continue even post-coronavirus time. So you're getting some really awesome content here from some really great, some really talented reporters. So we are so appreciative of everybody's hard work, so appreciative of being a part of the Fox owned and operated group so that we've got the power and the capabilities to do all this. We're taking a live look now at the United States Capitol in our nation's capital, Washington, D.C. I'm going to keep you there on the East Coast and show you New York City. This is just outside the Fox News headquarters, right across the street from Radio City Music Hall. Looks a little gloomy out there in terms of weather. It's been raining for sure. Look at the wet streets. But I will say I'm noticing a few more cars there on the road than I'm used to seeing during these coronavirus times, the stay-at-home orders, the quarantine periods. Looks like some people are slowly but surely starting to get back out there. We're going to continue to monitor the streets for you right here on News Now. I am going to update the latest from Johns Hopkins University so I can show you the numbers there. And I'm literally just hit refresh to make sure that you get the latest numbers. Here is a live look as soon as the website loads. You can imagine being 4:05 here in Arizona, 7:05 on the East Coast. A lot of people are taking a look here. So here's the worldwide numbers. More than 3 million cases, 3,187,030. Unfortunately, look at that. We've lost more than 227,177 people. So let's take a look here at the scope here in the U.S. Unfortunately, more than 1 million cases, standing at 1,037,526. The total number of deaths, we're approaching 61,000 there at 60,846. That huge number there on the top right-hand side of your screen. Remember that number used to be the number of people who had contracted the virus and had since recovered. Now it is the number of people who have been tested in the United States. That stands more than 6 million at 6,026,170. So the little bit of silver lining there, because we're getting to see that testing is becoming much more prevalent. So feel free to let me know on the YouTube chat if you have been tested for COVID-19, or perhaps you were sick and you got the antibodies test. You don't have to say your results, but just if you feel like engaging in conversation on the YouTube chat, it would be appreciated.
I'm going to take you out now to the state of Washington, where their Governor Inslee just wrapped up a news conference not long ago. Again, this is News Now, whether you're watching on YouTube or you're watching on coronavirusnow.com. We are so grateful for you News Nowers worldwide, and we'll continue to provide you the updates as they become available.
Can I see your screen? Can you turn it a little bit so I can see it just in case? Is that okay? Great. That's really helpful. Oh, thank you. Thank you. Good afternoon. As you know, we've made the first steps in reopening our economy. We've lifted some restrictions on low-risk construction and outdoor recreation like fishing and hunting. And we've done this in a responsible way at the right time, I believe. Today, we are also pleased to be able to issue additional guidance to our hospitals on what procedures qualify as non-urgent surgeries. As some surgeries that doctors and hospitals were uncertain about how to go forward on our Stay Home, Stay Healthy initiative. And this will allow additional patients to have non-urgent surgery. It's going to obviously help people get access to new joints and the like, and it will help with revenue picture of hospitals as well. And I'm pleased that we have been able to do this in a way that will make sure that our nurses, our respiratory therapists, our physicians have access to personal protective equipment. And that's an important part of this because we want our heroes working in our hospitals to be adequately protected. I think we found a way to have both more non-urgent surgery and protection for our medical staff. We know that in every instance of reopening our economy, our guidance for lifting these restrictions are based on data and science. They're based on our ability to appropriately guard our health. Over a week ago, I said that I did not expect that the entirety of our Stay Home, Stay Healthy measure could be lifted on May 4th. And today I'm confirming that based on the data and science, that is the case. So based on the data at our disposal, the current order of Stay Home, Stay Healthy will remain in effect. And we will have more details Friday on the phased-in approach about how we will open our economy in a safe way. And we want to be comprehensive and transparent about that decision-making. That's one of the reasons we're here today. So today we are going to go through the metrics, the numbers that we will be looking at to determine when we are able to start the next stage of that reopening process. You might think of it that we have started down that process by reopening construction. We have started down that process by opening outdoor recreation businesses. And for the next steps, what we're going to talk about today is the metrics that will inform us about when we start the next step of the next phase. Friday, we will talk about what those phases will be. So you might want to think about it that today we're talking about when we will be making those decisions and how we will make those decisions. And Friday, we will talk about the what of how those phases will actually work. So this is a two-part discussion starting today. In general, I know this recovery has seemed long, but if we can avoid having to reinstate these restrictions, we know this very simply. The quickest way to reopen our economy is make sure that we get this job done. We do not want to go through this pain again. We want to make this a one and possibly done situation that we then can restrain this virus through testing and contact tracing and isolation of the relatively few people who become infected. So the fundamental principle we're following is let's just do this once and get it over with. And I think it is much better to be disciplined now with this approach rather than have erratic steps at a later date. I think one way to look at it is it's much better to do something 100% one time than have the sacrifice of 90% twice. And that guides our decision making in this very difficult challenge that we have today. I'm joined today by retired Navy Vice Admiral Raquel Bono. State Health Officer Kathy Lofi and Catherine Guest, who is the Deputy Intelligence Section Chief of the State Emergency Operations Center. And they'll be available to answer questions after I talk a bit. Today marks 100 days since our first case of COVID-19 was identified in our state. And we know our statewide community has changed greatly in ways large and small. And I think this may be one of our most difficult times that we've had in the state of Washington, but it is also the perhaps best time to demonstrate our community commitment to laying a sustainable foundation for the health of our state. It was FDR's prolific first 100 days where the concept of 100 days of action, I think, was started. We will see how history treats us about our leadership during these first 100 days and the days to come. And I hope that we will see great success. And we have seen considerable success already. We know those first 100 days have been extremely challenging and life-changing for all of us. And thankfully, the vast majority of Washingtonians have really responded admirably. That's why we've been successful. And we recognize that people want to go back to work. We want to open our businesses. We still can't do that for many of our folks safely. But we can give a picture of what the spread of the virus looks like and what we can do to mitigate it. So every day we review the data, in fact, hourly sometimes. And the public can view almost all of the data we have at the Department of Health website. That's at coronavirus.wa.gov, coronavirus.wa.gov. So we have sort of 5 buckets of metrics that we look at in this process. And I just want to show you what they are in general. All of them need to have reduced risk. All of them are at a position today that we have to improve our current situation if we're really going to take the next step of reopening. And as this chart indicates, these are first, disease activity, second, testing, third, contact tracing, fourth, risk to vulnerable populations, and fifth, the status of our healthcare system and its ability to respond to the pandemic and its readiness. And I'd like to talk about them with you today so we can be completely transparent with Washingtonians about how we're making these decisions. One thing to note, under each of these kind of buckets of metrics, there are multiple metrics, and I'm sharing just a few of them, the highlights, today. You'll notice that there is no one factor in our discussion today that is completely dispositive, and that's by necessity. There is no one number that is a magic number that can guide our actions. We have to use our judgment, which means we look at all of the numbers that go into the central question of when we can reopen our business in a way that doesn't dramatically increase fatalities in our state. So the first metric is our disease activity graphics. And this is a place we should start, obviously, because it's the status of the virus in our state. And I want to show you some of the metrics that we look at. They are not all, there are other things we do look at, but these are some of the highlights. First, we look at the cases per day judged by the date of the illness onset. This is a bar graph, obviously starts in February at a very low level. It rises through March, begins to go down in April, and you'll see we have case counts right now in the 100 to 150 range. By the way, the last bars are somewhat incomplete, by the way, because we accumulate numbers late in the day sometimes. So what we've seen is on the cases we're having by day. Now, these are cases where we have confirmed a person has COVID-19 by a test. They've gone up and they have gone down to some degree, but they are still significant. We still are seeing on a daily basis as to the diagnosis of the disease in the range of 200 Washingtonians a day. That's too high. And we have to get these numbers down to a level where we have wrestled them down to the ground so we can move to the next phase of our recovery, the next phase of opening our business and the next phase of how we really insulate and isolate people who are infected so they don't infect other people in the community. Nonetheless, this is showing some progress, but we are not out of the woods yet. The next metric we look at are deaths per day by the date of the illness onset. So what this graph shows is it shows the deaths that happen judged by the date that a person's illness started. And that's important because obviously people are in the hospital for some period of time between the time they get ill and between the time of their demise. So we backdate these to look at the date that people actually got sick. And you'll see that this has gone up significantly during early March, reached a generalized peak, and has come down during the April period. But we are still not at the level where we can be confident that if we release our social distancing, these numbers will not begin to go up as well. Our next metric that we look at our cases of COVID-19 hospitalization by the date of first admission. So we compile the hospitalization of people as they come into the hospital, and this chart shows that number by the date of the first admission. Again, goes up through March, reaches a peak, and has come down. And this is a good sign because it gives you some sort of hopeful projection of the upcoming weeks of people's course while they're in the hospital. But again, the numbers are too large, and we have to get these numbers down to a position where we can be confident that the numbers will not spring back up again, according to the epidemiologists. And by the way, I'm very appreciative of our expertise, some of which is on the phone today. It's very, frankly, makes me proud when I talk to Dr. Fauci and Dr. Birx and Dr. Redfield, who are in the administration, who run the CDC, and they tell me repeatedly that they believe our public health agency here is one of the best in the nation, and they certainly have been doing great work in the last 100 days. So we've seen some progress, but we're not down where we need to be. The next chart is the cases of COVID-19 hospitalization by illness onset, and that is a little different because it looks from the date the illness started rather than the date that people actually came into the hospital. But fairly similar curve in that regard, coming down, but not far enough. The next slide, and if you'll bear with me, this is a bit complex, but it's very, very important into our calculations. This shows the effective reproductive rate as best judged for the illness in King County. This is for data in King County. We really don't have data to allow this evaluation statewide yet, but King County is instructive. This is called the R0 number. That means letter R, number 0. And basically what it tells you is how many people become infected for each person that is infected. And you'll see that that number was over 3. It was approaching 4 in February of this, or excuse me, in March, early March of this year. And that meant that for every person who became infected, almost 4 other people became infected. So in order to stop the spread of this disease, obviously you have to get that number down dramatically. Now in King County, it looks like we have accomplished that. The R0 number is down by this dashed line, which represents 1. And as you'll see on the sort of beige to the right of the screen, it shows the spectrum of the most recent evaluations. Again, this was a few weeks ago, down around the level of 1. And what that means is for every person who's infected, they would infect 1 other person. Now, that's good in the sense that the numbers would not grow over time, but neither would they shrink. And the problem is that we have only achieved this level by very vigorous social distancing. The allied effort of millions of Washingtonians, particularly in King County here, have joined together to get a social distance that has made sure that we limit that to a 1-to-1 infection rate. But if we remove the social distancing, that number is just going to go back up again, according to the epidemiologists, and we'll continue to see a growth of the disease. So the fact is we have to get this number down to be in a position to assure ourselves that this virus isn't just going to come roaring back. And we need to see continued improvement on this R naught number if we're going to have confidence that we will be able to restrain the progress of this virus. The next 3 slides are important because they show projections of the future according to our modelers. So we have access to some of the best modelers into the world. These are folks who look at the daily data and plug it into their algorithms. They make certain assumptions about the course of the disease, and they provide a projection into the future. Each model is based on somewhat different assumptions and data sets, and we look at all of them. The first one is with the Institute of Disease Modeling here in Washington State, a well-respected group. And I'm going to take just a moment to go through this slide with you because it's a very important metric in our thinking. Basically, the dots you see are data points, and the model then reaches, in a sense, averages of these data points. And what the line shows in the middle of this sort of beige area, you'll see that the line went up in March, in a sense peaked or plateaued in late March, and is projected to continue to go in somewhat flat, just maybe a little bit decline if, this is a big if, we continue our social distancing, if we continue our efforts. But the model also projects a gray line on the right side of your screen. You'll see a gray line that starts to ascend again. That is the line that depicts what will happen to the number of people getting sick if we abandon our social distancing at this time or shortly after this time. It goes up dramatically. And when I say dramatically, I mean that. It means hundreds of people will die. And I have to tell you, I just don't think we can become inured to death. We see numbers, but each one of these numbers is a person. It's a son lost their mother or brother lost their sister. And this is a serious slide to look at because it means if we stop our efforts today, we're going to see a lot more people die in the state of Washington in not too distant future. So this is the Institute for Disease Modeling. A second model is by the Institute for Health Metrics in Seattle. This shows a similar depiction of some of the historical events and then predicts some things happening in the future. The red line, the solid red line, shows the historical numbers of the deaths per day, and then makes some projection in the red dotted line moving forward. The little vertical dash line is where we are today in today's date, or close to it. Now, unfortunately, I have a different slide that I meant to put in here, but the IHME modeling essentially depicts the same thing that the previous model depicted if we abandon our social distancing. And their projection would then show that dotted red line, which today is going down. Their projection is that it will continue to go down, but only because we're doing our social modeling, our social distancing. It would start to go up again fairly dramatically if we were to abandon our social distancing. I'll show you a third line. Yayung Gu, he's with MIT, again has some projections going forward. If you look at the projections of their modeling, not quite as optimistic given the rate of the curve is not as steeply down. But again, this is only if we continue our social distancing. So the summary, if I can, of this first bucket of metrics is that we have made progress. Washingtonians can be proud of the progress we have made, but we know that this disease will come roaring back if we abandon our current operations. So we have to go further to get these numbers down so we then can go to the next stage of reopening our economy and moving to our next stage of containing this virus, which I'll get to in just a moment. So our next bucket, if you will, is testing capacity and availability. Now, this is very important because obviously if you're fighting a war, you need to know where the enemy is. And our ability to know the status of the disease in general amongst the population is very important on what strategic decisions we make and when we make them. When can we open up some of these businesses? We need testing to be able to have an assessment of the status of the pandemic in this regard. We also need testing to be able to identify the people, obviously, who have the virus so that they can be isolated to prevent the spread of the disease. And I have to tell you that our testing capacity has been sorely taxed. If we could look at the slide, this is a slide, if you look at the bar graph in the lower left-hand corner, the beige and kind of tan graphs, there's some good news in our testing capacity. If you look at the tan-colored bar, it shows that we could do ideally 22,233 tests a day. That's the possible maximum of the capacity to analyze tests. That means when you take the sample, you run it through a machine, and they give you a result. So the machine part of this, we have over about 22,000 we could do run a day. That's a fairly good number. We would like it to grow over time, but it would be a good start. Unfortunately, because we don't have additional swabs and the viral transfer media, that's how they transfer the sample to the lab, we only can do about 4,650, which is the darker tan bar. So what you see is we have to have increased testing material if we're ever going to get to our what should be the capacity for tests today, so that when someone calls up and said, I've got a fever and I've got a cough, boom, we can get you tested right away within 24 hours, and we can take the next measure. Now, our success in this is dependent on our ability to get test swabs and to get a viral transport medium. And as you know, if you've been listening to some of our discussion, we have been urging the President and the federal government to give us greater assistance. We have scoured the globe for this material on a daily basis. I talk to CEOs of companies around the world about the ability to get access to this material from Switzerland on east. But we simply have to manufacture more of these products. And so we have been urging the President for some time to use the Defense Production Act to essentially order companies to make these products. We are desperately in need of this so we can get people tested in our long-term care facilities, in our meat packing plants, and everybody on the street who has symptoms can be promptly tested. There's been resistance to that proposal, but now we're seeing some glimmer of hope. I was told by the admiral in charge of this 2 days ago that more swabs would be sent to us from the federal government in the next week or two. We are very hopeful that that promise is met because it is necessary if we're going to achieve our goal of getting this testing capability that is very necessary. We've been appreciative of people around the state helping us in this regard. We've got some help from some local business people that have helped us find some access, but we need a guaranteed long-term stable supply in the millions of these test supplies to be able to help Washingtonians get tested in an appropriate fashion. Our next bucket of information is the necessity to have a very vigorous effort to, once we have people who are positive, to make sure that we investigate all the people they have come in contact with so that we can contact those people and get those people isolated so that they can protect their health and so that they don't continue to spread the pandemic. This is a very labor-intensive process. It involves armies of people being on the phone and email and text messages, first interviewing the person who has a positive test, and then going out to everyone around them and finding out who could potentially be being affected, getting those people tested and isolated if, in fact, they need isolation. So if we can look at what we have now about the potential of people working on this subject, if you look at this bar graph, It shows the number of case investigators that we now have and will have working on this. Today we have about 565 people statewide who are working on this issue. We hope by May 4th it'll be 1,378, and by May 11th we're shooting for 1,500 people. We're standing these people up. We are training them. We are training them in the privacy measures that we have to take care of, and using the technology to use whatever appropriate technology we have to communicate. So that is going on. We're very appreciative of the Washington National Guard. They're contributing about 700 members of the Guard that are helping build this capacity. And this is one of the highest priorities from the state of Washington right now. We have to treat this like a fire department. When you call for a fire, the fire department comes. And when you call with the COVID symptoms, we want you to get the same kind of response so that we can get on these diseases right away. So we're working on that, making good progress. The next slide shows some of our places where we have isolation and quarantine capacity in the state of Washington. It shows where where we're in excess of our 50% goals in that regard is in the green. And so we have facilities in most of our locations, but we have more to provide, and we are looking for additional isolation capacity. Now, I'd like to talk with you for a moment about a very challenging issue that we're going to be faced, and that is that as we find more people who are positive for this disease, and we will, because we will be doing more testing, most of those people, first off, all of those people will have to isolate for all of our benefit. And most of those people will obviously want to do that in their homes. That's going to be very challenging because when people isolate in their homes, it's not just them who have to isolate. Their whole household has to isolate. That means they can't be going outside of the house, except maybe for a moment's walk around the house. So that's going to be very challenging for our families, but it is one place where we can all be supportive of one another. Those folks are going to need people to do grocery shopping for them. And, friends can do that. We are going to have some capacity to do that as well. But that isolation is absolutely critical if we're not going to go back to a reemergence of this virus. And I appreciate everybody's work to help on that isolation capacity that we will be building to succeed on this. The next bucket of information we're looking at is risk to vulnerable populations. We know that we differ in our ability to sustain ourselves economically and otherwise, and so we evaluate what kind of risks there are to the most vulnerable amongst us. So if we can look at the next slide. Some of our most vulnerable clearly are people in long-term care facilities. And this slide shows the number per day of additional long-term care facilities that are reporting COVID-19 infections in their facility on a daily basis. The blue line that's climbing up there is the cumulative total of long-term care facilities that have COVID-19 in their facilities. This is an extremely important metric for us because these are the most vulnerable citizens in Washington state. And our ability to restrain fatalities is significantly dependent on our ability to make sure these people get the closest infection control humanly possible. I'm pleased that we now have strike teams that are out into many of these facilities to make sure they use the best protocols to reduce infection in the facilities. And I'm glad that we acted early to try to restrain visiting of people coming into these facilities. Very difficult for us not to be able to visit our loved ones, but critical for their survival not to interfere and inject these viruses into these facilities. You'll see that this is a significant number. Today, it's about 225 of our facilities have confirmed COVID-19, and that's why we were particularly vectoring in to make sure we do everything humanly possible for these folks in these facilities. The next slide that we are looking at is the divergent suffering dependent on vulnerable communities and a lack of equity. This virus is not totally equitable, and we're concerned about that. If you look at the demographics of the Washingtonians who are suffering from this disease, you see differences. this might be difficult for you to read. I'll just read a couple of our numbers. For our Hispanic members of our community, Hispanic folks represent 13% of our community, but they represent fully 30% of our cases. So the Hispanic folks in our community are having a disproportionate impact on them because of this disease for a variety of reasons. And we want to see every way we can to reduce that disproportionality that exists for. I'll just leave it on that right now rather than leave the entire graph. It shows an interesting disparity, however. The fatalities are different. Hispanic folks represent 13% of the total population, but 8% of the fatalities. So this is a non-equitable virus, and we are dedicated to finding all we can to try to reduce the inequities associated with this, in part by doing things like having standards for workers in the agricultural community. One of the things we're working on right now to provide standards of hygiene so that folks to reduce the risk. And testing is obviously very important as well, so that when we have folks that might be working in the ag community who are in difficult situations, we can increase the testing capability. This goes back to this testing capability that we talked about. The last bucket is our healthcare system readiness. We've been focused to make sure that our health system can take care of any surge of the pandemic, and so we evaluate that on a daily basis. The slide I'll put up now basically shows the available beds that are available in the state of Washington to care. These are additional beds that are available in our system, but currently are not used by a patient. And you'll see that we have maintained a relatively healthy number of just under 1,000 additional beds that could be available if the pandemic springs back upon us. This is important because this virus has been shown to, frankly, explode. That has happened in New York, it's happened in Louisiana, and we have to make sure that we have that maintenance. We also see a number of ventilators that are available. On April 28th, it was 848. As you know, because we've been successful, we've been able to send back ventilators to the federal government, and that's a good thing. And this is frankly a testimony, this graph, to the diligence of Washingtonians who have really abided by the social distancing strategy. And Washingtonians ought to be proud that we have kept people out of the hospital because we've made decisions about not exposing ourselves to this virus. And I want to thank everybody in that regard. And if you'll forgive me for a moment, I'm going to note a couple notes. The last slide I will show you is the status of our state personal protective equipment procurement. We have been intensely focused on improving our PPE access to people. We've been so frustrated. Many nurses have not been able to have the masks they needed. Emergency personnel have had to reuse masks. We need additional masks for our industrial components as we bring companies back online. They're going to need additional masks as well. So we have been searching the globe for this material since day one. I'll just give you some sense of where we're getting our PPE from. There's a pie chart you see. We've got about 13 million pieces of PPE through our state procurement system. We've received just under 3 million from the federal government, which we appreciate, and we've got about 2 million in donations, which we appreciate. Many businesses have been very appreciative. They've found stockpiles of this, and they've donated it to the healthcare system, and we appreciate that. But this is well short of what we need, and if I can, the right-hand bottom chart shows what we've ordered in the top orange line, shows what the dates we wanted to receive in the sort of broken stair-step line, and the little blue at the bottom is what we've actually received. So what you can see is we have been both dedicated to obtaining this material and have not been able to get as much material as we need from any source. This is, again, something we've urged the President to use the Defense Production Act to order companies to make this material. That is starting to happen, and we'll hope that that will accelerate. I want to thank the business people that have been pitching in. Today I had a visor that was manufactured by a company in Tacoma, Outdoor Research, Dan Nordstrom is now making masks for us. Many small companies are making all types of equipment. I want to thank the business community for helping on this critical shortage. So that is a rundown of our metrics. I'll just close before I stand for questions of a comment about these metrics. And that is, I think what we saw is there is no one number that any of us can hang our hat on to make an independent decision based on one number. We have to look at all of these in compilation, and we have to make sure that they all are significantly improved so that we can move to the next phase of reopening our economy that we will talk about Friday. But we've got the information that we need to make that decision. We just need increased and continued discipline and determination and resilience and compassion that Washingtonians are showing big time across the state of Washington. So for that, I'll yield for questions.
First question comes from Rachel with AP. You mentioned the current tests that could be done, but is there a number between the 4,600 that are currently being done daily and the 22,000 that's a goal that you're looking for as you continue to turn the dial and opening up the economy? And then also, is there a plan to do random statewide testing of asymptomatic people to get a better handle on how many people are out there who may be contagious but don't have symptoms and would need to be isolated as businesses start reopening and people start going back to work?
Yes, your first question is, we think a realistic goal during the next month or so is in that 20,000 range capability. And the reason we think that's a reasonable goal is, A, it's really what we need to be able to have that very rapid testing of everyone with symptoms so we can get them isolated. And this is critical because, we've been dedicated and we have been effective in the blunt instrument of social distancing. But this is a surgical approach. This is like a smart weapon against this virus, which is testing, contact tracing, and isolation. But that starts with testing. And we think that range of 20,000 is really necessary to give us high confidence we're going to be able to do that on a very rapid basis. So we need to have that tool ready to go as we go to the next phase. The reason we think it's reasonable is that if the federal government's statement that they gave me 2 days ago, I was on a call with the president and the vice president, and Admiral Guar, who's in charge of this process, and he told me flat that we would have enough of our swabs to quadruple our current testing in the next week or two. So we are basing this projection on that, and I'm very hopeful that that comes through. I know the Admiral is sincere in his commitment to us, but I also know that we've run into glitches in the past. So that's a realistic goal, and we have it. Your second question about broad-scale testing of non-symptomatic people. We would like to be able to do that, to have some better surveillance about the spread of the disease. There is the start of a process to be able to do that by doing antibody testing, using serology testing. And that's going on now in Seattle, where we are looking at, when I say we, I mean the research labs, are looking at used blood that is left over from the blood bank and looking to see what percentage of those have antibodies for the virus. That means people with antibodies have been exposed to the virus. Doesn't mean they have that. So that is the start of validating that process to be able to move forward. There are also some other companies that are coming up on antibody tests that might be able to do these antibody tests in mass. I talked to Siemens company yesterday about that. They think they have a technology that might come in several weeks that could do mass testing for antibody testing. And that will be useful for surveillance purposes, so we can get a handle of what the percentage of people is that actually had the disease that may have been asymptomatic and they didn't even know it. But I want to offer a huge caution about this, because there's some folks that have argued that this is a get-out-of-jail-free card, that once we can do that broad-scale antibody testing, we can all go back to work under the very mistaken assumption that because you might have a positive antibody test, You are therefore immune from the disease and immune from transmitting the disease to other people. There is simply not medical research to really show that that's the case yet. In fact, the World Health Organization said that that's just not an assumption that any of us can make at this time. So further research might show that, plus or minus, but at the moment, we cannot depend on antibody testing to set us free. We cannot depend on getting an antibody test, showing that we have the antibody, and then feel free to go back to work and ignore social distancing. That would be a potentially fatal mistake. Now, there are some that are trying to trumpet that and suggest that's why we should just abandon our current efforts. But that is a very dangerous bet, and we cannot gamble on this.
Next question comes from Joe with the Seattle Times. You have given some specific metrics on things like the number of testing you want to see for things to open back up. But what are some specific metrics for the information you just shared, some of the charts that you want to see before the state can reopen? For example, what number of cases per day would you like to see? Where would you like to see the
Take another live look, everyone, at our United States Capitol, in our nation's capital, Washington, D.C. My name is Pilar Arias. I'm here with you for about the next hour and 45 minutes until Christy Larson takes over for the rest of the evening. We do have a live picture of the podium that Los Angeles Mayor Eric Garcetti will be speaking on in probably about 30 minutes. Meanwhile, though, I'm going to take you to Southern California. We can get an update from Los Angeles County from earlier today. This is News Now. If you are watching on YouTube, please like, share, subscribe. Let your friends, your family, your coworkers, your neighbors, everybody you know about us. If you're watching on coronavirusnow.com, well, you can't like and you can't share or subscribe, but please let all your friends and family and coworkers still know about us. All right, everyone, Los Angeles County coming up next.
And as is in most of our institutional settings where we are doing lots of testing, the vast majority of people who are testing positive are in fact asymptomatic. The facility released a media statement on this testing yesterday, and you can find more information about it on their website. We do post daily information by facility that includes the number of positive and suspect cases, as well as the number of people who have died among residents and staff. And you can see an updated report on all of our LA County cases at the Department of Public Health's website at publichealth.lacounty.gov. The Los Angeles County Sheriff's Department is also reporting 66 positive cases amongst their staff. 258 staff are quarantined, and 786 staff have been able to return to work. The LA County Fire Department is reporting that they've tested 79 employees. 18 of their employees tested positive for COVID-19. 8 of their staff are isolated at home, and 17 employees have returned to work. And thank you so much, Sheriff Villanueva and Chief Osby, for continuing to provide this information to us every day. 139,497 people have been tested and had results reported in LA County. 14% of the people who are tested are positive. And again, that number has not changed much over the last month. I want to encourage everyone to get tested, particularly if you have symptoms, and to note that the test only takes a few minutes. There are appointments available at the regional testing sites. You can go online and find the testing sites and make an appointment at covid19.lacounty.gov/testing. As we move through this pandemic, I want to share some context on the numbers that I report every day. There are many unique challenges here in our county that make groups of people particularly vulnerable when there's community spread of a new or novel virus. In certain parts of the county, especially certain neighborhoods in LA City, there's high population density, and this means that there are many people that are living close together. When people live in close proximity to one another, it's much easier for this virus to be able to spread. We also have among one of the largest populations in the country of people who are experiencing homelessness, and also people who are marginally housed. And we have a large number of people who live in poverty. These are community members of ours who are at greater risk for poor health, and if infected with COVID-19, they may experience more serious illness. So I ask that you help us make sure that people who have increased risk have services and support that they need so that they can both get tested, treated, and receive support services to avoid them falling victim to COVID-19. The fact is we also have a large population of medically fragile people living in skilled nursing facilities. We have 379 skilled nursing facilities across LA County. And this means that there are as many as 35,000 to 40,000 elderly, medically fragile residents who live in our nursing facilities. And they're also at much more increased risk of both contacting the infection and also having serious illness should they get infected with COVID-19. These factors do contribute to relatively high numbers of hospitalizations and high numbers of deaths that we see in LA County. And this is very similar to other large and densely population cities and counties across the country. In spite of our vulnerabilities, we're also seeing our rate of hospitalizations and our rates of people testing positive for COVID-19 remain fairly stable over time, with hospitalization rates remaining at about 22 to 25% of all cases, and positive test results remaining at around 12 to 15% of all tests. This is because of all the work you're doing to slow the spread. And as we prepare for recovery, tracking the information on the number of new hospitalizations every day will be critically important to assessing how well we're continuing our work to slow the spread. And in closing, I want to thank you again for doing your part to protect our community and to save people's lives. The key to getting through this, including through our recovery, is working together. And LA County is blessed to have both strong leadership from our board and our mayors across all of our cities and our residents and community organizations. And I know we'll continue to do an amazing job at collaborating as we prepare for our recovery period. So please, for now, I ask you to keep doing what you're doing. Follow the safer at home orders and take measures to prevent the spread of the virus and protect your loved ones. Infection control practices and physical distancing will remain with us for months to come. So it's good to get these down and to make sure that these tools we all feel comfortable using all of the time. They do slow the spread. I have enormous gratitude for all of you and for your service and for working together to, in fact, slow the spread of COVID-19. And I'm very proud to be part of the LA County community. And now I'd like to introduce Dr. Galley, the Director of Health Services.
Good afternoon, and thanks for joining today. My thanks to the board and to the Department of Public Health, to Dr. Ferrer and all of her team for their leadership in helping us move to recovery. Yesterday, the governor of California released his 4-stage plan for reopening California. The state will be relying on 6 different indicators that will determine when we are ready to progress to the next stage. One of these indicators is specific to the stability of our health and hospital systems. We need to have stable hospitalization trends and adequate surge capacity within the hospitals to care for both COVID patients as well as those with other conditions. In assessing our readiness to proceed to the next stage, we will continue to share information on hospital system capacity and projected demand trends. My continued thanks to Dr. Roger Lewis and to his entire team for their continued work in tracking this data across Los Angeles County and using it to project anticipated bed demand over the coming month. Our latest modeling continues to show that physical distancing is preventing transmission of COVID. The model predicts that if we reduce physical distancing, hospitals would experience an increase in patient volume after a delay of approximately 2 to 4 weeks without the implementation of other effective control measures. I'll go through in just a minute our modeling updates rather quickly, but I want to be clear. Safer at home and physical distancing is working and has been effective in flattening the curve in Los Angeles County. But I know it is also very difficult. We all feel it, and many are suffering economically as a result of the measures that the virus has forced us to put into place. But with the stability of the health system, Los Angeles County is one step closer to being able to begin paring back gradually the safer at home restrictions over the coming weeks. As restrictions are eased in a few weeks, we must continue to ensure that we are physically distancing as much as possible at the same time that we're working to get people back to work and restarting the economy. Physical distancing will be our new normal for quite some time. Turning now to the slides. Our first slide shows the hospital patient projections. Our new case projections continue to be well within the expectations and the band of uncertainty that we've outlined previously. There was just a slight increase week over week of new cases that required hospitalization. This means that our hospital system continues to be able to support those who need care, both for those with COVID-19 and those without it. I want to take this opportunity to remind people that the hospital system is there for you, and it is able to take care of you whatever your physical condition is. If you're having a medical emergency, if you have chest pain, if you're having symptoms of a stroke or other concerning symptoms, please go to the nearest emergency department or dial 911 for assistance. We do not want people to stay at home with what may be life-threatening conditions. The hospitals are there for you and can take care of you throughout this COVID-19 pandemic. On the next slide, in terms of beds, we're seeing that patients are spending longer in the hospital than what we previously modeled and anticipated. This means that compared to what the model showed us last week, the bed projections are slightly higher. We're still learning about the clinical treatment and the course progression of those with COVID-19 and are learning directly from the experience of real patients in Los Angeles County who have the disease and are receiving care across public and private hospitals. We're using this local data from the hospitals across the county to be able to inform the model's projections. Despite this increase in the length of stay, we are still well within the hospital system's capacity to meet our anticipated demand for beds. On the next slide, we'll shift to a look at the ICU bed capacity or intensive care unit capacity. Week over week, we are seeing largely similar projections around ICU bed demand and capacity. We continue to prepare new ICU beds so that we can activate those and bring them online if the need arises. The next slide focuses on ventilators. Same thing, week over week, we still project that there is a sufficient supply of ventilators for those individuals who require mechanical ventilation to support their breathing. On the next slide, the model continues to show that we must maintain physical distancing and that if we were to pare that back suddenly to pre-order levels, the situation would be dire, with the vast majority or virtually all of the county and the residents of the county infected by summer. In closing, I want to offer my sincere thanks for the healthcare workers on the front lines and for all of their amazing work and dedication to caring for those in need. And my thanks to every one of you as a member of the public for obeying the Safer at Home Health Officer order and for physical distancing as much as possible when you are outside of your home. Your actions have saved and are continuing to save lives. With that, I'll turn it over to Ryan for questions.
On today's call, please press 1, then 0. Our first question will come from the line of Betty Halsell with the LA Sentinel. Please go ahead.
Hi there. Thank you so much for taking my call and delivering this news every day. The whole team, Barbara Ferrer, Catherine Barger. I just need clarity, and this first question is directed to Catherine Barger. I just need to know where exactly are we seeing, is there a public chart in place that's visible that has the measurable numbers in order to reach the 4 benchmarks that you outlined previously? For example, or for instance, do we need 50 more test sites to see, results? Do we need, how many isolation locations do we need in order to, relax the safer at home order? I also take into the fact that we are aligned with the California state governor, but I kind of just want to see a visual if that's available. And then the second question is for whoever can answer. I personally see the reason why the numbers reflect a disproportionate rate within race and ethnicity is because there's an inequality within race and ethnicity within the city as far as resources go. I see the elderly being prioritized daily, which is needed, granted. I see first responders being prioritized daily, also very much needed and grateful for that. But I'm only hearing the numbers regarding the need to close the gap in resources for the underserved communities, in specific African Americans, since we, have acknowledged week after week that we are the highest death rate within COVID-19 related deaths. So I just want to know exactly what we have in the future because we are entering a new post-pandemic era. What exactly do we have in plan? What motions are on the table to close that gap? Thank you.
So I'll answer the first one. I can be pretty short because your second one I'm going to let Dr. Ferrer talk about, and if Dr. Galley wants to. But on the first one, those 4 measurables were created through the Department of Public Health, and I will make sure that we put up online something that shows what the measurables are because, quite frankly, we're depending upon public health based on the numbers each and every day, and then we look at it across the week and actually the month. So I promise you we'll get that up there for you so that there's something that will tell people what the measurables are, especially around the testing component of it. But I'm going to let Dr. Ferrer talk about the second question regarding minority communities and lack of access.
Yeah, thanks so much, and I appreciate the question I appreciate both questions, making sure that we're transparent and people know what are the metrics we're using to both gauge what phase we could be in terms of our recovery, but also then to make sure that we're not seeing some numbers that would cause concern and ask us to go back and reassess what we need to do in terms of our health officer orders. But I think the second question is extraordinarily important, and we did post a plan yesterday online, so I urge you and our viewers and listeners to feel free to look at the plan. We also are asking people to help us implement the plan. It's got about 8 different suggested areas of action. The most immediate focus for us, however, is to make sure that there's good access to testing, and I want to thank Dr. Galley, and she can come and talk a little bit about how she's making sure that that access is appropriately being distributed to make sure that those communities that have had the least amount of access see more access, but also acknowledging that we need to make sure that these testing opportunities are embedded with our trusted providers in many of our communities. So I think the testing strategy Dr. Galley could talk more of, but that's number one. If you can't get easy access to testing, it's pretty hard to know whether you need to isolate and your close friends or family members need to be quarantined. So we've got to improve the ability for people to get tested. And along with that is for people who are testing positive, it's extraordinarily important that they're connected to care. At this point, given the higher rates of chronic diseases in many of our communities of color, making sure that people understand that, as Dr. Galley mentioned, our hospitals are safe, our clinics are safe, and people who have underlying health conditions at the first sign of illness during a pandemic really need to feel like they've got a place to go. And if they don't feel like they have a place to go, we need to help make sure that we're available to help people find an appropriate provider. And along with access to treatment for health issues, It's really important that people have support that they need. These are extraordinarily difficult times. They're more challenging in communities that have not had access to the appropriate level of resources and opportunities, again, disproportionately among our communities where people have less income and where, in fact, there are people of color that are living in greater numbers. And this is the support part of the House. And the county family is here, again, as a family, to make sure that people are, in fact, finding access to meals and to food. And for those people who are homebound, there's a lot of expansion of our ability to deliver meals to people's houses. But we have to connect the services that are here with the people who need them most. And those are the immediate action steps for us. Making sure people can get tested, making sure that people are connected to healthcare services, they have good access to really skilled medical care and needed care, and that we're providing supports so that during this difficult time, people have what they need to really feel both cared for and to be able to survive. So, but we have 6 other items that need action that are listed in our action plan, and we're happy to get suggestions. We're relying very heavily on our community partners to help develop both this plan, but also the plans to really address the underlying inequities, the root causes of poor health among many people of color. So thanks for that question. We'll go on to the next question, unless Dr. Galley wants to talk about testing.
Just briefly on testing, we're focused on a several-fold plan to be able to ramp up dramatically the number of tests that we're able to perform across the county. This is focused on several different populations. First, obviously, anyone who's symptomatic needs quick and easy access to a test, and then as Dr. Ferrer pointed out, they need to be able to be linked to the healthcare system to provide for their ongoing clinical needs. Then there's focused testing that is needed for those in institutional settings. That includes the skilled nursing facilities as well as other long-term care or congregate living facilities. It includes those who are in correctional environments, in the jails, the prisons, and the juvenile halls and camps. We also need to make sure that there's implementation of testing strategies for those in congregate living situations for people experiencing homelessness. This includes the shelters, as well as other encampments for people experiencing homelessness. There's also strategies that are needed to be able to focus, I think, in part to get at your question, on specific at-risk groups, even beyond those vulnerable populations who are in the institutional settings. We're all deeply concerned by the data that shows that individuals, Asian Pacific Islanders, African Americans have higher mortality rates from COVID-19, and we need to make sure that the test strategy is responsive to that. The preliminary data from the testing sites, the drive-through testing sites that have been rolled out across the county, is that the test access very closely mirrors the ethnic and racial mix of the county, but we need to do more and better than that so that we're enriching testing in communities of color and in low-income communities who appear to be particularly susceptible to mortality from COVID-19. And so efforts to expand testing access points, which will be continue to be rolled out over the coming week, will focus on testing deserts, focus on low-income communities, focus on communities of color so that we can make sure there's easy access, and then critically the connection to healthcare services across the entire county. I'll take the next question.
That comes from the line of Jim Roop with Westward News. Please go ahead.
Thank you very much. Good afternoon, everyone. Again, curious about recovery. As I understand it, to be considered recovered from COVID-19, you have to have 2 negative PCR tests within a 24 or 48-hour period, something like that. Total number of cases in LA County since we started counting, 22,485. Number of deaths, 1,056, which leaves 21,400 left. How many of those people are recovered? Certainly we are keeping track of that. I don't imagine that 21,000 people are still infected with the virus. So how come we're not hearing about the number of recovered? Because that would be very, very important in the numbers that you do give us.
Thanks so much, Jim, for that question. So at the very beginning of the outbreaks across the country, the federal government through CDC recommended that cure test that you're talking about, that people needed to be tested after they were positive for COVID-19. They needed 2 tests, 24 hours apart, and both tests needed to be negative. CDC dropped that requirement early on because there was a real lag of appropriate testing for people who were ill, and there was a lot of testing that was going to determine whether someone was cured, and instead went to more prescriptive formula that says after, well, at the time it was after 7 days.
All right, everybody, Los Angeles Mayor Eric Garcetti just took to the podium. Let's listen in live here on News Now and on coronavirusnow.com. Not quite sure if they have the audio up yet, everybody, because it appears it hasn't officially began. So hopefully the audio will come up here in just a second.
You're all good. Just in the time. 5, 4. Good evening, Los Angeles. During nearly every day in this crisis, there's been some milestone, some holiday, some celebration, anniversary, or usual marker missed while we're at home. Moments when we typically come together and unite around a mission or a cause or a moment. And today is no different, because today is Denim Day. You might see a suit up here, but I'm wearing my jeans down here. A day which for over 20 years, I, with so many other people here in Los Angeles, around this country and world, wear denim to mark our work and raise awareness about sexual violence and sexual assault, and to make sure we do everything we can to stop it in our midst. At a time when so many of us are vulnerable because of our stay-at-home orders, our health and safety are paramount in all of our minds. And so no one is more vulnerable than a survivor of assault, one who every single day lives with transitioning from a victim to a survivor and moving on with her or his life as best possible. Today, we have to, even if we can't stand shoulder by shoulder, we have to metaphorically stand shoulder by shoulder with all victims of sexual violence and assault. One in which I remember the first day I wore these jeans and we got a call when I was a council member to my office and they said, "Why is my council member wearing jeans?" And a conversation ensued about a case in Italy where a judge overturned a rape conviction because the woman was wearing tight jeans, so she must have given consent. That started a worldwide movement, and Patty Giggins and Peace Over Violence, an organization based right here, has taken this worldwide. And so we say today that here in Los Angeles and nowhere in this world will we tolerate sexual assault or violence. And for those who are experiencing violence, even in the midst of this pandemic, please reach out, get help, call 911, allow our police officers to get you out of a dangerous situation and to bring perpetrators to justice. And to the survivors in our communities, remember you are not alone. We are here with you. We're here to hold you. We are here to make sure you get through this. And we are here to ensure that this doesn't happen to somebody else. And by speaking out and speaking up, we can get you the help that you need and ensure that we see one day in which we eliminate sexual violence in our community. This is the same ongoing commitment of solidarity, of love, of support that we bring to our fight against COVID-19. Winning that battle starts with understanding what numbers tell us about where we stand. So let me begin, as I always do each evening, with the data from today. As I always mention, too, our data snapshot, our summary, is available online at coronavirus.lacity.org. The same deck of information I get each day is available for you, so check it out. We can't go through every number in this briefing, but there's valuable information for you, your family, your community, and for one day, us making forward motion to getting back to normal. Today, the county reported 1,541 new cases, bringing the total number of confirmed positive COVID-19 cases to 22,485, a 7% increase since yesterday. For comparison, the past 7 days, we've seen an average daily increase of 886 new cases a day. As I've said, these are the reported cases in the last 24 hours. Doesn't mean these are the cases that have become positive in the last 24 hours. We smooth these numbers out, some days higher, some days lower, to an average that helps us know exactly where we are today. In the city of Los Angeles, there were 683 new cases. That brings the total to 10,380, a 7% increase as well. And we learned of 56 new deaths countywide, bringing our total to 1,056. This is a 6% increase since yesterday. And for comparison, we've seen about 47 deaths per day for the last 7 days. Across the county, our general emergency hospitals have right now 1,276 beds available, including 1,018 acute care beds, and ICU beds are at 258 available, as well as 1,091 available ventilators. This continues to hold good numbers, making sure that we haven't exceeded our capacity even as our cases continue to grow. Public Health report, the Los Angeles County Public Health Department also released a very important report that I hope you will check out. But let me summarize a couple things that talked about breaking down the number of COVID-19 cases here in Los Angeles and deaths by neighborhoods. These numbers showed us that on the whole, working class Angelinos and those living in poverty are suffering disproportionate rates of infection and some of the highest rates of death per capita in our county. In analysis of the data, the LA Times noted that some of our lower income neighborhoods in central Los Angeles are losing more than 40 people for every 100,000 residents, a rate 4 times higher than the county as a whole. Many long-term care facilities are located in lower income areas, and we think that's a part of this. And in this new data, in part, it reflects the tragic reality that this virus is hitting our elderly population especially hard, as well as those who are comorbid, a technical term meaning people who have pre-existing and vulnerable conditions. But it also tells a story that I've tried to paint in these briefings, that this pandemic has created new injustices and highlighted old ones, that while the virus can infect everybody, it doesn't affect everybody equally. It lays bare longstanding inequities in our city and our country, trends that are the result of generations of neglect, discrimination, and bias. That's why equity and access have guided our work since the very beginning, and why we've worked to quickly expand testing in those neighborhoods that are hardest hit. Because along with hand washing and disinfecting, covering our faces and physical distancing, testing is one of the best tools that we have to stop the spread of this virus. That's a truth we realized from the very start of our fight against COVID-19, and we acted swiftly to ramp up testing everywhere in Los Angeles. Early on in this crisis, LA stepped in to fill a national void, and we launched our own testing program. We started 40 days ago, quickly moving, building a testing infrastructure from the ground up. And I'd like to take a moment to lay out the scale of that so that you can appreciate the hard work of all the volunteers and firefighters, city officials, county officials who have worked to make sure that there are tests available to those who need them. It was Friday, March 20th, starting in a parking lot in Elysian Park, that the city began testing our first responders. And on that first day, we had the capacity to test 145 people. It seemed like a big number at the time. It was a small number in retrospect, but it was an important milestone that kicked off a massive scaling effort. Not one day went by when that effort didn't continue to expand our capacity. In that first week, by March 27th, we tested 5,000 people at 4 locations across the city. And on March 30th, Community Organized Relief Effort, or CORE, teamed up with the city to help us scale at our testing sites in Northeast Los Angeles, South Los Angeles. And on April 1st, we were joined by the county to expand testing for people across the entire county of Los Angeles. On April 3rd, we were up to 12 testing locations across the county, including 6 within the city, with a capacity to test 3,500 people in a single day. And a week after that, on April 10th, we nearly doubled our testing locations and capacity, surging to 22 locations and 6,000 people per day. And we said we'd double our capacity again, and by April 17th, we were up to 12,000 people per day. Today, we're at 34 testing sites with a capacity to test 18,000 Angelinos every single day. And over the past month, we've tested over 140,000 people just through those centers. Let me put that in perspective. In the United States, the COVID Tracking Project estimates there are approximately 200,000 tests a day. In Los Angeles County, where we just have 3% of the population of the nation, we have the capacity to conduct roughly 9% of all tests in America. This hasn't been a race to blindly ramp up testing. Like scientists working around the clock right now to find a vaccine and therapeutic drugs that can help with this crisis, we have made targeted testing decisions to help us ramp up in the right way with the right populations. Early data showed that COVID-19 was disproportionately impacting African Americans, so we quadrupled the size of the Crenshaw site. We opened up a walk-up center in Kedron Community Health Center, and through our partnership with the county, new sites were added in Inglewood, Charles Drew University in Willowbrook, and we saw outbreaks at skilled nursing facilities, so we surged teams and tests to those folks where our grandparents and parents might be, and where our vulnerable seniors live. And we became the first big city, and maybe even the first city in America, to mandate monthly testing be available at all of those skilled nursing facilities. We know that unhoused Angelinos, many of whom have underlying conditions, are both susceptible and vulnerable. Susceptible because they're on the streets, vulnerable because of their pre-existing conditions. So we stood up a testing facility on Skid Row, which in 9 days has tested more than 600 people. Just 3 of those so far have been positive. We have increased our testing capacity, but we have to keep doing more. I've been driving my team since the beginning. I want to thank all of them, led by Jeff Gorell, our deputy mayor, led by Dr. Eckstein, his counterpart, Dr. Kazan, and all the folks at Public Health and Health Services in the county, as well as cities who have helped stand this up together with CORE and other volunteers. As long as this disease spreads, we have to continue to scale. And as long as this disease takes lives, we must test. We know that coronavirus is a silent killer that moves quietly through the population. And many of the people who transmit the disease, this is why it is so deadly, don't know that they have it. We call it asymptomatic, but let's just say they don't have symptoms. They're infectious, but they're not showing any symptoms. And this illustrates why making testing available to anyone who wants it is essential. We heard national leaders talk about that in early March, but it's been difficult for folks to scale that up. which is why tonight I am so proud to announce that Los Angeles will become the first major city in America to offer wide-scale testing to all of its residents, with or without symptoms. And we did that in just 40 days. So all of the things I've been talking about, worrying whether you work in a critical sector, whether you have symptoms or not, moving forward, in the city of Los Angeles, you will be able to, whether you have symptoms or not, get tested. Those with symptoms will, of course, have the first priority, but we have the capacity, we believe, to move forward with that starting tonight. So if you think you might have COVID-19, want the reassurance that you don't, if you've been around people that you have seen with symptoms, get a test. We can do it. And I want to remind everybody, these tests are free for the public, no cost at all to you. But you can't put a price on the peace of mind of knowing that you can't infect somebody around you. So sign up tonight at coronavirus.lacity.org/testing. We have the capacity, so don't wait, don't wonder, and don't risk infecting others. This is a really important step to prepare for other steps forward in the weeks to come. We want everybody to be safer at home, but for some folks, we know that home is not necessarily a safe place due to domestic violence. And Los Angeles' domestic violence shelters typically house survivors and help them get to other housing within 30 to 45 days across a network of 1,000 beds. But as a result of this pandemic, obviously, people had to stay in place. There's no place for them to go, and those beds were full. A lack of available beds for new individuals seeking help and seeking hope suddenly dried up. And that's a problem that our LAPD has seen, a spike in daily domestic violence calls. And we have to meet this incredible need and ensure that survivors of domestic violence are met with critical care and support and do not become homeless as a result of this violence. And that's what we're doing. I mentioned it before, but let me spell it out. Rihanna, through her Claire Lionel Foundation, and Jack Dorsey, CEO of Twitter, through his Start Small initiative, they stepped forward and they donated $4.2 million to the Mayor's Fund to launch Project Safe Haven, which will house up to 900 families over the course of the next 3 months. I thank them both for their hearts, for the speed with which they did this, and the ability to save lives as we're saving lives. And I want to recognize a dear friend and the president of our Library Commission, Mai Lassiter, who played an instrumental role in getting this done. Thank you, Mai. Contracts have been executed between the Mayor's Fund and nonprofit organizations to provide case management, wraparound services for the 900 domestic violence survivors identified. And I'm very grateful as well to Lyft, which has stepped up and generously donated vouchers to transport these individuals and their families to these safe havens. So if you're a survivor of domestic violence or you're a victim tonight, we've got a resource to help you. Reach out. As I mentioned, you can text 911 if you feel that you're in a dangerous situation. Call 911 if that is available to you. Or go to coronavirus.lacity.org/DV resources to learn how you can get the support that you need and that you deserve. One individual who was placed into safe housing the other day had been forced into prostitution by an abusive partner. She and her son, who suffers from autism, were in a horrible, dangerous situation. But she reached out, and Project Safe Haven was able to place her into safe accommodations. Out of danger, she said, and I quote, "I can't believe people care enough about me to give me this opportunity." I want her to know we do care about you and any other survivors that are out there right now. I want every domestic violence survivor to know we care about you. Your safety is not an opportunity, it is your right. And you're not alone, and Los Angeles is here to help in the midst of this crisis. Every step we've taken during this crisis comes from a central impulse to protect the people of Los Angeles. That's why we're extending protections to survivors of domestic violence. It's why today I signed into law both a right of recall ordinance and a worker retention ordinance, which will ensure that workers who are hardest hit in those hardest hit industries, who have lost their jobs as a result of COVID-19, will be the first in line to get their jobs back once rehiring begins. And I want to thank Council President Noreen Martinez and her colleagues for leading the charge to get this passed through the City Council. and for her relentless advocacy on behalf of workers across Los Angeles. There's no doubt that we will feel the impact of this pandemic for some time, and the road to recovery will be long, but it's never too early to begin planning to put people back to work. From our hotels and our airports, from our restaurants and entertainment venues, LA's workers bring our city to life. It doesn't just happen magically. It happens because of hard work, and we want to reward that hard work moving forward. So let me make this commitment to you, the workforce that's been furloughed and is working without pay. In your moment of need, we will honor your experience. We will not let you be undercut by newer and lower wage workers. We will protect your jobs and your livelihoods. We owe you nothing less. As this crisis continues, my friends, I know it's tough not to start to grow restless. Everybody wants to know how this moment ends. They want to know when this moment ends, how we can emerge from this darkness, and what our brighter future, our new normal, might look like. You welcome me into your homes every single night through this address to offer answers and ideas and solutions. And I promise you that every detail that I have, I share with you as soon as possible. So I promise in these coming days, as we get close to May 15th, which, as I say each night, is not some magical flip of the switch or an opening of the doors and going back to what it was like before, but will be the beginning of our first steps out, if these numbers hold, that we will plan those things openly and together with our county, hopefully within our region, across cities, and of course, communities as well. That whatever it takes to flatten this curve, to keep strengthening our response, and to eventually start reopening our economy, to begin the long, hard work of both recovery and reimagining. Some of the days this week we'll be talking a little bit more in depth about how we do that. And look, I'll be straightforward, just as an Angelino, I know it can get confusing. You hear some things at the national level, and the state level, and the county level, and from a mayor. I try to synthesize all of those because I find them all helpful. What Governor Newsom has brought and his leadership, which has been tremendous. What we hear from national leaders who can give us guidance, and working closely together with my fellow 88 mayors across this county and our neighboring mayors up and down the state. We have you in mind. We want to make sure your safety comes first, that we don't make a misstep that results in crowded hospital corridors, more people dying, but that we also don't throttle the future and see opportunity disappear, something we can never recover from or rebuild from. So I want to thank you for your patience. I want to thank you for your persistence and let you know that towards the end, when we look at these days, the 2 weeks that are leading up still to the May 15th deadline, it's like the end of a race when you feel tired. I know the temptations are to get out there. Temptations are to maybe sneak away and do something that you know you shouldn't. We have to finish this race strong. And there's another race waiting the next day. As I mentioned, this won't stop anytime soon. It's going to be a series of sprints for a year or more. But I'm confident in you. I'm confident in your generosity. I'm confident in your strength and resilience. I'm confident in your discipline because the numbers don't lie. LA has saved lives, and we're going to need those same qualities to continue saving lives and rebuilding livelihoods. So let's keep it up and stay safe and stay healthy and stay at home. Thank you, Los Angeles. As always, much love and strength to each one of you. With that, happy to answer questions. First question, please.
First question is from Laura Nielsen with LA Times.
Hi, Laura.
Hi there. Hi, Mayor. Thanks for taking my question.
Of course.
So, as you know, dozens of cities around the world, including many in the U.S., including New York, Denver, Oakland, San Francisco, Boston, have started restricting car traffic on some streets to give people more space to walk and bike and maintain social distancing while they're outside. Why hasn't LA done this?
We are going to. I'm very supportive of that. We have a working group across the city. I think it's really critical how we do it and when we do it. That we not, as we saw at the beaches, there's some places, Australia's opened their beaches from 6 to 9 in the morning to exercise. It's been a successful way to open beaches. We saw pictures in Orange County that looked maybe potentially less successful this weekend. So it's very important not just that we take action, but we do it the right way. So we have a working group right now that includes my office, council members' offices, our Department of Transportation, our Bureau of Street Services known as Streets LA, and I do hope that we can do that in many parts of the city. I think it's important not to jump the gun before the May 15th deadline to make sure that we listen to county public health. I've talked with Dr. Ferrer. She doesn't support that at the neighborhood level at this point. It could draw too many people to one area. It could be something that spreads the disease. So we have to be extremely thoughtful, extremely careful about it. But it is something I absolutely do support. And as we know that there won't be a full-scale reopening, I think it's an exciting moment for us, especially people who live in dense parts of the city who really don't have any place to go. That if we can find streets that we can safely close in a network of an area so people don't go to one area, but everybody has places close, that is the criteria that I asked my team to look at and that we will as a city. So I'm excited to do that. I support it. It's something that will be forthcoming, but that planning is already underway. Thanks, Laura. Next question.
Jim Rope with Westwood One News.
Hi, Jim. How you doing?
I'm very well, Mayor. Good evening.
Good evening.
Thank you very much for taking our questions, and please thank your family too.
Thank you.
Must be a very understanding family.
Yes, I appreciate it. They are.
To be out so much to do this, we appreciate that. One of the things that is coming up is, at least a lot of questions coming up, is that as people start to get real optimistic in some recovery, we see a light at the end of the tunnel, so to speak, with some of the measures that the governor has talked about and some of the things you've talked about. So as we look toward recovery, there's some concern that eventually this is going to be put on the backs of the taxpayers. So how do you reassure Angelenos that when push comes to shove and the economic reality starts to hit about how much loss there was in the city's economy, that taxes aren't going to be raised or that things aren't going to happen, that it's going to wind up putting a lot of burden on the residents of this city?
Well, there's no question coming out of this that not just a reopening, which I remind people will not just be a linear reopening, meaning that we take steady steps. There's going to be times we take steps forward and the disease will cause us to retreat. There's times we're going to take steps forward and we didn't figure out how to do it right. The safety protocols didn't work, the physical distancing didn't, and we'll have to retreat. Other times we'll take steps forward and the world won't change, or it'll still be getting better and we can take bigger and bolder steps. But you're right, it's not just about reopening, it's about this recovery and who will pay for it. It's my philosophy, two things. One is the best thing we can do to pay for recovery is to get our economy going. That when people pay normal taxes because they're back at work, because we have businesses paying sales tax, that is the best way for us to finance recovery. Second, though, there's no question this will be shared sacrifice by all of us. Many have sacrificed who are at home. We made sure as a state and as a country we're paying for unemployment for people who can't work. Those of that who are working are getting haircuts. Many are furloughed, taking pay cuts. Other people are looking at what we need to do to make sure we get help from the federal government. And every night I've said, we can't do this if the federal government only bails out big corporations and banks, but doesn't help cities and states. Because we provide the critical city services, not just now during this crisis, but the ongoing crisis, and that keeps people safe. Domestic violence survivors need to have somebody to call at 911 and make sure that a cop shows up. We need to make sure that when somebody's having a heart attack, that there's a firefighter there. We need to have trash picked up. We need to make sure our parks are safe and green and beautiful. So there's no question there will be shared sacrifice, but I'm trying to do my best to limit that impact, especially on lower income and working class Angelenos, middle class Angelenos, who are the hardest hit by this. We don't anticipate right now balancing the budget by raising taxes or raising any fees. I can't speak at the national level where obviously they're spending a lot of money, how in the long term they will pay for that. But at least here locally, we squirreled away more in the reserve fund than ever in our history, double what it was before the Great Recession. But this is also going to hurt more than the Great Recession. So to me, the best thing we can do is to enact smart ways that are safe to us to open the economy and ways that get more people working, get more revenues paid, get more people who are, going to places that give us sales tax and parking tax and other things, and that should lead the way. If you go with taxes first and no businesses can get back up and running and they can't hire any people, it's like a never-ending sinkhole. So we'll be looking at that more on that later this week when we're announcing some of the folks who are going to help us do that planning and that reimagining of the future. in a couple days. Thanks, Jim.
Thank you, sir.
Next question.
Alex Mitchelson with Fox 11 News.
Hey, Alex.
Hi there. Congratulations on the testing. That's a big deal.
Thank you.
And the thought, though, of testing 4 million people, how is that actually going to work? Who's going to process all of this? What labs are going to be working on this? How long is it going to take to get those test results back? And sort of the bigger question about testing itself is, a test shows where you're at right now in this moment in terms of coronavirus. You could get coronavirus tomorrow. So are we going to be having multiple tests for people?
So great questions, Alex, and we wouldn't have moved forward if we didn't have confidence, at least in the capacity. We have been opening up each night to more and more people, and still at the end of the day, we have some tests that are left over. So we had the confidence that we could move forward. I would encourage people, it's not going to be 4 million people all rushing to the testing centers overnight. And we're noticing, for instance, we've offered all of our firefighters testing. Not all of them are taking us up on it. People who feel healthy and say, I haven't been around anybody, and I've been, staying at home for 14 days. I feel confident. I don't need to waste that. For other people who are working still, and maybe not in a critical industry, or other people who were around somebody who was sick, but they never knew if they had coronavirus or not, this is a smart thing for us to do. And having that capacity absolutely allows us not just to go once, but to go back multiple times. Now, you shouldn't be getting yourself tested every single day. That's not the doctor's advice. That's nobody's advice. But it is important, especially for people who are looking as we approach the May 15th date, if we open certain sectors or certain spaces, if some people return instead of telecommuting from home to working where they have other members of the public around them, it's smart to make sure that you are clear. The second thing we've all talked about is blood tests. We know there's 1.5 million of those coming to California. Those have to be used differently, and as Barbara Ferrer has always said, they don't tell you whether you're infectious right now. They're more a historical look. Have you ever been infected? And I hope that some of that can move hand in hand as the state begins to distribute those. And the state is looking to set up some more testing centers here on the day-to-day are you infectious virology test too, which we welcome and will embrace. But if we could put both of those together, you can see, am I one of those maybe 4 or 5% that have actually had it? That's great to know. Doesn't mean necessarily you're immune, but it's great to know. And then secondarily, the more important thing is, am I potentially infectious right now? Because as we've seen, many people get infected that have no symptoms, and that's how this silent killer spreads. So I'm very excited we're there. We have the confidence in it, even if it overwhelms. We've been getting usually about a 24 to 48-hour return time for our drive-through testing centers of those results. Occasionally it's spiked to 3 days, but it's generally in that 1 to 2 days back. And then lastly, we also have a lot of tests that are not the drive-through centers and walk-up centers. Those are the ones that we're doing with our unhoused Angelenos, our seniors as well. Those are a different sort of tests. Those take a little bit longer to get back, but it's definitely under a week. Those are effective as well, and we're saving those for specialized environments. And so to that point, absolutely, people could get multiple tests. We're not putting a limit on that, but we encourage people. If you feel you need a test, get one. If you want to be safe, get one. And for the first time, we're opening up that to people without symptoms, no matter where you work or even if you're not working at all. Thanks, Alex. Next question.
Emily Albert with Reyes with Los Angeles Times.
Hey, Emily, how are you?
Good, hi Mayor. The Los Angeles City Council voted today to ask you to put a moratorium on debt collection and to also declare collection agencies as non-essential businesses. Do you plan to take those steps, and why or why not?
I want to thank Councilmember Monica Rodriguez who introduced that. I think it's a really smart motion. I think it's one that absolutely cuts to the heart of those who are hardest hit, getting doubly penalized potentially. I've asked the city attorney to assess whether that's under the jurisdiction of what a city can do legally or whether that financial oversight exists at the state and federal level only. If we do come back that we can do something at the local level, happy to not only embrace that, but to lead the nation with that. So we'll just wait and see what the city attorney says. But I really want to appreciate whether we can do that ourselves or whether this motion helps us push for a state or national movement on this. I think it's absolutely critical. People, through no fault of their own, who see because of COVID-19 lose their jobs and see their credit go down, are going to have years of digging out of that hole, and that just seems wrong. That is of no fault of their own. So 100% support that concept. We're making sure that we have the legal jurisdiction. If we don't, we'll push for that at the higher level. Thanks, Emily. Next question.
Mary Beth McCady with KTLA Channel 5 News.
Hey, Mary Beth.
Hi, how are you?
I'm good.
Yes, I saw or was listening to you, and you were talking about May 15th and that being, a special day as far as making it to that date. And I'm just wondering, though, what type of changes would we see, if any, as far as loosening restrictions if the state doesn't lift their stay-home order?
So I think the state has been clear that regions can begin to move. They will have a base that we can't go beyond, but there's already been some flexibility. For instance, with some initial criticism, people were worried, as I said, about the construction industry. We thought those were vital jobs to protect and critical work to continue in a housing crisis and all the infrastructure needs that we have between public transportation and our airport and port. We were able to pull that off well. Northern California today joined us. We never stopped doing that, and there were 5 or 6 counties that did that. So it shows how the state is allowing flexibility of regions depending on what they want to do. It's too early to say the specific things, not because there's a secret plan, but it really does require making sure LA City doesn't do something that Long Beach isn't also doing, and Pasadena isn't doing, and Santa Clarita isn't doing, that the county is moving together, and hopefully some conversations between county leaders in the region. So just as we've seen in Northern California, when a number of public health directors from a number of counties in a region move together, I think that's a really ideal model, to have public health professionals from Ventura and Los Angeles and San Bernardino and Riverside and Orange and maybe even San Diego County move together. So it's not confusing to the public, so that it's uniform, and because it just makes sense. A disease, a virus, doesn't care where we draw a county border or a city border. We need to do these things together. But certainly, I think in the area of where we can go and spend our money, if that can be safely done, as we've shown in grocery stores, the sorts of spaces where we can go and get some fresh air and stay healthy while still staying away from each other, those are places I'm certainly looking at, that I'm hopeful that county public health will sign off on, and having conversations with our supervisor, Catherine Barger, who chairs the Board of Supervisors, and her colleagues, with Dr. Ferrer, with my colleagues like Robert Garcia in Long Beach, and Mayor Tornick in Pasadena. Both of those cities have their own health departments, to make sure we're moving together. And I just want to keep saying it every single time. May 15th isn't a day where everybody should be planning. It's over, celebration, big parties, quinceañeras, bar mitzvahs resume. Everybody's going to be back in hundreds of people, concerts. It's going to be small steps, but I do think people deserve those steps. Right now, we're so hungry just to see a little bit of forward motion, and if we can do that in a way, especially where the need is high, where the risk is low, and the ability to make safe is high, to me, those are the places we go first. Thanks so much. Next question.
Thank you.
Next question.
Cohen with Los Feliz Ledger.
Hey, Alex. How are you?
Hey, I'm great. Thank you, Mayor.
Good.
I think that's a really big deal that everyone can get tested. It's fantastic news.
Good.
I have 2 questions
Sure.
on 2 different topics. The first is regarding the 40 trailers that are going to Griffith Park and will be set up at Friendship Auditorium parking lot. I'm curious, since there already is a lawsuit against the bridge shelter that's going in their housing, why that location, and why not maybe like the LA Zoo, for instance? And how was the site chosen?
Do you want to ask the second question as well, and I'll answer them both?
The second question is, any update on the microloan program? How many applicants? Has it started to be funded, and has it been made easier to apply?
Absolutely.
Thank you.
On the second one, I know you applied, and I asked folks to follow up specifically on your application last time, so I'll see if I can get you information. I don't have the update. I think the last time I got that was about 3 days ago, so let me follow up and give you the exact numbers. We're also hopeful we can continue to expand microloans and always simplify. We appreciated that feedback. We think we got them out to many people faster than even the federal government did, but filling that hole and using potentially some of the dollars we got from the Coronavirus Relief Fund, the CRF, which was part of the CARES Act, is something, together with the county that received over $1 billion from that. What can we put together to help more small businesses who really the PPP program didn't hit? who don't bank with the big guys. So let me get you those numbers. In terms of Griffith Park, that was done by a whole group of people that work on this, from the Homeless Services Authority, my Office of City Homelessness Initiatives. We consult with the county and the state on those. And we usually put them close to where people need them to be and where we can provide the services. So I believe that's why the services were there. I know we had a lawsuit on the Bridge Home Shelter, which I just saw new pictures of. It's going beautifully, and one of 2,200 new beds that are part of the different shelters that we are opening up around town. And just as we've been sued other places, we continue forward. We've won those lawsuits. And what was beautiful in Los Feliz is you had the Residents Association, you had the Neighborhood Council. Everybody embraced that. And there will always be some people who say no, and I understand those fears. I don't dismiss them. But we can't solve homelessness by not building beds. And these trailers are a great way to keep people safe during this. We've seen how many people are experiencing homelessness along the Los Angeles River, especially right there, not all the way up towards where the zoo is. And so we hope that that can be a resource to keep people safe and to bring them indoors. And then lastly, as I said last night, shame on all of us collectively, from the federal level all the way down to the local, if we let people just return to the streets when this is done. So I'm spending a lot of time. I convened a group of business leaders last night to talk about how can we get the funds and ensure that we can use some of the COVID-19 relief dollars to bring people not just into housing for a couple months or for a year if this lasts that long, but then to permanently get them into housing, because this is a once-in-a-lifetime opportunity to make a bigger dent in our fight against homelessness. So I'll follow up with those other numbers for you. Okay, thank you. Next question, please.
Claudia Tishusa with KNX News Radio.
Hey, Claudia, how are you?
On the testing for all, regardless of symptoms, is that just for residents of the city of Los Angeles, or is it open to any LA County residents as well? And then I have a second question.
Sure. It is for the city of Los Angeles residents to begin with. I know the county's working really hard on that too and may get there very soon, and we're in discussions with them, but right now it's for anybody in the city that is symptomatic or that doesn't have symptoms.
Okay, sorry, it's really hard to hear you on the teleconference.
Oh, don't worry.
You're done answering the first question. And then the LA Times had an interesting article today on wastewater analysis as a possible way to monitor the spread of COVID-19. I wonder if that's something that might be done here. Why or why not? Thank you.
I haven't seen that article. I sometimes misread the clips in the paper. I'll check it out. I don't know is the short answer. It sounds very intriguing to use wastewater to look at some of that. But let me follow up with you. I'll talk to also LA County Public Health to see. We obviously have a lot of the sanitation. They have a sanitation district. But if that's something that helps us be able to assess that, it's certainly something we'll bring to them. But first, I've heard of it. Thanks for bringing it to my attention, Claudia. Next question, please.
Elizabeth Cho with LA Daily News.
Hi, Liz.
Hi, I actually had the same question as Claudia, but I couldn't hear the answer that clearly.
About the wastewater or about the testing?
Oh, sorry, about the testing, whether or not it's city.
It's City of Los Angeles residents. Right now, moving forward, it's the City of Los Angeles residents tonight, starting tomorrow. And I know the county's working very hard. They could be there very soon. But right now, it's the city.
Okay, so I guess it's not all 35, it's some of the 35, right?
You have to go through the portal, and you just give what your address is in there, and that'll direct you towards one of the centers. So it's not in every single one, correct? Any other things, Liz? Is that it? Okay. All right. I think I was told that was the last question, so I'm going to switch to Spanish. I'll be taking some questions in Spanish at the end. But thank you again, everybody. Please sign up, get a test. We're going to continue adding as much capacity as we can, but we appreciate all that you are doing. I know in these next 2 weeks, it feels like each day is almost like a year, but hang in there. I believe in you, I believe in this city, and I believe in our future. Thank you and have a good night. And now I'll switch into Spanish.
Everybody. All right, everyone. Thank you so much for watching News Now, whether you're watching on YouTube or you're watching on coronavirusnow.com. Pilar Arias still here with you for about the next 35 minutes, but I'm going to say good evening right now. You probably won't hear my voice again unless an update breaks live that I need to tell you where we are headed. But as of right now, we're going to stay in California and listen in on Gavin Newsom's update. He is the governor from earlier today.
program that we framed as beginning to solve two problems at once. And the frame was simple. We have so many restaurants throughout the state of California struggling, those that are just doing takeout, struggling to keep those doors open, others struggling to keep tabs on their employees that are now on unemployment, others that haven't even imagined the prospect of being able to even open modestly for takeout. We have seniors, millions of seniors in the state of California, many with no access to nutritious food, no access to prepared meals, no capacity at home, if isolated, to even prepare those meals in the first place. And so we advanced a framework to begin the process of reopening restaurants to start to provide those meals, 3 meals a day, delivered, packaged, prepared, delivered to the doorstep of seniors all throughout the state of California. That program now is just starting to take shape in cities and counties, large and small, all across the state. The state of California put out the framework, and it's the city's responsibility to engage the restaurants and work through the protocols. We've seen cities like LA and others really excel in this space, and we're very encouraged by this program. In that same spirit, in that same framework of collaboration and partnership, today we're announcing a strategy to do the same around food, but now focusing on farms to families, focusing on the issues that obviously are front and center all across the nation, and that's issues of food banks and how we could do more to help support our farmers, help support farm workers, and also help support food banks here in the state of California. This new initiative that we're launching today is a partnership between the federal government, the state of California, and philanthropy. It's a strategy that's rather simple. Currently, our farmers, our ranchers, are experiencing about a 50% reduction in demand, which is a jaw-dropping reduction in demand. They have excess produce, they have excess commodities that they simply, in many respects, as perishable items, some of them, they cannot distribute. We have food banks that have, on the average, seen a 73% spike in demand. Here we are, breadbasket, the world, California, and we want to address that mismatch. We want to address the supply and the demand. And so that's the announcement today, to work with the ranchers, to work with the farmers, to connect them to the food banks, and do so in a way that jumpstarts our capacity to deliver nutritious food, high quality, locally produced produce, poultry and dairy and the like to those most in need in the state of California. The partnership currently has about 128 farmers and ranchers providing food to 41 food banks being distributed in 58 counties. The goal of this announcement is to provide 21 million pounds of fresh food and fresh produce on a monthly basis, 20 to 21 million pounds of fresh produce and other commodities to our food banks. We've raised some $3.6 million to jumpstart this program. We want to extend this program through the end of the year. And we're blessed to have philanthropy, including Kat Taylor, who's been passionate in this space. She is committed to raising some $15 million. She initiated a contribution to that end to help get this partnership in place and help us launch it. But it is that partnership between our federal government, between state agencies, between philanthropy, and then our farmers and our farm workers that will pick and pack and distribute this fresh produce and these other commodities to our food banks. We are very excited and enlivened by this program, and I want to thank, and I'll introduce her in a moment, our Secretary of Agriculture, Karen Ross, who's helped spearhead this effort and advanced this cause and brought some of the biggest brands in the agricultural community to the forefront, from Foster Farms to California Rice Association, the National Dairy Association and bringing Grimway and others, Sunkist and the citrus side, Pacific producers, a partnership out here on the Pacific coast, even doing fruit bowls and the like. Again, all of this in the spirit of collaboration to provide these new food packs to families in need. I can assure you, you look back on the last recession, you would not have seen these food packs with so many nutritious items, perishable items and other items that were locally produced and immediately distributed. So we're very excited about this. It's the spirit that finds the best of California and a spirit that certainly I hope will enliven people all across the state of California. I want to just mention those that are on the front lines in terms of our food banks and the incredible pressure they're facing. I stated a few weeks back that we contributed, because of the support of the legislature, the Assembly, and the Senate, Democrats and Republicans, supporting our food banks. We were able to distribute $20 million of an emergency grant to our food banks to enhance and advance our efforts in terms of providing these food boxes to families in need. We also announced the National Guard. The first mission the National Guard advanced during this pandemic was a humanitarian mission to support our food banks. We also worked in collaborative spirit with partners like AmeriCorps that have done an amazing job, Team Rubicon that's done the same, Cal Volunteers, all in an effort to subsidize not only the increase in demand, but the decrease in volunteers at our food banks when this pandemic took shape. They have substantially addressed a lot of those issues. It's not by any stretch perfect, and I will, as always, ask on you to the extent you are available to help support that cause, to volunteer your time and attention through our CaliforniansForAll.ca.gov website, because the food banks still need more volunteers. But I want to acknowledge the partnerships that have been advanced, particularly between those four organizations, the National Guard as the original anchor, and AmeriCorps, Team Rubicon, and Cal Volunteers are really helping support the distribution of food for those most in need. So connecting California's farms, farm workers, connecting to the cause of our food banks, getting product and produce that otherwise would literally be thrown away as waste, and now providing a tax credit to the farmers of 15%, and providing a wage to the farm workers, and getting philanthropy to help support this, and getting those federal dollars drawn down that otherwise would not be drawn down is the spirit of the announcement today. But there are two other components that I want to share as well. We got two waivers from the federal government. One waiver is rather significant. The CalFresh program, our SNAP, our food stamp program, CalFresh program can now today provide access to commodities online. So if you have a CalFresh debit card, you can now go online and utilize CalFresh at scale. We start with just two partners for the moment, and that's Amazon and Walmart. And so that's just for the moment, Amazon, Walmart, but now you can shop online with CalFresh. We want to expand those partnerships beyond Walmart and Amazon. I'll announce that when those partnerships are available, but currently we are affording this because of that waiver to everybody in the state of California. And I say everybody, it's about 2.2 million households, a little over 4 million people that now can avail themselves to access that opportunity online today as well. The second waiver that I wanted to mention, the third announcement of the day, is also a rather significant one. Because of the work of Speaker Nancy Pelosi and others, we were successful in being the beneficiary and the recipient of a pandemic EBT program. We were able to work with our federal partners on an additional waiver for this program to provide up to $365 additional dollars, an additional $365 available under this pandemic EBT program for children and families that otherwise would have gotten the benefit of reduced or free breakfast and lunch in our public school system. Because we shut down the schools, still doing learning, distance learning at home, but the physical schools are shut down, those meals with a universe of roughly 3.8 million children that are eligible for those programs. Those programs are not providing, in every case, those meals. And so this pandemic EBT program will make available a universe of up to $1.4 billion for 3.8 million eligible families. Again, that's the universe of possible to begin to utilize those dollars from that CARES Act to advance their nutritional needs. So we think that's a significant thing. I couldn't be more pleased and proud of the work that Kim Johnson's done at the Department of Social Services to help organize and set up that program. The framework for that eligibility is about a 64-day period from March to middle of June. But the universe of available dollars is rather large, and we just want to make sure it's socialized, and we're doing everything in our power to get that information out there, and of course encourage others that may know people that fall into that category of being eligible for free or reduced breakfast and lunch programs to know that these dollars are available for them through the EBT program, and we're going to do our best to get them in people's pockets because we deeply recognize people's food insecurity, not just their economic insecurity, and we don't want to exacerbate that to the extent we can. So partnerships in our food banks, partnerships with our farms and ranchers, partnerships with local producers to help local food banks, partnerships in terms of philanthropy and volunteers, people doing more to create more access and opportunity, and not just in person, but now also online to draw down eligible dollars, federal dollars in the CalFresh program, and now this broader waiver for our kids in public schools. And so I'm very proud and very pleased to be able to make these announcements today. It's the spirit of our times, the spirit of California. What often takes a year, now we need to do in months. What takes a month, we now need to do in weeks. What takes weeks, we need to do in days. And what we used to do in days, we need to do in hours. And I recognize every day I come here making announcements, also following up on previous announcements and metrics and marking moments. I realize it can be overwhelming, but that's the moment we're living in. You can't just do one thing at a time. You've got to do many things at a time. And we're dealing with a pandemic. We're dealing with a crisis. It requires a focus. It requires an intentionality. It requires people doing things they never imagined possible, even just 2 months ago. I'm just incredibly proud of everybody doing what they can, as we say, to meet this moment. And so one of them, I'll just offer the mic here in a moment, is our Secretary of Agriculture, who has been actually fighting for some of these programs for years. Since my days as Lieutenant Governor, I heard her talk about these programs. And again, sort of proving the point, in just a few weeks, she was able to put something together that she's been talking about for years, our Secretary of Agriculture.
Thank you, Governor, and thank you for your leadership. We appreciate your support. We appreciate everyone's support for really looking for California-grown product wherever they might be. Our farmers this year have gone through quite a shockwave, like all of us have, but they're working every day to continue the kind of bountiful, nutritious productivity that is a hallmark of California. We are blessed to have the farmers and ranchers and farm workers that we have, who have made us the #1 agricultural state and the leader in our tree nuts, in our dairy, in our fruits and vegetables. I like to tell people that if you've had a salad today, there's a 50-50 chance all of that product in that salad came from the great state of California. But the shock to closing down food service has ramifications for how we all shop and eat these days. 50% of our food dollars are spent in the food service arena, no longer in retail like it used to be. And that has backed up product. And because it is so perishable, some of it has just come out of the ground, destined to go across the country. We had a program that was in place because of the foresight of tree fruit growers.
Just going to pop in here, everyone, to let you know, I know that the audio and visual sync is a little bit off, but it's from the record that came from our sister station today. Unfortunately, I can't fix it.
But we don't want it to go to waste. We want the citizens of California to have access to that healthy food. They ran a pilot program that led to the California Association of Food Banks developing the Farm to Family program. I am proud that when I was a member of the State Board of Food and Agriculture, we created a partnership to make sure that we could take this program statewide and use it to prevent waste, to use it to get all that is good that we grow in the state to the citizens of the state. It is a highly developed network. It has logistics like any other food distributor does. It has 4 regional coordinators that go out and solicit donations from our growers and our ranchers. They take straight donations, and oftentimes, if there's just not enough money to cover the farmer's costs of harvesting that, they will pay a portion of the harvest costs to be able to get it transported into the central food bank so it can be repackaged and distributed up and down the state to the 41 food banks that are serving all 58 counties. It's a remarkable program, and I believe because we had it in place, we were able to prevent extensive food waste that was bound to happen because of the suddenness of the change of our economy and our buying habits. I also want to thank the people on our state board who have a standing task force around food banks and food insecurity. They are meeting even as we are here today, discussing not only the short-term way to respond to the tremendous need of our citizens, but also what do we have in place long-term to be able to ensure that every child, every senior citizen, every family has access to healthy California-grown fruits, vegetables, tree nuts, poultry, beef. We have it all 400 commodities. Looking forward to working with you, Governor, to expanding this program. Thank you very much.
Thank you, Madam Secretary. As I say, Secretary Ross has been working on this program for years. It's a very important program, but it's never scaled to the extent now it will. I noted 128 participants. She has already identified over 200 additional farmers and ranchers that now want to participate in this program. And because of this jump start, we believe it will substantially and significantly expand in real time. And thanks to her leadership, I'm confident that will take shape to the benefit of hundreds of thousands of families all up and down the state will have these quality opportunities to get America's finest produce, some of the finest citrus, well, I won't go through the list, and dairy and rice, but you get the picture. And we're very, very grateful that people will be getting these food boxes. And by the way, just for what it's worth, I say food boxes. We're literally organizing these in boxes. That $20 million emergency grant, about 900,000 of these boxes went out. It provides a family of 3 or 4 up to 3 to 4 days of food. So it's not just canned items. It's, again, all of these other perishable items that are fresh and ready to be consumed that otherwise in a supply chain where market demand's dropped in half would otherwise, as we said, go to waste. And so that's the importance, the architecture of this program and power of this program as well. Let me just extend, as we do daily, a little bit of update before we open it to questions from folks on a number of key issues and indicators in this state. Yesterday, we talked about a number of indicators and talked about those that we believe are beginning to turn green, some that are yellow, some that are still red. We did a deeper dive yesterday as it relates to businesses and schools, a little bit on child care facilities. We talked about moving from this phase that we define as phase 1 into phase 2 in a matter of weeks, not months. And we talked about phase 3 and 4 being months, not weeks. One of the critical indicators that is prevalent in all of our discussions is the number of people whose lives have been lost to this pandemic, a number of people hospitalized, a number of people in our ICUs. I mentioned last week we started to see a record number of deaths in the state of California. I began this week by announcing that tragically we had lost 44 55 lives on Monday, 54 lives yesterday, about half of the daily number of families that have been torn apart because of this virus compared to the prior week. Unfortunately, today, it slipped back slightly up, 78 families that have lost a loved one. And so, again, we monitor this daily. It tends to be the lagging indicator, but it's just a reminder that we're not out of the woods, a reminder of the importance of the stay-at-home orders, the reminder of the importance and potency and power you have as an individual in terms of physically distancing from others and continuing to practice social distancing. Accordingly, while we have seen the number of hospitalized patients flatten and become relatively stable in the state, I mentioned yesterday that it went up modestly. Today, it went up yet again modestly, about 1.2%. Still within the margin of stability, but again, not where we want to see those numbers. We don't want to just see a stable, flat curve. We want to see that curve decline significantly. 0.4% decline in the number of, or rather 0.4% increase from a decline yesterday, a modest decline in the ICUs, but we certainly are seeing stability in our ICUs, and that allows our ventilation inventory to be now north of 10,500. That's just within our 416 hospitals, and in addition to that, our own state capacity in terms of our reserves and those that we have obviously lent to other states across the country. So again, encouraging, but by no stretch of the imagination where we ultimately need to see those numbers go, and that is sustained decrease, but certainly still within the frame that it's been over the course of the last few weeks. I want to update you just briefly on the incredible call volume. I've every day or every other day updated you on the work we're trying to do to improve your experience and your capacity of access and distribution of benefits and funds to our unemployment insurance system. 3.7 million people now have filed for unemployment insurance just since March 12th. They have distributed now just shy of over $6 billion, not just shy. They have distributed over $6 billion of benefits, $1.2 billion just yesterday. Just in a 24-hour period, they were able to distribute $1.2 billion. We saw, not surprisingly, a spike in applications yesterday. We saw about 235,000 people apply for unemployment insurance and the new PUA program. That's a pandemic unemployment assistance for people who are self-employed, people who are independent contractors, gig workers, and the like. That was the first day that we had that system operational for PUAs. We were able to unpack those numbers, and it's roughly 190,000 individuals. The substantial portion of that increased volume was in that PUA category. I am deeply aware that many of you tried to access that system online, in person, and struggled to get in every day. And I was very sober about this last week, sober about it yesterday, in terms of addressing the fact that this is day one yesterday, now day two, that we are getting our arms around this. Again, unprecedented volume. You went from 2,500 applications a day just a few months ago, all in, just yesterday, 235,000 applications. Not an excuse. We have to meet the moment. We have to provide more support. And I mentioned the chatbots that we're putting up and the new texting technology. I talked about the 1,340 people that we hired and repurposed to help support the call volume, the extension of the hours, 7 days a week, 8 to 8 p.m., and also talked about the additional 600 staff that we're putting on this and the new business strategies in terms of how we conduct ourselves and how we are able to answer questions much more aggressively and forthrightly, including some of the eligibility changes. They're all part of loosening the capacity and our ability to deliver on your expectations and what you deserve as people that are fearful about their economics and fearful about their ability to just buy food, pay for rent, support their children, support their families. So we are making progress, and those numbers are bearing fruit. Over $6 billion, $1.2 billion just yesterday, averaging a little over $1 billion. And last number of days each day, 1.2 again just yesterday. PUAs now finally coming online, and the turnaround on those is well within not the 21 days for unemployment insurance, but within a 7-day period, 24 to 48 hours for those overwhelming majority of people that have debit cards. Those that without one will probably be a 7-day period, but well within, we believe, our capacity to deliver, though I'll be honest and forthright in terms of updating you daily on those numbers as well. One other number of importance, and that is the continuing progress that will be made in our efforts to provide homes for the homeless that are in congregate facilities that are otherwise vulnerable to exposure of COVID-19 or have tested positive or have compromised immune systems. We have now well in excess of 12,500. In fact, it's 12,603 hotel rooms have been acquired now in the state. Over 1,200 of those trailers, in addition to those rooms, have been distributed all across the state. And we have thousands and thousands of individuals that now have the dignity of a key lock and a door in a place, at least for the moment, to call home because of Project Room Key. And I just want to thank everybody for putting together a program in just a few weeks and getting this program up and running, including the people that make it work. And those are the 3 meals a day that are also delivered to the doors of people that are participants in Project Room Key through Chef Jose Andres and World Central Kitchen and the incredible work they've done to partner with us and provide 3 meals a day for those vulnerable Californians as well. So trying to do many things at once, trying to do all of it in a condensed period of time. All of these things require partnership. All of these things require collaboration, capacity. And again, I just want to express deep gratitude for all of our local elected officials, our state and federal officials that have helped all of us meet the guidelines and begin to process many of these programs concurrently as we work our way through this pandemic. And so that's broad strokes. The updates on the numbers, I'll just mention one final one before I open up to questions, and that's testing. Always important. We'll update you tomorrow a little bit more on contact tracing and our workforce and our new partnerships that we're forming. But on testing, we broke, at least from my perspective, an important threshold. Again, we started 2,000 tests a day in March. March was just last month. April, we said by the end of April, we'll go from 2,000 to 25,000 every day. We are almost there. We've been averaging a little over 20,000 a day. 25,000 plus yesterday, over now 600,000, 603,000 plus tests so far in the state of California. And I mentioned yesterday the new partnerships with these end-to-end tests that will focus disproportionately on rural California and underserved parts of our state, particularly in Black and brown communities in this state. I mentioned that OptumServe, 80 sites, all of them will be operational by Monday. They assure me of that. We'll test that over the weekend, but they're getting sites up in Shasta and Sutter, other sites, Humboldt, that we announced a few days ago. And then we're seeing Verily, a separate contract, do the same in some of our inner cities as well. So it's not, again, the test numbers. It's who we're testing and how we're addressing socioeconomics, justice issues, and doing more to make sure that we are, that we have the right information as it relates to the impact on this virus on all of our diverse communities up and down the state of California. With that, I'm happy to answer questions.
Haley Winslow, Good Day LA.
Haley?
Hi, I'm actually with Supervisor Wagner in Orange County right now doing an interview with him. They unanimously voted yesterday to approve reopening businesses with guidelines in place, and I just wanted to get your thoughts on that. I'm actually in the middle of the interview right now, and Supervisor Wagner,
can't help you with the interview. Let me just.
What we were saying is the Orange County order satisfies Orange County. The sheriff will not come and ticket you, but the state orders and any local city orders remain in place.
All right, Supervisor, I think it was Supervisor. I'm not sure who is on the line, the reporter or the supervisor. I think I'll let you get back to your interview. But I, as you know, laid out very detailed terms yesterday, the strategy for California to make meaningful changes to our stay-at-home order. As many of you know, we have 6 indicators that will determine our decision-making. It won't be on the basis of, political considerations. It won't be on the basis of pressure. It won't be on the basis of what we want, but what we need to do. And what we need to do, from my humble perspective, is listen to the public health experts, listen closely to what's happening with the virus, look at data, make the determination to guide our decision-making. As everybody knows, this state is a very large state. Conditions are very different in different parts of the state. I will say about Orange County, it's important. The supervisor is well aware of this. Orange County is the 4th highest number of people of all 58 counties hospitalized in the state of California.
Racial equity ordinance, and we also have some additional special guests with us. In addition to Mayor Barrett, County Executive Abley, Dr. Ben Weston, and our Public Health Officer, Ann Christensen. We are joined by County Board Chairwoman Marcelia Nicholson and County Executive-elect David Crowley. So, and we're going to do things a little bit differently today. We're going to put our public health professionals after our special guests. So we'll start with Mayor Tom Barrett. Please go ahead.
Thank you very much, Brian. And this is a special day for many individuals, particularly at the county. And I wanted to congratulate our new chairman of the board, Chairwoman Nicholson. Congratulations. Obviously, the new county executive-elect, County Executive-elect Crowley. And I want to thank County Executive Abley for his years of service. And I think that today is a fitting day with this historic signing of the racial equity ordinance that the county has promulgated. And I think, unfortunately, what we have seen over the last 7 weeks is we have seen how much the challenges that we face as a society really are amplified in our African-American community. The fact that today, as we sit here, of the deaths in Milwaukee County from COVID-19, that 88 of those individuals are African-American underscores the seriousness of the healthcare challenges, the living challenges, and the disparities, the racial disparities that we see in our society, and we see right here in Milwaukee County, in the city of Milwaukee, throughout this nation, quite honestly. And so it is important for us to deal with these issues and deal with them head on. And if we don't identify these issues, if we don't come up with solutions to remedy them, we're just going to be in the same place over and over and over again. And so I want to applaud everyone who's been involved. I thought that the piece that Dr. Weston did, that was in the newspaper over the weekend, was a very accurate depiction of the challenges that we face as a society. And it's because of the leadership that we're seeing throughout this crisis that gives me hope. And I think that's what people are looking for right now. They're looking for hope. And particularly this week, the horrible incident that occurred 2 days ago, that's a neighborhood where we want to see more hope. And I think we as leaders have an obligation to create hope and provide hope, but also to be honest with people and to be really telling as to what the challenges we face are. And that's what you're seeing right now. So I'm very pleased that we have so many people coming together to try to address the issues we face. So with that, I'm going to thank County Executive Abley for all of his leadership on this issue and turn the screen over to him. County Executive Abley.
Well, thanks, Mr. Mayor, and thank you everybody again for joining us. As I typically do, I'll start by reminding everybody of what those numbers are. Confirmed cases, 2,897, of which 1,261 are African American. Fatalities are now 168, with 88 being African American. And as a reminder, the African American community is 26% of Milwaukee County. As a reminder, the disproportionality directly correlates to the same disproportionality you see in everything from employment to healthcare opportunities, access to good education, jobs, etc. And we talk about it a lot. I think it's appropriate that in this setting, we are signing this resolution because, as I've often said, the disparity in these numbers during this crisis is the starkest illustration and most tragic you could ask for of conditions that have lasted for decades and decades and decades. And if we don't take this as an opportunity to catalyze ourselves as a community and know that we are better than this, if we don't see it as a moral obligation for every elected official of any party in any office to place as their highest priority changing this reality to the one that we know, everyone knows in their heart we deserve. Those numbers are huge, but every single one of those numbers is an individual with family, with friends, with colleagues, with lives, with hopes. And it's easy to see these numbers getting bigger and forget that. We can't. I could not possibly be more excited about the leadership that the county has going forward. We have an incredible chairwoman who I've worked with. I've had the privilege of working with Chairwoman Nicholson on many issues, though nothing as important as this. And our county exec-elect and my friend, David Crowley, there are no two people who are better prepared and more appropriate to serve in leadership in this county to face this crisis than David and Marcelia. They're incredible public servants, and I'm proud to work with them. So, as you know, we're signing this resolution. I'm signing this resolution that was passed. If people are wondering, so what does this do? We've been talking about racial equity for some time at the county. The Office on African American Affairs was created years ago, but for some time, each year, more and more of our everyday decisions on everything is informed by a positive, trying to accomplish a positive impact on racial equity. It's our hiring decisions, it's our appointment decisions, it's what companies we work with, it's how we provide service, where we provide service, which service we provide. We have a racial equity tool that determines for budgeting. And it's built into our process. What this does, what this ordinance does, is commits every single employee of Milwaukee County to embracing probably the most robust legal commitment in the country of any municipality to making a difference on this issue. And I just want to, again, thank the board, and in particular, Chairwoman Nicholson, for her leadership on this, which has been great. I know we're all going to continue to work on this. In the short term, right now, we're all focused on getting through this crisis and saving as many lives as possible. But we cannot live through this moment. We cannot go through any change in leadership without being starkly clear about the by far most important issue we all face, which is these disparities. And right now, the lives that are being lost, and even for the people who survived, the lives that are being just crushed and destroyed, the relationships being strained, it's tragic. So I will turn it over to my successor. For what it's worth, I'm in the courthouse right now. I've been cleaning out the old office, David, so you're going to be in good shape. Hopefully, I left a few surprises for you in the desk, as my predecessors have done for me. And a quick shout out to Dr. Weston. Just prior to this call, I had reached out to him, and I had noticed that if you look at our website, where the dashboard does such a good job of illustrating the daily numbers and specifically by ethnicity, so you can see that disparity. When you looked at the confirmed cases by race, it showed 1,100 because that's as high as the bar could go for African Americans. It's actually 1,261. And, if you need another illustration of just how disproportionately high they are, there's your illustration. The good news is in the Department of Quick Response, in literally about 3 minutes of my telling Dr. Weston this, his team has already corrected it on the website. So for that and for all your other great work, Dr. Weston, thank you. And with that, I will turn it over to the county executive-elect.
Actually, I'm sorry to jump in. We're going to jump to Chairwoman Nicholson next, and then we'll come back to County Executive. No problem.
Apologies.
Thank you, Brian. First, I want to thank County Executive Chris Abele and his staff, as well as the Office on African American Affairs and my board colleagues for their partnership on this ordinance and working to embed racial equity into everything we do at Milwaukee County. I want to also thank County Exec David Crowley for joining us today. I'm really excited to work with you in the future. What we know today is that racial inequities are the result of intentional and unintentional racist policies and practices in government at all levels that give advantages to white people and leave behind people of color. Currently, Milwaukee ranks 71 out of 72 counties in Wisconsin in overall health. And health outcomes in the Black community are even worse because of racism embedded in the structure and culture of local governments and really society at large. And that's not okay. Now is the time to confront it, and signing this ordinance today is an example of confronting it. We as leaders in government have the responsibility to dismantle institutional and structural racism and lead the way in addressing the inequities that perpetuate racist disparities. And as legislators, we have a unique role in crafting and passing policies that work to improve the lives of everyone. As chairwoman, I've made racial equity and improving health outcomes for people of color my top priority. And I will work with my colleagues on the board to conduct our work as legislators through a racial equity lens. I will also provide a vehicle for hearing and discussing findings monthly and work with staff and board to set a legislative agenda that puts racial equity at the center. Racial equity isn't just about people of color. It's about everyone. It's about having the ability to thrive regardless of zip code, regardless of race, regardless of class. Through this work, I believe we can make Milwaukee County the healthiest county in all of the state. And I look forward to working with the county executive-elect and all of Milwaukee County in achieving that dream. Thank you so much for having me today. And I'm really excited to begin this work.
Thank you, Chairwoman. And now we'll hear from County Executive-elect David Crowley.
Thank you. Thank you for everybody for being on this call. For folks who don't know, Milwaukee County's vision is by achieving racial equity, Milwaukee County can be the healthiest county in Wisconsin. Racial equity will be achieved when race no longer predicts the health outcomes and outcomes for everyone to improve. What we do know is that racial inequities are the result of explicitly and implicitly racist policies and practices at all levels of government that have given certain people an advantage and those a disadvantage. So discriminatory and racist policies and practice of government and other institutions that Milwaukeeans rely on to thrive have played a central role and continue to impact health outcomes along racial lines. We do know that Milwaukee County ranks 71 out of 72 counties in Wisconsin in overall health, according to the County Health Rankings Index. And health outcomes for the Black community are worse in Milwaukee County because of racism embedded in the structure and culture of local government and societal at large. And I think we've seen that happening and playing out, particularly with the COVID-19 crisis. And I just want to say thank you for declaring racism as a public health crisis and creating a process for achieving a vision for Milwaukee County to be the healthiest county in Wisconsin. And so I want to thank County Executive Abele, the County Board Chair, the Office of African American Affairs, and other leaders at Milwaukee County who has been addressing these inequities internally to make sure that Milwaukee County's institutional and decision-making practices are having racial equity at the center of the discussion. And I just want to say that with this ordinance, we're going to be able to use a tool, the racial equity budgeting tool, which is structured to look at everything through a racial equity lens for departments to use to critically assess the impacts of budget decisions on communities of color. This tool is designed to do four things: make intentional connections between the strategic plan here in Milwaukee County and the budget, to use racial equity as the key guiding principle for important decisions regarding investments and disinvestments, initiate conversations on topics related to strategic objectives, and provide baseline data on departmental efforts to inform enterprise-wide decisions. So I'm looking forward to working with our departments, working with the county board, and many of our internal and external partners to make sure that we're doing everything that we can to make sure that racism is no longer an institutional problem, particularly within Milwaukee County government. Hopefully will be a ripple effect to affect all of this region. And so I'm looking forward to this opportunity and making sure that when the tide rises, all the boats rise. Thank you.
Thank you very much, County Executive-elect. And now we're going to try something that's probably unprecedented in all of human history. County Executive will tilt his laptop camera towards his desk, so we can get a nice visual of him actually signing the document. So please bear with us while we make this work here.
Thank you, Brian. I actually tried the tilt the laptop approach before this and managed to drop my laptop. So I'm just going to hold it up so you can see. This is the ordinance. And this underlining approval, signing my name, and dating it as what will be the last ordinance after 9 years that I sign, and I couldn't be happier that this is the one that I'm signing. And again, thank you to the board, thank you to the chairwoman, and thank you to the county executive-elect who puts us all in great hands.
Thank you.
And County Executive Ailey, could you just hold that up to the camera one more time for us so folks at home can get a good look at that? Great. Thank you. Okay, so I'm sure. So I don't see any questions in the chat yet. So we're gonna jump to Dr. Ben Weston, who will provide the regular update on COVID-19, plus I hope some additional comments on racial equity, and then our public health officer.
Thank you. Good afternoon. Starting with the numbers, and I'm actually going to just real briefly pull up our dashboard here. So we have 2,897 confirmed cases in Milwaukee County, 168 individuals who have died. County Executive Ailey pointed out, but you can see our stark differences now that we expanded this upward a little bit in the cases here. And then I just wanted to point this out and pull it up to show a few new items, that I think will be helpful for our public, our decision makers. One is this 14 and 7 day map. So you can now see more accurately what's going on over time, what's going on over the last 14 days where the clusters are, and then just over the last week where most of the cases are. And it has all the same layers as we've had previously to see demographic data, to see heat mapping, to see density per capita. The other item is testing data. We've talked about how we're ramping up our testing. So you can see our total tests performed here, a run of tests per day down here with the positives down in blue, how many tests are turned around by our labs within 48 hours, and then the percentage of tests that are resulting positive. Obviously, we hope this number continues to trend downward. So this is some more data, some more numbers to inform everybody. And then I think it is worth mentioning as well, I appreciate County Executive Ailey mentioning the quick turnaround time, but that is very little to do with me and a lot to do with the Office of Emergency Medicine, data management and mapping team, Shannon and Zach to be specific. So definitely credit to them as well. A lot of work that goes into that dashboard. So speaking of the dashboard, when we initially developed the dashboard, our aims were just that, to provide transparency and information to the public, while also enabling our stakeholders to have a unified understanding of COVID-19's effect on our community and better determine resource allocation. When we created the dashboard, the county executive made it very clear that he wanted race and ethnicity information for our cases and our deaths to not be hidden under tabs and layers, but to be immediately visible, immediately understandable to both the general public and decision makers alike. And this is not, I don't want to put words in his mouth, but this is not because we're proud of the lack of disparities in our community, but on the contrary, it's because we're working to view COVID-19 and view our interventions and our messaging through a lens of racial equity. And it's because of this data that we know that an African-American person in Milwaukee County is more than 3 times as likely to die from COVID-19 as a white person in our county. And while COVID-19 starkly outlines the racial differences in our community due to the visibility and the near real-time spread of a pandemic, these disparities are not new. We see them in heart disease, we see them in stroke, in cancer, infant mortality, and overall life expectancy, along with many other health measures. We see this on a community level in large part due to, as has been discussed, the historical, the institutional, and the ongoing effects of marginalization and racism in our community and in our county. So this racial equity ordinance emphasizes and I think integrates into high-level decision-making the importance of this lens on racial equity and the transparency that we seek with the challenges and the disparities in our community. Thank you very much and stay safe.
Thanks, Dr. Weston. And now we'll hear a report from our public health officer, Ann Christensen, who's the director of the North Shore Health Department and the health officer there. Director Christensen. And you're muted, Director Christensen, at the moment. There you go.
Great. Yeah, thank you. Thank you for the opportunity to be here today, most importantly for this important message for everybody. As noted, I represent the 11 health departments in Milwaukee County and have the privilege of putting the public health perspective on COVID-19 as well as today's comments. I do want to just talk more generally about the progress that we keep seeing in terms of our day-to-day work on COVID-19. Just in the last 24 hours, we received results from 44 different cases who were positive. That compares to 9 days ago where we saw results from 98 people. So again, the trend that we're seeing is demonstrating progress, especially with the stay safe at home order in place. And we're really thankful to the community for all your work in making a difference with heeding the order to stay safe at home. I wanted to talk today about some of the public health measures that have been voiced in the media, as well as where we're going in our next steps with what we're going to be focusing on. And I think that there's been a lot of talk of contact tracing and what does that mean and what is that? And I feel like it's important to bring that up today, especially because contact tracing is an investigative process, number one, but it is also a window into the stories and lives of the people that are impacted by COVID. And public health really has the privilege of working with people for the course of an isolation period or quarantine to help them really navigate the concerns, the fears, and the conditions of which they're living under, either having COVID or being exposed. So it's really a great privilege for us to work with community members in this capacity. So as you hear about it, again, it's talked about in terms of a scientific tool, but again, it's also a tool that really is a privilege for us. And we hear the stories of people that struggle with being in circumstances where this impact that they're having, be it an isolation period where we're asking them to stay home for 7 to 14 days, that's really challenging for many people. And our role is to work with their employers, their families, whatever social supports they need to try to help them in that time where they are struggling either emotionally, financially, or just socially to really be in a place where they're safe and supported. So we are with people in this time as this contact tracing process and recognize that, again, that's quite a privilege for us. Just wanting to talk a little bit about it, again, to sort of dispel any myths about what contact tracing means and to really help people understand as we scale up our work in this, that it takes a tremendous amount of resources from public health. And we're talking about scaling up staff in the local health departments to be able to have enough resources to basically identify and track all of the individuals who test positive for COVID, but then all of those people that are within the vicinity of that person who may be exposed. So that's a tremendous amount of human resources to do that work. Early on, when we didn't have Stay Safe at Home in place, our health department, as well as others, were tracking down hundreds of people that may have been in contact with a single case. That was a tremendous amount of work. Because orders like Stay Safe at Home and movement restrictions are in place, really our contact lists are very small right now. They're really minimal to household contacts. And you see that with the data that we're sharing, that those decreases in the people exposed are having direct impacts on the reduction in our cases. So that is a very good thing. It is why we've got this order in place and why the governor talks about dialing it up slowly so that we don't all of a sudden expand those contacts again to be in the hundreds, because that's just too many. We wouldn't be able to control the spread if we continue to have that many contacts. So I have a request of the public in terms of this process to help us navigate the next steps. One, very importantly, is if you're sick, stay home. So don't go out in public. It's really important that this advice be heard, because again, if you're in public while you're sick, everybody in your vicinity becomes that contact person that then local health has to follow up with and notify that they've been exposed. So if you proactively stay home while you're not feeling well, that list is very small for us. So that's one very basic ask that we have of everybody in the community. The second is if you're tested, there's two things. One is if you're tested, stay home until that test result comes in. Again, don't be in the community, because if you test positive, that whole time we have to find everybody that you've been in contact with. Again, a tremendous amount of work. And then just in terms of making sure your doctor has your address and a way that we can reach you. There's a lot of resources that go into tracking people down. So just make sure when you get that test done that that information is current and available. Again, it does make it easier. We're very much going to be able to meet that notifying contacts within 48-hour goal, which is what we have set out there with that general information. So I know that sounds like you'd be surprised that that information is not available. It sounds like it should be, but just that's important for people. So again, the process is very straightforward from our end, but with these little things that we can do, we can all stay safe and making our work helpful for you in this time, both if you're identified as a case as well as if you're a contact. And again, just to remind you that health departments are here to support you in this time. We recognize that this is scary for some, but we are here to help and support and provide you with resources and information that you need while you're either sick or in quarantine. So that's my public health message today. Thank you.
Thank you, Director Christensen. So now we will go to questions. And a couple notes. Chairwoman Nicholson had to leave. She has a service she has to attend this afternoon, so she won't be available for questions. And we're also joined by the Director of the Office on African American Affairs,